although I hope it doesn't happen, we have to be responsible, whatever the consequences. We have to do what your state says if we want a shot at turning this around. And part of the reason why we now are increasingly going to more extreme measures is because the initial reaction was so incompetent from day one. It'll go away on its own. This is no big deal. We have no cases. The United States, even with the little amount of testing that we are doing, are rapidly heading in the direction of being one of the countries with the most cases in the world. Now, of course, we have a really large population, but remember, we had, quote, leaders telling us we would likely see very few cases here. Dr. Anthony Fauci, who's the director of the National Institute of Allergy and Infectious Disease, he now is saying straight up, cancel or postpone any event with 50 or more people for 8 weeks. 8 weeks as a starting point. That's a long time. I get it. But understand that the way these infection curves go, every day that it grows is another day on the tail end you need for the decline. Without a vaccine or treatments, if you have 10 days of case growth before you turn it around, you need 10 days of declines to get back to where we are today. If you delay slowing down case growth for 15 days, you then need 15 days on the back end before you get back to where we are today. Meaning for every day we don't deal with this, we are actually losing 2 days minimum, not to mention the exponentially disastrous effect on the medical system as ICUs become overwhelmed, as we lack ventilators. So this will add up quickly. Today is day 14 in the United States of that steady case growth. Imagine where we will be in another 14 days if we don't turn it around. So in that context, states are starting to shut down. The federal government is not doing what they need to do here. They have been far too slow. They have been far too dishonest. They're just making things up whole cloth, which I will talk to you about momentarily. So Ohio is shutting down bars and restaurants, period. Now, remember, some places may be ignoring the decrees at their peril. And it's true that there are places which will say shut down and people won't do it. And local police are not going to be able to necessarily enforce every single bar or restaurant following the rules. It requires people doing it. It requires restaurants doing it. Illinois has ordered bars and restaurants to close starting tonight until March 30th. That's a couple weeks almost. Here in Massachusetts, Governor Charlie Baker says all gatherings of more than 25 people are banned. Restaurants can be takeout only until April 6th at minimum, and possibly all the way until April 17th. Some conflicting reports about the exact dates. Schools are closed. Things are closing down. California Governor Gavin Newsom says California will be closing bars, nightclubs, and wineries, and that everyone aged 65 and over should be self-isolating. Do not go out in public. Washington State is shutting down restaurants, bars, entertainment, and recreational facilities. Restaurants will be allowed to do takeout and delivery. There are people who still say, you know, there aren't that many cases. We have 340 million people and we have 3,500 cases as of right now. Number one, understand that we don't have 3,500 cases. By some estimates, we likely have between 1 and 500,000 cases. We are just not testing. We're not testing. We don't know how many cases we have. There are people who will say this is simply going too far. When you understand the math of viral contagion, you realize you have to do it before it's too late, because otherwise it's too late. It needs to feel like it's too early, because otherwise you're going to be behind the curve. And look at what happened in Italy. It's a tragedy what's happening in Italy. They did too much too slowly, and now they have more active cases than China, despite having a population that's 96% smaller than China's. Think about that. And that's because of delays. Every day matters. You've got to turn the corner on the new case number, meaning you need to change the inflection of the curve from more new cases each day to fewer new cases each day. When you look at new cases in the United States, it's up every day. This is the time to shut it down, because otherwise in 10 days, the U.S. could look like Italy. If this comes to your state, and it likely will at the rate that we're going, be part of the solution. Don't be part of the problem. And by the way, don't hoard, okay? The hoarding situation's getting very bad. There was no toilet paper shortage expected. Rumors swirled that there would be a shortage. Think about it. Why would all of a sudden there be a shortage? Doesn't actually make sense. People buying all the toilet paper they see creates an artificial shortage. And you have tragic stories of elderly couples driving around all over the place, not feeling well in many cases, looking for a roll of toilet paper because you have people, and I'll play you videos momentarily, people fighting. It's like Black Friday looking for the cheap TV over toilet paper. I went to a couple local grocery stores. All yogurt was gone. All eggs were gone. All meat was gone. Frozen vegetables, frozen fruit, all gone. Fresh produce, by the way, plenty of. People, I guess, completely ignoring that at this point. Don't hoard. Build up a strategic supply of a couple of weeks of food, which most of us should have anyway. A couple of weeks is reasonable and non-perishables, and understand that you will make the problem worse. It's really, really bad what's going on. This next story has absolutely exploded, and it's as detailed as it is disgusting. As we're discussing today, a whole bunch of companies are working on coronavirus vaccines. That's a good thing. One of the companies is a German medical company named CureVac. There are now widespread reports with corroboration that Donald Trump offered $1 billion to this company to secure the vaccine for the United States only. Now, the reaction from Trumpists was totally predictable. First, they denied it was true. Fake news, fake news, fake news. Oh, it's been confirmed by German officials and authorities. Well, they said, good for Trump. He's watching out for us, America first, which is exactly what you would imagine a Trumpist would say about this. So let's go through the details. Trump was interested in buying this future possible vaccine for the United States for $1 billion. This became known inside of Germany to the point that the German government was almost negotiating against Trump, offering money to the company so that the vaccine would stay in Germany and be available to everyone as it should be if and when it is ready to go. Germans were understandably outraged. The world is understandably outraged. Trump wanted to get the vaccine here and only here somehow to help him politically. That's what this is about. That's what Donald Trump was trying to do. Now, of course, U.S. officials can't deny the story because it's been corroborated so widely. What they're saying is it's been misreported. For example, U.S. officials are saying, we're talking to lots of companies who are working on vaccines, and we can offer money to them to help them. Of course, that's not what this what this is. And any solution that is found, they say, should be shared with the world. What they're not saying is, would it be shared with the whole world at the same time, or would the United States get it first, giving Trump the opportunity to announce, I got us the vaccine. Americans are getting vaccinated before anybody else. Now, adding to the intrigue here, last week, this company, CureVac, weirdly announced they were changing CEOs. This was unusual. CEO Daniel Menechella was replaced by Ingmar Hohr just weeks after Menechella met with Donald Trump. The hypothesis is, and again, this part is more speculative, the hypothesis is that Menechella may actually have been willing to accept the $1 billion from Trump to give the vaccine only or at least first to the United States. The board and stockholders of CureVac caught wind of it, fired the guy, put in a different CEO, and said very clearly, if we are successful in developing a vaccine, it should help and protect the entire world. The German health minister, Spahn, said that a takeover of CureVac by the Trump administration is, quote, off the table, that CureVac will only develop a vaccine for the whole world, not for individual countries. Look at where the world is today. Donald Trump offering cash to give him the vaccine, to let him get the benefit. And of course, after denying that this happened, his supporters predictably started saying, hey, this is good. Trump's president of the United States. Trump is not president of Italy. Trump is not president of Germany. His first priority should be get us the vaccine. But of course, this is as immoral as it is stupid. The disease didn't start in the U.S., yet we are now increasingly ravaged by it. Vaccinating only Americans wouldn't help since no vaccine is 100% effective, not everyone would get the vaccine, and the disease would simply keep spreading if only Americans were vaccinated. This is aside from this being utterly disgusting. It's also very, very short-sighted. This is that sort of dumb America first mentality that's not only immoral, but it's also idiotic in this case. And as I read this, I realized, if Trump wasn't born to a rich family, instead of trying to buy a vaccine for $1 billion from Germany, he'd be the guy buying the hand sanitizer in order to start price gouging by then selling it at 30 or 40 bucks a pop. Understand that Germans are shocked and appalled by this. People in Germany can't understand, how is Trump even a person that exists in the world? Never mind, how is he president of the United States? And sadly, these low information Trumpists who see him as unable to do any wrong say, love it, go Trump, make America great again, keep America great again. It's a nightmare hellscape of embarrassment made worse every day. And just to put a final point on this, imagine for a second the reverse situation. Imagine a pandemic was spreading all over the world, and it turned out that a U.S. company had a vaccine ready to go. And imagine that the U.S. company sold rights to the vaccine to, I don't know, Italy or Germany or France or China or Russia or whoever. And maybe later they'd make it available to Americans. The same people who are saying don't regulate businesses and what a good job Trump is doing trying to get us the vaccine would be saying, take over that business, put the executives in prison. It is a disgusting double standard. It's truly a stunning story. And my guess is over the next few days, we'll learn a lot more about the details. Make sure you're following me on Twitter for all the latest COVID-19 updates. A lot is happening on my Twitter account at @dpacman. We'll take a quick break and be back right after this.
The David Pakman Show at davidpakman.com.
The David Pakman Show isn't some corporate media show with huge advertisers and a media conglomerate supporting us. We actually depend on support from our viewers and listeners. The easiest way, the most rewarding way, the most exciting way to support the show is to get a membership at www.joinpakman.com. You'll receive the world-famous daily bonus show for supporters only, the commercial-free audio and video streams of the show every day, and you'll be part of the solution. Because of membership, we are independent and we're able to cover whatever stories we want, whatever stories our audience is interested in, without executives looking over our shoulder. And it's why we've grown from a weekly show to a daily show. Much to the dismay of the Hatriots, we can't be pulled off the air unless all of you cancel your memberships. Please don't do that, but please do sign up today at www.joinpakman.com. Support independent progressive media. The David Pakman Show is now on Instagram as David Pakman Show. Check out behind-the-scenes pictures, memes, funny stuff, and more. Follow us on Instagram at David Pakman Show.
The David Pakman Show at davidpakman.com.
Today's new members of the day are Robert Little and Stephen Moncrief. Robert and Stephen, thank you for your support. I also want to say thank you to today's longtime sustaining member of the day. That's Paul Foster. Paul's been a member for almost 5 years, and we are now just days away from our first 10-year David Pakman Show members. Incredible. Join them at joinpakman.com. Grab a membership. You get the commercial-free audio and video streams of the show, as well as the bonus show available only to members. You can also get a 40% discount off of your membership with the coupon code THISIS2020. You all know I call things as I see them. And right now, it's time to call the virus situation as I see it. Idiots and bad people are destroying our ability to curb this virus as soon as possible. Their behavior is putting people at risk, and it will cause people to die unnecessarily, people who didn't need to die. Now, I'm not just talking about the people in our government. I'm also talking about just regular old people. You might remember, and by old, I just mean regular people, not elderly. I did a story back in February of last year, about 13 months ago, called "It's Time to Admit That Many Americans Are Stupid." And clearly this struck a nerve. It got more than 600,000 views. very positive reaction, more than 16,000 likes. But a lot of people didn't like it. A lot of people felt that it was an attack on them to some degree, or on people who just lacked education. And this is not what we are talking about. We have never had a clearer case of bad and dumb people will be the death of us than what is happening now in the era of coronavirus. Coronavirus has exposed the deficits in our systems, the deficits in our healthcare system, in our economy, in our president's capacity to deal with a crisis, a total lack of capacity, that is. But we're also hurting because of bad and dumb people. And I'm going to go through some examples with you today. Of course, the context being to stop the spread of the virus, absent functioning antivirals, a vaccine, antibody treatments, all of which are under development. It's going to be a while. We need to reduce exposure and transmission. Stop gathering in large groups, work from home, stay away from other people, all this stuff. Many states are realizing it, shutting down bars and restaurants and gatherings even as large as 25 people. Look at just a sampling of what happened over the weekend. This is just a handful of examples. There are hundreds or thousands of these. Oklahoma Republican Governor Kevin Stitt posted a tweet of himself out with his kids in a very crowded restaurant saying, "Eating with my kids and all my fellow Oklahomans at the Collective OKC. It's packed tonight." This is the exact opposite of what medical experts say we should do. And of course, we live in a world where one party has decided medical experts are basically just people with opinions, which we can ignore if we don't like them, because it's just like saying, I think low taxes are good. It's just an opinion. Our Republican governor here in Massachusetts is taking this seriously, activating a system to get nurses from out of state licensed in state within 24 hours to keep up with demand, saying close schools, work from home, starting a restaurant and bar closure other than takeout and delivery starting tomorrow. And meanwhile, the Oklahoma governor is bragging about being at a packed restaurant with his kids. Is this weaponized ignorance, or is this a bad person? You tell me. Governor eventually deleted the tweet because of the obvious blowback. People are hoarding. People are hoarding food of all kinds. People are hoarding toilet paper. This is creating an artificial shortage. There was no expectation that the supply chain was actually going to be disrupted for toilet paper, nor that toilet paper usage would actually go up. But people are going crazy, and they're doing it with food as well. Here's video of people rolling around on the ground, pushing each other, yelling at each other, and fighting for toilet paper at some big box store. I don't even know where this is. Doesn't matter. It's happening all over for toilet paper.
One per person. One per person.
Again, this is all started by rumor about a shortage. People go fight for toilet paper and they cause a shortage because people are hoarding it. If people just kept buying toilet paper at their normal rate, using it at their normal rate, there'd be no shortage. There'd be no scuffles for people pushing each other in order to grab toilet paper. Are these stupid people or are they bad people? I don't know the answer. More and more in blue states, people are staying home. St. Patrick's Day parade here in Boston canceled. If you're from the area, you know just how big of a deal that is. Not everywhere, though. Here's a girl at some kind of St. Patrick's Day street party talking about, well, I'm 21, I'm immunocompromised, but I don't care because I take supplements.
I have a compromised immune system, but I'm still only 21. But I'm not even worried because I just take supplements and I self-medicate, so it's fine.
Is this a dumb person or is this a bad person, for lack of a better term? South Korea has tested large numbers of asymptomatic 20 to 29-year-olds and found that a whole bunch of 20 to 29-year-olds who feel fine have the virus, and they are spreading it all over if they do what this girl is doing. It has to stop. Here is Republican Congressman Devin Nunes going on Trump brown-noser Maria Bartiromo's program on Fox and saying, hey, you know what? This is a great time to go out to a restaurant. It's not that busy. You can get right in and get a table.
And there's a lot of concerns with the economy here because people are scared to go out. But I will just say, one of the things you can do if you're healthy, you and your family, it's a great time to just go out, go to a local restaurant.
Yeah.
Likely you can get in easily. Let's not hurt the working people in this country that are relying on wages and tips to keep their small business going.
We're very sympathetic.
Don't run to the.
Understood.
Yeah, just don't run to the grocery store and buy $4,000 of food.
Right, they're cleaning off the
Go to your local pub.
We want to be very sympathetic to what's going on.
No pushback from Maria Bartiromo. Should that be criminal, what Devin Nunes said? I tweeted asking, should this be criminal? A whole bunch of my Twitter followers said, yeah, what Devin Nunes is doing there should be criminal. Now, Devin Nunes isn't wrong to be concerned about the economy. The economy isn't a free fall. But the problem is a systemic structural one. The solution isn't to now say, well, we have to just keep going to bars and restaurants. What we need is a system of paid sick leave so he can be less concerned about the restaurant employees, not having disbanded the pandemic response team, having a functioning healthcare system. These are structural problems that they don't get solved by saying go at the individual level and continue to engage in the behavior that's spreading the disease. If we are going to have this level of both stupidity and just straight up disregard for others, we are in very, very serious trouble. And as we see the partisan divide, Republicans have to a third as likely to be worried about coronavirus as Democrats, to be taking action around coronavirus as Democrats. We are in a situation that is only going to get worse. That's where the data is pointing right now. Okay, there's a ton of disinformation and straight up propaganda floating around about coronavirus. So I want to go over the actual science around cures, treatments, and vaccines that are being investigated, what's most promising, timelines, etc. Before we jump in, remember, drinking silver won't cure coronavirus. Prayer won't cure or prevent coronavirus. Buying a 2-year supply of toilet paper certainly won't help. Black people aren't immune, as was floating around. This is not a Chinese bioweapon created in partnership with Kim Jong-un. We'll get to that. This is a virus, and as such, we can look at vaccines, antivirals, and antibodies. And then in the meantime, the treatment of symptoms and, of course, social isolation in order to prevent transmission. The treatment of symptoms, of course, includes things like breathing assistance through ventilators and other things that can be done while the body is attempting to fight the virus off naturally. Let's first talk about vaccines. Vaccines take a while to develop. There is a large range being cited for how long it might take until a vaccine is ready for public use. You have to get through development, clinical trials, approval, production, distribution. There are some vaccines that are ready for trials. The timeline that is most realistic for a vaccine being ready, optimistically, we're looking at 8 months. Less optimistically, looking at 18 to 24 months, sort of at the most conservative. There is already a vaccine from the Israeli Migal Galilee Institute because they've had a poultry coronavirus vaccine for a while. They've modified it to be a human version. It should be ready to test any day. But again, the testing is the beginning of a very long process. There's a bunch of other vaccines in development subject to the same timeline. The vaccine is, of course, for people not yet sick in order to make them immune. No vaccine is 100%. The idea is if lots of people get it, you can build herd immunity, reduce what's called R0 or R naught to below 1, meaning one person is infecting no more than one other person on average. Right now, the R naught of COVID-19 is between 1.4 and 3.9. And obviously, until we get that below 1, we will continue to have more cases. Second, antivirals. COVID-19 is a virus, not a bacteria. So antibiotics would not work against it. Antivirals are used to treat viral infections. Antibiotics go in and destroy the bacteria. Antivirals instead tend to prevent the virus from developing, replicating, or spreading. There's a few promising ones being tested. They all have their side effects. One is called remdesivir. It's made by Gilead Sciences. It was developed for Ebola. Didn't really work well for Ebola. It's being tested in clinical trials right now. including, I believe, in South Korea. Now, there are conflicting reports about how well it's working. There was a report last week saying it's working well, other reports saying it's not really clear it's working better than placebo, and it has significant side effects in a large portion of patients. We just need more data. Maybe it's an antiviral that could be modified to better work on COVID-19 with fewer side effects. There's another antiviral being tested in Japan called Avigan. Now, this was actually developed by Fujifilm, and it was developed as a broad spectrum flu antiviral that Japan stockpiled, and it can have serious side effects up to and including birth defects. So women 18 to 40 straight up shouldn't even be using it at all. Experts think this is probably Avigan not going to work well enough to justify the risks. And then we have the possibility of giving people antibodies. Antibodies actually neutralize the virus pathogen, the specific one. When you fight the virus off naturally, you develop antibodies. The idea is take the antibodies from patients who have recovered and transfuse them into a serum, which you can give to another patient. The issue is the logistics are tough because right now, the antibodies you can get from one patient in the tests that have been done are enough to give to one patient. 1-to-1 is not a great ratio in terms of the logistical task that's required. It's being looked at. There are also side effects, fever, allergic reactions. You can also transmit infections. That's being tested in China. At the earliest, it looks like fall. Then Dutch researchers have found another antibody, which they say seems to be working against the virus in lab settings and could be used to develop an antiviral. It's also early, could be a while until that is developed. So as all of this comes together, what we're quickly learning is the social distancing, work from home, avoid crowds, shut down restaurants, going out only for necessities like groceries and medications, otherwise remaining isolated. That's all we have right now. And until some of these things can be developed, we have to do that. Unfortunately, too many Americans aren't taking it seriously. I don't want martial law. I don't want police lockdowns. That will get very, very ugly. So people have to start cooperating. Otherwise, it's going to get even worse. We'll be continuing to cover this on our Instagram account. Follow The David Pakman Show on Instagram at David Pakman Show.
The David Pakman Show at davidpakman.com.
The David Pakman Show is audience-supported media. I really mean that, not just a catchphrase. And much of that support is small contributions on Patreon, contributions as small as $1 per month, meaning just cents for each hour-long episode of the show. Plus, patrons can also get the daily bonus show and the daily commercial-free TV show by pledging at patreon.com/David Pakman Show. We've rolled out great new perks on Patreon, including free bumper stickers, t-shirts, coffee mugs, and more at different giving levels, as well as exclusive content. And it all comes with the pleasure of knowing you're supporting independent progressive media, an alternative to the corporate stuff that is as much a part of the problem as our political system. If you value the show and have as little as $1 to put towards independent media, check out patreon.com/David Pakman Show and make a pledge today. It'll feel good, and I'd really appreciate it. Patreon.com/David Pakman Show. Did you know the David Pakman Show is on all sorts of different platforms? Find us on YouTube at youtube.com/The David Pakman Show, and on Steemit, the blockchain-based publishing platform, at steemit.com/@David Pakman. That's STEEMIT.com/@David Pakman.
Welcome back to the David Pakman Show.
So we've gotten to the point where any attempt to do actual journalism and hold people in positions of power accountable is going to be written off as an attack by a huge portion of Americans, because that is exactly what their fearless orange leader, Donald Trump, is doing. Donald Trump was asked by reporter Yamiche Alcindor during his coronavirus emergency declaration on Friday about how he shut down the pandemic response team. Trump called the question nasty, claimed to have no idea what she was talking about, but also sort of blamed Anthony Fauci, who was standing behind him, who just said, I don't know anything about it. This is just disgusting and stunning. And watch Trump say, well, I don't know. That's a nasty question. Maybe ask Anthony Fauci. I have no idea.
My first question is, you said that you don't take responsibility, but you did disband the White House pandemic office, and the officials that were working in that office left this administration abruptly. So what responsibility do you take to that? And the officials that worked in that office said that the White House lost valuable time because that office wasn't disbanded. What do you make of that?
Well, I just think it's a nasty question, because what we've done is, and Tony has said numerous times that we've saved thousands of lives because of the quick closing. And when you say me, I didn't do it. We have a group of people. I could ask perhaps my administration, but I could perhaps ask Tony about that, because I don't know anything about it. I mean, you say we did that. I don't know anything about it.
You don't know about
the
reorganization that happened at the National Security
It's the administration.
Council.
Perhaps they do that. You know, people let people go. You used to be with a different newspaper than you are now. You know, things like that happen.
But this was
Please go ahead. We're doing a great job.
Notice Trump slipping in there. Well, you changed jobs, so like maybe the pandemic response people also just changed jobs. Nothing to see here. Denying it happened, but saying if it did happen, maybe Anthony Fauci knows something about it. Now, there's something special that I have for you today on this. Back in 2018, Trump was asked, why did you cut the pandemic response team? And at the time, Trump knew exactly what he was being asked about, and he didn't deny doing it. And in fact, he defended what he did. He said, hey, we haven't used those people, and I don't want to pay people that we aren't using. Remember, Trump 3 days ago saying, pandemic response, that's nasty. Maybe ask Fauci. Here is Trump right after he did it saying, oh, yeah, I did it, and here's why.
Some of the people we cut, they haven't been used for many, many years. And if we ever need them, we can get them very quickly. And rather than spending the money, and I'm a business person, I don't like having thousands of people around when you don't need them.
So Friday, it's I didn't cut anyone. That's a nasty question. If anybody did get cut, maybe Fauci did it. I don't know. When he did talk about it back in 2018, he knew exactly what he had done. He defended doing it. But the real thing here is, listen, Trump being a liar and Trump being incompetent, that's not new. The treatment of journalism is what is actually nasty here. Calling journalism nasty is very, very nasty. Donald Trump has framed up a situation where, as far as he's concerned, he's done everything right and Obama everything wrong. Questioning him about it is nasty. Asking questions like, you did this and it didn't work out well. Are you responsible? That's a gotcha question in this era. And of course, there's always the question, is he more likely to refer to women as nasty? Is he more likely to be referring to black women as nasty, as is the case in this particular instance? I don't know. We'd have to run the numbers on that. One never knows, but what's nasty is Trump's behavior, his competence, which is incompetence, his treatment of others, and absolutely and totally weaponizing delusional narcissism. Weaponized delusional narcissism maybe should be the tagline of this administration. Let's talk about lying. I'm against lying. And I know that that's a quaint statement to make at this point, but I want to hear the truth from our politicians, even if it's not good. But not all lying is created equal. Lying about, I reduced the deficit, when in reality, you reduce the rate at which the deficit was growing. Okay, I mean, listen, these are lies. They're provable lies, but it's very different than the pandemic is under control. It'll go away soon. No one will die. We will have few cases. Donald Trump cannot and will not stop lying about coronavirus. And this included, and it continued when he announced the national emergency for coronavirus on Friday. A national emergency for something he said 2 weeks ago was nothing and would be going away. No, he announced it at a White House press conference on Friday. And one of the things Donald Trump announced was that Google is making a national coronavirus testing website where you can type in your symptoms, follow a flowchart process to be told, do you need a test, and then be directed to the closest testing location to go and get tested for COVID-19. Let's take a look at what Donald Trump said, and then we'll look at what the truth is.
I want to thank Google. Google is helping to develop a website. It's going to be very quickly done, unlike websites of the past, to determine whether a test is warranted and to facilitate testing at a nearby convenient location.
Notice that Trump even interrupted his lie there to say that other websites weren't developed quickly. He was referring to healthcare.gov, the Obamacare website. Again, just obsessed with Barack Obama, even as we're in a national emergency. Now, the real problem is Google had no idea what Trump was talking about. They had no idea Trump was going to announce this. Trump even said Google has 1,700 engineers devoted to this project. It was all a lie. First of all, Google's doing nothing. Alphabet, which owns Google, has a unit called Verily. Verily is working on a triage tool for coronavirus testing meant to be for healthcare workers in the Bay Area who may be exposed in the process of working to treat coronavirus. Google immediately started getting a flood of inquiries and questions when Trump announced this. They had to put out a statement that included clarifying, quote, statement from Verily, we are developing a tool to help triage individuals for COVID testing. Verily is in the early stages of development, planning to roll testing out in the Bay Area with the hope of expanding more broadly over time. Trump can't stop lying. Remember that in the Oval Office address last week, he said we're shutting down all travel from Europe. Turns out U.S. citizens and U.S. residents can go back and forth. Wasn't true. Trump said the Europe shutdown includes cargo and trade. It didn't, but it still rocked the markets. Trump said insurance companies were waiving copays on coronavirus treatment. Turns out it was only copays on coronavirus testing. The man cannot stop lying. It is life or death for many people. It appears that Donald Trump has put not only Mike Pence in a position of power in this entire fiasco, but also Jared Kushner, who knows absolutely nothing about infectious disease or pandemics or public health or outbreaks. He just knows nothing about it. We're dealing with bad people who are also incompetent and are in way over their heads. How would you expect garbage in, garbage out? How would we expect to get anything but garbage coming out when everything that is being put in is garbage by people who don't know what they're doing, are in over their heads, and seem to care more about optics and elections than actually preventing death? That's the bottom line.
The David Pakman Show at davidpakman.com.
Did you know you can get David Pakman Show stuff, whether you're looking for David Pakman Show coffee for your Chemex, French press, or espresso machine, or a t-shirt? It's all available on our website, shipping to anywhere in the world at davidpakman.com/gear. The Very Stable Genius t-shirt is popular. The If Ivanka Weren't My Daughter t-shirt is actually popular with kids of all ages. We've got sweatshirts and hoodies with Hatriot Mail designs, more than a dozen available colors. And did I also mention that there's coffee? Oh, and bumper stickers too, plus no bogus supplements. If you're looking for something to give you the strength to lift a school bus over your head or make you live to 200 years of age, you're not going to find it on our store. Check it all out, shipping anywhere in the world at davidpakman.com/gear. If you want a 15% discount, all members and patrons get a 15% discount code. Check out the store at davidpakman.com/gear. If you're wondering, how does the David Pakman Show afford to exist? The answer is mostly through memberships and Patreon. You can support the work we do by signing up for membership at joinpakman.com or pledging as little as $1 a month at patreon.com/David Pakman Show. Perks include the daily bonus show, the commercial-free audio and video feeds of the show, and the positive feelings that come from doing the right thing and making Hatriots cry through your support of independent progressive media. Jump in today at joinpakman.com and patreon.com/David Pakman Show.
The David Pakman Show at davidpakman.com.
I have a really interesting video to look at with you today. We are truly seeing the worst of what a dishonest and incompetent administration is capable of. Dr. Seema Verma was interviewed by Fox News' Martha McCallum. Now, Dr. Verma is the administrator of the Centers for Medicare and Medicaid Services in the Trump administration and part of the coronavirus task force. She went on Fox News and was asked 6 times by Martha McCallum very specific questions about the number of tests, ICUs, and ventilators available for coronavirus, okay? Trump has been insisting for weeks anyone who wants a test can get a test. They can't. That's not true. Trump has been saying people who are flying into the country are being tested. No, they're not. They're sometimes just having their temperature taken. Trump says there are more than enough tests. There are not. Trump pretends like our cases numbers are accurate because we're testing so many people. We're not. The numbers aren't accurate. We might have 500,000 people currently infected. And I have to say, this is not praise of anything other than Martha McCallum in these 5 minutes, okay? It's not praise of Martha in general. It's not praise of Fox News. It's merely Martha McCallum realized she was being snowed. She does a good job of exposing this Trump robot who can't stop lying and can't answer a single question. So I'm going to play for you a bunch of questions, which essentially ask the same thing. What is the number of actual tests available? What about the ICUs? What about the ventilators? And you will notice how every single time Dr. Seema Verma just talks about something different. And Martha McCallum tries to bring her back, and Dr. Verma just again answers about something else. When even Fox News hosts have to expose a Trump bot for obvious lies and deception, you know they're being more deceptive and dishonest than usual. Let's get right into it.
My pleasure. How are we doing on these tests? So I remember last week, I believe, Alex Azar, the HHS secretary, said that there would be millions of them out there by the end of the week. Has that happened?
You know, our focus is on making sure that people that need tests can get tests. And so one of the things that's already available is that at every public health laboratory across the nation, these tests are available. What we're working on now is to increase the capacity in the private healthcare system, because most of us, when we go get tests, we don't go to a public health lab. You're used to going to your doctor's office, they order the tests, and that usually is handled through our private healthcare system. And so we've been working with the private system to essentially ramp up so we can make sure that those tests are available.
Our focus is on making sure people who need the test get it. So we're working on capacity at private versus public. It's not an answer. So Martha McCallum tries again. You promised millions of tests by now, and we don't have them, right, Doc?
So is it true that there are millions of those? It's now almost the end of the week. So has that mark been met that we heard about from Secretary Azar? Because I was at a doctor for something else the other morning and asked, and they said, you know, we can't get them. We've been calling. We called the state. We called here. We can't get our hands on them. And then I heard it from another doctor earlier today with the same story with a patient that she wanted to test, and she tried to get a test for that patient and was unable to do so.
Well, today, one of the things that we did, Dr. Hahn and I hosted a call with over 1,600 representatives from hospitals to work with them around how they can do the testing inside their hospital laboratories. The other thing that we're focused on is preparing the entire healthcare system. Some of the conversations that we've been having with hospitals is making sure that they have.
Again, no answer. Question is, you promise millions of tests. My doctor says they have none. She answers, well, listen, we've been having phone calls with hospital reps about testing in hospitals. We've issued guidance, no tests, no answer. And Martha McCallum is starting to get irritated. She filibustered there for more than a minute. Eventually, again, Martha McCallum manages to get a word in and asks another time. And this time she says, well, we have ICU shortages. We have ventilator shortages. We have shortages of equipment to do tests.
Okay. But in terms of actual equipment, we heard Bernie Sanders today, for one, coming out and saying that there's a major shortage of ICU units. We've heard that there's a shortage of ventilators, even swabs and equipment for the actual tests. What's being done about that? And how concerned are you that when these numbers do start to rise, which Dr. Fauci has told us to expect, that there'll be enough ICU units, enough ventilators to help the people who do get sick in this country?
Well, that's why we have an emergency prepared system. You know, we're used to dealing with disasters. If we look at some of the disasters that have happened around hurricanes in Puerto Rico and Florida, there is a system in place to make sure that folks that are on the front lines have the equipment and the supplies that they need.
So are you saying that we do have enough?
One of the things that we're doing at CMS is to have rapid dialogue with healthcare providers. So we're meeting with providers.
Well, we have a system. But the question was about equipment. Oh, but there's no answer to that. We have a system. We have meetings. We have guidance. They have plenty of dialogue and guidance, clearly. But what about the equipment? More filibustering about tests and equipment. Martha comes back in again And this time, Dr. Seema won't even let her ask again, just talking over Martha McCallum.
The needs that they have.
Yeah, I understand
the other
that.
thing that we've really
But can I
focused
just
on
ask you one more
is
time?
telehealth
Will there
and
be
making
enough
sure that people understand, hey, before you go into your doctor's office, you can call your doctor on the phone and have a discussion with them. And they can tell you whether you need to come in or not. And that's really important because we don't want to have people have to travel unnecessarily if they're not feeling well.
No, absolutely.
And if they come into a healthcare facility, they could also be putting others at risk.
Martha tried to ask again, and the doctor just said, you know, call your doctor, have a discussion. Eventually, Martha McCallum gets to ask one more time. And this one is just nuts. Dr. Verma goes directly into saying Trump has been bold and decisive, and check out the look on Martha McCallum's face. She can't believe it. It's a smirk of disgust as the last big lie is told. And Dr. Verma knew it was a 5-minute interview and this was the last 30 seconds. Praise Trump and avoid answering the question.
Making sure that providers can use telehealth and telemedicine to serve their patients.
We've made that point here quite a bit, and I think it's a very important point to make. But before I let you go, I want to ask you one more time. Are there going to be people in this country who don't get a ventilator if they need one? Are you concerned that the actual physical equipment that is needed to serve the people who will get sick is out there? Can you reassure everyone tonight that there is not a shortage of ventilators or ICU units?
And that's why the president has taken such a bold and decisive action, right? We're not waiting for this to get worse. We're not waiting for this to be a crisis in our healthcare systems. And that's why the mitigation strategies that he announced last night, limiting travel from Europe, not allowing that. We've given travel advisories on cruise ships. That's why we're taking all of this action, because we don't want to put stress on the healthcare system.
Okay, that's not a direct answer to the question, but it sounds like a hope that there won't be enough sick people and we won't run out of ventilators because we have mitigated, and we certainly hope that's the case.
Guys, this was 5 minutes. Martha McCallum asked 5 times, tried to ask 6 times, was only able to ask 5 times about tests and ventilators and ICUs, and there was not a single factual answer from this Trump bot who just, it's almost like her software malfunctioned and she just kept repeating the answers to a different, she was working off of a script for a different interview. It didn't matter. She loaded up that script and read it for this interview, and it's dishonest, it's disgusting, and, this is nothing other than saying, at least here, Martha McCallum kept asking and said, those aren't really answers to my questions. What else can we do? They're just not going to be straight with us. Fox News, now going to a very negative Fox News story. Fox News allowed lunatic Christian Jerry Falwell Jr. to suggest that North Korean dictator Kim Jong-un may have created coronavirus as a weapon to attack the United States. We need to listen to doctors. We need to listen to pandemic specialists. We need to listen to scientists on coronavirus. We don't need lunatic Christian preachers who come from a line of lunatic Christian preachers in their family, like Jerry Falwell Jr., to go on television and say these things. And if they say them, we need them to be held accountable, which Fox News did not. So this is a clip of Christian pastor Jerry Falwell Jr., associated with Liberty University, son of the late Jerry Falwell Sr., who once said 9/11 happened because of gay people and abortions. His son, Jerry Falwell Jr., goes on Fox and Friends, which Trump regularly watches, remember that, and check out not just what he says, but how the Fox News clowns don't even push back at all about it.
It's just strange to me how so many are overreacting. The H1N1 virus in 2009 killed 17,000 people. It was the flu also, I think. And there was not the same hype. It was, you just didn't see it on the news 24/7. And it makes you wonder if there's a political reason for that. Impeachment didn't work, and the Mueller report didn't work, and Article 25 didn't work, and so maybe now this is their next attempt to get Trump. But I had the owner of a restaurant asked me last night. He said, "You remember the North Korean leader promised a Christmas present for America back in December. Could it be they got together with China and this is that present? I don't know, but it really is something strange going on.
Well, Jerry, so regarding the fact that you're going to continue to have classes,
people are overreacting. There's too much news coverage. This is politicized. Coronavirus is just like impeachment. And isn't it possible this was a weaponized virus created by Kim Jong-un and China to attack the United States? Fascinating, Jerry. And you guys are continuing to hold classes. That's the reaction from the Fox News people. Now, let's go through it at two layers. At its face, this is absurd, first and foremost. But think about it a little more deeply. Other countries so far, there's still time, but so far, other countries have been hit way harder than the United States. Italy, Iran, China, Spain. So why would Kim Jong-un punish the United States by creating a virus that disproportionately kills people in Europe and Asia, at least for now? Every aspect of this appearance is weaponized ignorance, and it's irresponsible. It's InfoWars level stuff that is being allowed on Fox News. I told you last week, attorneys general have been sending out notices to people selling fake coronaviruses like drinking silver. They should be sending out the same notices of cease and desist to Fox News for allowing known disinformation to spread, which will cause panic and misunderstanding and potentially cause even more cases of coronavirus and deaths. Now, one other thought to consider. Jerry Falwell is simultaneously saying this is all an overreaction and it might be a North Korean bioweapon. Think about that for a second. If this really was a North Korean bioweapon, aren't we underreacting? That would be insane and effectively an act of war. If it is the case that this is a North Korean bioweapon, we're not overreacting. We're drastically underreacting. But Fox News just says, oh, yeah, right. And you're continuing to hold classes, Jerry, at Liberty University. Fascinating, fascinating. They've all failed us. The people that elected Donald Trump have failed us, as he now is completely in over his head, lying uncontrollably, diarrhea of the mouth, can't tell the truth. It's like Pinocchio with Donald Trump, except the more he lies, instead of his nose getting bigger, his face becomes more orange. And meanwhile, Fox News is allowing this stuff and continuing to have people on saying this is a great time to fly. The planes will be empty. This is a great time to go to nice restaurants. The restaurants will be empty. These people will be our undoing. And we are working against not only the virus, but we are working against the disinformation viral spread that is happening simultaneously. We have a voicemail number. That number is 219-2-DAVID-P. I got a bunch of these questions about the connection, the possible connection between coronavirus and the election in November. Take a listen.
Hello, David. The name is Gerard, longtime follower. Question for you. If the coronavirus should keep going on until November election time, could Trump declare the election postponed, canceled, and essentially go on as president without an actual election?
Not really. So here's the thing. First of all, Trump couldn't postpone the election by himself. You would need congressional support to do it. Even with congressional support, it would be difficult to do. Trump could say it, but that would not make it so because Congress sets the time, place, and manner of federal elections. But the thing is the following. Congress would need to rewrite 3 U.S. Code subsection 7, which has the timeline for electors, which are chosen by states, to vote in the Electoral College. Remember, when we vote in November, each state is saying we want our electors to vote in this way at the nominating at the electors convention. That is set for December 14th. So if lawmakers manage to delay the election, they really couldn't delay it beyond, a few days before December 14th without having to rewrite the Constitution itself, which says the president can hold office a term of 4 years. The election is happening at this place, so on and so forth. Now, here's the other thing that a lot of people are worried about, which is imagine that Trump succeeds in doing it. Does he just remain president? And the answer is no, because this has been researched. The 20th Amendment terminates each presidential term at noon on January 20. So even if at the federal level, at the states level, things were delayed, Trump as president would be terminated on January 20th regardless. Now, of course, it would all be a legal fight. It would be unprecedented territory. But the idea that Trump could do this to just stay in power for some period of time, seems extraordinarily unlikely and not something that I would put too much time into worrying about. The real question now is what's going to happen with the primary. Louisiana and Georgia already deciding to delay primaries. There's now a fight about whether the primaries happening in March should even be delayed. That is a much more present thing. We've got a great bonus show for you today. We will actually talk about Georgia and Louisiana postponing their primaries. We will talk about Trump saying that he's going to waive federal student loan interest due to coronavirus. And we will also talk about Trump considering a full pardon for ex-advisor Michael Flynn. We knew it would happen. All of those stories and more on the bonus show. Get access instantly by becoming a member at joinpacman.com.
The David Pakman Show at davidpakman.com.
We're going to call this to order. I didn't realize we were past time.
Oh, right. Thank you.
So we'll call this to order at 6:32. Please rise for the Pledge of Allegiance.
I pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
All right. See Mr. Dunkley coming in here.
Wow, skinny.
I wish. So, given everything that's going on, there's going to be some alterations to the agenda. I do have a couple of additions. couple of things that we had asked the people that had requested to be on the agenda, whether they felt it was pertinent tonight. So we will table the town picnic discussion. We will also table the town and select board policies under old business. Additions to the agenda, I have 1, 2, 3. First will be to make appointments. I'm sorry, that one's actually already on there. So we have the other one, discussion about a direct mailer to identify vulnerable adults. The other one is going to have to do with some town employees and potential pay during these closures. I don't feel that that needs to be an executive session. Would you agree with that?
I think that's
Okay.
No names are going to be said, right?
Yeah, we can do that without that, sure. And that's all that I have.
Oh, and Maddie Arms, we appointed her as our representative to handicap, but we also need to state that she's also our liaison, so that it carries through.
Yeah, okay.
I'm sorry.
Where would you like to do that?
I missed that.
Maddie Arms is our representative to handicap, but we need to state she's also our liaison.
Okay. Thank you.
All right.
So moved. That's all of them.
Can I get a second?
Second.
All those in favor?
Aye.
Aye. All right. So we will continue. Chair remarks. I have to be honest that I all day had tried to figure out how to address any of the stuff that's going on. Certainly I have children that are seeing it as well, dealing with the schools, and this is nothing but a learning curve, and each day we are figuring new things out, and just as we feel we have them figured out, things change. So we're doing the best that we can. The one thing that I can assure the town of Vernon is that your elected officials, your town employees, everybody has certainly come together and worked tirelessly to get through this. The EOC has been unbelievable in keeping us updated with things. Just reaching out, Sarah Coffey, who's here with us this evening, she has been in touch with us to make sure that Vernon is okay, just seeing what we might need. So given that, I think that we are headed in the right direction, and we'll get through this as a team here. So with that being said, I would ask that David Emery and Mark Snow join us for a committee report.
Good evening, everyone. I'll just give you a brief update where things are going, because I'm confident that after we leave, it'll be different. That's how rapidly things are changing. I sent out some reports this morning, and as of this evening, they've already changed. However, let me give you some of the things where we are. I'm going to talk a little bit about what the state has done and ordered and changed, and then I'll go into what we did in Vernon. As of right now, you know, the governor ordered all restaurants and bars closed as of 2 o'clock this afternoon. However, takeout orders, or as they call takeaway orders, are still an option for restaurants to do, and some are electing to do that and some are not. So that's still open. Grocery stores are still open and operating. However, that will be determined by employees as they go along. If enough employees can't man the store, then that will be a complicator for them, as for everyone throughout the country. The state of Vermont is ramping up labs. There's the opportunity for not only the state lab, but for outsourcing for that to take place. And as of this evening, There are 12 positive cases in Vermont. They've tested 421 negatives. 474 are being monitored as of right now, and 143 have completed the monitoring. There's a lot of information out there, and probably the biggest thing is sharing information, and probably the most important thing is use some credible websites. Go to the CDC, and they've all been posted many, many times. However, I caution you and urge you, what you read on Facebook may not be 100% accurate. So I would tell you to use the accurate websites of the CDC and the state of Vermont Emergency Management, et cetera. We are suggesting any Vernon residents that have routine doctor's appointments or visits, that they contact that physician to see if they still want them to come in. And some doctors are stopping for a couple of weeks. However, anything that's an emergent or emergency, that's still on the table, that you please don't hesitate to activate your 911 system. If you do, you're going to be asked a number of questions about how you're feeling and what's going on and the particular emergency that's happening. The appropriate agencies will respond. Vernon Fire will respond as a medical team. However, depending on the case, they may or may not enter the house or the building. If in fact when Rescue Inc., the ambulance arrives, they are going to be geared up to take care of that. The nursing homes, let me come backwards. So that's where we are with doctors in emergencies. We feel extremely well prepared that that's going to be handled no matter what the emergency is. Last evening, we met with the emergency management group, as well as we invited a number of other people with us, and I forgot to mention that Mark and I are teamed up as a team. Mark is the health officer, as you know. So between the two of us, we seem to get a lot of information. Some of it's the same, and we forward it out to our team, and a lot of it's redundant. But it's better to have it more than once and know it than say you never got it. So what I'm going to pass out, and for your reading enjoyment, is a document that Mark prepared for us to consider, and then there's minutes from our meeting last night, so that I will pass those out together. I'm sorry.
I have that electronically. So, well, Mr. Snow, I need yours electronically. I can send it to you.
You don't think so?
That's only one. Then I have it, okay.
Okay. Did I get
That's
Some of this one might have been updated today.
So what I'm going to look at first is the one that's Vernon Emergency Management 316. And I'm just going to run down through that briefly, and we'll answer questions that you have. Again, I'm sure it's nothing that you don't already know. But some of the things that are happening, Vernon Green is one of the targeted areas that we have to be extremely considerable to help them. They have, unfortunate, the age group that's being looked at. They have some great stuff already in place. Visitors and stuff are stopped at the door. If there is any reason for people to enter there, such as rescues, or they will go through not only a questionnaire, but the temperatures will be taken before they enter the building. So they are pretty much on top of that. I talked with Vermont Yankee, and because they're not operating, the crisis is considerably lower than what it would have been. And at their point, if in fact their employees North Star's employees and their workers end up, the only thing that would do is extend some of their deadlines and their target dates. The other part is the security part, and you can sleep well to know that they have a good handle on the security side. The fire chief, as I mentioned, is feeling comfortable where he is with the response. Mutual aid is now and has been a product and is still in effect for a fire. The Vernon School, as you know, has been closed. Today, as of today, all the schools in the state of Vermont, there were some options where they could run Monday and Tuesday, but now the state of Vermont is completely closed. And one of the things is that they're continuing to do their meals, and it's set up so that meals for kids that typically got that will still be able to get the meals. Part of the plan is to, the buses will run the bus routes and utilize the bus routes for dropping off meals as necessary.
In addition to that, the Vernon Green did indicate last night that they handle the Meals on Wheels program for Vernon, and that they do have the capabilities of providing some additional meals. Any referrals should be directed to Chris McAvoy at the Brattleboro Senior Meals, and he'll make arrangements with Vernon Green to make that happen.
Okay, good. The Sheriff's Department is on board as far as responding to emergencies. They will respond to the emergency, the medical emergency, but they probably won't participate unless it's needed. One of the things that you're going to talk about later is identifying who in our town has a special need, and we have a list of people that Tom has been on today and has done an extremely good job of identifying that. So we may be ahead of that game. However, I'm not so sure that sending postcards might be a good idea anyway.
Mr. Chairman, just because of your lead on that, but in a lot of the agencies I've spoken to today, we are ahead of most communities in doing the making sure that our vulnerable populations are going to have communication back and forth from these agencies, either through the town hall or through the EMD. Or two of the agencies said no one's doing this yet, but you guys. So,
and also I think important to extend that, saying that yes, but that's also only the people that are in those systems are accounted for. Mm-hmm. So we are missing a large group here.
And that's been part of the questioning, but I'll let
Right. Well, I'm hoping we're not missing a large part.
Well, sure.
I'm hoping that we're going to get that number. However, I'm confident there are numbers of people out there in our town that aren't receiving some of those services that hopefully we can identify. So having that said, as Mark mentioned, the Meals on Wheels for Vernon is done through the Vernon Hall. And they have indicated, or Mr. Sleeper indicated, that we're encouraging people to go through Chris McAvoy. However, if we know of people that haven't, we're still going to feed them. We're still going to make sure that works. One of the things that we would shout out to all our Vernon residents and saying that if you're willing to be a volunteer, to go on a volunteer list for different tasks that may come up, send Tim Arsenal email or a phone call, and we'll get your information and put you on that list and maybe task you for help as thing goes on. As of right now, we are in pretty good shape. I'm not sure that any of us will ever be ahead of the curve, but we're keeping our wheels on the ground. the road commissioner who's here, and he can speak to it, but he's all set with his mutual aid systems and whoever. We're somewhat fortunate. We don't expect more than 10 feet of snow the rest of the year, but we're fortunate that maybe the time of the year might be helpful to us. Bruce Burks at the Vernon Church does the food shelf. And they get their food and stuff through Vermont Food Bank. And they are comfortable with how they're handling it and with what's happening. And they're going to continue that, and people will still be able to go there. However, the process may change where they'll bring the food out to them versus them going in and shopping.
And I do believe that if, and speaking with Bruce, that should delivery need to happen, I believe that there's volunteers in that church that would be willing to help with that.
And that's correct. Looking down through, we had Deputy Whittle with us last night, and as you know, the Sheriff's Department had created a long time ago a program called Are You Okay? And that's still up and running. And if people want to use that, did you get forms today?
I did.
Okay.
Yep. And
So
that was also posted to the Facebook page from Tim today as well.
okay. And I know Tim's going to update Vernon's webpage, unofficial webpage.
Yes.
He's going to do all of that and get that done. The Vernon store at this point is going to stay open. And they are operable. And in a nutshell, and it truly is a nutshell. Anything that?
No, I would just repeat what you said in regards to people gathering information. Use reputable websites such as CDC, the Vermont Department of Public Health. The dial 211 is also an informational number. Vermont Emergency
We do have
Management.
to be careful with 211, and I found this out the other day, that with our border of New Hampshire sometimes will pick that call up. They will give you an 800 number to call Vermont's 211, but if we are on the Mass border or close enough to the New Hampshire border, it'll kick us off to a different tower.
That's the first time I've heard that.
Yeah.
Good to know. So there's numerous respectable and websites out there that you can get information from. We do not recommend using social media for that, such as Facebook. I believe that's pretty much it in a nutshell, with the exception of, remember, we all have a role in this during this pandemic, and what the Vermont Department of Public Health is sending out as for a message to everyone is to be prepared, but don't panic. Stay informed. Take everyday preventive measures. Social distancing. Avoid large gatherings. Avoid close contact and direct contact. And wash your hands frequently. Those are the basic messages that are being sent out by government agencies today. I guess moving forward, in addition to volunteers, if there's anyone out there that knows of a neighbor or someone that may need some assistance, they are certainly welcome to give myself or Dave Emery a phone call or an email, and we are making that available, and Tim will be posting that on the website in the near future as well.
Michael?
Questions?
Jeff?
Yeah, I had a question about testing. So let's say, for example, that you have a fever and a dry cough, and you do not have a general physician or health provider. Don't go to the ER, right? But what do you do at that point?
Well, if you call 211, they will actually try to hook you up with one of the clinics. However, If you can't do that, you can call the hospital directly, and the hospital will say, come up here, stay in your car, we will come out and we will meet you outside. And so people that don't have physicians aren't gonna just be brushed away, but one of the opportunities is to call 211 and see if they can hook you up with a clinic. If that doesn't happen, then call the hospital direct. And
So if you end up going to the hospital, is that where you're tested?
that's correct, yeah.
Okay.
Right now, for our area, the testing is being done at the hospital. However, they're looking at alternative sites that may be done. All depends on how they can keep up with it or whether they can't keep up with it. And alternative sites may be posted and for that. And I'm not a physician, so I don't know what the cases are, but some cases will be admitted and some cases will be sent home for monitoring. The hospital in Brattleboro and the hospital associations have a whole group where they can put people in different spots for different things. So right now, the surge capacity hasn't been met. So, however, we could. So again, it's all dependent on how many times people wash their hands and keep distance and do everything that you're supposed to do. And we may help not spread that any more than we have to. But as we've seen in other countries, we're not out of the woods. And what it looks like is, it was a 2-week, 4-week, 5 months, and now there's even rumblings about June and July. But today we need to get through today and see what tomorrow brings. So I don't know if that answered your question.
Oh yeah.
Okay.
Yeah,
Go ahead, Mary.
Just so you know, Dave and I did attend a meeting last week at the Brattleboro Fire Station. There was Brattleboro Memorial Hospital and Vermont Department of Public Health personnel there. And at that time, staff from BMH indicated that they feel very comfortable at the level that they're at for staffing and supplies. Of course, that could change, quickly, but as of last week, they felt very comfortable where they were, the position they were in.
And correct me if I'm wrong, we had representation from our fire and EMS at that meeting as well?
We did.
Okay.
We did. Yeah. Yes.
In urgent care, I'm just throwing that out there because that's kind of becoming more popular. Are they playing any role in this, or are they saying, don't come to us?
No, that is still on the same tack that it was, same track. Urgent care is connected with the medical field, and they are getting all of that information that everyone else is getting. And so, yeah, you're okay with that at this point.
Okay. Sandy? Gene? Tom?
No, I'm good, thank you.
Okay, well, thank you. And it truly, my cell phone will be posted here shortly. VernonEMD@gmail.com. Call the phone, it'll forward to my phone, so whatever Vernon residents need, we'll make sure that we take care of it.
Okay. I'm gonna ask Sarah to speak, if you guys could hang out in case there's anything that we may need.
We might need Sarah.
All right, perfect.
You want to
Come on.
Yeah, come on up.
Thank you. You know we have a good help.
Yes. I will, Sarah, thank you.
Hi, everyone. So I touched base with Tim and Chris, and I'm happy to be here tonight. It's, as your state representative, just want you to know that we are all in the legislature taking things pretty seriously. And I think you probably all know that the State House we're not convening this week, but we're working remotely. But before we left, we passed a package of bills in the House that the Senate is taking up this week remotely, so to help with a number of things. And I shared some of that information with you by email. But I think what I just want to say is, I'm here to be of help. I'm helping. I get a lot of updates similar to what your emergency management team I've been hearing a lot about people concerned about work and employment and small businesses and what can be done. So I've been sharing information with Tim, but folks should go to the Department of Labor. There's folks about unemployment insurance. There's a lot of good information there. And there's a lot of emergency measures being put in place because of what's going on. We're concerned about, of course, Vermont's like the most vulnerable Vermonters, about folks who have to work, who work in emergency services, and how they might need childcare. The governor, I was on 2 calls today with both the Brattleboro Downtown Development Corporation, DCC, and they're having weekly calls starting this Friday. I'll send all of this to Tim so he can include it on the website, but weekly calls, resiliency webinars for small businesses and freelancers, to kind of give them, it's a confusing and complicated time right now, so they can help folks navigate. There are emergency loans through this that can be available through the Agency of Commerce and Community Development. So all these kinds of things are available to folks. And I want to reiterate, the message about relying on using reliable websites, because there are a few schemes that we've been hearing about. There's Johns Hopkins University has a very good site, but there's like a mock site of theirs, and it's being used to, send out viruses. So folks should be careful about the websites that they use. Today we were on a call, the Joint Rules Committee, which is made up of Senate and House leadership. We had the commissioner of Department of Children and Families talking about what the governor was going to be announcing around child care centers, that some of them were going to be directed to close unless they were serving families who were emergency workers and their children. And believe me, there's a lot of details that everyone's still figuring out, like how this is going to land on people, because we know just as much as our nurses, we need those folks in the grocery store to be working there, as well, and they're kind of essential operations. And there was a conversation that we had with the secretary, it was the Department of Labor, about supply chain and food and groceries and everything. And it was very reassuring to hear that there are enough supplies out there. Probably what folks have been experiencing is a mad rush. I know toilet paper is a hot commodity, as is Purell, right? Mm-hmm. So
I bought some today.
Yeah.
I was able to score 20 rolls.
Yeah, you can resell that for a lot.
Yeah,
but
I use it.
So I think, the idea is, if we, there will be more coming in, and there was reassurance that the supply chain, for groceries in our country is here, and just to also encourage people to maybe not hoard, to really, buy what you need, so that your neighbors can, when they go to the store, that they have what they need, that we can look out, for each other. So those are the kind of, that's what I'm sharing with you, what I'm hearing, but I'm also here to be a resource for you. We're working, I'm regularly working remotely, and we'll be kind of, the IT department within the legislature is figuring out how we can do our work remotely while still having, public access to our work. So it's all in process, as we say. But I'm, here I hope people will feel comfortable to reach out to me, and I can answer any questions if people have questions, and I'll do my best. There were some questions that came up in Guilford about a few town processes that they needed me to ask about. So I don't know if folks here have any concerns legislatively or otherwise.
Tom?
I'm sorry, I was, one of the things that I'm hearing is for citizens who may be told to stay home from work and they don't have remote access, it's more service or retail and they're restaurant. How will the state coordinate with whenever the bill from the House gets pushed over to the Senate in Washington? How is that going to be? Do you know how that's going to be handed down to the states for implementation at this point? Is there any, even though it hasn't been passed and signed, is there any?
Which I get the federal level, right?
Yeah.
So it was interesting that you should ask that, because today on one of the calls I was on, we had folks from our congressional delegation from Welsh's office and Leahy's office on the call. And there are 4 key bills that are moving between the two bodies, and there is still a lot in play. Yeah. So but we do have we have pretty smooth communication with those folks, and those folks are also participating in the Joint Rules Committee meetings, which happen daily. Good. So it's really, and the legislature is working very closely with the administration. We're a team on this, you know. So, and some of the things that we passed in the House, we passed without knowing exactly what was going to be done on the federal level, but there were things like, for example, retired doctors and nurses, to give them the flexibility and ability to help join in the case of an emergency. Amendment to expand paid sick days to businesses with 5 or more employees, all sorts of things like that. So if the federal government doesn't take care of it, we hope we will. And we have to do this all the time, to coordinate with what's going on at the federal level. But so far it's been the communication has been good.
And the 5 or more, if I could, Mr. Chairman, seems to be a good filling the gap, because what I'm reading about the federal legislation right now, it's 50 or more, or 500. 50 to 500, and those above 500 may be exempted, and those below 50 may be exempted. So your thought of knowing that some of these businesses in the state are really
scale
small.
Of Vermont, right? We're a small scale.
Yeah.
So
thank you.
So thank you. And I know one of the questions that came up in Guilford yesterday at their special select board meeting was a concern around deadlines with developing the town plan in Guilford. Because of the public, they made the decision yesterday to postpone and cancel many of the public meetings. And as you all know, with a town plan, you need that public hearing process. So we're looking. I'm going to be looking and finding out if what kinds of deadlines are going to potentially be extended, and that might come up for you in your work too, that you realize that you might need that. So please just, don't hesitate to reach out, any of you. So
thank you.
Thank you for your work. I think with emergencies, we really do see the best of Vermonters, and I really do think that, you all are an example, and you have some great, really well organized here, and please let me know how I can be of help.
Jean?
All set, thank you.
Sandy?
Thank
you. The only question that I would have is if anything over at Entergy had to be with North Star, if any of that had to be extended deadlines, is that going to, and maybe Michael can help with his experience from Endicap, is any of that going to affect any deadlines? Is there anything at the state level, if that?
Well, I also sit on Endicap as well, so Michael and I sat on, I think a lot of that, it's all in an MOU, and I think we should just probably reach out to them. I think it's probably a question of workforce, right? If something happens with workforce, most of that stuff it's all dictated by through the MOU at the state and the federal level. So I think I would hope that if there needs to be a conversation about that I think there's a lot of openness about whether what needs to happen. So
perfect. Jeff?
Yeah.
Not any questions, thanks.
Yeah.
Michael?
Thanks for coming.
Yeah.
I have one more.
Go ahead.
I'm sorry. Could you check with the federal folk, Peter or the senators, on whether the VA center in Bratt could be also used as a clearinghouse for testing?
They're doing no in-person business.
Right, but they could perhaps set up a parking lot test situation just to add one more venue.
One more venue.
Yeah.
Drive-through.
Yeah.
Do you know more about that, Michael?
I just know that they're not taking any patients into the office right now. I called the other day.
They're closed.
Only for telephone.
Only for
consults.
telephone. Yeah, and that is Congressman Welsh is one of his areas,
Right.
so I could definitely reach out.
I have
to
a
them.
call, but they're, everybody's busy right now too, so.
Sure, yeah. Well, I'll shoot them an email. Sometimes it's it's nice having the new email address that I have. So,
Yes, exactly.
yeah. Well, I'm gonna stick around for a while, so if other things come up, and if I slip out, it's just because I have to feed some kids at home, so.
Well, if you do slip out, we appreciate it. The fact that you called the other day just to touch base, I think that Vernon and Guilford is very fortunate to have you. So thank you.
Thanks. All right.
Gordy?
Yes, sir. Good evening. And I did want to say congratulations, welcome aboard, Mr. Root. Thank you for serving our town. And as a fellow resident, I just wanted to say thank you to all of you for your service, for all that you're doing. And Tom, welcome aboard. Thank you. As Thomas Paine, the political activist of the 1700s, said, these are the times that test men's souls. And your job is not an easy one. And as a financial advisor with Edward Jones, going through these volatile times in the market, I feel some of your pain, okay? But Angela Mayu said it best. She said, every storm runs out of rain. And I tell my clients regularly, this too shall pass. So again, thank you for what you're doing. And every day we get closer to the end of this very unique situation in our country's present situation. The reason that I'm here tonight, though, I just wanted to bring to your attention that two $100,000 bonds have been called in the last 2 months. One was a bond from the Royal Bank of Canada, and the other one was a Federal Home Loan Mortgage Corporation bond. I checked with Cindy Turnley, the town treasurer, and she is not in need of any of that cash at this point and feels comfortable reinvesting that into another bond. And so what I'd like to propose is that we reinvest that into a federal agency bond. It is the Federal Farm Credit Bank bond. And just for your clarification and understanding of what that is, I'll just give you a brief description. This is a Federal Farm Credit Bank bond as part of the Farm Credit System. It is a cooperatively owned nationwide system of banks and associations that provide services to farmers, ranchers, and producers or harvesters of aquatic products, rural homeowners, and agricultural and rural cooperatives. This bond is a AA+ rated bond, so it is a highly rated bond. Its coupon rate or interest rate is 2.78%. And at this point, I would just entertain the motion for you to grant us permission to reinvest the $200,000 that is available to put into this bond. And again, sticking with our conservative nature in our portfolio and our bonds, it has been a benefit for the town to be investing as conservatively as we have been, as you can tell by the past month or two. So I'd entertain any questions that you might have.
Michael? Good.
Good, thanks.
Good.
I move that we authorize the investment of two $100,000 bonds with Federal Farm Credit Bank.
Moved and seconded. All those in favor signify by saying aye. Aye. Opposed? You're all set, sir.
Okay, gentlemen, ladies and gentlemen, thank you very much. Have a good evening.
Thank you. Mr. Walker, come on down.
I'm actually going to change this to two, Chris, for the state.
Whatever you want, man.
Well, they've changed everything on us, the rule of everything. The first one is for a signature for certification of compliance for the town road and bridge standards. What has been in place is just a yearly thing. We'll go by what we have in place with the state.
Okay.
Mr. Chairman, I move that we approve and sign a certificate of compliance for town and road bridge.
Motion. Second moved and seconded to sign the certification of compliance for town road and bridge standards. All those in favor, please say aye. Aye. Opposed? All right. Is that for all of us?
So,
All right. Number 2, sir.
Annual financial plan for the state for class 2 and 3 roads. Normally, they go over it and send it back, but they're not working. They wanna know if I could do it. What we've done every year, it's filled out, it's actually on the back. And I will send it off to them, and if things have to change, they will let us know.
No class 4s on that, huh?
Nope.
Just checking.
Entertain a motion to sign this, please.
So moved.
Can I get a second?
second.
Moved and seconded. All those in favor signify by saying aye.
Aye.
Did you second?
Aye.
Aye. Here, opposed? Perfect. There it is.
And I'll make a copy before I can get it to you, Tom and Tim.
In light of everything else that's going on, is there anything that we should be aware of? Anything that everything's good?
Everything's going
Happy
good.
down there? Life is good? Employees
Yep.
are feeling good?
Yeah, you get my message today?
Yes, I did. Yes,
okay.
yeah, and I'm sorry, and I sent that over to Tim
Okay.
because he's making the volunteer list, so he'll have that information should we need it.
All right.
So I appreciate your help on that.
The other thing, I asked Tom, we missed it.
Yeah, we did.
Truck bid, to put it out, I'm wondering, will the board let us put it out to bid instead of going to trade it in, to actually sell it outright from the garage and try to get what the dealer would get?
Do you have a number on that yet?
We can probably almost double it. I know what they offered us is 12,
Which truck are we talking here?
the 03 dump truck, full-size truck.
Okay.
Sounds good to me.
Is that a 10-wheeler, dude?
No, single axle.
Single axle?
Gene, any thoughts on that?
Sounds like it'd be worth a try.
I agree.
Yeah.
All right, then I'll take that out that we're not trading it in, just so I know.
Should we vote on that, or?
Okay.
I'm asking you because I don't know what I'm doing over here, so.
It's a good idea because we're waiting back.
Okay, so I would entertain a motion.
I move that we allow David to try to sell the 03 dump truck outright.
Second.
Moved and seconded. All those in favor?
Aye.
Aye. Opposed? All right, go for it, sir.
And this is just an FYI for you guys, it's brought up the last 2 years at town meeting, because of the time of year, I figured I'd do it. So it comes up at budget time again, and everybody will be on the same page. And that's it.
All right, thank you, sir.
Yep.
All right, we are into the approval of minutes from, what is that, March 3rd? Thank you, guys.
I move that we accept the minutes of our reorganization meeting, March 3rd, as written.
Can I get a second? Moved and seconded. All those in favor, please say aye.
Aye.
Opposed? And we are all set with that. Bills and warrants.
Okay. I move that we approve payment of the following warrant. 19T accounts payable, $85,273.19. 7S payroll, $7,776.29. 8S payroll, $7,800.23. 9S payroll, $7,075.98. And 10S payroll, $7,869.52. And ratify 18T accounts payable, $15,402.62.
Second.
Moved and seconded. All those in favor signify by saying aye. Aye. Opposed? All set. We will move on to new business. Michael, welcome to the select board. Thank you for volunteering in the absence and being willing to fill that role for the next year. It's appreciated and we're happy to have you here. If I may, I would like to skip down to new business number 3 and invite Seth up here. And Seth is going to join us for 2 things that we have on here. So as long as nobody is opposed to it, I'd like to bounce around a little. The recreation's old lawnmower was brought into question at town meeting, actually asked if we would entertain either an offer to buy that or to accept bids on that. I did ask Seth about it. I did go over to the North School today. There's 2 attachments. One is a parking lot brush broom thing. There's a snow blower and the enclosed cab that goes with that. I mean, it's doing us no good. It's sitting there, so I think, I guess my thought was that we put that out to the town for bids with a starting bid of $500. And unless, I don't know what anybody else's thoughts are, that was my thought. And Jean?
There's 3 accessories there?
2 accessories and then yeah.
I have
Maybe
no idea what
I'm,
the value is.
yeah, maybe we should find out what's wrong with it first here.
I would just say it's an as-is
sure
sale. I mean, if you, looking at it sitting next to the new one, it looks like an old lawnmower. It runs, well, we don't use it in the winter, so we haven't used it for a blower. We haven't used the attachments. It's I haven't used any of those since we've had it. My understanding is when we received the new one, that the dealer that delivered it felt like if their mechanics went through and fixed it all up, there was a chance they might get $2,000 for it, potentially, with all the things. And of course, that's after somebody's gone through it all and made it look pretty. So I would be comfortable with the $500, starting bid. I think is reasonable. And it's not doing us any good. We're just storing it at this point.
Gene?
And to be clear, the money would go back into the capital plan. My department doesn't receive any revenue for it. It just goes into the capital plan.
So hopefully it could go for, less than 500.
Right. Yeah.
I guess if it seems like that's the best we could do.
We may get more than that. I don't know. There may be
Right.
somebody that comes in and says, "Oh, we'll give you $1,500, $1,000." I'm not sure.
Okay.
But
It's kind of a reserve, right?
right.
Sandy?
Okay.
Jeff?
I think it's a good idea.
Michael?
Yeah, anything that's sad, the lines are no good anymore and stuff, so it's fine.
Yeah, it's pretty worn out. I will definitely say that. But
What's the process? Do you put an ad in the paper? Do you, to make it, if you're gonna take bids on it, do you make it public so when
I'm looking directly at you for the answer on this one.
Yeah, you could put it in the paper, if you're just doing it to the tent, you should put it
in the paper. Okay.
Well, do you wanna put it in the least expensive paper of general
Yeah.
circulation, like the Commons or something like that? Could you get me some specs on that, please, and I can get the ad written up so you don't have to worry about that, but I need to know the year and the model and stuff that goes with it, and as is, of course,
Yep, I can do that. I didn't bring a pen.
So we'll miss the deadline, it won't go in this week's.
That's
comment.
already out.
I don't mean this, it won't go in next week's comment, it'll be the week thereafter.
Okay.
So,
And then when you have that information, it can easily get posted on some of Vernon's
oh
media.
yeah, I'll give it, Tim is like the wizard of getting stuff where it
Right.
belongs, so I really do lean with his expertise, so.
Sure.
So I would entertain a motion to put that lawnmower out to bid with a starting bid of $500 listed in the Commons, as well as our Vernon pages.
So moved.
Second?
Second.
Moved and seconded. All those in favor, please say aye. Aye. Opposed? All right. This next one, we're gonna jump down to one of the additions, which was the payroll question. And I think, Sarah, I'm certainly glad that you're still here to weigh in on this. I'm going to get into my phone and read a message that I received today. No names. All right, gotcha. The Vernon Preschool, as you know, follows the WSESU schedule, so we will be closed until Vernon School reopens, which per the governor at this point, I believe, April 6th, Sarah?
Yes.
Is the tentative reopen date. The Vernon Preschool staff consists of 4 staff members. They are named here. 2 of them are full-time, 2 of them are part-time. One of the part-time is 15 hours weekly. The second part-time is 10 hours weekly. These hours are regularly throughout the school year, and our staff relies on this income. Vernon Preschool staff is dedicated and committed to our class success. They work around 6 students. Tough days, busy schedules throughout the year. They volunteer additional time by preparing and planning at home, communicating with preschool families, and running errands for the classroom. The role our staff plays is far more than the time spent in the classroom. They deserve to feel appreciated during this scary time. The school closure is out of our control, and during these unknown times, our staff deserves to receive their weekly pay. Though school is closed, we all still have bills to pay for, food to buy, and other expenses. I am very appreciative of our staff and feel that Vernon is very fortunate to have such a dedicated group of preschool staff. I think that this speaks directly to what Sarah was saying, that even in Montpelier, they're feeling that, what are we going to do? We've got residents that depend solely on their paychecks from here. I will just come right out and say that my opinion on this is that this is a voted on budget. It has passed, and this is out of their control. And I would say that these people should be paid until April 6th, when we can reevaluate the situation and see what would happen at that point. And now I would, Jean?
These people in,
What does
that mean?
This is just our preschool staff.
Just the preschool?
And if we had other departments that were forced into shutting down, I would feel exactly the same way, that we would have to look at that. And certainly, this is no fault of their own. This is not a snow day that they can use a personal day to make up for. This is not, these people, in my opinion, should not be forced to use up all of their sick days to make their ends meet through this. And then we go back to school on the 6th, and they have no time that they can use for the rest of the year.
And I think at this point, all the rest of the town employees are still able to work, because we don't want to leave anybody out.
Yeah.
So, absolutely, I support that.
We've budgeted for this. It's not costing us a cent, and they certainly deserve it.
Jim?
Yeah, I have no problem with it. I do have a question. Are teachers still being paid?
Teachers are different because they're contracted. The preschool are our town employees. The other ones are through the SU. So I know, and I will only speak to my district, our teachers are still being paid. I am still being paid because I'm contracted. We do run into a situation where the paras, again, they are not our town employees. These are the SU employees. Paras, they fall into a different category where they're not contracted. So in my district, again, that's Wyndham Central, so I'm not speaking for Wyndham Southeast. They have the opportunity to come in and work with teachers. They have the opportunity to come in and work with custodial staff. Really anywhere that we can find some hours for them, those are available to them. That same opportunity is not allotted to the preschool staff.
Yeah, I realize there's some teachers, trying to educate remotely. So, yeah, they are being paid. I guess I would, again, I'd support this, and I'd like to be consistent with the educational system.
Michael?
I agree, it's already budgeted.
I would entertain a motion to continue paying our preschool staff until April 6th. Actually, why don't we put it on our next agenda for the select, because that should be the 7th, I believe, April 7th. and then we could reevaluate, and at that time, we should have some insight from Montpelier at that point where we're headed. Perfect, so I would entertain a motion for that.
So moved.
Second.
Moved and seconded, all those in favor, please say aye.
Aye.
Aye. Opposed? Perfect. Seth, you are all set, sir. Thank you.
Appreciate it very much.
If you would be kind enough to reach out to her, that would be appreciated.
Absolutely will do.
Thank you.
Take care.
All right. So we are done with 1, 3, and one of the add-ons there. Update of town official contact information sheet. Did you have one of those with you, Tom, or?
No, but I did not bring it. Tim is working on updating it, and you're working on updating it.
Yeah. See all the
Okay.
red?
Yeah. Let me send to you what we have. Tim did some work on it. And you folks mark it up as you see, and there may be some duplications, and then we can get a final draft off to you for the next meeting. You'll have it.
Works for me.
Thank you.
We need to amend resolution for municipal planning grant. Tom?
I'm not sure. I don't think I brought that with me this evening either. I'm sorry. I'm gonna have to take a pass because I don't have it in front of me, Chris. I apologize. I didn't bring it down.
Is that deadline sensitive or?
No, they've actually, we got notice today that they were putting the grant requirements out another 30 days. Till the ones due in April are now due in May, so I'm not too concerned about that.
Okay.
If there is an issue with it, I'll get a hold of you.
All right, so we will table that until the 7th. We need to appoint Vernon representation to the Wyndham Regional Commission. Is that usually Tim that is in that seat?
Tim is our representative now, right?
So I would entertain a motion to keep him there.
So moved.
Second? Moved and seconded from Michael to appoint Tim as our representative to the Wyndham Regional Commission. All those in favor, please signify by saying aye.
Aye.
Opposed? All set. We are tabling the discussion about the town picnic. Obviously, we don't even know if we're gonna be able to have a town picnic in June as of now, so kind of a moot point. Maddie Arms, if you would speak to that, Sandy?
Okay, we just need to reiterate that Maddie Arms, while she is our representative, she also serves as our liaison, and she will keep in contact with us as a board on what's going on at handicap.
Okay. I thought I had put the appointments of, so our solid waste committee has nobody on it. Do we need a vote on that? I'm sorry.
No, we just needed to state that.
Okay. So our solid waste committee has Bob Spencer on it, who is a non-voting member. I put something out just letting the residents know that we needed to refill that committee, and I was blown away by the response that we got. So I will read some names here, and as long as there is no, everybody is in favor of it, I would just entertain a motion that we appoint to the Solid Waste Committee Don Rosinski, Debs Lockwood Tyson, June Turner, Bob, I will kill this last name, Uccello, Munson Hicks, and Carol Campbell.
Is that 1 R or 2 R's in that, Carol?
That's a great question.
Okay.
And those are the names that I have, and I did pass that on to Bob Spencer. He was on board with all of those names, and I think that given how that committee has run recently, where it's been next to no people, that if we start with this number, I think that that's a great place to start, and let them get to work on the pay-as-you-throw issues, and hopefully we can get back on top of that. So I would entertain a motion for those names.
So moved. Second.
Moved and seconded to appoint the names listed to the Solid Waste Committee. All those in favor, please say aye.
Aye.
Opposed? All right, all set. The last edition that we had at the EOC last night, we were talking about how do we find out our vulnerable residents? How do we get them so that we have that information on hand, so that in events like this, we can be asking Deputy Whittle to, hey, just check on these people. Tim can give them a call. We can certainly look into this. We bounced some ideas around, obviously recognizing that we live in Vermont and we are a bunch of stubborn backwoods people that don't want help. So the thought was, and the suggestion was, that we do a direct mailer of postcards. And the reason for that would be that would give us the opportunity for, I will use my family, that my grandfather would never ever fill this out, but he has 2 kids and some grandkids in town that would get that could certainly fill that out for him on his behalf, so that it's there. And that would certainly anger my grandfather, but it was in a case like this where we don't want them leaving, we don't want them going out and about. But again, I mean, it wasn't that long ago that we dealt with Irene and all of these other things. So Tim says it's about $200-ish to mail them out, somewhere thereabouts, the same to have it printed. So the thought was it would be about $500 would be more than enough to cover that. And I was just curious the board's thoughts on this.
So what is it gonna ask? I mean, there's gonna be questions for people to answer. This is what it's gonna have.
Yeah, so it's pretty much,
Do you know someone?
do you know somebody? Is there somebody in your family? Is there a loved one that lives in town that we should be aware of in these cases? Tim and I have not gone much farther than just a quick note on what the board's thoughts were on this, but it would certainly be spelled out that, you know, we're not coming knocking on doors, we're not giving you phone calls this is just in these cases, so that we know that our EMS can check on these people, or just kind of a way that we can start to rebuild that community strength and support of helping each other, looking out for each other.
You can start keeping a record too of those "Are you okay?" forms if you start making the calls that came through today from the sheriff's office. Those, you know, you can start getting a data bank, if you will, of that type of thing. If I could, just one other, all of these human service agencies that I've been contacting through last night's meeting as well, one of the things I'm asking them, you know, the people you are dealing with, we're not asking them who they are because there are HIPAA issues related to that, but people that you're working with, that you may only work with them a little bit for perhaps physical therapy, and they get out and they go out and get their own food and their meals and so forth. Maybe now they can't if they're concerned about getting out in the social distancing issue and all of those types of things. If you know of those folks, you can let us know, or you can have them call us directly, because you can't tell us who they are. Have them call us directly, or you might be able to hypothetically say, so-and-so on X street may be someone you want to get a hold of, and we can build a data bank from that as well.
Thoughts? Jean, Sandy?
Are you gonna include those at the nursing home and Union Hall, and because those are pretty well, you know, you've gotta have a bus there to get them out of there.
Yeah, I mean, I think the Birches and I think the Huckle Hill House are different.
Right.
I'm not sure, I mean, the hall is staffed 24/7, so I'm not sure that one's as important, but.
So would you ask for their phone numbers or just their 911 address?
What do you think? This is a quick note at an EOC meeting that we were trying to come up with ways to make sure that we did not overlook anybody in this.
Maybe if they put down their name, like if Michael was answering for his mother, who probably kill me for saying this, she's not old enough yet, but if he was, he could put his name down and they could contact him personally for the address and the phone number if they don't want it printed.
Sure.
I don't know.
Jeff?
Yeah, I think it's a good investment in our community. It's probably something that's gonna have to be done every so often, though.
Mm-hmm.
You know, as people come and go.
Not just elderly either. You know, it could be people with disabilities otherwise.
Certainly, yeah, I mean, I think the wording would be vulnerable.
Right.
But,
Jeff right now.
Would you like us to contact you?
Yeah.
Check yes, please, you know, give us a number, your contact number or email, we can reach you.
you check yes just for the free meal delivery.
Could have used the delivery a
Yeah,
few weeks ago.
Michael?
I'm not gonna speak on the mailing because it has to do with my job, but you could reach out to the post office because rural carriers see people every day that most people don't.
That's right.
I can't do that, but somebody should.
Can they do that as rural carriers? Can they let us know?
Refer you to the postmaster, Vernon.
So what do we wanna do?
I would do it, we'll have to work on tweaking it to be sure we can touch on everybody.
Yeah, I think it's something you should pursue. When it's a little more concrete, the details, and we can talk about it again.
So if we, if Tim was able to have that ready for our next meeting, we could make a decision on that.
Or if he had it ready beforehand, he could let us know and we could ratify it. Something that important
Yeah.
could be done that way, I think.
Okay. Motion on this?
I move that we allow up to $500 for preparation and mailing of postcards for vulnerable Vernon residents.
Second.
Moved and seconded. All those in favor, please say aye.
Aye.
Aye. Opposed?
Abstain or
And
whatever.
abstain.
Yeah. We are gonna table the select board policies. Despite everything that's going on, I think that we still need to have a discussion about the town administrator recruitment, and what our thoughts are on that, it's kind of, with town meeting and with everything else, it's kind of gone stagnant for a little bit, and I think that we need to open that back up. And I truthfully am not even sure where we left off with that, because there was some follow-up with VLCT and then everything went away, so.
That was what primarily just to try to locate an interim.
Is that what that, okay?
Yeah, I believe so.
Because
Yeah,
I thought
that's-
last time they were part of, but there was gonna be a fee and
Right.
to have them
Right.
help us with that hiring
Yeah,
process.
Wasn't that 6,000? Wasn't that the number?
Yeah.
Yeah, it was
So
somewhere thereabouts.
6,500.
But first,
Yeah.
we need to get that job description under control,
Mhm.
you know, because we've kind of started maneuvering things a little bit with that. And then I think from there, you could approach VLCT to advertise, right?
We were talking about Indeed as well.
Mm-hmm.
I mean, I
Or
think,
start with just that.
I think part of it is gonna come down to what's left in that job description too. If we go through that, is that still a full-on town admin position, or have we gone to more of a administrative assistant role, or, and if we start to head in that direction, do we need VLCT to be the ones that are leading that hiring process, or could we do that internally to save the 6,500, or,
Right.
I mean, these are things that
Right.
we're gonna have to figure out here.
The board's gotta decide what it wants out of the position.
Mm.
But if you are going to look for someone that has grant writing acumen, which is not always a town administrator acumen. But a lot of town administrators can. If you bring it down to an admin assistant or an executive assistant type level, however you might want to call it, you probably may not, that is a better term, may not have the same level of expertise relative to grant ability when you bring the level.
Do they have people, grant writers, that do it like on a,
Freelance?
yeah,
I can give you 3 or 4 different people that do that, and the Wyndham Regional Commission should be able to help you with some
Okay.
grant writing as well.
you pay them.
Okay, and I don't know the breadth of, but I know in past lives, both in Vermont and otherwhere, the regional planning commissions were very helpful in that type of thing. They were also helpful in grant administration. But I think the board, just because of what I've heard from different members, need to really decide what in fact you want this person to be and to do. There are a number of position descriptions in the area, small towns. Guilford, Putney has a town manager that's a little different. Northfield has a town administrator position. They're a little bit bigger, not a lot bigger, but they're a little bit bigger. Different state, different laws, that type of thing, but a lot of same issues, same about number of employees, that type of thing. You need to really just figure out, if you don't want this person to have strong personnel oversight, then you have to work the job description to be very clear of that too. So it really is something that this board, and maybe you wanna do a facilitated meeting on that, and I'd be more than happy to facilitate that meeting for you, so you can, don't worry about taking notes, don't worry, just, have a free flow of the board. And make that, figure out exactly what it is you want out of someone that you're paying fairly good for Vernon, good salary for, and decide what you want that person to do.
Sandy?
That's a good idea.
Jeff?
Yeah, I like the idea of the facilitated meeting.
Okay.
Probably for Michael's benefit. If you can locate the very last copy of a job description.
For here.
him, yeah,
Mhm.
for here. When Michael's gonna need a copy.
All
I've
right.
lost my copy. I've got an old one, but an old job description.
I have one that was, done in anticipation of advertising. So it basically had all the same information that the past town administrator that was her job description. It was just maybe rearranged
This
a
was
little
from
bit.
years ago, or current?
Current, I guess. I mean, it was just done like in January
okay,
or
yeah.
something.
Well, that
It
was-
just got reorganized a little, but it had in it at least the latest job description that I had. It had everything in it.
So, Tom, could we task you with getting the most recent one out to the board as a whole?
Yep.
And if you could include a description from Guilford, Northfield, and pick one more. I don't care.
I don't go north, I generally go south, so going north, Newfane has someone, I think.
Do they have I don't think they have a town administrator, do they?
Dover. Wilmington has a town manager.
Just pick one, send us 3 of them.
Sunderland's a town, it's a
I
little
don't
bigger.
really want another Massachusetts.
Yeah, I
town.
understand, I'm just thinking of the smaller, Warwick has somebody.
Yeah, those are mass.
Yeah.
Stick to Wyndham County.
Okay. I'll find somebody, I'll
Okay.
find.
And if you could get that to us, and then we could try and figure out when we wanted to meet for that.
And if you look at the VLCT book that
Yeah.
has all the people in it, that tell you.
Yeah, I've had some.
Compensation and stuff.
Mm.
It would certainly be nice to have this rolling before the new fiscal year. When
Yeah, any money to advertise doesn't start till July 1st. That was in the budget we just passed.
Mm.
Because right now we don't have money for that.
I thought originally we had talked about using some of the remaining salary there.
Will there be remaining salary?
I'm trying really hard.
Oh, I'm not faulting you, but.
I mean, there will be remaining salary if we hire somebody soon enough. I mean, that's.
Well, I don't know.
Yeah, I don't really remember that.
But I mean, I don't think
I
that
think we threw that out there, but we,
if we push
kinda
this
like
off
not a
until,
vacant position.
If you push it off till July, you
Wow.
won't have anybody on until September, or end of August.
and then we're already touching
Well, I
that
know.
salary so.
If we can put off, getting billed till July 1st, we'll be all good.
But I think part of that is gonna come down to what that job description looks like and whether we need VLCT's help and those things. So I think that is the place to start. Let's look at 3 surrounding towns that are similar size, similar infrastructure, those types of things. Plus whatever the current job description was, and then we can spend a couple of weeks looking that over and making the changes and come back together and have that discussion.
Yeah, because you gotta look at your labor market, where you're competing against as well. What you're, for where you're drawing for candidates. There's a lot of things to look at. It's, but let's get the job descriptions out. The current one, and see what I can pick up from the other towns. Let's, spend an hour and a half throwing stuff up against the wall and seeing where it prioritizes out. And see what the board, determines that they wanna do for the town.
Everybody all right with that?
Sounds great.
Yeah.
All right. So after we get that, we could, do we wanna do that at the next select board meeting or?
I would suggest you separate it so you're not pushing up against other business.
Due to the facilitation meeting?
Yeah, because we're not.
We've got 3 weeks off.
3 weeks off, don't
Yeah.
we? Yeah, that's.
So do we wanna do it the last week in March?
Yeah.
Meet on that Tuesday and then we'll have our select board meeting the following.
So that would be the 6th is on, the 7th is on a Tuesday, so it would be
So that's our first meeting.
the 31st.
Yes.
Yes, I think it is.
Yep.
If you see my sister, wish her happy birthday that day.
All right, we'll do that.
Almost
So we can set that March 31st at 6:30. Does that work for everybody?
Mm-hmm.
Okay.
I will send out some, if I can find them in my pile at home, I'll send out some basic facilitation rules and guidelines on how we may wanna run this.
We do this in executive session, right?
No.
You don't?
We can, but I don't see why that would be executive session. I'm just figuring out what you want.
I don't know, I'm asking.
Right, as long as we're not gonna be saying, Chris said this and Chris said that, and it's Chris's fault.
It is
Oh.
Chris's.
I mean.
Maybe we need executive session.
No matter what, it's all gonna be my fault, so I'm fine with
Oh, no,
this.
no, it's Michael's, remember?
Oh, that's right, yeah. He's the new dog to kick around here, right? All right, so we will do that. I think that was Oh, I think you missed this one, Sandy. So other than that, I do need to announce that April 18th at the Vernon School, we were supposed to have a fundraiser for Kelly Wunsch. That has been postponed indefinitely, given everything that is going on. I have been in touch with Mary Ross. As soon as we have some idea, direction on this, we will get back with the organizers of that and allow them to continue that. Public participation, we have none. Correspondence? Admin report?
Mr. Chairman, if I could take a few minutes, just to, been around 3-4 weeks now. Thought I'd give you a little heads up as to what I'm doing. Not in great detail, but a couple of things. When I first came on, the task was to get ready for town meeting and get things ready and put together for that town meeting. I'm sorry. I hope that presentation went well and the board was pleased with that. I want to thank the treasurer.
I have to say that was probably the best town meeting.
Yes.
Everybody was friendly, everybody was respectful, and our town achieved some pretty cool things that night. I was super excited.
I really thought it was important. Sandra, as chair at the time, and I talked about putting things right out there at the beginning, letting people know, not hiding what had gone on, that you'd gone through some transitions and put it right out, and that you were getting ready to move forward, and things I hope were forward leaning. That's what we wanted to have happen. One of the other things that was put to me immediately was there was some concern that we were falling behind on some grant reporting. Not the one tonight, but other grant reporting. One had to do from the Vermont Community Foundation. It was a smaller grant. And one had to do with the safety provisions that were being put on at the Recreation Department on Pond Road. The Vermont Community Foundation grant, and I can't even get into the details of what it was. I just wanted to see where we were in the reporting. That was taken care of and completed. So there's nothing more that needs to be done with that small grant. I spoke to the Vermont Community Foundation directly, the staffer that was in charge of our particular program. The recreation grant, we're putting in various safety provisions up there. That is open until 2021. So I had a conversation with the rector. They're starting, they have some other things they have to do on that particular grant to put things in. It's a reimbursable, so we're collecting. We have quite a few of the receipts. They were real good about record keeping on that. And when he finishes up what he has to do up there with the swing gates and some other things that are going on, then we'll get those receipts, we'll submit. It's up to, it's an up to grant, so you may not spend the full amount that was budgeted. You may be able to do it for a little less, so the reimbursement will be less. But that is everything that needed to be done up to this date has been done. I attended the Northern Borders Council meeting that they had up in Londonderry about a week and a half ago. It'll be 2 weeks ago this week, because the Northern Borders Commission now extends throughout the whole state of Vermont. It was for a while just the upper 4 counties or 5 counties. It's a Vermont, New Hampshire, Maine, and part of New York State. Really in large part due to the work of our congressional and the other congressional delegations and senatorial delegations to put this together with the lead of the governor. The governor sits on that board. There's $4.5 million available in grant funding for each of the states in that part of New York. They are looking for actual projects. We're not ready to apply for a grant. They like bigger grants. Water and sewer are things they really like to do because it's, you can spend that money really quickly doing water and sewer projects. but broadband is something that they're looking at. One of the things that may be eligible, maybe a year out, maybe not this particular year, would be the Friends of the Governor Hunt group there, as they're working on a downtown type plan and what, for a village center and those types of things. If they get some planning done, there may be some implementation money that may be available a year or so down the road, where the application, they may have extended it because of this COVID-19, but as of a week and a half ago, there's no way we're gonna be able to make anything on that anyways. In Windham County, in the southern counties, there's a 50% match. And it can be some in-kind. They don't really like in-kind. We were pretty much told about that. But you can use other federal or state grants as a match. You know, where in a lot of programs you can't do that. So if you were to get a community development grant from the Department of Commerce and Community Development for, let's say, downtown work, you could use that money as a match toward anything you were applying for at the commission. And you also have a 2-year window to be able to get that match. So they could give you they could grant the grant contingent on finding the match. So it's flexible in that way, but it is not flexible in non-implemented, not planning grants. They're not looking for planning. They're not looking for fixing the town hall. They're not looking for that type of thing. But if you were to create a community center that was going to have an impact on the economic development of the town of Vernon, that may be something they look at. It was a pretty interesting meeting. There's a lot more to learn. We're working, I know that you have $15,000 to do a capital assessment. That's in your plan. And you have, I know, at least one company that I think the town of Guilford used. I've seen that email. There are other groups out there that do this as well. And I've been scouting around to see, given our square footage, you know, of the buildings, and Chris and I sat down and we kind of brainstormed the buildings too. I'm not sure if the school's involved or not, and they still have to.
Yeah, that, and I don't, we were talking about that the other day, and I don't remember if the school was one of those buildings we were looking at or not in that assessment.
I don't think so.
I don't believe it was either.
Okay, so that brings the square footage down, and it will bring the cost down for any firm that's looking at this. But we did go through a number of the buildings, trying to laundry list them out, and I'm gonna talk to Dude Solutions as well. And there are a couple other companies, they're nationals, but they're good at what they do. I don't know if $15,000 will cover that enough, but the square footage is gonna be close, because you have the highway garage, the salt shed, the building across
Well,
the
we
street.
got to that number based off from the information that we were given from the
The other
company that
company?
worked with Guilford.
Yeah.
So if you're saying that the other company's 15 grand's not gonna be
I don't
enough,
know that
then-
yet.
Then we're just gonna stick with where we're at.
Right, but you should get more than one quote. Whenever, I think if you're spending $15,000-$20,000, if it was something else, you'd put it out to bid. You'd put it out for RFP. So I just wanna get, if they're too high, then they're too high, and you go with what you got, and that's good. But, so I'm just doing some follow-up on that, that's all. We have spent a lot of time on this COVID-19, you know, at least in the last week. In addition, the White House had a call-in conference call. There were about 3,800 people on the call, and it was really to hear what the federal agencies, HHS and others, were planning to do. That has changed almost 100% in the last week as to what was going on in the original call. But we've been trying to stay up on that, both on a state, regional, and federal level. Talked to you about that earlier. You have a copy tonight of the current budget as to where we are to date. I had a number of questions. I want to just indicate to you that any question, or as silly as they may have sounded for someone who hasn't been working with your budget, The town treasurer and her assistant have been nothing short of outstanding in their assistance to me. I just think you folks need to know that. As has the clerk's office. I am looking for funding opportunities via grant or other gifts as it relates to the generator for this building to move the Emergency Operations Center.
You're working on that with David?
I am working on that right now just to see what's out there. Then I'm gonna talk to David about
Because
the size we need.
David's already done the legwork on that.
Okay.
So I mean, anything that's involving the EOC,
I
certainly.
was just following up with what you had asked me to take a look at for grant funding a week ago.
Right, but I put in that
Yeah.
email that you work with David
Right.
on that.
Yeah, and I
because
will
he's
be.
already done all of that.
David Emery.
Yes.
Yes.
Yeah.
So we're looking at that as well. And I think that gives you a little bit of an idea of what I'm doing, other than I'm doing a lot of file research as well. I've looked at your pay plan, I've looked at some of those types of things, and just to see how it works. I need to know the mechanics of how things work as well. So that's where we are with that. Now on your, I had one other piece of correspondence to set out to you I didn't put on your desk earlier. This is just from the Wyndham Regional Economic Resiliency Team. It came from Adam at BDCC, and I wanted you to take a look at that. And that's just things you, because you don't have enough to read, you're not getting enough emails on things, I just gave you one more thing to. 3 beds, 3-bed meeting type stuff. The budget, I had a couple of questions on, and the treasurer was really, really good about helping me out with that. But if you just, I'm gonna give you some examples. The Lister's budget, from a salary perspective, is not near where it should be, given this coming up to toward the end of the third quarter, but there's been a vacancy. Okay, so that's what the answer is with that. If you turn 2 more pages over to general government, while there's a lot of the line items there, I won't get into the detail of each of them, that have not spent a lot in the line items, your general office supplies, for whatever reason, and those are shared through the departments, is currently a little upside down. And I'm gonna ask the treasurer for detail on that so I can see where that has been spent. I just got this yesterday, so. And it's, when we go into the general government, it's about 3 or 4 pages later, when you get to the town van.
Careful now, that one gets touchy.
I'm not suggesting anything bad, I'm just suggesting this is what I've observed.
Where is it?
The gas is over, and that may be the price of gas. I don't know if you get bid gas. You do, okay. So you may be paying, that when that bid came out last year, it may have been a higher price than it is now. That's, but that is something that you just want to keep an eye on. They're gonna need to, we're probably gonna use the van quite a bit too, if we're doing some deliveries.
That would not be coming out of this budget.
Right.
If that happened.
So those are just, and the other one was, on the town garage operation, and I have not spoken to David, this is again just an observation. You can see that it's been a pretty good winter. If you go down by some of those, it's been a pretty good winter. But your fuel oil, which is your, I think, your heating oil there, it's, you shouldn't use much more between now and the end of the year anyways. But, that was getting toward the tipping edge on that as well. Most everything else in the budget, is pretty much right on schedule. You'll see some of the general government things, you're way up for the year being late, but some things, I was speaking with Ms. Carr earlier, you pay your county tax, or you pay things up front, your insurances you pay in July. So those are gonna show that a big part of that budget's already gone early in the year, but you pay those as the policies come due. But everything else seems to be right about where it belongs at this point in time. And if you have any questions as you go through the budget line by line, just give me a call and we will get the detail for you.
Do we know if the salt used here for the stairs and stuff, would that come out of that supply line, or is that somewhere else? Is that?
Well, they come out of the general supplies?
I'm only asking because I know that the salt that we had was eating away the stairs. They've stopped using it and they had to buy another pallet of that. So I don't know if that would have anything to do with
Okay.
it. Worth looking at.
So if we get a
Yeah, I'm gonna get a
detail,
detailed sheet on that, so.
Yeah.
So that's really all I had on that.
All set, Tom?
Yeah, there's still a little feeling around the edges to find out, exactly who does what and how that works, but, overall, I think you're pretty well up to speed as to what we're up to.
Okay. Currently, all VLCT trainings that we had are postponed indefinitely, I believe. Sarah, do you know anything about that? Trainings, I believe everything is indefinite at this point.
Oh, I think if it's over a certain number of people, I think they put a lot, I would recommend calling them.
Okay.
'Cause
So I
I'm
don't
looking
believe
at
there's anything.
I'm looking at an update right now, I don't see anything
Okay.
about them.
We now have a special meeting on the 31st to discuss the town administrator job description. That will be at 6:30, followed by a select board meeting on April 7th at 6:30. I would ask that the board spend the next 3 weeks trying to think of some agenda items, things that we may have overlooked recently or over the last year, whether that's policies or any of that stuff that might warrant being relooked at so that we could start to head in that direction. And as for everything else, we got a lot of information on the COVID-19. Sarah was here to represent the state, and I think that we are in a great place to carry through this. And I have to say that just watching the Facebook page, as crazy as that is for Vernon, that we have seen a drastic swing in the way that our residents are communicating with each other, the way that they're coming out to help each other. And there is more of a sense of community over the last 2 months than I have seen on that Facebook page or felt walking through our school or even in this building. And it is great to see that and to feel that, and I think that we are in a tremendous spot to move forward. We just have to look out for each other, take care of our neighbors, and see where we go. We are adjourned.
we got a good amount done yesterday. So today I was thinking most of you would look at these little drafts that Jim has done. I showed you guys the draft on waiting study yesterday. He's done a rewrite on the gender language. And then on 226, which we passed out yesterday, the bargaining, he's prepared an amendment to strike out sections 6 and 7 because he put them in the bill thinking we would alter them, and then we didn't. So 6 and 7 have no changes, but we say they are amended to read, and they are not, in fact, amended. So this just strikes both of those out, so the bill will be shorter.
Okay.
No change otherwise. The other thing is, Andy reminded me that this was his bill, and so I asked him to report it because the one that we got rid of his language, but that's where we put the healthcare bargaining.
Oh, that's sorry.
So he's going to report this on the floor.
When you voted up yesterday?
Yeah. So Bloomer's going to work it out with him.
The question I have too, are we going to do with 224 anything with the literacy pieces or dyslexia, or are we waiting for the House to send over language?
Waiting for the House on so they're going to send a separate bill.
Okay. Because I got a few people who reached out like, oh, what are you doing to 224? And I'm just like, I think the House is sending us something. And
It's like a perfect storm of misinformation that we don't have any control over because Jeannie's system insists that we have to use the existing title for the bill.
It's not her system.
The system that Jeannie is forced to use. We cannot change the title. And then the House is working on it and has gotten everybody all stood up on structured literacy. And we chose as the only vehicle one related to structured literacy. So it looks like both committees are madly working on that subject. And obviously they're not doing anything. So just apologize to anybody. I've already written a couple letters like that where I'm just like, sorry, I know it's confusing from home, but we're not doing anything to cross over.
Yep, no, that makes sense.
Oh, did you see? I'm sorry, I was just looking at Mr. Hygiene, but did you see the Scotland has this legislation to make all, to everybody, every female in the country.
So that's like a state law, though.
In Scotland.
Well, Scotland's
it's bigger than Vermont.
No, but it's smaller than Texas or
Bigger than a breadbasket.
Smaller.
Well, California.
You're saying for all schools or for
Every female in the country.
So I had to grow up in college that's like that's on the all national Slovakia team.
I mean, if you
so that's like the all state Pennsylvania.
They're all.
No, we get it.
So let's just have a quick discussion about Corey's bill, academic athletes.
Is it something you want?
It's just a blank piece of paper that came out of the printer that can be used for something.
Jeannie, where is the stuff on the?
It's 328.
Using the underground on the electronic.
We could.
I think
On the
that fire
athletic
pro tank is
bill, Corey's bill. 328. Do we have a folder for the?
Yes, I'm using. You're gonna do that tonight?
We did it in the house. I liked it better because I had my iPad and I had my Apple Pen and I could color everything different colors.
We don't do
You know what I
that.
mean? So when I was taking notes, I could be like, red I didn't like, green I did like.
That's okay.
Now I'm sitting here like, oh, I didn't get a green pen, or I'm looking for a different color pen.
If you're ever wondering, so I had to do
Okay.
topic and
Oh, red is editing. Red don't like green.
So while we wait for Jim, Jim's coming?
Blue was really bad.
they're voting on the bill, and I said,
I was just gonna check in with the committee about where people are on the student athlete compensation bill. Because if the committee likes it, we can add it to the miscellaneous bill. I know there was some sentiment that we should wait.
yeah, I mean, that's what I thought, all the overwhelming for the testimony was that there's gonna be an, what do you call it, NCAA, meeting in, January, and that they were proposing some rule changes, and that, every Division 1, 2, and 3 all asked us to wait. Well, Division 1 didn't so much. Division 2
in Division
depended on the sport.
But Norwich did.
Yeah.
Norwich did. The guy who did say, he goes, I don't expect them to actually
do anything.
do anything in January. So that's my only concern of the January piece is that they even said, yeah, we have these proposals, but like anything, they get tabled. And so will it draw out?
Well, I mean, you did bring up the point of putting pressure on the NCAA if we take some kind of action. So I'm not opposed to that, actually. So there you go.
Okay.
Did that answer your question?
Yeah,
I wasn't here for the testimony.
okay, I was
So
on.
I'm not really sure. I'd have to review that.
I did talk with Skylar Nash. We were at another event, and we talked for about 15 minutes about it. It makes a very convincing case.
Is he the student athlete we heard
Yeah.
from? Yeah. So he was the one person that we heard from that was pretty clear that he wanted us to move forward and everybody to move forward. I think the most compelling thing for me in the testimony we heard was that there are what the other student athlete who was in here described, and I think this is more than just her description, as that 2% athletes really want it to happen, and the 98% want to go through this process with the NCAA to make sure that it treats them fairly, because it's a boon for football, men's, and to a lesser extent women's basketball, and hockey in some places, and baseball in some places. But other than that, because those athletes could probably make a lot of money on their name, image, and likeness. But the rest of the athletes, for the most part, with a few individual exceptions, would not necessarily benefit. There are some gender equity issues. There are definitely divisional issues with Division 1, 2, and 3.
But I'm not understanding why it's not fair to them. So take Skylar.
He'd make more money.
He would make a lot
the
more
golf
money.
Player.
Understood. But why should he not have the right to do that? Why does somebody who's really good at something and advertisers want them, why is it unfair to somebody who's not as...
So depending on how the rules are written, if they're written for those 2% of athletes to benefit, it may actually not benefit the rest of the athletes, depending on how things move forward with the rules.
But it couldn't be any worse than it is now.
Well, it commercializes, I mean, I think it commercializes the whole experience so much that the other student athlete said that she really appreciated the whole idea and culture of collegiate athletics that was not that was not like professional sports, and she was afraid that the whole experience would be ruined, or at least tainted by having this commercial aspect.
And that the athletic directors that testified all testified asking for us to wait from each of the 3 divisions, saying that there were a lot of concerns specifically for Division 3 and also potentially Division 2 about inequities, because they right now don't do recruiting and don't do scholarships for the athletes. And this would say, this wealthy donor could offer $50,000 to this car dealership that then could invite the star basketball player to sign autographs and have that be sort of an incentive for that basketball player to come to the school. And that just skirts around the Division 3 rules in a way that the athletic directors feel really uncomfortable.
I already have with that too, that the athletic directors don't have a problem with, is that the school sells the sponsorship to that team, to that local car dealership. The kids still gotta go sign autographs at the car dealership and don't make any money, because that's what happens now.
Right, I mean, money is in the system, it's just being exclusively made by the...
What I like about our bill is it just says they can make money off their likeliness, and it doesn't go into effect until 2023. So I think it does put that pressure on the NCAA to be like, California's doesn't go into effect until 2023. It does that same thing, gives the NCAA time to move it along, and basically, our bill would become, hopefully they would figure it out at that point.
What I suggested to Corey as a sort of interim measure is that we either do a resolution, which I know the Senate doesn't always like, but a Senate resolution urging the NCAA to act, or just a letter from our committee, or even joint if the House wants to join on, urging them to act, saying we've taken testimony, we want them to act, figure this out, and if they don't act, then we would move in the direction of state law. Just as I would have a hard time supporting it right now. My one college in my district has asked that we not move forward right now because it's Division III and they're very concerned. So.
Well, I like the resolution better than the letter idea. So obviously we don't have Andy today, but you know, we can see where we go on it. I can see sense both ways, either having it in with a date that goes out and could be pulled back or altered, and I can also see a resolution where you're essentially trying to pressure. I'm not sure how much pressure our resolutions produce.
Well, I think it would help our NCAA people who go into this process to say, look, we have this resolution from our Senate saying they want us to move, and we better get our tails in motion. We have, you know, a UVM student is on what is it? The student athletic, the SAC, Student Athletic Committee for the NCAA. She's one of 30 students nationwide in Division I who's on this committee, and they are the student voice in all the policymaking division of the NCAA. So she's a really good vehicle. I'm putting here because she testified. She was great. She's a field hockey player. She's a vehicle to get our message to the NCAA along with our athletic directors.
It dawns on me, I don't know the rule, like we're past committee drafting date and we're past bill drafting date deadline. Can you even write a resolution now? And
I think you can, resolutions are different. Yeah.
There's one that the Ag Committee may do that just got drafted.
Yeah, I don't think they have a deadline this year.
Okay, well, not sure where you land on the resolution idea, but
I mean, whatever we do to move the conversation, I think we're going to have to do the bill because I think they're very clear NCAA is going to table it. NCAA is not going to do it until 10 or 15 states finally do something and say. It's kind of like when we do those bills on like incandescent light bulbs. I know we did one and it was like we joined 16 other states. Finally, the manufacturers are like, fine, we won't make them anymore. It's kind of one of those things that
I did speak to Dave Watt.
He's coming in on Tuesday after the break.
After break, okay. And he had a few things he'd like to share with us.
And is he basically pass or wait?
He was not pass. He was against it, and he was
against
even
in the future.
Last time I spoke to him, but I hadn't talked to him now in probably a good week and a half or so.
He said he's opposed to it.
Okay.
So 25 states have bills now doing it. Most are like a national standard like ours. Florida is doing a bill that allowed them to go beyond that. But yeah. So eventually, when you get to like 10 states, Congress will also have to act too because they're not going to want different. NCAA will put pressure to put.
Theoretically.
Can't really count
But it looks like New Hampshire, New York, Massachusetts all have bills in us in the region.
Well, I don't think it's a bad idea to think about a resolution if we've had negative testimony to that extent. And Dave Walk apparently is going to come in opposition. But if mostly the opposition is timing, and if mostly the idea behind it is to push the NCAA, the resolution would work.
Did you see
Because no one was opposed to paying the students that came. They just wanted to
wait.
Did you guys read the thing that the student, I'm sorry, I can't remember her name, but the UVM field hockey player student sent us? She sent it to me, and I asked her if she'd sent it to all of you.
I didn't get it.
I don't remember it.
Oh, really? Okay, I can forward it to all of you. But she sent a link to the letter from the SAC committee that that basically lays out the 98% student argument, which I find really compelling.
Okay.
You also got to remember that a lot of the students, the 2%, also come from less means than some of the other athletes. Like, when you look at their schools that they attended, you know, I look at my school, like, most of the kids went to St. Lawrence, their parents and their Division III athletes were just playing sports, but they were going to go to St. Lawrence whether or not anyway. Where I think in the Division I sport, especially basketball, baseball, football, the people that's their only opportunity to higher education and to make, you know, money long term. So I think it's, when we talk equity and those other issues, I think some people are looking at it from perspective, but when they grew up on Cape Cod and went to Kent School or wherever they did, and they're
with Olympic athletes, they're allowed to monetize their image all along, right?
Yeah, so they haven't. They weren't 30 years ago, but they are
it's just
now.
recent.
No, I mean in their life all along. So like from the time they start their career.
Well, once they accept money, they can never participate in NCAA.
No, I'm just talking about Olympics.
Right, but I'm saying if you're young and you still want to go be a gymnast for the University of Michigan, but you're 16 and you're an Olympian, you can't accept money because you're excluded from competing in NCAA.
I'm just wondering, is the NCAA the only institution that enforces a ban on people monetizing their own image? Because in our society, that's a
That's how we all make our living doing this.
Well, or
it's the big bucks.
Yeah.
I mean, in a capitalist society, you know, you got a lawyer who puts ads on TV and says, you know, I'm the DUI lawyer, call me out. It's like to say, especially with, you know, many African American athletes, we're going to make lots of money off you, and we're going to forbid you to tap into any of that.
But they don't. I mean, but like the Division IIs and IIIs, they don't make money off of them. You know.
Well, now, but I mean, suppose like Skylar was talking about if he started Skylar Nash basketball camp every summer in Vermont or in the region, that might get to be like a big deal, you know, where he could make $50,000 in the summer or $100,000.
Yeah, and I think his testimony was very compelling. I mean, he made the argument, you know, he comes from a working class background in Chicago, and he can't get money to pay for his plane tickets back and forth and things like that. And the summer camp, and his one thing that he said that I thought was really compelling is the coaches can all do the, you know, summer basketball camp, but the students can't. And that's an inequity between sort of labor and management almost. But
the one that always bothered me was Kevin Sneddon did one for an eye doctor. I just remember a radio ad. It was, I'm Kevin Sneddon, the UVM hockey coach, and I can see better because they did LASIK for me.
And it's like, nobody's there to watch you, bro.
Yeah. So I think we should do something. I was hesitant to do a law because I was asked by my person to wait. And I think also if we wait and they don't do anything, then we can do an even stronger bill that really is more prescriptive.
We could even mention that in the resolution.
Yeah, because it would be, you know, January is when they meet, so we have plenty of time, assuming we're all, well, you're not going to, assuming we're all here, whatever, assuming one of us is here. We can do that. Corey.
Corey, do you want to talk with Michael Chernick? Okay. Great. So, no Jim.
Not yet.
Ledge counts.
Give me the house, Katie. They all left.
I think most of them are done.
They're voting.
Oh, is it
Oh, are they
Act
still?
250?
No,
they were done on the floor, I think.
No, but he's in House Ed and they're voting a bill out, that's why.
Oh, hey.
They may be voting the pre-K bill out. Did
you guys read the Vermont Digger story
about
that bill?
pre-K? Yeah.
It's pretty clear. It lays out pretty clearly what they're doing. You remember the testimony, or was it the year before? It might have been the year before. It was before you guys.
Oh yeah, I remember this.
Yeah, we did a session of testimony on pre-K and unraveling the dual oversight, but also the question of the licensed educator. Is that going to put private providers out of business? Should we expand it? You know, we went back and forth and we created this language ultimately that died because Dave Sharp didn't get his $10 million for expanded pre-K.
Right.
But they've redone that work from scratch on their own and come up with a different solution than the one we had worked out here. So we'll have to go back to the drawing board and hear from witnesses of all sorts.
All shapes and sizes.
Got some pre-K students in
Like
here.
a Dr.
See what
Seuss
they
book.
say.
I'm 3 years old.
Witnesses.
I'm pissed off.
I think it should be under the.
I'll bring my kid in. He's just gonna be like, I want Barney.
I want to get rid of the glasses.
And praise God. Hey, good at glasses.
He's just like Barney. We have an Apple TV remote that like my wife and I were talking to, like when if we're gonna put Barney on, we'll just be Barney. So now you got it. Barney.
I can't believe you're letting your kid watch Barney.
Good heavens. It's
Barney
an
struck me
abomination.
as bizarre and like sketchy.
But you know what?
The moment I saw
It's
it.
an abomination.
Barney taught him to clean up.
Okay.
Throws away
Like
things.
Teletubbies.
Teletubbies. No, I love Teletubbies.
Teletubbies, yeah. Teletubbies is one of those shows that I'm not going to say.
Although, if you think about it, it's weird kind of proto-fascism in Teletubbies.
That was you guys
So
in the
there's
room.
this loudspeaker and it's like, Teletubbies. And they all come out and
I know.
you're like, what is that? Giving the command.
And then there's SpongeBob. SpongeBob has his own Broadway show. Not SpongeBob is a Broadway show.
Oh, really?
Yeah.
I tried to, he's not into Sesame Street. There's a new Sesame Street show out on Apple TV that's like, it's called Finders.
Yeah.
Or the Problem Solvers or something. But it's, you watch 2 episodes, it's the same thing, so it's really annoying. Because they're like 3 steps to solve the problem, but it's the same thing with just a different problem. So
Right.
And you're just like, okay, no.
But it's always that way, like with Dora the Explorer. It's the same show every time.
Dora. Blue's Clues.
Dora was great. Blue's Clues is great. I like Blue's Clues.
Oh my gosh, so I
You
Blue's
gotta have
Magical Movie is
the
the
original
best.
Blue's Clues guy, though.
Yeah.
What was his name?
I can't remember.
I don't know.
There were 2.
They went to it, they changed him out, and the second guy just didn't do it.
Yeah.
It was disappointing.
So,
The Backyard
Sesame
Dance is
Street.
good.
Sesame Street started when I was like 6 or 7 years old. We're in the same age, right? So, I remember my school sent home a note to my parents that this was going to be a good show that was coming. I was going to starting on PBS. So my mother made me. She's like made me watch it, but I was always rebelling in creative ways. So I sat. She said, "You sit in that chair and you in front of the television." So I turned myself upside down in the chair. I was in the chair, but I was like in front of it. And she came out of the kitchen and she looked at me and she's like, she just went back in the kitchen. It was great. I was awesome.
You know what the best invention kids is now is he's got these markers. It's not even showing going on and off, but it's got paper that the mark only works on a certain paper. So it's like he can draw on the wall with it, nothing.
Nice.
It's a certain paper.
Wow. It's probably got PFAS in it or something.
Probably.
Don't let him eat those.
Probably
markers.
something wrong with it. That sounds like a miracle drug.
Jim Demarais.
We decided to tentatively craft a resolution around the athletic compensation bill instead of dropping it in here as a part of this bill. So do you know, is there any deadline on resolutions?
I don't know, that's a Michael's Turner question.
Yeah, that's what it's
Yeah.
Yeah.
Okay.
Very short.
And then I was wondering, were you able to, you and I had talked earlier today about that rewrite of the gender
Yeah, sure.
equity? Okay, let's take a look at that.
Yeah. Okay. So,
Oh, what did they just vote out? Did they?
yeah, I was just working, they wrote out the literacy bill.
The literacy.
Oh, didn't they?
If we take out, well, out of house education, in human services, and literacy's now out.
And literacy is
that grant?
mostly grants?
Mostly grant.
Okay. Is there any mandatory screening or anything?
There's already a statute in place, 2903, that requires screening.
Third grade?
Yeah, and I think it's page 1 through 3.
Okay.
And then also screening at 4 years old and beyond if you have any trouble. So I think there's a problem with compliance with that. So rather than do a new law saying the same thing, I'm just trying to get people to comply with this.
Carrots.
Yeah.
Yeah, okay.
Yeah.
I know, but you don't wanna testify to that.
So it'll, well, I assume it'll come over to us. Their money committees aren't shy about killing their bills.
Yeah, just a $800,000 appropriation.
Yeah.
No.
Yeah. Grants, always grants.
Okay, so this, so sorry, for the record, Jim Demery on his console, we are looking at draft 5.1 of what is essentially your miscellaneous bill, S24.
5.1, I have 4.1.
Oh, yeah, me too.
Do you,
Yeah, that's what I have.
That does not have language that Senator Ruth asked for.
is this 4 points? I have 4 points.
Yeah.
Oh, I'm sorry, I thought that I had sent the.
So you're working from 5.
Yeah, and it has, the 5.1 has your language in it, so.
We'll have to wait for Gene to print it out.
Is it in color, Jim? Is it all?
It's in color, yeah. I put in this bill as well the changes to Act 173.
Oh, good.
Is correct. But I'm not really ready to go through that with you because I've been running around and I need to get the sped timeline up for you. I'll go through with that. So
good to have it in there though, so we don't forget.
Yeah.
And we're gonna replace 4.1.
No, I did send it to the copy room, and this is what I got. You should have. I had gotten copies of it. No, I had 4 copies of it before.
Where?
I'll go see. Excuse me.
Actually, so you got that bill, that
273? Yeah, I haven't had a chance to look at it. I just printed it out.
Okay.
But, I'll look at it and do, when do you, next week? What time, when is good for you?
Oh, I'm around, so.
Okay.
Yeah, we can figure it out.
All right. I will probably look at it and work on it on Sunday, and I'll be in touch about, I'll email you.
Can you print your copy with
The line numbers, yeah, that'd be great. Yeah, it would be helpful. I don't know why, when I print them from, they won't do the line numbers, but yeah, that'd be good. I know, I'm printing it from my phone, so that may be why, but, and then the amendment to this bill about the health policy, I also got that, and then I need to talk to more people before I get back to you, but we can talk about both of those next week. Okay. Thank you. Interesting. I was impressed with how fast you were. He's too fast. I don't have time to look at these right now.
Well, it's not in my head. See, but
Yeah.
some of the written things, I write them down, but then I'll like, where did I write?
Yeah.
So I gotta like, go do it.
That is wise. I need to get better at that.
Well, I mean, in that case, Bernie could not step down without probation. You know what I mean? And at that point, if you're Scott, why would you, floss like good reasons? Okay, so we'll just.
Can I ask you, since we have a moment, did Bobby talk to you about 273?
Yeah, that seems fine.
You don't need it to come here? Okay. I just didn't want any, problem on the floor with people going, hey. Because it does affect Title 16.
No, understood.
Yeah.
But, it seems more properly like a money committee and ag.
Yeah, we're trying to keep it focused on local foods.
Yep.
And the vehicle is school lunches, basically.
And I think this committee wouldn't have any problem.
Yeah, there's nothing in it that I think you guys would have a problem with. But Bobby's trying to get the money from the ag sort of piece of appropriations rather than the education piece. So I think that's helpful too.
But he's understandably gun shy because he and Chris Gray have tangled over every bill for the last 4 years.
Yeah.
Hello, Allison.
You look surprised.
Please come in and brighten our room.
Hi, everybody.
We're just hanging out.
We were just doing that too. It's as if class was dismissed, and then we just had to discuss all sorts of things, ag issues.
It's like the day before Christmas vacation at school, where your teacher shows you Shrek,
Yeah.
Nice work on your library bill.
We talk about Blue's Clues. Thank you.
Nice work.
Thank you. Not a single question.
That's because we all know in our hearts it's all true.
That's true. Yeah, I
And much
tried to
needed.
lull you into thinking.
Behind it. It's our draft.
Hey. Oh, I'm too big. There's a draft. I see you're having just a quiet moment.
Yes.
A lull before the storm.
We're actually working, so.
Okay, enjoy. I figured these people wouldn't hung around if we were just having fun.
Oh, we're amusing them.
Thank you.
Okay.
Okay.
So, do you want to just go through one change on the menstrual hygiene products first? Or
Yeah.
Okay. So on page 8, on line 15, this now reads, this to the majority of bathroom issue. So it says now a school district and an approved independent school shall make menstrual hygiene products available at no cost in a majority of gender-neutral bathrooms and bathrooms designated for females that are generally used by females in any of grades 5 through 12 in any school within the district under the jurisdiction of the board.
Yeah, I think that gets it.
Yeah.
What do you think?
Yeah, it's a little convoluted, but yeah.
Yeah, that's what I was thinking. I was like,
Well, I understand.
It's such a simple thing.
Yeah.
Just put tampons in the bathroom, people.
But this is Ledge Council style. Like, I always, no, not just Jim. All of Ledge Council, correct me if I'm wrong, but this is what Bryn Hare and others say in judiciary. Because I'm always like, I would break that into either two sentences, or I would use M-dashes or something to have it not be one long.
I love M-dashes, but you can't use them.
That's what I mean. Your style criterion don't allow you to kind of break stuff up in that way.
Yeah.
I'm not sure why, but
Yeah, you can break things up in lists, but you can't. Yeah, I can't like.
but I think there's no real confusion there.
Yeah, I'm okay with that. I'm just looking at the next sentence, actually. Okay, so in consultation with school nurse, they decide which bathrooms, but didn't we want to say that they can decide how to do it?
Well, I think the bill is silent on that,
Yeah.
which allows them to do whatever.
To do what they want, okay.
Yeah.
But it does say that we do want them to have access to menstrual hygiene products at no cost and without the embarrassment of having to request them.
Yeah.
So that.
Yeah, so whether they use a basket with the product or a dispenser would be fine under the bill.
Under the way bills are.
But I think if we are not silent on it, we're going to involve ourselves in another definitional hunt.
Or another sentence like this.
One of my friends who has 2 teenage girls told me that she felt like she was the tampon fairy. So that is another option. They could use a tampon fairy.
So put that in the bill.
Yeah.
Put that in legislation.
Well, it's up to the school nurse if she wants to employ one.
Okay, keep going.
Okay, we're going to skip through what's on the next page. Is all the special education technical stuff.
Those are the tweaks in 173 that we will look at and come back.
Okay, and then we go to a new section on page 14. And this is piece of section law. And it reads gender balance.
I think it's 20 and 5, Jim.
20 and 5.
Now. So you have 19 and 6?
Oh,
Yeah, because the students just elected 2 men. Yeah.
Oh,
so I believe it's now 20.
Okay. So this reads, the Board of Trustees of UVM currently is composed of an overwhelming majority of men, with 20 men and 5 women. The Board of Trustees of the Vermont State Colleges currently has gender balance on its board. The state goal is to have the UVM board achieve gender balance by 2025 and maintain it thereafter, and the VSC board maintains gender balance. Gender balance means for the UVM board that the 25-member board is composed of 12 or 13 members, or women or people who identify as women or non-binary. And for the VSC board, that the 15-member board is composed of 7 or 8 members who are women or people who identify as women or non-binary.
Okay, so I'm sorry, but so you remember we got testimony that a non-binary person is not the same thing as a woman. We
Carrie Bratt,
object to, yeah. So we need to take out more non-binary. We need to concentrate on women at the moment. And then I think.
Fine with me.
I would agree. I think it would be wonderful if we had non-binary women on the board or non-binary people on the board, but I think that it dilutes it. Yeah.
Okay.
Yeah.
So we'll make that change.
Yep.
But are we going to say, then we're just going to put a period after who are women?
Period, yeah. Who identify. Well, no, who identify as women.
Well, if you say...
I think you can say
who are women.
You can just say who identify as women because you know I identify as a woman and
yeah.
So to be clear, we're saying composed of 7 or 8 members who identify as women, not who are women or people who identify as women.
Yeah, I think who identify as women would cover it.
Yes.
More completely without having 2 phrases.
Yes.
Okay.
Yeah.
So then we're saying that trans women
would count.
Satisfy this.
Yes.
Okay.
And then it goes on to say, given that the UVM and VSC boards have 4 categories of trustees, which include those
of there.
4 categories of, thank you, trustees, which include those appointed by the governor, by the General Assembly, and by representatives of the university, as well as student trustees. It is incumbent on the legislative and executive branches to undertake efforts to further the state goal in achieving and maintaining gender balance on these boards.
Why don't we say it is also incumbent?
Yeah.
Yeah.
Yep. It is also incumbent. Yep. And that says on before January 31, 2021, and annually thereafter, as part of their annual budget presentations to the General Assembly, UVM and VSC shall provide, at a minimum, the most recent 5 years of information on the gender composition of their respective boards of trustees. This information shall include the appointing entity, initial appointment date, and length of service, and shall summarize recruitment and replacement strategies employed for recently expired and imminently expiring trustee positions.
Looks good to me.
So we don't call out like the ones that are, appointed by representatives of the university specifically.
Yeah.
Self-perpetuating.
Yeah.
No.
I mean, couldn't we say
they're called out
here?
I don't want to use self-perpetuating because that term isn't known.
No, yeah.
So those are the folks who are, where it says on 17, and by representatives of the university.
Actually, let's put by self-perpetuating trustees there.
For both?
So it would say appointed by the governor, by the General Assembly, and by self-perpetuating trustees as well as student trustees.
What didn't Jim just say? It's not in the statute.
No,
to call him that.
No, he said that people wouldn't know the term, but I think probably many people would in the legislature. But that's what the term of art is.
Yeah, that's what they put on their website and everything.
Does that make sense, Jim?
Yep.
Okay.
But I don't feel like they've been. There's nothing there that says that they need to do something.
Right.
So why are we saying it's also incumbent on the legislature and the executive branches? We haven't said that they need to.
We could say on line 14, following where that sentence ends.
Yeah.
We could say the self-perpetuating members of the UVM trustees
shall them?
Well, I'd rather avoid that. So we could say.
Well, or you should undertake efforts to
yeah, should
state goal or
Yeah, should undertake efforts to.
Should or shall or may?
Shall.
No, not shall.
Oh, come on.
No, I want to avoid that, and that, this whole thing is written to avoid that. So, what?
Should.
Will. The self-perpetuating trustees have an obligation to address this imbalance in their choice of replacement trustees.
Oh, that's good. Did you get that? That's good. It's a good thing you're right.
With that change, how does it look?
Yes, that's okay.
Okay. We're not deciding anything, I'm just wondering.
Is that language only for UVM?
One second, what's that?
That's a good
Oh,
point.
Okay. What was that, Tim?
Is that language only for UVM?
Yes.
Yes, because right now State Colleges has priority.
Yep.
And we've said that we want them to maintain it, and they also have to report.
Yeah. So it's on.
Yep. Ruth, did you say something?
I was just about to ask about, there are student trustees on the
Yes.
State College Board too, as well.
Pretty sure.
Yeah, I think there is, yeah.
So where do you want the language to go? So
Right
At
after-
the end of B, section B.
Yeah, at the end of B.
Line 14.
Okay.
Okay.
Well, I think that's all I had for us to do today. I appreciate everybody sticking around for a little more.
evening, everybody. Welcome to Tuesday, March 17th, 2020, Select Board meeting, which is in turbulent times, I have to tell you. It's an interesting situation. A lot is going on. I'm Tim. I'm your captain tonight. And I just wanted to let you know that we know the meeting has been properly warned because we assembled it at 5:15 to go do interviews, but actually the interviews didn't happen. A little bit more on that later. And then we went into executive session to address some issues. So at this point, I just want to see if anyone can make a motion to approve the minutes of February 18th.
So moved.
Thank you. We have a motion to approve the minutes from February 18th. All those in favor?
Aye.
Aye, and that's 3-0. Well, I just found out recently I was becoming chairing today, so I don't have really fully formed remarks, but I do want to say a couple words that we're all going through a lot of emotional distress right now, I think. Speaking for my family and a lot of the people I know, there is a lot to think about and a lot coming at us as far as information. The way I kind of see this, and I'm sure everybody's heard this phrase, is that this is sort of a long rolling snowstorm that we can't see. It's like an invisible storm that we are all weathering. I think it's a great time to live that edict that we are Vermont strong. We want to check in on our neighbors. We want to take care of each other in a lot of the same ways we would take care of each other for a natural disaster. But we also want to stay calm because we need to really be there for people and to be there for our families and each other and our neighbors. We need to be informed, but we don't need to panic. I have learned a lot, as I'm sure a lot of us have learned a lot about COVID-19, which we're all dealing with. And I want to remind people that it's not an airborne pathogen like measles is. For all we know about it, which is still, there's a lot to be discovered, it's not like measles, where you could be in the same room with someone and contract the virus just by being near them. The distancing is because there can be surfaces that get droplets, and you touch surfaces and you share and you touch your face. And I think that's something really important to remember, because I see a lot on social media and just being out in the public a little bit, talking to people, of people kind of being afraid of each other and afraid of the normal interactions. And I really think we should resist that. There's other ways to safely interact. You see that we're spaced a little bit further apart here, and everybody's doing, different kinds of elbow bumps or live long and prospers and things like that. But there's a lot of vulnerable people in our community that still need our help, and we're figuring out ways to do that. And we're here tonight, and you're here, thank you, the public who is here tonight, because we are weighing risks, and risks, you can't eliminate risk anywhere in your life. That's just a misnomer that some people have. So what we're trying to do is reduce risk and still get the essential functions of the town going. And let's keep our first responders in our thoughts and our medical professionals, because their risk is way up here. And we're all here moving the town forward and taking a little bit of a risk to be together. And that's a good thing, I think. So let's just keep our heads together, and I think we're going to come out stronger on the other end. And that's all I have to say. I'm kind of rambling now, but that's the chair's remarks today. And I was also buying time because Peter had to grab
Thank you very much for buying time and for inspirational remarks. Yeah, I apologize. I had an important couple of papers that were back in the office, so I needed to run and grab them. I have done that. And I don't have town manager's comments about general topics this evening. I'll have plenty to say about COVID-19 under the agenda item.
Great. Do we have any other fellow select board members' comments or committee reports? Nope. Only three of us. That's weird to get used to once in a while. How about in our public here at our meeting room. Anyone would like to say anything that doesn't have to do with an agenda item that's already coming later in the meeting? Anybody at all? No? Oh, right to the mic. Yes, if you don't mind. Again, it won't amplify your voice, but it will allow everyone viewing remotely, which may be a few people tonight. Just remind us your name and where you live.
Good evening. I'm Elizabeth Howes. I'm a resident of Brattleboro. I reside in the South Main Street neighborhood. And I've been thinking that it would be good to liberate the neighborhood of the drop-in center activities and to relocate those needs to another address in town, perhaps the CF Church building for offices and case management, or to project further south, further north, to an area opposite the Hannafords, or to allow for an expanded housing unit, which I think is what is declared for the 54 address in South Main Street, that it would be large enough and would not be a large enough area, land area, would not be imposing upon the neighborhood. I've been on South Main Street for 23, 24 years, and I think it's time to liberate the neighborhood to believe in it as a residential area. I really, just the other day, I was walking down towards the co-op, and I must have picked up 85 cigarette butts littered both sides of the street like, like breadcrumbs all the way down. It just seems sort of, it's just tedious, a little thing, but it's so constant, and it's been constant for over these decades. I feel that the neighborhood needs to be able to think of it, the neighborhood, as residential. While the town still applies to the needs of persons who feel a need to be collective winter housing, as in the Austin campus, which I think it's good. They're a sector of population, of people, a time in your life when you just don't want to do anything. You just want to be able to lay down at night and just be able to be undisturbed during the day. It's I think we need to keep the Austin campus in mind. I think it's been good, and it's not that much of a burden to the community, to the grants for support for the drop-in center provisions. And then to move on, well, the second or the future address for drop-in center may be Home Depot. That's a very big building. And maybe across the street, a brand new spot right next to China Garden. There hasn't been anything there for decades, and it hasn't even been a parking lot. And it's just flat and wide open, and it could take a housing square very nicely. My second issue is during these rinsing of the public virus, that we consider the needs of the pets, perhaps through like a town ordinance, that our pets are treated for any wandering viruses that they may be carrying, that we consider cortisone treatments or antiviral treatments in the form of food drops that you could put on like a little biscuit or a little administer at meal times. That the pets, that we raise our awareness about pet health and consider that our pets need as much attention as are total strangers who are not really sure where to begin with treatment. Thank you.
Okay. Thank you, Elizabeth. Anyone else like to say anything about anything else that's not on the agenda? No? I think we're hoping to do a slight change in the agenda if no one has any objections. I think everyone wants to hear our COVID-19 update, if that's all right with my fellow members. And then we'll move into the liquor commissioner, I'm sorry, water and sewer commissioners.
Great.
So, Peter?
Thank you. So first and foremost, what I want to strongly encourage everyone to do in terms of access to accurate, reliable, current information about this, and particularly about how it is affecting us in town, because there's so much information in so many different places about literally worldwide impacts and certainly national impacts. I want to urge everyone to rely on the town's website, and I want to acknowledge that that we have a website that is in many ways out of date and kind of clunky, and we've talked about it here, and it's a priority for us in town government moving forward that we need to do a total overhaul of the website to make it more user-friendly. There's a lot of really valuable information there. But it can be sometimes hard to find that information. And so what I want to do is make sure that the community is aware that we have fixed that as it relates to COVID-19. It's going to be a longer haul to fix it in total. But for this moment, when it's so important, there's so much flying around and so much of that information is not current or accurate or reliable. We feel like it's really critically important that people know that there's a source here locally where you can go and check in daily and learn about what is happening, what is changing, what's moving on. And so we've built it in a way where on the town's homepage, smack in the center of it, there's a set of boxes related to COVID-19 and some summary information there, but mostly what it is access. Down 3 boxes on the right-hand side, you can get to the Vermont Department of Health, the Centers for Disease Control and Prevention on the national level, and the World Health Organization for the worldwide perspective. So those sites are being updated all the time by teams of experts. So on the health side of this, what we know, what we don't know, how it's spreading, what people can do about it to protect themselves. There's 3 direct links there, depending on whether you want to go into the state level, the national level, or the world level. On the left-hand side, there's a town updates box. And there is information, 2 other boxes where there's information specific to businesses and resources that businesses can access because of the significant concerns we'll speak about in more detail in a few moments about the impact that this will have on our economy. And also for individuals and families, a separate box to resources that people in the community can draw upon for human needs that are not organizational needs, but are at the family and individual level. Those 2 areas are going to be built up as time goes on. There's already some information there, and as time goes on, we're going to be making sure that well-vetted, valuable, accurate information gets added for the resources available to businesses and the resources available to individuals. The town's update portion, we are producing now a daily update of what's happening in town government, both over these last few days. The major emphasis has been on how we have been gearing down normal functions of town government and gearing up emergency functions of town government. And as we go forward, it'll be relatively more stable information from day to day, but you can go there every single afternoon and see an update. Anything that is new today is highlighted in yellow, so it jumps right off the page. And then there'll continue to be the summaries of what's happening. And we've divided it into emergency services and non-emergency and administrative support services. So welcome to any input that we might receive from the community about ways in which this could be enhanced, things that might make it even better. But our purpose in establishing it over the last couple of days has been to make sure that there is one site here in town provided by town government that's available for people to go to and know they can rely on that as being accurate information. From today's update, posted a couple of hours ago, back at 2:45 today, the main information I want to share, there's a couple of new developments today. We made a decision earlier today to suspend parking enforcement for the foreseeable future. So until further notice is a term we're going to be really familiar with here, because there's just no way of knowing, whether this is a weeks-long or months-long situation we're going to be dealing with. We know it's going to be a marathon and not a sprint. And so so we're using just, the things that we're suspending from normal operations, we're just saying until further notice. We'll be really transparent and use our community megaphone to make sure that we push out loudly into the community when things are gearing back up to something more normal. But parking enforcement is something we decided today to discontinue until further notice. By tomorrow, the equipment out there will actually be showing people that parking is free. But in the meantime, earlier today, we stopped patrolling for parking and issuing tickets. And there's a separate news release that's out that I won't go further into the details of that right now, but that describes how we will still continue to enforce for things that aren't about timed parking, but are about things like not parking by hydrants and safety issues like that. So anyway, there's details about that that'll be coming out to the community, hopefully in the media tomorrow. And then we also have effective tomorrow morning, so basically effective immediately since the offices are closed for today, we won't be selling pay-as-you-throw bags individually anymore at the Gibson Aiken Center and here at the Treasurer's office in the Municipal Center. And the reason we won't be doing that is because all of our town facilities will be closed to the public beginning tomorrow morning. Many places actually closed yesterday based on the additional reduced numbers, the advice that's coming from the health experts about how many people should gather in a particular place. We didn't do that because we had this meeting tonight and we didn't want there to be confusion about whether or not the building would be open for people to come. So we made Wednesday morning the effective time of our closing of all of our public facilities. But they will be closed until further notice. Town government will go on. We're inviting people, please, to remain in touch with us for the things you need from us, by mail, by phone, by email. There are ways in which we will still be providing services from town facilities, but the public won't be able to come into town facilities in order to, again, just reduce the risk and hopefully help to flatten the curve of the spread of the virus. Because of that, the town has always maintained these two locations where we sell individual bags so people don't have to go to a retail establishment and buy them 5 at a time. For the time being, we just won't be able to offer that service. That's going to be something where people will need to go to the retail establishments. The retail establishments will still be selling the bags, and they can be purchased in packets of 5. Beyond that, reminders from today. So those are the two things that were new today. Tomorrow, as I said, is when the closures go into full effect. Just a couple of reminders that have been in this report for the last couple of days, but for people who may not have been reading it, we want you to know that dispatch is now screening every call that comes in for potential COVID-19 implications so that word can be transferred out to the first responders about how to put the special procedures into place when necessary to protect themselves and the broader public when dealing with a case that might be COVID-19. And as the first responders arrive at any of these calls where there is potential hazard, they're going to go into a home and they don't know for sure exactly what they're encountering. They're doing what they call doorway assessments. Upon arrival, they're making sure that they have a better understanding of who needs what kind of help and what the experience of that household has been related to this virus. On non-emergency and administrative support functions, a couple of highlights. There's quite a lot more information in this daily update that we're putting out, so I'd urge people to go and take a look at that. But a couple of highlights that we thought people should be aware of are that the water treatment plant and the wastewater treatment facilities are both operating under special procedures that have been established in close communication with health authorities and the regulatory authorities at the state. It takes very specialized skills and training to operate these facilities, and obviously they are critically important to community health, to have the water plant continue to function effectively, providing the clean and potable water for us, and then wastewater treatment on the outflow side. And so we're making sure that the relatively small teams in a small community like ours are healthy, but based on how we're rotating shifts and how we're also communicating with other providers and with the state to make sure that backup resources are available should that become necessary. There'll be ways in which communities are collaborating throughout this, actually, in all different kinds of functions, in ways that we see often in mutual aid for public safety, less often in municipal collaboration around non-emergency services. We'll see more of it as we deal with COVID-19. So we wanted to reassure everybody that special actions have been taken to protect the functioning of the water treatment operation and the wastewater treatment operation. And then on the enrichment side, as opposed to the basic services side, both the library and the recreation and parks programming are closed, unfortunately. It's just not safe for us to be inviting people to come together for the purposes that those important institutions provide. The Recreation and Parks Department is still taking registration online and by mail. And the library is providing services, takeout services. So if you communicate with the library and you reserve a book or some other resource they have available, someone will come out and meet you at the door to hand it to you so that people can still at least borrow from the library. Everything's being really thoroughly cleaned, obviously, in between uses. But the institutions themselves, the buildings and the activities that go on that are so vital to our community life are closed until further notice. We are communicating, town officials are, in a variety of ways, select board members, staff members, with various people and organizations in the community around how they're coping with this, and different levels of support that are being provided in all different kinds of ways in our community. Some people have just organically created new networks of folks that are helping to support one another through this. And then there's also sort of reliable institutions in our community that have been set up to provide a safety net and support for various types of individuals and organizations, and those are obviously in place in a very active way, and the town government is interacting and supporting those efforts, and trying to make sure that needs that go far beyond our normal sort of community needs are being met. We also have canceled until further notice any meeting of a town board, committee, or commission other than this select board and the action that this select board will be taking later this evening regarding representative town meeting. So representative town meeting hasn't been officially canceled, but it will need to be because of the prohibition of having a gathering of anything more than 50 people. The board will be taking that official action this evening. And then for the time being, until further notice, the select board meetings will be the only meetings of public meetings of town boards that will be ongoing. These are necessary, obviously, in order to keep the business of government operational through these extraordinary times. As we come up with ways to provide electronic access to the public and potentially for electronic functioning of the members of boards and commissions, then there will be a ramping back up of the operations of those groups as well. But at this time, for the foreseeable future, for this moment, it's just the select board. I'd like to ask Mike Bacassi to come up and speak to the emergency service delivery and to the supplemental community services that are being activated through the fire department and other town services. And before Mike speaks, I just want to make something really clear to the community that is clear and very appreciated to all of us on the town team. While you know him as the fire chief, we know him that way too, but also as the town's emergency management director, and that's usually a really quiet role that has to do with a lot of planning and sometimes some training. At this moment in time and extraordinary moments like this, we look to Mike for the leadership that he provides and is providing related to COVID-19 to make sure that in a broader than normal way, our emergency services are delivered to the community to meet the high demands of such extraordinary circumstances. So thank you, Mike, for the incredible job you're doing, and please inform us about what that entails on the emergency side.
Thank you. Though I've got to say this hasn't come without a lot of help from outside agencies and within my own department. Assistant Chief Howard's been a huge help. BMH and Rescue Inc. both have had a lot of input into what's happening in the town. I hope to give you that broad perspective of what is going on in town. I really don't want to get down into the weeds. Things are changing very, very rapidly. I sent the town manager our town situational report at about 2 o'clock, and at 3 o'clock the first update came out from the state, and things are different already. From 1 o'clock to 3 o'clock, things have changed a lot. On the local side, for the local update, I'm glad to say, and I think this is very important, that we have no known cases of COVID-19 in Brattleboro. Though we may not know about them if it happens, usually we pick up on it, but right now there's absolutely no sign that it's in town as far as patients. Local EMS we've responded to several cases that sounded good, if you will, sounded very close to the symptoms. They've all proved negative. A plan's being developed to get out to the elderly and to the medically compromised. These are the high-risk groups for this virus. Assistant Chief Howard is leading that program. He's developing a plan and an outreach to see what we can do to help them. A lot of them I'm sure we're gonna see down the road, they're afraid to go out, and we want to be there to help that group to get the needs that that they need, such as medicines, even groceries. If we need to figure out a way to get them food, we'll make it happen. There's a group that's being pulled together, led by Rihanna from Groundworks. It's being called the Homeless Response Team. Our first meeting was Monday. What's today? Yeah. Was yesterday, and
it was like a week ago.
Yeah. That's going to be it's going to be a grassroots group, I think, led by Rihanna and Groundworks. So far, I think that's been our speed bump in all of this, is that we're having some issues pulling the plans together for that. But we're starting to get some leads on how we can work through that, and I think that hopefully by this time tomorrow we'll have a better direction on where that's all going. Some of the municipal actions that I've kind of highlighted, being very cautious not to speak for all the other emergency departments, but yet to give a broad statement that there has been no interruption in emergency response in this town. We have taken steps to minimize exposure of our staffs to, if you will, to the public. We're trying to minimize the social gatherings, the social contact. Some of the things that we're doing to help as a reach out, as of this morning, it's all been confirmed. We're using both fire stations starting tomorrow as distribution points for the school lunch program. They're going to be set up. Lunches will be brought in and handed out from both fire stations by the school district with the help of staff. Captain Emery is doing the organizing with the school district on that program, and all three captains on the days they're on duty will oversee it. BCTV has graciously given us remote access to their software, and we are now putting informational messages and a scrolling banner on both of their channels to keep the public informed of information they may need to reach out to different agencies, where they can get help, and obviously emergency messages that may come up. So like I said, the emergency services, there's no interruptions. We're operating normally. There's been some adjustments. Some of the support service functions, if you will, inspections on the police side, car unlocks, VIN checks, all of that stuff has been suspended for now. And dispatch, as the town manager said, they're screening every single call now that comes into dispatch. They're screening for COVID. And the reason for that is because a couple of times now we've kind of had a scare where a call's come in a different way. EMS has got there, and in talking to the patient, they actually screened very close to COVID symptoms. So we've decided every single call will get screened, and that's why we're doing the doorway assessments when it's not life-threatening. All of the essential services, if you will, either have or they're presently working on staffing plans for continuity of operations. So if a majority of our staff goes down, we have backup plans to keep all of those services not only staffed safely but operational. Brattleboro Memorial Hospital has taken several steps during this. They have now activated their ELC and put their incident command system in place. They are doing drive-up testing, and that's being done as an outpatient service, and only when it's ordered by a patient's primary care physician. So you can't drive up and just request a test. It needs to be ordered by the doctor. And as of about 3 o'clock this afternoon, they've administered approximately 75 tests. Access to the hospital has been limited to the main entrance of the hospital and the ER. Everything else has been locked up. At the front ER entry, all people going into the ER are being screened. And if they screen positive for possible COVID, then they're sent back around to the outside of the building, to the emergency ambulance docks, where they've got the testing set up there before they're allowed into the hospital. And then there's a lot of other safety steps. One of the big things that I learned today, BMH now has an agreement with Grace Cottage to handle overflow. So if this really blows up in our faces, and I hope I can explain this right so it's not confusing. The simplest way to explain this is that BMH is going to keep all of the COVID patients here in Brattleboro. All of the inpatients, for whatever reason, are going to go to Grace Cottage. And the reason for that is because BMH has the abilities to draw negative pressure on 2 of their ER rooms, and then a good portion of the second floor can be pulled into negative pressure, which will contain the virus there. Rescue Inc. has taken a lot of the same steps we have. Their quarters is closed to the public. All of their on-site classes have been canceled. Obviously, they've implemented a lot of infection control measures, and like us, they're limiting the number of providers that are coming in contact with a patient that screens positive. Some of the numbers, I'm sure, do you have this update in front of you? I don't know if you had a chance to look at it. No, Peter says. As of 1 o'clock this afternoon, the count in Vermont has gone up to 10 cases that have tested positive. and at 1 o'clock they had 4 non-residents that had tested positive. We're now up to 7 as of just before I came here. Some of those non-residents are being isolated in Vermont homes, and others have gone back to their main home. In the United States, very quickly, total death count, if you will, is now 75 people, which is up from 68 from the last. One of the things I would say we keep hitting a speed bump on, and we're working very hard on this one because it's going to take a little bit of planning, is the isolation, monitoring, and quarantine of the homeless if they get sick or are exposed to the virus. We're working on sites and how to staff those sites. We've been in contact with the state. Rihanna's reached out to a lot of private entities, and we still have a couple to contact, and hopefully we'll get some of that solved tomorrow. I don't know if you want to say any more on that, Rihanna, or?
I'm happy to, and I know we're speaking a little later, so.
I think it would be fine. Yeah. If you'd like to say a couple words on that subject. I have a feeling maybe there might be a couple other questions, and it's all related to.
Okay.
Yeah.
So speak now versus later.
Sure, if you don't mind. Thank you.
I'm Rihanna from Groundworks. So to kind of sum up all of our programs as a whole, we moved last week to start restricting out external visitors into our programs and started making lots of changes rapidly. Over the weekend, we were one of the homeless shelters identified. There's 4 areas across the state based on the capacity and the number of folks that we serve that were identified as high risk. And so we started moving folks from our spaces who are identified as hyper vulnerable, so over the age of 60 or experiencing underlying medical conditions, to motel rooms where they could isolate if need be. I do want to emphasize that no one in our programs are sick or showing any signs of symptoms at the moment. So we moved folks out of our programs to reduce the number of people so we could align with state guidance that we're receiving about how many folks we should be serving in our programs and precautions that we can take. Things like making sure in our year-round shelter that folks can have individual bedrooms as much as possible should people get sick, and that we're protecting those who are most at risk. Changes as of today, we closed the drop-in center and moved to the seasonal overflow shelter, where we're now running that shelter 24/7 in order to reduce the number of sites that we have, to make sure that we are staying fully staffed as things continue to change, and to cut down on the transportation back and forth. So our shelters, folks are moving in and out of, but in kind of greatly reduced amounts, so that we're trying to have folks have less contact with the community at large and lower the risk that way. One of the pieces to Chief Bucassi's point is that we convened a homeless response team. There is also a statewide homeless response task force that we are connected to, and I am the liaison to that group and then to the community at large. Out of that group, we have a number of committees, so working on general communications to try to streamline information and the delivery of that information to the community at large. A food committee working on food across the continuum from seniors down to kiddos. Our food shelf moved to a delivery-only model for its beginning this week, and so we have volunteers that we screen who are now delivering food to folks to cut down on the travel of folks and make sure everyone has food. Other committees include working on a congregate site should people get sick, what that would look like, and we're working with state partners who've given guidance around that, and working to identify a site and to ensure that we have backup staffing for all of our shelters should things start to look more dire. So lots of precautionary measures to be as safe as possible while also still operating programs and caring for folks at the same time. I think those are all the main pieces I have.
Thank you both. I actually had a question for, well, actually it could be either of you, because I think Liz and I were both lucky enough to be able to attend your first meeting, and thank you for facilitating that. I meant to bring a note, and in the rush to come here, I forgot to bring it. But there was some information passed along that I think is really important for anybody who doesn't have a primary care provider, which is a shockingly large number. I don't know the number, but a lot of people out there fall through the cracks of having a PCP. And without the PCP, it's sometimes questionable whether you can get the test approved. Do you happen to have that? There's a number that people can call?
Yes, so there's a couple of pieces, which reminds me of the other piece. In terms of volunteer management, we're really working to streamline volunteers, not just related to folks who are struggling with homelessness, for the community at large. And so Jen Jacobs has a great survey with a team of folks that she's put together. We have a volunteer management committee, and we're really trying to direct people to that survey, both to express if they can volunteer and also for community members in need of support, regardless of what that support need is, to that one central place, and then working on how information is shared from there.
Excuse me for interrupting you, but right there, while folks are paying attention to that point, I want to say that a link to that survey is in the information for individuals and families on the town's website. So if folks want to participate in that, either offering services or if folks need services, they can access that survey by going to the town site. Thank you.
Thank you.
Another thing I wanted to add was that so many of the volunteers for Meals on Wheels and so forth are over 60 now. And so you're looking for people who are under 60.
Yep, so we're screening volunteers out, much as we love and appreciate them. Our volunteer population at large in our community is largely in the at-risk population, so over 60 are struggling with underlying medical needs. And so we're asking those folks to please stay at home and let us help care for them, and asking younger folks who may have more time and capacity to step into those roles. And so that's part of the screening process that we're using, and additional processes to make sure we're not kind of furthering potential spread of how volunteers are dropping off and those sorts of things. To Tim's point, the piece around medical care is that VMH offers access to their team of providers, so through all of their practices, through the centralized scheduling department. I could look up the direct number for that, but
I have the number.
Thank you.
Oh, wonderful.
It's 251-8777.
Yes. So folks can call to access getting a primary care provider set up. Typically that comes with a pretty lengthy application. In the meantime, folks without a primary care provider can call, get connected to an acute care visit if needed, or get advice about what next steps they should take if they are exhibiting symptoms, rather than showing up at the emergency department. And if folks are struggling with needing health insurance or getting connected to a PCP, connecting with us at Groundworks, we can help get them out to the right person or provide that support directly to folks.
Thank you. And thank you for all your work on your end around this. It's been great. And also I wanted to say happy birthday, because I happen to know that you're...
Thank you. Strangest birthday of all time.
Yeah.
I'll look forward to celebrating next year.
Well, try to all celebrate with you when we're through this next year. Mike, do you have more to add? Thank you for that.
That's the short story of a whole lot of information that is constantly changing. I'll go out on a limb here, and I'll say that I feel good about where we are right now as far as our planning in the town government and for the town itself. Department-wise, the only fear I have is protective equipment. But we haven't used a whole lot yet. I think we're going to, and there's truly a shortage out there. The state has requested surplus from the national stockpile, but I think that their priority is going to be for the hospitals, understandably. So we're just going to do our best, and we'll figure it out going along.
Thank you.
You're welcome.
Yeah, it's always tough. We've been getting, the select board has been getting all of these pieces of information, and just to bring it all together and decide what's important, what's not important can be difficult. So thank you, Mike.
couple of things to finish
Yeah,
up.
I'll pass it back to you.
Thank you. Yeah. So I just wanted to mention one quick thing that segues from the description about the supplemental community services that we've just been discussing, and then hit a couple of other very specific pieces of this that are of great concern to a lot of folks in the community, and I've had a lot of inquiries about. The one additional tidbit is one of the services that has changed but is still being provided is the senior meals. And so while the senior center has to be closed for obvious reasons, for the protection of the clients there, and because it's part of the town facilities that are closed overall, still the service is being provided both through takeout and some delivery of the meals. And today they had a total of over 125 meals. So the folks who are making that program happen are still making it happen in a way that's having a significant positive impact for some of the most highly at-risk people in our community. And then two additional things I wanted to address are the concerns about the devastating impact that this can have for businesses in our community and every community, and the question about electronic communication, specifically as it relates to the holding of public meetings. So I want to just let folks know where we are related to those two items. The business piece is daunting. There are businesses in this community whose very existence is threatened by the magnitude of this crisis, and that's going to be true in every community across the country, which means then, the federal resources that are brought to bear and the state resources that are brought to bear around Vermont, all are going to have to factor in the fact that there is some degree to which the magnitude of the threat that this poses to our economy, and, saying it's the economy is a really sort of big amorphous thing, but when we drill down to street level in small communities and small businesses operating on a particularly small margin, the threat to real people and the fabric of our community is there. So that's a real threat, and it's not a threat that we can just mitigate in the way that we can some other aspects of this by just being smart and taking some unusual actions. But there are efforts that are underway already, recognizing that situation and knowing that there's going to be great need. Under the federal and state emergency declarations and emergency legislation that is being developed, some of it has already been acted upon. A good bit more is just in the works. At both the federal and state level, it appears that there is some help on the way, but it will at least initially be loans, not grants. And so businesses that apply for and receive that help will be taking on some additional burden as they operate into the future. But it's early in this crisis, and there's a lot of uncertainty about exactly what the details of that help from higher levels of government is going to be. In order to make sure that we at least have local businesses well informed and able to plug into the resources that will become available, the Brattleboro Development Credit Corporation, BDCC, which is the economic development agency for our region, is leading a regional effort to plug into those services. It involves the town, it involves the Chamber of Commerce, the DBA, and a variety of other organizations and local, state, and federal officials who together are trying to make sure that we have up-to-date, accurate information and are pushing that out in an effective manner to the businesses so that folks can connect to the local and state, or rather the state and federal resources that are becoming available. The big question that we're being asked is, what about local resources? Can't the town jump in to provide direct assistance to businesses here in town? And the challenge there for us is that we're so very early in a very long process, most of which we can't predict how it's going to unfold, either for individual businesses, the business community collectively, or the community more broadly. And so with the town's limited resources, making decisions literally in the first week of the full-on emergency that we're experiencing in Brattleboro. Some other places are farther along, but it's really, when you think about a week ago, Wednesday night, 6 nights ago, we were at Academy School holding the information meeting for town meeting. We knew that it was only a matter of time. We knew this thing was coming, but it's really in those last 6 days and more in the last 4 days or so that it is just suddenly, the world upside down for us. And so being this early in this process makes it difficult for the town to make concrete decisions of applying the limited resources that we have to do this or to do that. And so we have taken some limited action. There's another proposal that we have before the select board this evening related to some direct things that we can do because of ongoing relationships we have with certain businesses where the town has provided funding to assist those businesses in either starting up or expanding. But in the broader perspective, what we're trying to do is be a constructive part of the communication right now to help businesses access the help that is going to become available through the federal government and the state government. And then over time, see, in the broader context of everything that's going to need to be done for the health, safety, and welfare of the whole community, what resources the town may be able to provide in specific ways further down the road in this emergency to local businesses. So those will be things that will definitely be still interacting with the business community around, and the select board certainly will be considering as we go forward. On the electronic communications piece, we've had a lot of communication from folks. I know there's a level of frustration for some people in the community tonight, so if you're one of those people and you're listening on BCTV right now, I say to you, I understand that there are tools available where people can plug into a meeting like this remotely, and I want to make really clear why the town has moved cautiously in implementing those tools. So while there's a variety of different ways, some of them really powerful to connect people individually and in private meetings and organizations, those don't involve, those connections don't involve the open meetings law. We've got an obligation to make sure that we hold public meetings where we're doing the public's business in a manner that complies with Vermont's open meetings law, not just because that's the right thing to do, and government should set the right example by following all of the rules that are applicable to us, just as we expect people in the community to follow the rules that we make, but also specifically because the intent of that rule is to make sure that our public decision-making processes are open and fair, and that people in the community have an opportunity, an equal opportunity to participate. And our great concern is that for meetings of the magnitude that we hold with that special public obligation, we need to be sure that we can honor the letter of the law as it relates to the open meetings law. But we also need to be sure that the tool we use actually can allow for a manageable meeting, that the person who's in charge of calling on people can be calling on people in an orderly manner so that everyone has a fair opportunity to participate. And so that the decision makers actually all are equally participating, hearing everything that's being said, and in a position where their votes can be counted. So there may come a time as this evolves where even the decision-making participants of the meeting are remote. But as of right now, Vermont law requires that public meetings be held in a physical location. It does allow that those meetings in a physical location can allow people to connect in remotely. And we are actively researching the tools that are available to allow people to connect in remotely, so that by the time we actually commit to one, we have a very high level of confidence it won't lead to chaos, but rather will lead to orderly, constructive community participation in the meetings. So for tonight, we did this the old-fashioned way, and thank you to those of you who have come. To those of you who felt you had to stay home, we totally understand that. We hope that as soon as 3 weeks from tonight, when the next regularly scheduled select board meeting is on the calendar for April 7th, that by that time and maybe sooner, we'll be in a position where we know what tool we will use to allow for remote communication into these meetings, so that we can make sure that it is easier and safer for people to participate.
Thank you.
Having said all of that, we have 3 actions that we are asking the select board to take tonight, and then a 4th that we want to make sure is understood to be available to the board. One of these will require action as water and sewer commissioners, so I'm going to speak to the first 2 and the catch-all item. And then when your water and sewer commissioners here in a few minutes, we can address the other recommendation. Staff is recommending the cancellation of the representative town meeting scheduled for Saturday, March 21st, because of the fact that it would violate, and aside from the fact that it's just, I think, common sense at this point, given the necessity of social distancing, it actually would violate the governor's order at this point that no public gatherings exceed a maximum of 50 people. So we'd ask that you take that official action. Our plan will be, if you do agree with this way of moving forward, we can't be sure that we would be able to hold a representative town meeting by May 9th, but obviously we will need to hold one as soon as we are able to hold one safely and in accordance with the emergency regulations. And so if the situation improves quickly enough that we're able to hold a representative town meeting on May 9th, we think you should. And the reason for that is beyond May 9th, there are technical details I don't think we need to go into tonight, but related to the town's own obligation under our charter and our statutory obligation, where there's timeframes after town meeting acts when certain things are appealable. And in order to now allow enough time for those other processes to play out if necessary, May 9th would be the last time we could hold a representative town meeting this year and still have those other processes be completed by the beginning of the new fiscal year on July 1st. So we can go deeper into those weeds when you're actually having to make a decision about warning the town meeting. What we want to do is just make sure that the community is aware. We're keenly looking at those deadlines and at holding the representative town meeting at the first opportunity. But for now, because we don't really know when that opportunity will be, we think you should just cancel Saturday's meeting. And we are hopeful that the circumstances will be appropriate, that we can bring you a warning for the April 7th meeting, which would give the proper more than 30 and less than 40 days notice for a May 9th representative town meeting.
Did you want to go through these recommendations?
Absolutely.
Totally, because I would love to hit the pause button, just make sure that everybody here has a chance to ask any questions, make sure the fellow board members have
That's a good point.
So if you want to just outline for us, and then we'll just take it all as just a open question period.
Sure. So the second action we're asking for is that you authorize that recipients of small business assistant program loans from the town's program income be allowed to defer their loan payments until further notice. So this is one of those actions I mentioned in my comments earlier where because we are the maker of the loan, it's a action that is readily available to us, that doesn't involve creating some kind of new program of the town or a commitment to one segment of the community at the expense of another segment of the community. We have these loans out, we're going to be repaid. One of the ways in which we can actually increase the likelihood of being repaid is to help the businesses stay afloat, but more practically, because every business is going to be stressed by this, we think that this is low-hanging fruit and the appropriate thing for the town to do. And we're just asking that it be until further notice for the same reason as everything else is until further notice. We can't reasonably predict a time when it will be appropriate to bring the monthly payments of these loans back into action. We will work through this with those businesses and with you and bring that action back to you at an appropriate time. For tonight, we're asking that you just act to allow the recipients to cease paying on those loans until further notice. When you are water and sewer commissioners in a few minutes, we're going to ask that you suspend until further notice the shutoff of water service as a consequence of non-payment of utility fees. As a matter of fairness, it's one of the harder things we do in town government. It doesn't give anyone any pleasure to ever shut off water to a household or a business. But as a matter of fairness to all the ratepayers, we have to have requirements to pay or else the service ceases. There are ways in which folks can go onto payment plans and extend the time to get back in good standing. But when those fail, we have procedures for warning folks that there's going to be a shut off and then actually shutting off the water. We believe that in these extraordinary times, especially where hygiene is central to the community's well-being, but more generally just when there's going to be folks struggling economically in lots of different ways for lots of different reasons throughout the community, we believe the appropriate thing to do is to suspend any shutting off of water service until further notice. And the last action that we are not proposing, but sort of making sure is known, the select board members certainly know their role within the community. We just wanted to make sure that in these times when things are moving and changing so fast and there's a lot of action, a lot of decisions being made, under the declaration of emergency by Governor Scott, the town as a subdivision of the state is exercising some power to make decisions and take actions that are outside of the normal boundaries of our day-to-day operations. And so it's important in the oversight role that the select board has over town government that we make sure that it's clear that if you choose to provide any other direction as a select board to me and the town staff regarding modifying or adding to any of the emergency actions staff has taken, that we appreciate receiving that from you this evening.
Thank you so much.
Thank you.
So that was a lot, but this is in the spirit of how everything's moving these days. A lot happens all at once. So I just to first open it up, I guess, to select board comment on any of the points of our COVID-19 update we just heard from Peter and Mike and Rihanna.
You go.
Now I got a list. Yeah, so as has already been said, you know, a lot has happened in the last several days, and it feels like a long time since we sat here, and it's kind of a different world right now. I'm really, really appreciative of all of the town staff for all the work that they're doing right now, in particular to our emergency management team. So I really appreciate the work that's happening. In the community, there are mutual aid efforts going on. Jennifer Jacobs's kind of one was referred to earlier, and just to reiterate what Peter was saying, there's a link on the town website for folks to sign up. So that's like volunteering to provide services to folks in the community. And also, you know, there's a way to communicate needs as well. And I would imagine that the fire department, through the work that they've been doing already, is kind of collecting kind of needs from folks through their non-emergency phone number. Is that right, Lenny? Yeah. And so, you know, it's uncomfortable maybe to say I have a need. I delivered some food for some people yesterday, and they were really grateful. And it was also, you know, it was a kind of an intense moment. And I think it's important that people feel okay to let folks know what their needs are, and there's many people in this community that are ready to step up and help out in whatever way they can. So I just want to kind of shine a light on that. The library, you know, is a really important resource in our community, and closing the library is not just about people losing access to reading material as easily as they would have had before. You know, it's also a place where people gather for meetings, but also gather for shelter. And so I'm pretty concerned about how that will impact folks' ability to stay warm, to stay safe. And I think that Rihanna already kind of spoke a little bit to some of the work that's happening there, so I'm really grateful for that. I guess one thing I wanted to kind of flag about the library is, you know, they're doing this takeout book service, and they also have online resources that you can access from your home if you have the internet using your library card. So if you don't have a New York Times subscription, that's fine. You can access it through the library website. They also have a subscription to the Reformer. There are websites where folks can do, you know, homeschooling and whatnot. So I just wanted to make sure people know about that. And then the other things I wanted to say are kind of questions, and some of them might not be answered in this room. I am really concerned about the economic impact of people being laid off from work or having their hours reduced by their work. Those people who are paid employees have recourse, in the most part, I believe, to unemployment insurance. The state has been making some pretty swift changes about unemployment insurance right now. So you can call and you can get in the process of applying for unemployment insurance if that's something that is available to you. And folks should not feel shy about that. I'm pretty concerned about people who aren't eligible for unemployment insurance, but who are losing access to their livelihood. So people who own their own business. We've already kind of talked a little bit about like what will the town's role be, and I know that we don't want to make any hard decisions right now, but I'm wondering what our community will look like in a few months' time after all this hopefully passes as easily as possible. And I hope that we can stay open to being flexible and nimble about our use of town funds to support people in those situations that don't have access to unemployment insurance. I want the BDCC to step up right now and support our local businesses in ways that go beyond just words. I want our state government to do the same thing. And obviously I want our federal government to do the same thing. I have a couple of concerns about vulnerable populations. So you mentioned already about the senior meals program, and I'm glad that that's continuing. I was concerned about that. I know that the fire department has been collecting information months back about folks that aren't able to leave their home as easily with mobility issues. And I hope that we'll continue to check in on those folks and make sure that they're getting what they need. And immunocompromised people in our community are obviously at great risk right now. I work next door to the AIDS Project, and I know that they're continuing to provide services. They also had a lot of people come into their office yesterday who really shouldn't have been coming there. That it would be safer for them to stay home. So I hope that as a community, we will support organizations that are providing meals to seniors, that are helping those with disabilities and those who are immunocompromised to continue to deliver those services, and maybe to even increase those services at this time. And then the other population that I'm concerned about, those people that need to be accessing a medically assisted treatment program like those offered by Habit Opco. Those folks are required to go to that site on a daily basis, and you can correct me if I get this wrong, please. And I hope that Habit Opco will step up and make services available for people to take home rather than putting themselves in harm's way. And then the FoodWorks delivery service that you all are doing right now, I participated a little bit in that yesterday, and that's another thing that people should plug into if they can. Final thing I want to say that's about our town business. We talked about not proceeding with any water shutoffs for non-payment, and we talked about deferring small business assistance program loans. I wonder if there are other ways in which we can make it as easy for people right now. So if there are fines for like a late payment of a water and sewer bill, or a fine for late payment of taxes, if we could consider waiving those at this time. If there are other fees or anything that we are charging because of some kind of delinquency, that this might be a good moment to waive that. I'm glad that we're doing the shut off moratorium, I guess, and the free parking. And I want to encourage people to be reasonable about the free parking, right? Folks need to have access, and this isn't a time to just stick your car there and forget about it, and so be nice to each other. It's a crazy time right now, and I'm really hopeful that we will get through it unscathed as much as we can. You want to talk about evictions?
I think you just
Yeah, I'll talk about evictions. So I don't think that the town of Brattleboro has a role in pausing evictions. Bob, maybe you can speak to that. My understanding is that the state of New Hampshire passed an executive order yesterday that pauses all evictions in that state. And I would like to think that the state of Vermont can follow New Hampshire's lead in that regard.
That would have to come from the legislature on that, as the town does not control the law with respect to evictions. But certainly the legislature could take such an action when they reconvene.
Okay. All right, I said my piece.
Okay. Well, I just want to say I'm grateful for all the work that's been done and all the information and everything from going to the website to calling your neighbor are all examples of community, and that's what we're here for, to care for each other. I'm in favor of all these motions, and thank you all very much.
Is anyone out there in our physical audience at the time who would like to speak to any of these discussed motions and ideas and information? Kate? Please let us know who you are.
I know the general. I'm Kate O'Connor. I'm from Brattleboro, and tonight I'm here on behalf of the Brattleboro Area Chamber of Commerce. And first, I do want to say thanks to the town for giving out concise, real, true information. Your website is great, and if there's anything that the chamber can do to help push out any information, we will do it. We're trying to send out a regular newsletter. We tweet and Facebook and everything. So if there's something that we can do for you, let us know.
Thank you.
And I do appreciate Peter's comments and Daniel's comments about the business community. And that's why I wanted to, come here tonight and just stress and make sure you folks are aware of the anxiety that a lot of the businesses are feeling. As we know, bars and restaurants are closed, and the people that worked at those bars and restaurants are no longer employed. There are also theaters and other performance venues that are closed, and the people that are there aren't taking in a paycheck in most cases. The majority of the businesses in our town are small businesses, which means it's not just sometimes the employee is the owner, which puts an added strain. We've heard from multitude, or whatever the right adjective is, of businesses that they're not closed right now, but if they sell a product that people aren't buying because they either can't come out of their house or they don't have the money to purchase the product anymore, they're about to face laying people off and possible either temporary closure or permanent closure. So what I think we would like, and I was on the call today with the Brattleboro Development Credit Corp, and Peter and Patrick were on it too, and I can tell you, Daniel, I think that BDCC is stepping up. They've not only got Brattleboro involved, because they're a regional economic development organization, and they put all of us, the Downtown Alliance was on the call, the town of Brattleboro was on the call, the Brattleboro Chamber was on the call, as were representatives from Wilmington and Bellows Falls and Wyndham Regional Commission. And the problem that I think we're all having right now is there's so much information that's coming from so many places, and you turn on the TV and now there's going to $1 trillion from Congress. Hopefully that will pass and get somewhere. But I think what would be helpful from the Chamber's perspective, and I suspect from the Downtown Brattleboro Alliance's perspective, is if we could start the conversation with the town now about what the needs of the business community are. Because as I think Peter referenced, this is something, and both of you referenced in different ways, Daniel was saying this is a need that's now, and it's also going to be a need that's 3 months from now, 6 months from now, and how many months down the way. So I'll just tell Peter maybe I could give him a call tomorrow, and possibly we could sit down and really start thinking it through now, because if we don't plan now, it's just going to, this whole thing is going to get worse for everybody. But if we can know what the end game or what our midpoint game is, working with the business community, it may alleviate a lot of the stress that people are feeling at this particular moment. So I appreciate your comments, and we'd love to work together and start working now. And, you know, I'll reiterate, if there's anything that the chamber can do to help the town, I tweeted out about free parking, you know, anything like that that is just helpful, we will do it. And I say that to Groundworks and anybody that's listening. If there's something that they need people to know and the chamber can help amplify that message, we will be there to do it.
Thank you.
So I'll call you tomorrow.
Good.
Mic drop.
I should have been the one that knows not to do that.
Anyone else would like to say anything about that big package of information and ideas just then? No? I think I just wanted to say that it feels like at the moment nothing that we have control over, which is a lot of people need to understand we have limited control in some areas and limited abilities in some areas. But I don't think anything that we have control over is off the table. We want to be talking about this stuff to the business community and our vulnerable populations and everybody who just is trying to survive this. That's the thing. I mean, I've talked to several business owners of restaurants today, actually, and they let me know that they're all sending out info via social media, whatever, personal appeals to support, if you can still afford to support your local restaurants through takeout, if they're still offering it, please do, because it's going to be a lifeline to get them through this time, hopefully. But even with that support, it's probably, some of them won't be able to hold out too long. So we hear this. That's all I wanted to say. So with this big list that we have, I think one of the easy decisions at the moment is maybe considering RTM. So I would entertain a motion for that portion of our recent discussion. Anybody want to?
Okay, Tim.
Thank you.
I move to cancel the representative town meeting scheduled for March 21st, 2020 at 8:30 a.m.
All right. Liz, this feels like a big thing. You know, it really is.
It is a big thing.
But it's something we have to do. If there's no other commentary on that, we have a motion to cancel representative town meetings, which is scheduled for March 21st. This is this coming Saturday at 8:30 a.m., which now seems completely impossible. All those in favor?
Aye.
Aye. And that's 3-0. Jan? I would entertain a motion concerning our small business assistance loan program.
I guess I'll do that one. I move to allow recipients of small business assistance program loans to defer loan payments until further notice.
All right, Daniel has made a motion to allow small business assistance loan program participants to defer their loan payments until further notice. All those in favor?
Aye.
Aye. And that's 3-0 as well. Does anyone feel the move that we should go ahead and make any other further motions amongst the board at this time, recognizing that it is very early in the landscape? So I think that's one of the things that I really am feeling right now. Things are moving so fast as far as the federal and the state support. We're not sure what we would be supporting or not supporting, but I think very soon we'll have a clearer picture of that. So, great. So that sort of does it with this COVID-19 section. Thanks for your patience, those of you who are here for other items. And our next item, item B, has to be postponed because we don't have...
We're going to go back to... yeah, we need to go back to water and sewer.
Oh, I'm sorry. Yes, I'm leaping ahead. We're going back to water and sewer commissioners. So do I have a motion to convene as water and sewer commissioners?
So moved.
All those in favor?
Aye.
Aye. Okay. We are now water and sewer commissioners, and we have a couple of items that we need to consider.
Yeah, I think if it's okay with the board, I'd like to see you take action on the suspension of the shutoffs, because we've talked a lot about that already, and then we can move into the one item that had been agended for tonight.
Indeed. Indeed, and whose turn
Shall
is
I
it?
make a motion?
Certainly, thank you, Liz.
I move to suspend until further notice the shut-off of water service as a consequence for non-payment of utility fees.
Thank you. Liz has made a motion to suspend until further notice the shut-off of water service as a consequence for non-payment of utility fees. All those in favor?
Aye.
Aye. That's
Thank you.
3-0. Thank you.
So the item that had been agenda for tonight is a routine purchase of an important piece of equipment that likely will cause a smile and maybe giggles. It's a sewer rotter. And a sewer rotter, as you might imagine by its name, is used to clear clogged sewer lines. We've all seen plumbers use those in our homes, I expect. I certainly have seen that in my home. But this is a sort of industrial-sized, industrial-strength sewer rotter that the utilities department uses when there are roots growing into sewer lines in town and other kinds of blockages. So the rotter that we had is worn out. We went out to bid to purchase a new one. And actually, I should correct that for the record. Rather than actually bidding it, we used a membership system that does collective bidding on behalf of lots of utilities that we belong to, called Sourcewell. And using that Sourcewell membership for the procurement of this, we have identified the rotter that we need be provided by J.F. McDermott Corporation, and the cost would be $61,824.16. We recommend your approval.
All right. And so we're a little bit over the budgeted purchase.
$60,000 was budgeted, slightly over that. But we would still recommend $1,800 extra to buy the right piece of equipment that's needed. We recommend your approval. Okay. The fund has money to cover it.
Comments, questions, anybody?
Nope. I'll just note that it really isn't over budget because they had anticipated selling back their old equipment and it was apparently worthless.
So that means there's like an old sewer rotter kicking around that you can take home.
Or bring into the parade on July 4th.
July 4th. Sure.
Order option.
We can
How many
only
people
hope.
would be required to carry that?
I think the Strolling the Heifers that's sooner.
We could gift it. We could gift it. Okay.
Yeah.
Enough. Well, I guess I would take a motion if anyone is
I'd love to make
so
a motion.
moved.
I am moving to approve the purchase of a sewer rotter in the amount of $61,824.16 from J.F. McDermott Corporation.
Thank you, Daniel. You have moved to approve a purchase of a sewer rotter. All those in favor?
Aye.
Aye. That's 3-0. Great, thank you. Now I think I can say that item B on the agenda is going to be...
Should we adjourn this meeting?
Oh gosh, Daniel, thank you. Jan was about to yell at me. May we adjourn?
Please.
Okay.
I move that we adjourn as a water and sewer
The 3
commissioners.
really throws us off.
And I'm
sorry.
sitting in a whole different wing over here.
I know, she's on the wrong
I
side.
don't have my buddy.
Okay, all those in favor of adjourning as water and sewer commissioners?
Aye.
Aye.
All right, now we have shed that burden. And now, can I say that item B is going to be postponed for the amusement of our audience due to, just complications. Item C is something that many of us up here and many of us in our community are very excited about. I'm not going to tell you what it is because...
See if you can guess by looking at who's coming to the table.
Yes. All 3 of you could come up.
So, good evening.
Good evening.
Trying to calibrate my excitement here.
We need something exciting.
Yeah, that's right, in light of all that's going on in the community. But this is a very exciting time for the department and the basic committee because we had a bid opening and we've been raising money for years. and years and years and years. And the time has come where I think we can put the shovel in the ground upon your approval this evening. About 13 days ago, we had bid opening for the skate park project. We received 2 bids. One bid from Parker Construction of Hardwick, Vermont, for $280,000 with deducts of $4,250. I'll go into what those deducts are in just a quick moment. And the second one was from Bernie LaRocque and Sons of Guilford for $288,800 with deducts of $4,700. The deducts are something that we can do within the department. It's seeding and loaming and planting some trees around the parking areas and around the walkways, pathways that will be leading to the skate park. When we put this out to bid, as I mentioned there, with the low bid coming in at $280,000 minus those deducts. And then we got to add some few things in because as we sat before you a few months back, we were talking about ways that we can look at the RFP and recalibrate things so that it would fit into the money that we have raised. The basic committee, prior to probably an hour ago, had raised what's in your package this evening of $279,765. Since we were sitting here this evening, we raised another $2,000. So in the last 13 days, the basic committee has raised $9,400, which is about $200 shy of what is needed to meet the contract to Parker Construction. So what I'm asking you this evening is to, there's a lot of different numbers here, numbers of the deduct, but the bottom line, what we're asking you to do is to enter into a contract with Parker Construction, and on top of that, we are asking for the board to consider $10,000 to be used towards a contingency up to $10,000 because this has taken all the money that's been raised, and nobody wants to go into a project not knowing what could happen, and we all know anything can happen at any time. So what I'm requesting of you this evening, as I said, is to enter into a contract with Parker Construction for $275,750. And we're also requesting authorization of the $10,000 to be expended from the capital fund balance if necessary.
Thank you. Jeff, do you have anything to add?
No, I'm just happy to be here. It's been a long road.
We're happy you're here too.
I'm very happy, and I know I really appreciate everybody sticking with it as their boys have become young men. They're still in the committee, so that's wonderful. And I'm glad we're all at this point.
I don't know about this skate park. I don't know. It's great. I'm glad that I get to be on the board at this time, and maybe we can all get shovels and do that whole thing.
Sure. Oh yeah.
And Josh Steele, if you're watching, ye of little faith, you said it wasn't going to happen. I said it would happen, Josh. Now look. So let's go ahead and make that motion. You got questions?
I do. I don't have any paperwork about it. We're supposed to sign something or something?
No, you're authorizing us to proceed. I'll execute the contract and we'll get started as soon as the circumstances allow.
Yeah, well, it's amazing that we're here because a lot of us have had little parts to play along the years. And back when I first joined the board, we brought it up again. John Allen and I were talking about it a lot, and we committed some town money then. And it pushed us along, and then we stepped back, 2 steps forward, 1 step back type thing. But you guys have been with it from the beginning, literally, and we so appreciate that. And my 2-year-old son, who when I I started getting involved didn't exist, or I had no idea he'd exist. He's excited about it. He's not able to say skateboard yet. But, so I think I speak for a lot of people in saying that thank you. And it's a nice moment we're having right now to focus on something positive and something we can see, hopefully in the warmer months, start to come to fruition. So thank you.
I'm ready to make a motion.
You should do it.
I move to award the bid for construction of the skate park at Living Memorial Park in the amount of $275,750 to Parker Construction, and to authorize an amount not to exceed $10,000 to be expended from the capital fund balance if necessary.
Thank you, Liz. Liz has made a motion to award the bid for the skate park at Living Memorial Park in the amount of $275,750. I almost want to say, and 15 cents, because that used to drive John Allen crazy, to Parker Construction, and to authorize an amount not to exceed $10,000 to be expended from the capital fund balance if necessary. All those in favor?
Aye.
Aye. 3-0.
Aye. Thank you very much. Guess it doesn't mean we go woo-hoo, right? Thank you very much.
Thank you. But you could keep raising money, right? I mean,
oh yeah.
Oh yeah, no
you never
problem.
know.
Don't let up on that, gas. Let's see. Oh, we have a
Cemetery there.
Exactly. I'm sorry. I expected Carol to be with us, but
yeah. Carol, we're gonna
Thank you.
all that excitement.
All of that excitement. I need to stick around.
I'm just happy that wasn't my fault for once.
That's
Thank
not
you,
like you.
Carol.
Sorry about that. I'm off my game tonight. Sorry about that.
Not at all.
Okay, so we'll go to a different type of subject. And that's cemeteries. You go from a high...
Great circle of life.
A big circle of life is right.
We're dying for both of them.
Right. Again, I apologize for my early exit. With that, we had a bid opening on March 5th for cemetery maintenance. That is for both Morningside Cemetery and Prospect Hill Cemetery. This year we received 3 bids ranging from $17,000 up to $19,985. As I've mentioned in years past, the cemetery bids are kind of unique because they fall in two different fiscal years. So there is enough money in the current year to get us through April, May, June, and then going forward to the second part of the contract. I'd recommend this evening that we move forward with awarding the contract to Independent Landscape and Property Management of Newfane, Vermont. They are a new company. I checked their references and had a lot of conversation with them about the type of work, what the expectation is, and I do feel comfortable this evening recommending to you that we go forward.
Great. Any questions?
I actually do have questions.
Excellent.
Yeah, I didn't think I was going to, but it turns out that I do. So you said, the type of work and the expectations. Can you say a little bit more about the type of work and expectations?
Yeah, what we do, we put this out to bid for, I believe there's 19 mowings over the course of the year. Includes spring cleanup, includes fall cleanup, it includes trimming of hedges at the cemeteries. And so we wanted to, we probably have close to 40 acres of cemeteries that you're maintaining. So when a lot of these people, some of their big projects are 6 and 7 acre projects. So going from a 6 or 7, your biggest projects are 6 or 7 acres to 40 acres. Part of doing my due diligence was, do you have the equipment that you can go forward and maintain that type of work? But this is mostly just mowing and trimming.
Okay.
And Prospect Hill is probably our most challenging cemetery because the equipment is getting bigger and bigger. And there's still just so much room to get between those headstones, which takes a lot of man hours to get that work done. So by the time you get to one end of the cemetery, it's time to start back over at the other side. I hope that answered your questions. If
Yeah,
not,
it does. Yeah, I have an additional one. It's kind of a sensitive question, and I'll just ask it. A community member said to me that they felt that they found a large number of needles in Morningside Cemetery. I wanted to know whether that was accurate, and if so, like what the trends are about that, and what some possible solutions are.
that's true. We do have some encampments that take place throughout our cemeteries. We work with Groundworks from time to time to help us out managing that. And so we do that. We pick them. We do see them. We pick them up and try to make the area, because a lot of people use mostly Morningside, more so Morningside than Prospect Hill for a lot of exercise. Walking the roadways and stuff. And we try to get down there as much as we can as Rec and Parks, but also that part of the contract when they are down there. And I was pretty upfront with them. I'm like, you are going to see this, and you will need to make sure that you're cleaning it up and training your staff and to do so safely under the guidelines of the Vermont Health Department.
Okay, thanks. And I'm not saying that to necessarily point blame at any place. Like, I think that people in our communities use drugs, and some of those drugs require needles. And if we had safe places for people to do that, and a plan for like where to put that refuse, then maybe we'd handle it better. So, I'm not saying that's an action the board needs to take, but like, I've been spending a lot of time these last few days reading Johann Hari's book, Chasing the Scream, which is about the history of the drug war, and it's a good municipal read. Would recommend. But this bid sounds pretty good to me.
It's a tough transition.
Yeah. What can you do?
So, how good does it sound to you?
It sounds like I would like to make a motion about
it. That was my need.
So I move to award the bid for seasonal maintenance of Prospect Hill Cemetery and Morningside Cemetery to Independent Landscape and Property Management in the amount of $17,000.
Thank you, Daniel, for making a motion to award the bid for maintenance of Prospect Hill Cemetery and Morningside Cemetery to Independent Landscape and Property Management in the exact amount of $17,000. All those in favor?
Aye.
Aye. 3-0. Thank you, Jan. And thank you, Kara.
Okay, take two. Thank you.
Now, since we don't have Steve, I believe I'm going to pass it over to Peter for our next agenda item.
Yes. So this one is follow along to something you did really very recently. I think it was the end of January 28th. You authorized that we move forward in partnership with VTrans for the construction of a sidewalk and the modification of the intersection. So the sidewalk will run along the eastern side of Route 142 from the new Hinsdale Bridge once it's constructed down the slope there to the intersection with Royal Road, which is the access into Morningside Commons neighborhood. And then this project also involves the modification of that intersection so that the signal will allow, there'll be crosswalks added or a crosswalk added, and the signal will allow for safe pedestrian crossing of the street. So we've been through the purpose of the project and some of the history of why it's been a tough project to get defined and priced well enough for us to be able to move forward with, but yet earlier this winter we were able to arrive at a way for the town to be able to afford its share of this. When we talked back in January about the fact that our share would be $70,000 out of a total project cost of about $535,000. So the lion's share of this is being paid by the state using federal highway funds. That makes the federal highway fund usage makes the process that's followed to complete the project a bit more cumbersome than it otherwise would be. There's steps that have to be taken and well documented in order to keep the state in good standing with the feds so that the money keeps coming into Vermont to fund these kinds of projects. We knew that also heading into this, but some of the details weren't known when we first approached you about this. So the memo that I provided to you dated March 11th provides a little bit more detail about that, about how we're going to share the responsibilities with VTrans. It does not change in any way the financial split. We're still looking at approximately $70,000 as a town cost. We will be providing, we told you back in January, in-kind labor as a contribution to the project. We now have a much better handle on what that in-kind labor is, and I want to be clear that it's substantial. Dan Tyler, who is our superintendent of utilities and highway, will be the project manager for this and is familiar with the requirements, and he, along with others of us on the town staff, will make sure that we dot all the I's and cross all the T's. We think that the substantial investment of in-kind services is well worth it to be able to accomplish this improvement for just $70,000, money which is available for this project in the capital fund. And so we're asking you tonight to authorize me to sign on behalf of the town the project agreement that will, the grant agreement that will be the official kickoff of the partnership with the state.
I just had a question. So Mr. Tyler's services are in addition to the $70,000?
That is correct. Yes, the $70,000 is cash out of our capital account, our capital fund, into the project, and then Dan's time will be substantial. Others of us will be giving less substantial, but still, time to the project because of the fact that it is the procedural requirements are more rigorous than if we were just deciding to do this ourselves.
And I would see his time and input as a benefit to the community because that means that it's built the way we want it.
Absolutely.
Okay.
Yes.
Daniel, any questions?
No, it's a good thing.
I had a quick question. It's already been authorized through town meeting. You made a note of, correct? Because of it's going to be coming from sidewalk?
Yes, so to be clear, there is funding for sidewalk construction in the capital fund, has been for the last 4 years at least, that is authorized by town meeting without it being specific to exactly where those sidewalks will be constructed. We will be using those funds to build a sidewalk in this location.
From last year's town meeting?
Actually from accumulated funds. So it's because of how the capital fund works, there are times when there's more than just this year's allocation in there because of whatever circumstances led us not to spend all of it last year. But we carefully account for sidewalk money to be spent for sidewalks and bridge money to be spent for bridges and so on.
Just that you don't need the meeting we just canceled.
Correct. We don't need any additional authorization of funds. We have what we need for us to honor our commitment through this agreement to pay $70,000 for this sidewalk.
Great.
Thank you. And if anybody out there is wondering if this would impact our ability to repair and replace existing sidewalks, what would the answer be?
Thank you so much for asking, Tim. The answer to that would be
someone's out there thinking.
In our operating budget, we also have been increasing in recent years the commitment to of funding to repair and replace small sections of sidewalks. So the capital funds the creation or replacement of significant sections like this one, and the operating fund sidewalk money does like a couple of squares at a time here or there where there's need for safing up a sidewalk.
Thank you.
Well, it sounds like a great idea because it's going to take that Royal Road neighborhood and incorporate more into the community.
Exactly.
And, anticipate the new bridge work and incorporate that into the community as well.
Exactly. And yeah, just, speaking to that, it's not just good infrastructure for the safety that it provides. It actually is going to encourage folks to walk. It'll be a connecting section now so that folks from the neighborhood at Morningside Commons can walk all the way into Main Street, which I'm sure they have done, but they've done at their own peril up until now because of the lack of sidewalk through this section.
Yeah, absolutely.
Yeah.
Or indeed to be able to walk up the bridge, correct?
And up onto the bridge to
there are a
catch
couple
the
of
beautiful views.
planned viewing areas.
It's true.
And there's a lot of truck traffic on that road.
But no fishing, probably, from that bridge.
Don't know.
Okay, let's not go there. But another exciting thing for the future of Brattleboro, that's a little bit of a break from our current issues that we're dealing with. Anyone want to make a motion?
I'd be happy to.
Thank you.
I move to authorize the town manager, Peter Elwell, to execute a grant agreement with the Vermont Agency of Transportation for the transportation project known as Brattleboro STP BP 1917 to provide pedestrian improvements between the Morningside Commons neighborhood and the new Hinsdale Bridge.
Thank you, Liz. Liz has made a motion to authorize Peter Elwell to execute a grant agreement, and that is for providing of pedestrian improvements between Morningside Commons neighborhood and the new Hinsdale Bridge. All those in favor?
Aye.
Aye. That's 3-0. Thank you. We are now listening to Peter once again. Sorry, as we are wont to do. We like that. For a procurement of engineering services.
Yes, indeed. So we talked at length during the budget process about the increased burden to municipalities that stormwater management represents based on the adoption of the state's Act 64 to improve water quality throughout Vermont. And this is one of the ramifications of that, implementing additional, very detailed, very complex planning about the work that's going to need to be done in various locations in order to comply with the regulations. So we're asking tonight that you authorize us to spend an amount not to exceed $30,900 to engage Stevens and Associates to provide several different pieces of engineering in different locations for different purposes. So there's actually 5 separate aspects to this engagement, each of them small in their own right, but together they exceeded my $10,000 authority, which is why the matter is before you tonight. I should note, because of one of the other things we talked about related to this broader topic throughout the budget process, is the importance of us preparing to and then moving forward with the creation of a stormwater utility as the funding mechanism for meeting these much more significant requirements for stormwater management. That this is not related to that. This is, more minor investment in specific improvements that need to be done here on the near term that will not be part of the creation of that better mechanism for getting this work done. We do expect to be back in the months ahead. Exactly when is hard to predict right now because of COVID-19. We were preparing to probably bring you something in April on this topic. It's likely to be a little later on now. But we do plan to come to you by, say, summertime with more details about how we would move forward to create that stormwater utility. And at that time, we will need to authorize additional engineering funds to move that process forward. But for tonight, this is specific location, specific work, and we're asking for $30,900, not to exceed $30,900 for this engineering.
Thank you. Would Daniel or Liz like to? Liz, would you like to comment on? Well, you have considerable expertise with this area. So.
I've read all 5 of the applications, and they all looked kosher to me, and I'm all for it.
Yeah.
Good.
As you were mentioning the budget, I was like, oh yeah, the budget. Remember the budget?
Yeah. The trauma we sometimes forget very soon.
Yeah, that's true. Yeah, all good.
Well, who would like to make a motion?
I suppose I would. I move to approve proposals from Stevens and Associates for stormwater related services for a fee not to exceed $30,900.
Hard to say.
Yeah.
Thank you. Daniel has made a motion to approve proposals from Stevens and Associates for stormwater related services for a fee not to exceed $30,900. All those in favor?
Aye.
Aye.
3-0. Thank you. And we have a finally, well, not finally, but we do have a financial report to squeeze in.
We do.
Would you like to give
Sure.
us a...
So the financial report is good. I'm going to give a couple of highlights from it as usual, but then I want to speak more broadly to town finances and the circumstances we find ourselves in with COVID-19 again. topic of import in terms of lots of different impacts, one of which will be financial for the town. So through the first, how many months of the year? 8 months of the fiscal year, we are in solid shape where our expenditures are below the threshold for 2/3 of the year. We've spent 64. When you prorate the large annual expenses and create a monthly flow, we're at 64.1% expended. That's about normal for this time of year. We usually end up somewhere north of 96% expended, but not fully expended. That's obviously the way we want to manage the budget. So we're on track for that in the general fund, and likewise in the utility funds and the utility fund and the parking fund, where we are at 63%, 64% in the utility fund, and the parking fund is right at 67.8. It doesn't involve those prorations, but revenues in the parking fund up until this 8th month report have been running well, and so that also was, everything here is a nothing to be alarmed about report. It has also, for folks who may want to look at it on the town's website, it has the normal monthly information about the status of our loans and stuff. But rather than spending time on that, what I'd like to do is put in perspective the fact that, this was chugging along until this past week as a relatively normal year, some unexpected expenses, but also some ways in which we could save on certain things. And the spending was in line with reasonable expectations for being 2/3 of the way through a fiscal year. Our revenues all are in good shape. So in all of the three funds, we were just solid, steady as we go. That has completely changed in this past several days. In parking, because of the decision we made tonight, the revenues are going to be significantly below target. Our expenses will probably be lower than the target, but they won't go down by as much. The largest single expense in the parking operation, just as it is for all of town government as a labor-intensive service delivery organization, are salaries that we're going to be continuing to pay during the time when our revenues are not coming in. And so that's not going to put us in any kind of a precarious long-term position related to the parking fund, but it means we're going to end fiscal year 20 not in the position that we shoot for. We will spend more money than we collect in the parking fund this year. The utility fund may end up the same way. It's got a much more complex set of circumstances there. The action you took tonight related to the utility fund was to suspend shutoffs. We expect that when the May payment comes, actually one thing I'd like to just digress on for a minute. I almost spoke to it when you brought up delinquencies, Daniel. I thought, no, I can wait for another night. But there's not much to say that we're fortunate about, but in the context of all that is misfortune all over this COVID-19 thing, there are glimmers of bright sides here or there about details of it. And one is the timing of how this happened is coming right after a payment due date. So we just had February 15th as the last time that taxes and utility fees were owed to the town. We had normal collections at that time, no surprises. The next time they're going to be due is May 15th. We don't expect May 15th to be normal. We expect that there's going to be quite a few more people and organizations that are strained and may not be able to make their payment at that time, but we'll see how that turns out. Maybe this will be shorter lived. Maybe it'll be weeks and not months, and folks will get back on their feet and we won't have such an impact. But I think we should expect that there will be more non-payment at the May 15th timeframe than normal. And so we may end up upside down also in the utility fund at the end of the year. But again, in a situation where we've got substantial enough reserves and a solid enough overall financial condition to not be a long-term concern. But in the short term, we may end this fiscal year in a deficit position. In the general fund, the same thing might happen, but we will be carefully and separately accounting for the emergency-related expenses. So in order to make sure that our documentation is really clear for the federal authorities who may be coming to audit our books in order to make refunds available through FEMA processes or other government processes where we might be eligible to receive reimbursement for some of the extraordinary expenses we're going to incur. We will document that well as we go along so as to be able to be well positioned for that recovery after the emergency is over. That will all get reconciled in a way where it will be a general fund burden in the end. There's no other funding source for those expenses other than the grants that we might receive and we might not. And so there's just a lot we don't know about that at this point. We'll keep you well informed as it unfolds. But again, all of that is, the unfortunate but necessary word of warning that while, when this was prepared on March 4th, we were in a normal, solid position. We now have a lot that's unknown, and the likelihood that some of our financial operating condition at the end of this fiscal year will be in deficit. Overall, for the long term, we're in still a very solid financial condition.
So as the state and federal government do whatever they're going to do,
yes,
does the municipality have people to help us decipher what aid might be coming to us? Is the Vermont League of Cities and Towns a group that would help us make sure that we're getting what we're entitled to? And
sure. Yes, they will do that. We also, as you know, we're in between finance directors right now, but we have the interim finance director is somebody who actually has audited Vermont books, municipal books. And so she's a person who will be familiar with how, whether it's Irene related or some of the more minor emergencies that have happened, it's not uncommon that on small scale emergencies that are not affecting our whole society like this, that there are, virtually every year, some municipalities that are affected by some smaller scale disasters. And if there's enough impact to those areas from those storms usually or other incidents, then a presidential declaration will make them eligible to receive reimbursement for some of the expenses incurred. And so that's a process we're all pretty familiar with. Fortunately, we don't have to go through it every year. But those of us who've been in municipal government for a while know how those processes work. And to the degree that there are sort of arcane accounting details related to that, we'll have Lori to provide the guidance to the town about how to make sure we first document the information correctly. And then by the time we're applying for reimbursement on any of this, we'll have a new finance director on board.
Super.
Thank you.
Something you mentioned reminded me of a question I forgot to ask a little earlier, so I'd like to just ask that.
Mm-hmm.
The employees of the parking,
yes.
What will they be doing?
So there will be, to some degree, some repurposing, and this is not just in parking, it's kind of spotlight on parking because of the fact that we're going to stop issuing tickets. That particular group is a small group. There are larger groups of employees in some other town departments that will actually be, for a while, not needing to do their normal function. And they will either do sort of special project things that we don't normally have time for that are going to be valuable to the department and to the town more broadly over the longer haul, and or be repurposed to assist with some of the community work that we're doing, to food delivery or other kinds of support for what we ourselves in town government are doing and what others in the community are doing to just keep things happening, to keep people who have needs supported in the community. So there will be a variety of different ways in which that happens. There will be some days when neither one of those things is necessary, and there'll be employees who are sent home for their own safety and for the safety of others in terms of social distancing, and will be paid for that because we're sending them home. But there will be as little of that as possible in order to make sure that either through regular town operations or through the extraordinary needs that we're facing right now, folks are part of delivering the service to the community.
Great. Yeah, of course, that's the answer we wanted to hear, because Daniel laid out a very good list of all the community efforts happening, and if we can plug safely into some of those.
Absolutely.
Yep. That's what we should do. Thank you. Well, thank you for that report. Anyone else?
Do we need to have a break for the...
Oh, gosh, I didn't even think of it. Do you folks need a break, you guys? Yeah, okay. Sorry, I know there's a couple of people here that have been waiting for the next item, but if we could just take a strict 5-minute break, I think we'll do that, and we'll reconvene at 8:25. Thank you. I don't know whether I should do that for reopening, but you've joined us back after a quick 5-minute break, and we are at letter H, as Daniel loves to say, because he's from a strange part of the world.
Australia.
Australia, that's right.
Well, down under.
We have a couple guests. Would you like to join us up at our table of inquisition? Came up with
Presentation.
table of honor, I'm going to call it that.
That sounds kinder.
Would you mind introducing yourselves?
Sure. I'm Rihanna Kendrick from Groundworks Collaborative.
Thank you.
Josh Davis from Groundworks Collaborative.
Why are you giving me that look? Not everybody who's watching knows exactly who everyone is.
I'm happy to introduce myself. I also live in Brattleboro proudly, and so.
Ditto.
Excellent. Thank you for being here. Peter, would you like to?
Actually, I'd like Patrick to
that's right.
give us an overview of the situation. I think while the action item tonight is really clean and clear, it comes with a good bit of history attached to it. So we'd like Patrick to kind of lay that out and certainly hear from the Groundworks leadership about it as well.
And Patrick wrote an excellent memo, so please.
Well, thank you, Tim.
Thank you.
And thank you, Peter. I'll just take a couple of minutes before we turn it over to Rihanna and Josh. And just talk a little bit about the project, the role that the town has played in this project, actions that the board have already taken in support of the project, and of course, why we're here tonight and the reason for staff's recommendation. So the project is called 54-60 South Main Street. And while the project will do a number of things for the organization in terms of enhancing its efficiency of its operations, its principal function is to develop a permanent home for the seasonal overflow shelter. As many folks will recall, the seasonal overflow shelter for years was situated on Main Street at the Baptist Church. That building was sold. That use could no longer continue at that location. That put Groundworks in a bit of a pinch. The town of Brattleboro worked closely with Groundworks, looking at any number of different locations around town where we might be able to, situate that type of service. They found a temporary solution, temporary in a couple of years, up at the Winston Prouty on the Austin campus. But of course, that too has come to a conclusion, and so almost by process of elimination, their existing location at 60 South Main Street became the focus of the permanent home for the seasonal overflow shelter. So it was at the beginning of 2019 that the board authorized submission of a grant application to the Vermont Community Development Program. The grant application was in the amount of $500,000, at which point in time the town contributed from a revolving loan from program income, $50,000. That was received well by the state, but funded to the tune of $400,000. And because of the challenges around fundraising for this effort, at a subsequent action, the the select board authorized an additional supplementary commitment of $100,000, raising the town's contribution on this project from $50,000 up to $150,000. So that's where we were the last time the board took this matter up. The project continued to move forward. Consultants and engineers working for the project secured all the necessary permits, and the only remaining item that needed to be completed in order for the final phase of the project to begin is the remainder of the fundraising. And while their fundraising efforts have been successful and are ongoing, we have reached a point in time where the organization needs to pull the trigger on this project. In order to be ready for next winter, which I believe starts sometime in November, there's a 6 months construction project that needs to occur. And in order for that to happen, Groundworks needs to execute a contract for construction by early April. So we're at a time crunch. We're at a point in time where it's time to decide, are we doing this project? And I believe the answer to that is a wholehearted yes. There is currently, as of the date of the memo in the board's packet, excuse me, about $506,000 of funds remaining to be raised. And we've been working with Groundworks and some of the other project partners to try and go back to each funding source and see if perhaps there's a little bit more that could be had. The town submitted on their behalf a enhancement request to the Vermont Community Development for an additional $100,000. I believe that's likely to be funded, especially if tonight's action moves forward. The USDA and the incentives to be provided by Green Mountain Power are, we believe, all but certain. There are other funding sources that the organization is looking at, some opportunity zone tax credits, and then actually as a worst case scenario, there is borrowing against assets of the organization. And we think with this combination of final pieces of this $3.1 million project, after your action and after the action that will be done up at the state in consideration of the enhancement request, we think that positions Groundworks to be able to execute this contract in order to be ready for next season. Does that seem about right?
Yeah, that's fantastic. I would just update one thing. Since we submitted this memo to you, we've raised an additional $28,000. So that brings the bottom line to the gap to $478,000. And so, like Patrick said, we've been continuing to fundraise, but really thorough overview both of the history and our current status and the urgency that we have to start this project just as soon as we can in April so that we can be into our new space in November. The schedule is extremely tight.
Do you want to give us just a very quick overview of what the new facility will look like and the services it'll provide?
Sure. It will really bring all of the vast majority of our services under one roof. So we'll have a expanded, adequately sized day shelter. And in that program, we'll have a kitchen so that folks can cook meals. We'll have a pantry that will be stocked. We'll have multiple bathrooms with showers. We'll have office space. We'll have meeting space in the new building. Also upstairs, there'll be a second floor where we'll have our administrative offices. Now that space will convert at night into the shelter space. And so we'll have storage at both ends that will allow beds to come out and unfold, and really we're using every nook and cranny for shelter space as well. Also be a mezzanine in the main area that'll be open, that'll have 4 bunk beds that will be available anytime. Those won't break down and set up again, and so if folks need to sleep during the day, they can access those. 60 South Main, circa 1780s building, will be updated for our HealthWorks team to do their work out of there, and that's our embedded provider from the Brattleboro Retreat, our RN from Brattleboro Memorial Hospital, and our HCRS provider will be working out of there along with our case management team and representative payee program.
Great.
Well, I just wanted to mention you're continuing to fundraise, and do you have a matching grant?
We have a matching grant. We do from the
Vermont Country Store.
Thank you, Vermont Country Store.
Yeah.
Yeah, and I think with this fundraising that we've done, we've almost captured all of that match, but we're continuing to set up matching grants and work with folks to close this gap. We've been really successful.
I just thought that the people in the community want to know in case they want to contribute.
Absolutely. And I would say a deep sense of gratitude both to be back here because the town has already been very generous in the support of this project. The state has already been generous in the support. And so I really appreciate the fact that you're entertaining an additional ask for this project because we think it's really worthy. But I'd also underscore that individuals and businesses in this town primarily have given $1.5 million, have pledged $1.5 million to this project, which I think is a testament to the importance of this project, the support of this organization, and the support of the people that we serve. So I don't want that to go unnoticed. That's almost 50% of the project is coming from local support. So thanks for pointing that out, Liz.
Thank you. Well, I feel it's someone's duty, I think it'll be mine at the moment, to just point out to people watching that this, if approved, comes from our community program income, which originated originally, and Patrick, tell me if I'm wrong, originally as federal, state pass-through grants. It also is a fund that gets loaned out to businesses, for instance, and gets replenished periodically as they pay off. It's been very successful for multi-purposes in our town.
Yes.
And it is restricted to housing and community economic development.
Correct.
And certainly what you guys provide helps, really you could argue, in both those arenas, but certainly in housing, which is a critical need that we have right now. Especially given recent events, we have all kinds of housing on top of our minds. And people need a home to go home to and sometimes to isolate in. And that's one of the problems we're addressing with COVID-19 right now. Just wanted to throw that out there, that this is not general fund money that we're considering.
Meaning that it's not from the taxpayers.
Correct. Thank you for that clarification. Do you anticipate any expansion of services or any changes in that regard coming up?
You
want to comment on that at all?
Expansion of services with the new project?
Well, expansion of capability or capability of expanding services.
I think an efficiency that we have, and also, being under one roof is going to dramatically change our programs. Right now, we are pieced out across the community, and so being able to do what we do under one roof is not only going to have great outcomes for the people that we serve, but also the people that work at the organization. In terms of expanding services, that's the question. Yes, absolutely. Talking about having a shelter, we're getting into the spring. Now is the time that we start to close down our seasonal overflow shelter. And for years, we've talked about the hardship that comes with that, the fact that we pass out tents, and that tenting is part of our emergency housing system. And so with this building, we'll be able to go back in our strategic plan. When we started the groundworks, we put in that strategic plan to have a year-round shelter. And so it's been a question of location and then also a question of resources. And with this, we answer the question of location, because this will be our building. We won't be renting from anyone. It'll be a secure building for us to provide our services for years on end. However, it'll be a question of the resources that will be needed to operate this program year-round. Given our current capabilities and support that we're seeing from the community for the work that we do, I foresee in the very near future that that is something that we would be able to provide the community as year-round services.
Great. I think that's great news, because year-round services is not only something that we all want to see, it's absolutely necessary.
Absolutely.
For our clients.
I just have a completely different question, more about COVID-19. The state sends warming funds, and they're about to end. Will that be extended because of the virus?
Yep, the state task force is looking at the capacity of all warming shelters to extend their services. So last days have all blended together at this point. Friday evening, they surveyed every warming shelter in the state to determine a wide variety of things, and that was one of the questions they looked at, is do we have the capacity to continue to stay open for longer? And we certainly do, and are working closely with our partners at Winston Prouty, where we're not the only tenant at that space, and so far have received significant support, not only from them, but from all of the tenants on the Winston Prouty campus. So I anticipate it's highly likely that that's something that we'll be doing this year.
I think one of the few positive things that could come out of the virus is that the community's understanding of the need for your work.
Good point. Well,
How do we feel? Well, indeed.
Motion? Is it my turn?
I think it is.
All right then. I move to approve a grant in the amount of $100,000 from the town's revolving loan fund program income to Groundworks Collaborative in support of the project located at 5460 South Main Street to establish a permanent seasonal overflow shelter.
thank you. Liz has made a motion to approve a grant in the amount of $100,000 from our revolving loan fund to Groundworks Collaborative in support of 5460 South Main Street and their permanent seasonal overflow shelter. All those in favor?
Aye.
Thank you.
Opposed?
Thank you.
Thank you so much.
Thank you.
Thank you.
And thank you for all your work.
And thank you, Patrick, for the support.
Hey, my pleasure. Thank you.
We have a small grant to reallocate.
We do.
Item
So
H.
it's a reallocation of Homeland Security funds that we were made aware of. So we applied for a very specific, very small amount, $1,600, to enable the town to purchase 2 multi-purpose devices that are used when doing swiftwater rescue activities for the fire department. We were in front of you, if this sounds eerily familiar, it's because it was only about a month ago we were in front of you to ask for permission to apply for this, but almost as soon as we sent in the letter, they sent one back and said, yes, you got it. And so what's before you tonight is the acceptance and appropriation of a grant for $1,600 from the Vermont Department of Public Safety for the town to buy those 2 multi-purpose devices.
Great.
They sound very useful.
They are, in multiple ways.
Yes. Let's get one.
At least as useful as they were
Let's
just a few weeks ago.
Yeah.
Would you like to make a motion?
I would. I move to accept and appropriate a $1,600 reallocation of 2017 funds as a state Homeland Security grant from the Vermont Department of Public Safety.
Great. Thank you for that motion to accept an appropriate $1,600 reallocation of funds as a state Homeland Security grant from the Vermont Department of Public Safety. All those in favor?
Aye.
Aye. And that's 3-0. Jane. So we get to committee matters. We had some appointments to interview committee members earlier today. However, none of them could make it.
Yes.
So, go ahead.
Well, if I may, so because the individuals weren't able to be here to be interviewed, and because we've temporarily suspended the operation of town committees, and because this particular committee has enough members on it right now so that if we resume that activity before you make these appointments, they still can function, it might be appropriate that you postpone action on these applications until such time as the emergency has settled down and the individuals can come be interviewed by you and you can make an informed choice.
I was thinking that too. Was anyone else? Yes.
Peter's a mind reader.
And we do have 4 applicants for 1 vacancy, which is terrific.
Which is unusual. Yeah.
We love that. Would anyone like to announce other? We don't have to make a motion to do that, do we? No.
You can just agree to move past it. Yes.
So agreed.
Consensus.
Do you want to add the tree to that announcement?
To the announcement? Sure, since it's still open.
Since it's still
Yes,
open.
please. Yep.
Sure. I don't mind doing it. Would you like me to read the vacancies?
Go right ahead.
Okay. So we do have, people are invited to apply for some remaining committee vacancies, one of which is still the Tree Committee, which has 1 vacancy. And then there is the ADA Committee has 1 vacancy. All of these have, oh no, sorry. The Arts, I was trying to make it simple. The Arts Committee has 1 vacancy. The CPCC, which is the Citizen Police Communications Committee, has 1 vacancy. The Conservation Commission has 1. The Developmental Review Board alternate has 2. And the Inspector of Lumber, Shingles, and Wood is also searching for a bright-eyed, bushy-tailed inspector. So, but just 1.
Maybe there's a squirrel somewhere.
I don't know what. I guess it's getting late, and I'm getting
getting punchy.
May I speak to K&L, please?
Oh yes, certainly.
We're almost done.
Certainly.
And the last 2 items on the agenda tonight, both related to annual business that is done around the time of town meeting, and both of these actually relate to the timing of town meeting, and so they have become moot tonight by the virtue of the action that you had to take to cancel town meeting. So,
Indeed.
Unless you have something else you want to talk about tonight, we're done.
No, unless there's any other commentary, that brings us.
I move to adjourn.
Oh. Good idea. Liz has moved to adjourn. All those in favor?
Aye.
Aye. 3-0. Thank
Wash
you
your
very
hands.
much. And Pretty CTV for providing safe viewing for all of our citizens.
Thank you all for being here for our latest update on COVID-19, commonly known as coronavirus. The state, nation, and world learn more about this new virus every single day. And public health officials and governments across the country are working to put what we learn into action, because our top priority is to protect our people. While most, more than 80%, who get this virus experience mild to moderate symptoms, we know some people, especially older Vermonters and those with serious health conditions like heart or lung disease and diabetes, are at higher risk of becoming very sick. The best information we currently have from the experts concludes that slowing it down and preventing as many cases as possible is the best way to make sure the most vulnerable, the very ill, and the elderly get the care they need, which in many cases will include hospitalization when they need it. Put more directly, this is more about protecting the vulnerable. And while many will either not get it or see mild symptoms, we all have to do our part to slow it down to protect the ill and older Vermonters who are at risk. This is the lesson from other countries, like China and Italy, where efforts to slow the spread were not implemented early enough, and now we see them struggling. So today, we're going to enact mitigation measures that will help slow the spread, which means better health outcomes for those who get this virus. While Vermont only has 2 known cases at this time, we know it's just a matter of time before there are many more. I want Vermonters to know how very fortunate we are to have so many incredibly talented and hardworking people in the Department of Health and Vermont Emergency Management, as well as first responders and healthcare providers across the state who've been working very hard to prepare for and respond to this virus, and who will continue to serve us well. But as more information becomes available about how important community mitigation strategies are to slowing this, we must take more action to protect the ill and elderly. Every single one of us has an incredibly important role to play in this. We're all in this together. We're going to act together, and we're going to get through this together. That's why today I declared a state of emergency. And through these emergency powers, I'm implementing several additional mitigation strategies, which will be in effect until April 15th. Though that could be shortened or extended based on what we experience on the ground. Again, it's important to keep in mind, this strategy is focused on protecting our most vulnerable, which based on science and data means the elderly and the very ill. Specifically, these actions are designed to prevent and control outbreaks, protect those at greatest risks, minimize the risks to the public, maintain the health and safety of Vermonters, and to limit the strain on our healthcare system, and to slow the spread of infection in our communities. First, to protect our older Vermonters, I've ordered long-term care facilities to restrict visitor access, with exceptions for family visiting kids and terminally ill loved ones. I know this will be very difficult for everyone involved, but we also know the residents of these facilities and those seeking care at our hospitals are most at risk, and we must take short-term measures to protect them. Second, room or single space for social or recreational events. Now, I understand the disruption this will cause, as well as the economic impacts, but we've seen its effectiveness in other countries, and we must do our part. Third, to limit and protect state employees and their communities, I've suspended all non-essential out-of-state travel for state business by state employees. The Secretary of Administration and Commissioner of Human Resources are also directed to encourage and facilitate more employees to work from home over the next month. And we encourage employers across the state to do the same if possible. My executive order also outlines additional steps to support the Health Department's work, including providing resources for the Department of Public Safety to assist with their contact tracing and investigative efforts, directing the Department of Financial Regulation to analyze demographic information in order to know the potential impacts on our population, workforce, and economy, and more. Additional steps and details are outlined in the executive order. And while I know many are concerned about our pre-K through 12 schools, in close consultation with our team, especially our healthcare team, we have determined that closing schools at this point is not seen as effective, at least not yet. We believe keeping them in schools rather than at home alone or with their parents or grandparents who are at risk is the best approach at this time. However, this is something the Department of Health, Emergency Management, and the Agency of Education are closely monitoring and reevaluating every day, and we will not hesitate to act if the risks change. As a result, schools and parents should be preparing for this possibility. In closing, I want to thank this group and their teams behind me, as well as those across state and local government and in our healthcare system who are working long hours with a fierce commitment to serving and protecting Vermonters. I also, again, want to thank members of the press for the calm clarity you've helped us communicate to Vermonters. Your professionalism is greatly appreciated and much needed in these times. Finally, and most importantly, I want to thank all Vermonters for their understanding, cooperation, and action to help protect and support their own families, as well as care for their neighbors. Because stopping this virus is about protecting the very sick and elderly from its effects. As I've outlined, this is going to require some unique and, yes, disruptive measures. and we need everyone's help to make them as successful as possible. My fellow Vermonters, I know many are concerned and even scared. I also know some will think this is not enough, and others will think this is far too much. Please know, every decision I make will be informed by the best science and the best experts we have available. And we are truly blessed to have some of the best professionals working with us. I also want to make this very clear. We are going to get through this together. We will be united in our commitment to protect the very ill and elderly from this virus, and this will unite us in our actions. We will work together as a community to defeat it in the short term, so we emerge stronger and more resilient for the long term. There's no doubt these are difficult steps that for a few weeks or possibly months will change what we do in our daily lives. And I also need you to know there may be more that may be necessary. But the compassion and commitment of our people and communities will see us through. We have to rise above frustrations and fear. We can't focus on how this may set us back, because what it's really about is about who we are as Vermonters and how we're going to lead our state forward. Here's the bottom line. It's not in our DNA to turn our backs on the most vulnerable. We're going to face it, fight it, and we're going to win. And just like after Irene, we're all going to do our part to help each other at this time of need, to show our children how the calm, compassionate determination of Vermonters and our communities can meet any challenge. So with that, I'm now going to turn this over to Dr. Levine to share the latest on what we're seeing in Vermont, as well as what we know about this virus. Dr. Levine.
Thank you, Governor. And I also would like to thank the members of the Vermont media. In addition to your usual good work, you've been essential conduits of this important public health messaging to Vermonters. I know what you've heard today and over the past several weeks can be, frankly, overwhelming. I'd like to, in the next few moments, give you a brief status update, tell a little more about the virus and some of the rationale from a public health standpoint for what you've just heard. As of earlier today, we still have only 2 cases. We are monitoring well over 200 Vermonters, a number that is going to increase significantly related to our second case, and to the fact that the CDC has added to its recommendations for travelers returning to the U.S. As of this week, people returning from most of Europe will be asked to stay home for 14 days and monitor their own health and report their travel to the health department. These are the same directions we've been giving to people coming from other areas with widespread, sustained transmission of COVID-19, including China, Iran, and South Korea. You can find the full list on our website, healthvermont.gov. To date, we've completed monitoring for almost 100 Vermonters. Prior to today, we had tested almost 140 Vermonters in 10 days. We're anticipating an additional 100+ test results today. Based upon the experience of many other states and some of our adjoining states, we fully expect this number to increase. I'll tell you just 1 or 2 things we don't know so much about with this virus. How infectious is someone who has no symptoms? How infectious is someone, and for how long does it last after their illness? But there are very important things that we do know. As I've said many times, 80% of those who contract this virus will have mild to moderate illness. The incubation period from the time one is with someone who has the virus is 4 to 7 days. It can, though, be up to 14. Transmissibility is thought to be one person has the ability to infect 2 others. And then they, of course, have that same ability, which is why it's so important early on to try to contain the virus. The case fatality rate is 1%, much more than seasonal flu, which is 0.1%, but much less than the human race's prior experience with novel coronaviruses like SARS or MERS. And the 1% is an average. The case fatality rate is far more skewed toward the elderly and the chronically ill, those with underlying predisposing conditions that we're always telling you about. And we know the young are markedly less likely to show signs of infection. And that's why the focus of the strategy the governor has outlined is so directed to protecting our most vulnerable populations. We also know that the virus is transmitted by respiratory droplets, and the distance is about 6 feet. And that is why, as you'll hear, social distancing strategies can become so important. We don't know how long the virus can persist on a surface, on something that's not alive. It's thought to be anywhere from seconds to minutes to maybe an hour. The public health and our state's response to this outbreak is a matter of using what data we have, anticipating what the future may hold, and the timing of our approaches. And if you think about it, our goals are quite straightforward. Protect the most vulnerable, protect as many people as possible from getting infected, knowing that many still will, as this is truly a novel virus for the human race. And prevent the healthcare system from becoming overwhelmed so it can deliver the best possible care to those in need and still retain a robust healthcare workforce. So I'm going to illustrate this with a picture because I think it's worth 1,000 words, and it'll speak about the measures the governor has addressed to help flatten this curve of potential spread of virus in Vermont. I'm a little tall for this. Just for everyone's frame of reference, this axis is number of cases, and the horizontal axis is time. And for the sake of this discussion, the amount of time doesn't matter. We can call it weeks, we can call it months. If we look at the experience of earlier countries, when the virus took hold in the population, it had a very rapid expansion through the population. I'll call this a spike in the number of cases. Very dramatic rise, and seemingly as dramatic a fall after a period of time. If I could use our colleagues in Italy as an example, and they actually want me to use them as an example because they want the world to learn from their experience, this was a period of perhaps 10 days or 2 weeks, very rapid, in northern Italy. Our goal is to prevent such a rapid spike because this dotted horizontal line illustrates the capacity of our healthcare system to deal with this infection. If you overwhelm the capacity of the healthcare system, you run into problems with the healthcare workforce, with hospital beds, with ICU beds, with ventilators, everything. So as the term has been used, we want to flatten the curve. And that is this blue curve here. All of the measures that the governor has described are called mitigation measures. We are following in Vermont a parallel course, mitigation and containment. Containment is the work of all of the public health personnel following the Vermonters I've described and instructing others about what to do when they return from travel, etc. Mitigation are all the strategies you just heard about how this may impact our daily lives in the coming weeks. It's believed that with these mitigation strategies, in effect, you flatten that curve, you may prolong the duration of the virus in the population, but the healthcare system can take care of everybody and not be extraordinarily stressed in an acute period of time. That's the whole purpose of what you've been hearing about, protecting as many people as possible over time. So what every one of us can do, and what we will do in our individual actions, will certainly matter when it comes to your health and the health of your loved ones, and especially how much we can limit the spread of germs and the impact of this pandemic in Vermont. It's important that everyone stay very informed of this fast-moving situation and take personal responsibility for following the Vermont and CDC recommendations and guidance. And as you've just heard, we're asking everyone to strictly follow new guidance and restrictions, which you can find regularly updated at the healthvermont.gov website. You've heard about hospitals and long-term care facility visitation policies. And obviously, no one wants to introduce an infection in those settings. And I think intuitively, Vermonters understand that they shouldn't be attending those places in a state of illness, and that the less interaction the public has, the more likely we will have healthy populations that don't have a virus introduced. We want to help the individuals who are housed in these long-term care settings and hospitals, as well as the staff and workers. You've heard a lot about lab testing lately. And in order to identify people who are most at risk of illness, we're prioritizing lab testing. We've prioritized it for people with symptoms of disease, which we've told you include fever, cough, and shortness of breath as the most common symptoms. And we've encouraged individuals with those symptoms to call their healthcare provider, not to physically go to their office unless instructed to do so. And we've avoided testing people who do not have COVID-19 symptoms. On the horizon, in the very near future, the healthcare lab that has been doing all of the assays will be augmented by other labs who have been provided permission and certification to do this kind of testing as well. This is all very important work for what we call surveillance, so we can actually figure out where on this curve we are at a point in time and when certain strategies may need to be expanded. The governor's provided you with a lot of information about what in public health terms we call social distancing. Social distancing measures include these cancellations of mass gatherings, adjustments to the way we work. We all know how disruptive these things can be from our normal day-to-day life. It seems that the most controversial public health recommendations surround considerations for school closures, and I'd like to spend a moment on that topic. I'll say from the outset, we, like all other states, do rely heavily on the recommendations of the Centers for Disease Control, as well as the available science, the reports from other countries' experiences, and consultation with school health experts. And speaking of school closure, that should be viewed as part of a broader suite of community mitigation strategies, useful at a time when there is significant community spread of infection, meaning person-to-person spread without other risk factors. I'll be frank, much of this relies on mathematical modeling data, but it's not believed that very early in an outbreak, 2-week short-duration closures can have an impact on the curve that I've shown you, or on medical outcomes. The advice is to time such closures slightly later in community spread, but before that spike in the curve would occur, and that a longer than 2-week closure might be important at that time to be effective. Obviously, a longer closure would have significant implications for student academic support, for school-based meals and other services, and we must take into consideration something the governor mentioned, the really undesired or unanticipated consequences of initiating school closures early, such as removing a family member from their ability to generate income and be part of the workforce so that they can care for their children, or having grandparents care for children, and they, being the vulnerable population, becoming ill from the virus. Thank you all for your attention. I'd like to now introduce our Commissioner for the Department of Disability, Aging, and Independent Living, Monica Hutt.
Good evening, everyone. What we know is that the population served by the Department of Disabilities, Aging, and Independent Living, both older Vermonters and Vermonters with disabilities who may have underlying health conditions, are at higher risk for the COVID-19 infection. As the Department of Health has articulated so clearly, our primary goal is to slow the spread of COVID-19 and ensure that our healthcare systems can keep up with the demands for care to ensure the best outcomes for all Vermonters. Our focus at Dale remains on prevention. Because of the enhanced risk to those populations receiving long-term care, the governor has announced through this executive order an approach to limit the risk and exposure to the virus for those more vulnerable populations. By restricting visitors to long-term care facilities, carefully screening all individuals entering those facilities, and promoting strong prevention measures within facilities, we're doing all we can to keep vulnerable Vermonters and the staff that care for them safe. We realize that this response could be very distressing to family members and acknowledge that it may create some hardship. Please note that by doing this, we are prioritizing the health and safety of the people that you love. Dale has been working in lockstep with VDH in terms of guidance for long-term care, screening, and recommended protocols. Communication is critical to ensuring that facilities and entities serving vulnerable Vermonters have the information they need to provide good care, make good decisions, and adjust their practices according to the most up-to-date information and direction. We at Dale are pushing out all the information we receive from VDH and the Centers for Disease Control to all our long-term care providers. It's important to remember that in addition to facilities, we have vulnerable Vermonters receiving critical services in their own homes and communities across the state. It's important that all those providers that are offering services to vulnerable Vermonters have the information they need to keep themselves and others safe. So in addition to long-term care facilities, those networks receiving information from Dale include our designated agencies, area agencies on aging, home health agencies, adult day programs, senior centers, and meal sites. We are particularly grateful to the Health Department for all their work and for access to their expertise. Dr. Levine made himself available for a Q&A call with our long-term care facilities this week, and we'll be having the same kind of call with home health providers next week. We're posting the Q&A information on our website. We have a Dale staff person in the Health Operations Center starting on Monday full-time to represent the needs of older Vermonters and Vermonters with disabilities. Additionally, we're working diligently to answer questions as they come up. As information changes and strategies evolve, we're available to field calls and respond to questions, even if we need to consult with others to get the best information possible. In response to questions and concerns from our provider community, we're updating information and developing new guidance regularly. As we develop new guidance, it's available to all on that website. We are committed 100% to doing everything we can to ensure the health and safety of our most vulnerable Vermonters. We ask that everybody in Vermont join us in this effort. If you're sick, stay home. Forego in-person visits to friends and family members who may be vulnerable. Call or FaceTime them. Follow basic precautions and encourage others to do so. By taking personal responsibility for your actions, you can keep yourself safe and keep vulnerable Vermonters safe. Finally, I want to express my sincere gratitude to the thousands of long-term care staff and community providers on the ground right now, taking care of our most vulnerable populations. They are doing extraordinary, critical work, and I can't express enough my admiration for their no-nonsense, common-sense approach to getting the job done and serving Vermonters. And now I'd like to introduce and ask to come forward Director Erica Borneman from Vermont Emergency Management.
Good evening. The State Emergency Operations Center was activated on Wednesday at the direction of Governor Scott to work closely with the Department of Health Operations Center to coordinate the response to what is now the COVID-19 pandemic. That work has involved the implementation of community mitigation measures, just like these that we are announcing tonight. These new measures have built into our operations, and we are working with agencies to ensure questions are answered about that implementation. We are also working to communicate the details of the executive order to the public in a simple and effective way that's easy for everyone to understand. We communicated with emergency management directors and local officials today, and will continue to do so as these are implemented. We also are in regular communications with the first responders throughout Vermont, and will continue to do so as well. The State Emergency Operations Center will be activated throughout the weekend and until further notice to ensure these questions are answered and provide further guidance as necessary. We continue to urge Vermonters to work with their local officials and emergency services and emergency management directors now and in the coming days. And we will continue to work to support them and provide assistance from the spectrum of state government. Thank you.
At this point, we'd be happy to try and answer any questions you might have.
Dr. Levine, you mentioned something about the second positive patient. It's like a lot of information was going to come out of that case. Can you explain that a little bit?
No, I wasn't saying information. I was saying the amount of contact tracing and the increase in the number of individuals in Vermont that we will be working closely with.
I mean, because of contact with patient two?
Yes, in that vein of thinking. Sorry.
What will the sanctions look like for people that violate this restriction on gatherings?
We are very confident that everyone will adhere to this. I know we're a small community in Vermont, and we're hopeful that they'll take this as a measure to protect us in the long run. I'm not sure there'll be sanctions, but we will provide the opportunity to educate them as to the policy, and then hope they do the right thing.
And you said this applies to non-essential social and recreational gatherings. Is there going to be a more specific definition of what exactly that would include or exclude?
Well, any gatherings with 250 people or more.
Churches that have more than 250 people?
Absolutely. Right.
What about like base lodges at ski areas?
Well, again, yeah, it would apply to them as well. We are hoping that they will, again, produce some strategies that might provide for that social isolation, maybe on their lifts and so forth. For instance, they wouldn't have to put 4 on a quad. They could put 2. They could limit the number of people getting on the lift. I think there are strategies that could be put into place, and we're hoping that they will comply and help us with this.
How do you define gatherings of over 250 when it comes to schools where, between period breaks involve gatherings over 250 kids in the hallway? Let me ask my question, please. And there are many other settings, cafeterias, in which more than 250 students will be present at one time. Is any guidance being given to schools about that sort of thing?
Well, again, we're basing everything on the science, and we're trying to determine how we can best help the most vulnerable, the aging population, and we believe this is the right strategy. Obviously, this is different. Work settings and so forth are different than recreational events and social gatherings. So a school is not considered a social gathering point, non-essential social gathering point.
Young people are at low risk for coronavirus, for COVID-19 serious illness, but they may well, because of that, be ideal carriers.
Yep.
Is that taken into consideration?
Absolutely. Everything is taken into consideration. That's why I had said this could change. We don't know how long this strategy will be implemented. We will take this day by day. And as Dr. Levine had said, if we do this too early, it might not be helpful. And so, and as well, I mean, we have to consider the kids themselves and where they're going. Not everyone has a home to go to. Some, their most, the best environment for them is the school, and that's where they get the most attention, that's where they get fed, and that's where they get the most social interaction with their peers. Otherwise, they go home, they could possibly go home to no one, and that wouldn't be a good situation either. So we have to balance this out, and again, understand that we're flexible. We're going to watch the data. We're going to work with the superintendents and communities, and to underscore, if in the executive order as well, the school districts themselves can close their schools. We will work with them if they feel it's necessary. We may see that there's an outbreak in a certain area where we may need to close the schools. And if a parent decides that they are no longer comfortable with their child being in the school, we are providing for them to take them out of school without any repercussions to the student, and provide for any instruction we can at that point. So we want to make sure that we're doing all we can to help them.
At what point would the administration step in and say schools in this area of the state have to close? How serious would the outbreak have to get?
Well, I'm not sure. I mean, again, we'll rely on the data and the science, and we're monitoring that daily, as you know. Some of the tracing that we're doing will lead us to that, possibly. But again, it's a very fluid situation, and we'll be prepared to act in a very quick fashion if it appears that it'd be beneficial to do so.
Commissioner Levine mentioned mathematical modeling. Have you seen any mathematical modeling that forecasts projected infection rates in Vermont?
You know, it's interesting because we have an aging demographic. I've talked about this a lot. I'm fearful that with our aging demographic that we may be more vulnerable than other states. And that's why I put these measures into place, why I've asked the Labor Department as well as the Department of Financial Regulation, the commissioners involved, to do some modeling for us. And let's take the data and see where we're going with this. So we're fully prepared. Don't have that data at my disposal at this point. I know they've been working on it, and whether they have it now or not, I'm not sure, but I haven't seen it yet.
Has the CDC provided any state-level forecasting related to infection rates?
No.
What's the capacity of our hospital system to treat serious cases? How many ICU beds do we have? How many are occupied right now? I mean, what's the capacity if this gets serious?
Yeah, again, you might be able to, somebody else might be able to answer this, but that's some of the questions. Those are some of the questions that I had as well. We want to collect as much data as we can. Secretary Smith.
Today we have 236 available beds that we could do surge capacity, add another 50 onto that surge capacity to roughly around 283 beds. That's with no mitigation strategy. For example, doubling up size, no calling in other hospitals from out of state, using other hospitals, just the capacity that we have today.
And how many of those beds are full right now?
Those beds are empty right now.
How many tests are being administered right now? How many positive, how many negative?
We probably have the up-to-date data as of now. Do you have that, Dr. Levine?
Have it today. We are testing at least 110 individual patients, and those results are on the precipice of being reported out. And I said we've already tested in the short week to week and a half that the state could do testing because we were allowed to by the CDC. We've tested 140, the majority of which are negative. And in addition, there were 5 Vermonters tested by New Hampshire related to the Dartmouth-Hitchcock episode and positive case they had there, and all 5 Vermonters were negative.
Governor, you said that said in your remarks that in China and Italy the response was too slow and that helped the spread. I've heard on multiple occasions that basically the U.S. is on Italy's track, but 2 weeks behind Italy. Does that mean that we have been too slow? Not necessarily just Vermont, but the whole country.
Yeah, I think in some respects we have to be honest with ourselves. We are learning more every day, and we probably should have advanced earlier than this. But again, I would say Vermont might be a little bit unique. We've had only 2 positive cases at this point in time, and so it hasn't hit us yet. But it's only a matter of time before it does, and we feel we're positioning ourselves well to mitigate this in the future.
There's a UI component to this executive order. Can you talk about specifically what that will allow that is not permissible under the status quo?
I'm going to have our Commissioner of Labor come forward, Mike Harrington. I thought it was important. I mean, obviously, this could be a burden if we're asking people to stay home for 14 days, or they have loved ones or family where they have to take care of them. So we wanted to find a way to accommodate them. We think we found a way with the legislature's help. And Commissioner Harrington, maybe you could respond.
Sure. Thank you, Governor. So I'll have you repeat the question just so I make sure I answer all parts of it.
There's a component of this executive order
Yep.
that authorizes some new allowances for the UI fund for workers who are affected by COVID-19. Can you
Yep.
isolate exactly
Sure.
what's going to be allowed now that was not previously permissible?
Yeah, so right now, the biggest change or the biggest piece of information is that people who are impacted by this and told to self-isolate or to quarantine, they will be eligible for benefits. And so we will see that, we will treat that as a temporary layoff, and that for that isolation period, they'll be eligible for benefits. That is the biggest piece right now that we will be putting into place over the weekend and for next week.
How is the state of emergency going to affect the census, right? And next week, I believe it is, we start door-to-door polling. So.
Yeah, that's a great question, and I don't have the answer to that at this point in time, but we'll have to contemplate that as we move forward. Obviously, the census is important, but we don't want to put people at risk either.
What is your response to Trump's emergency declaration today? Do you think it goes far enough, and how do we expect it to help us in terms of funding or otherwise?
Yeah, unfortunately, I did not see his address. I did hear that there was a declaration. I think he made it at 3 or 4 o'clock, but that's all I know about it. I will say I've been in contact with Congressman Welch. He would hope to be here tonight to actually talk about the economic package that they'd hoped to pass today. He texted me before I came down and said he was not coming. They were on standby. They had not made a deal at this point, but he hoped that it was going to be something that would be obviously positive for Vermont and our country. So I'm hoping as well that they come to some agreement for the welfare of U.S. citizens.
Up until now, the testing protocol, probably a question for Dr. Levine, the testing protocol has been if someone presents with symptoms that appear to be COVID-19 and a physician or a healthcare provider recommends a test, they are tested. Has that protocol been expanded at all?
It's been expanded in terms of the original CDC guidance was only hospitalized patients, and we took that restriction away from the get-go and allowed people who are thinking they have the condition but are in their home and not requiring hospitalization to be tested. I have to say that public health, one of its major core duties is surveillance, so that we know where we are on that curve. And our ability to do that is going to be very much expanded, in the next several days, based on our testing capacity, based on capacity that gets expanded into the private sector, and our major medical center can then perform as well. So I believe we'll have a lot more data, and again, be very nimble with that data and be able to tell, do we have regional expansion? Do we have statewide expansion? Are we holding steady? Whatever the case, and make the decisions we need to make.
But for now, the protocol is not expanded.
Right. It's not been expanded to someone who has no symptoms.
Okay. I mean, in other countries, the countries that have been most effective at limiting the spread or mitigating the extent have done broad-based, widespread testing, and we're not doing that.
And I would make the we as a country rather than you single out the state.
No, certainly.
Because that's been the biggest criticism of the country at this point in time. As you point out, we don't want to have situations like happened in Italy happen here. And I think we're sort of at that pivot point right now where we can try to intervene in the testing protocol as well as in our knowledge about cases in the state and make better decisions.
Would it be wise to expand the testing protocol to include people in senior homes, people who work in senior homes, other highly at-risk people out in Washington State, and major focus of an outbreak was in the senior residence?
Right. I don't think we would do just blind testing, though, of places that have no reported cases, no reported illness. I'd rather us be more strategic in that matter. But I do believe we have plenty of people who don't have symptoms who have had an exposure history. And I think we should continue to focus on that population because that population may be the canary in the mine, so to speak, that will help us understand how rapidly or not rapidly this virus may take hold within our borders or within the country in general.
We have been hearing from some people who have had some symptoms, are sort of being able to sit tight. So I guess, is the availability of tests an issue at this point?
The availability of tests has not prevented us from testing appropriate people. And I think just the fact that 110 are being tested today is testimony to that. That far surpasses any day that we've had yet to date. We've made sure to make this a clinical judgment of the clinician that the patient has been connected with. So I can't speak to what would happen at that juncture.
Doesn't that add a lot of subjectivity to it, though? I mean, it would seem that it might be good to take the subjectivity out from the local level.
No, I think it's objectivity, to be honest. I think a physician armed with the knowledge of what their patient is complaining about, what they know about their patient's history, and what they know about their risk factor history for this virus provides tremendous objectivity, and we rely on their clinical judgment in that case.
Has the testing capacity informed testing protocols?
The only way it has is if people have absolutely zero symptoms.
But I mean, if you had significantly more capacity to test people tomorrow, would you begin testing more people than you are right now?
I don't believe the 110 involves a lot of people who were denied the opportunity to be tested today.
The question is, if you had significantly more testing capacity, would you be testing more people?
We would be testing people who we judged were appropriate for testing, just like we are now. And they are presenting to the healthcare system as opposed to the health department. And we are relying on the clinical judgment of the clinician with our guidance.
If people can be asymptomatic for 4 to 14 days before they start exhibiting symptoms, if they exhibit symptoms, then waiting until they're sick seems to me inadequate.
Understood.
You know, I've thought a lot about this as well, and we never know when we become infected. We could test someone every single day, and they could still get infected the next day with one doorknob, let's say, or coming in contact with someone who has it. So it would stress the system. We have to, again, prioritize. We don't have an unlimited number of tests. If we did, maybe we would test more, but we don't. And we have to be honest about that we're doing all we can at this point in time. We're monitoring the number of tests we have available. We're hoping to get more in the future. We've heard from the federal government that they're producing more. So we want to make sure that we keep up with what we're doing today first. But there are some talks about private companies coming forward with accelerated tests, and if they can do that and we can get them in Vermont. I'm sure that some people would like to rule that out in terms of whether they have it or not. But again, I would stress that that could change from day to day.
Any data points yet that you can look to that will allow you to begin to quantify the economic effect on Vermont?
Well, again, that's what I've tasked our Department of Financial Regulation, Commissioner Pichek, with, to trying to work with others, labor and tax and so forth, to try and determine what this is going to mean to us. Because we know if we can get the numbers and the data, and it's just math at that point, and at least have an idea. But I don't know at this point. We just talked about this about 8:30 or 9 last night at a meeting, and tasked them with that at that point. So I don't think we've come to any conclusions, but we hope to very soon. And that way we can go and make the case to the federal delegation about what our needs, what we think our needs would be, which might be typical of others, or maybe not. But we'll come up with something that makes sense.
As it relates to financial resources being put toward COVID-19, it looks like the only thing in this emergency order, just based on a brief scan, is reallocation of resources at DPS to assist with contract tracing at the Department of Health.
Yeah,
Are there any other new spending or reallocation measures that you are planning as part of this?
Yeah, we're going to have to reassess daily. I mean, we're keeping track. We did get some money, federal money as well, that's been passed on to us here in Vermont, but we know that's not going to be enough, so we have to continue to assess the need. But we're okay right now, and again, working with the legislature, they've been willing to do whatever they can to help and assist along the way. So between the federal delegation and the legislative delegation, we'll figure this out, but we have to have the math first. We have to figure out what our needs are before we move forward. But suffice it to say that we know this will grow, and this is going to have an effect on our economy here in Vermont.
We're hearing about a shortage of personal protective equipment for healthcare providers, masks, gloves, that sort of thing. I guess where are stockpiles right now, sort of number-wise, and what's being done about that?
Yeah, Erica.
So the State Emergency Operations Center has been working closely with the Health Operations Center to inventory our statewide cache of masks and personal protective equipment. So we do have an understanding of that. The Department of Health has also submitted an additional request to the Strategic National Stockpile for additional PPE, and we're still waiting to hear about the timing on the delivery of that. And still working on the prioritization of that personal protective equipment.
How much are we requesting from the?
I don't have the numbers in front of me because that's coming pretty quickly. So.
What happens if and when critical members of the COVID-19 response team that you put together contract the illness themselves?
Well, again, we'll continue to reassess as time moves on. That's why it's critical we do all we can first to put into place mitigation efforts. But we know it could impact our workforce. We already have a shortage in our workforce, and certainly amongst our staff and so forth. We have continuity of operations plans in place for every department and agency. So we'll put those into place and act upon them as necessary.
The second patient has been listed in critical condition as of yesterday. Is there anything to add to that patient's status?
That would be a hospital. No.
Say no change.
Dr. Brumstead said there has been no change.
There have been pictures going around of empty grocery shelves, people buying large quantities of essentials. How much of a concern is that, particularly in some rural areas where they may only have a country store and a Dollar General to buy groceries from?
Yeah, the hoarding that I'm seeing and the panic that's ensuing is concerning to me. And I think we all have to think about what our real needs are. If you look out, we hear a lot of people wanting to stockpile, and there's certain products, I don't understand why they're stockpiling, but they are. If we look out over what your needs are over the next 3 to 4 weeks, that's all you need to have at your disposal at this point in time. We have a very compassionate state, and we come together and give when it's needed. And I would hope that Vermonters would not try to stockpile things they don't need that others do need. So let's keep in mind that we're one community, and but I am concerned about that. But I've been told that they will be restocking, and there are more products coming. But this isn't, this is unusual, or this is not uncommon across the country. We're seeing it everywhere.
At what point are state agencies and state employees going to be working remotely? If that is at all, in consideration? And if so, when would that take effect?
Yeah, I mean, we've, Suzanne might be able to talk about this, Secretary Young, but we're asking that they work with the agencies, departments, to put together a plan and move forward on this. Would you be able to elaborate on this, Suzanne?
Sure, Governor. At your direction, we have worked with the Department of Human Resources to put two things in place today. One is a ban on non-essential out-of-state travel, and the other is to encourage teleworking. We already have a telework policy for the state of Vermont employees. What we are hoping to do is be a little more generous with that, be a little more aggressive with that, so we can start to lower the volume of state employees in some of our office buildings to the extent that we can. So we are putting out some telework guidelines and working with our human resource managers and our cabinet to encourage that as an option.
The State House is a well-known petri dish. We just sent all of them home, many of them in high-risk groups, all of them back home throughout the state. Was there any consideration given to testing members of the legislature before they left?
Well, I don't think, with all due respect, that they're any more special than any other Vermonter. And I know that they might be at risk, but there are others that are at risk as well. And no one that I know of asked for a test or was experiencing any of the conditions that would warrant a test.
I share your evaluation of their specialness, but they are a unique group in that they are dispersed to all parts of the state from a central location that's known to be an incubator of disease. Regardless of their specialness, isn't that a concern?
Again, I'm not sure that I've heard of anyone that had experienced any of the conditions or symptoms that would warrant a test. And if they had, they could have come forward and we would have tested.
Lawmakers are, of course, working on a package of bills which would be like a short-term economic fix for COVID-19. I guess, what's the role of your administration sort of in those talks, and how are you working with lawmakers?
Yeah, we're trying to work hand in hand with them. Obviously, they want to help, and we would like their expertise. We may need them in certain cases, but we're waiting again for the economic package from the federal government, what this means with their declaration, if they're successful with the House, and I'm not sure about the Senate at that point, but I'm not sure what their economic package is either. At this point in time, we are okay. Certainly, we're fluid. Our budget is good. We're still getting revenue in. We're fine. It's much like consider this like Irene. When Irene hit, we were able to take advantage of a lot of federal money in the months and years to come. I would imagine that this is like our Irene, and we'll be able to make it through initially, but we'll need some federal help in the coming months. But I don't want to do anything legislatively that would hurt in terms of the federal package.
And then I guess if we do see some sort of shortfall of revenue or some sort of hit on the state's budget, I guess where would that money come from, or would there be cuts in human services, or sort of what would that look like?
Yeah, it may be all the above. Certainly, we would be heavily involved in that. We'd have to prepare for that, but we have the ability to do so.
Looking at the timeline of updates come from your Dr. Levine. Your last press conference was on Sunday. Now we're Friday. I know it will take time for some of this data to come in, but how is the process in terms of transparency going to work between the administration, the health department, letting the public know about?
Yeah, I'm sure you've been to healthvermont.gov. Gives up-to-date information every single day, and that's been distributed on a daily basis. That's your best resource at this point in time. If you have any questions about that, any Vermonter should go to that website because it answers a lot of questions and it gives all the up-to-date information that we would have. But if there's more information you need, obviously, we're just a phone call away.
Is there a need for more frequent briefings?
As needed, I would say as needed, we will provide them.
So just to clarify, as this data comes in, it will be put out?
It already is. Yeah. Yeah, it has been for quite some time.
Earlier you mentioned that we might be turning to private companies to sort of administer some of these tests or go through the results. What sort of vetting are these companies doing?
This is on a federal level, and I know that there's some large companies that I think in New York, I've heard that there are companies that are coming forward. They'd have to be approved by the CDC or someone, FDA, and before they're put into use. But I've heard of them. I don't have any details about them. Anything else you can offer with that?
Dr. Brumstead offered earlier that the Mayo Clinic is going to be contracted with the medical center to provide testing, and they appear to have capacity, meaning sufficient testing materials, kits, reagents, etc., to do the testing. So we'll have at least two sites then, the public health lab and the medical center lab.
Have you basically been depending on or following the guidance of the federal government? And is that good enough? I mean, the federal government response has come in for a lot of criticism.
Yeah, so as I said, the minute we were allowed to do testing, we said restricting that to an only hospitalized population doesn't really allow us to do our public health surveillance function and get a handle on where is this virus in our population. So we changed that immediately. So I don't want to say the federal guidance is poor because the federal guidance has been excellent from the CDC. However, we've been able to be independent as well and come to strategic decisions that make sense for the state.
Have you consulted outside experts? There are a lot of good people at UVM, for instance.
Actually, we work very closely with a lot of people at UVM, and I'm at the point now where I'm having once to twice weekly phone calls with many kinds of audiences, which include many people who are quite knowledgeable.
Has there been any discussions about Vermont prisons, prison population, and mitigating?
Secretary Smith?
Sure, there has. There's been great focus with the Vermont prisons, including various issues dealing with supplies and social distancing. For example, today we've instituted video visitation to make sure that the people that are coming to our prisons are segregated from our prison population. We also are, as you probably know, when a prisoner comes into our custody, there is a screening process that takes place. Now that screening process has been expanded to include the questions dealing with COVID-19 as we move forward. We've also increased our supply chain in terms of days on hand, in terms of food, medical supplies, other supplies in there as well. And we've been having daily conference calls with the commissioner as well as his superintendents on anything else that we can do as we move forward.
My sister happens to be on the board of a small town library, and she told me that they are having trouble getting cleaning supplies because of the general depletion. Is anything being done to provide supplies to not just state agencies, not just public entities like schools, but also other places where the public gathers?
Yeah. I had the same thought when I started seeing all the empty shelves on the news, and so I was concerned. I've asked what this declaration, the state declaration, emergency declaration, would do, whether that would free up any resources from, let's say, any federal institutions that might have stockpiles of certain products. So I haven't received the answer back on that, but I've asked the question.
Understanding the effort here is partially trying to make sure the healthcare system doesn't get overwhelmed. Has there been any thought put into what would happen if hospitals do start to fill up, any places to put what additional patients are
Yeah.
traditional healthcare
Yeah,
facilities?
and I will let others speak to this, but there is a emergency plan that can be implemented if that happens.
And probably Dr. Bromstead could really speak to this, being from a being from a hospital. But all the hospitals have medical surge plans, and a part of that is things like canceling elective surgeries and non-essential procedures to make room for more critical patients. And it's really the medical surge system in the state is a tiered surge approach, where hospitals have plans for surge within their walls or even without their walls. And then there are other surge sites in a real catastrophic event that we would have to bring in some additional assistance to run, but there are sites identified for that as well.
Thanks, that's a great answer. What I'll add is there's another piece of this for us, and that's the people capacity to take care of anybody that needs our services. So we've done a lot of work to make sure that we have alternative staffing plans, that we can have sharing of staff among the hospitals. And I just heard today that normally for our physicians, they go 3 deep for an on-call schedule, so that if the first 2 people go down, you've got a third. We've gone 4 deep. So we're really obviously taking this incredibly seriously and working with the state to make sure that we have the capacity. Obviously, the best thing is, as Dr. Levine and the governor have said, to make sure that we blunt that curve.
So we've got, of course, the travel recommendations from Europe, but what about from areas within the U.S. that have higher cases of COVID-19, like Florida, New York, Pennsylvania? Is there any sort of recommendation there?
Well, certainly what we're doing with the non-essential travel for state employees is something to keep that in mind and recognize that there may be some coming in from other states. It's not just from other countries or where people have been before they get to the other states. So that's why we implemented that procedure, and we're hoping that businesses will follow suit as well, because anything we can do to reduce and restrict this will be better off in the long run.
Considering that some European countries have much less of a problem, some have more of a problem, why the entire continent?
Yeah, it's a great question. I mean, we're seeing it in the United States thus far as well. There are some states who don't have any cases that we know of, and many that have had outbreaks. So we'll probably won't know why until much later. Right now, it's just to really take care of the problem at hand.
In doing the travel self-quarantining from people traveling back from Europe, that's based on President Trump's action?
Yes, I mean it's...
And the Centers for Disease Control,
right,
using data, tells us that.
Doesn't include Great Britain?
That was the president's decision.
So it doesn't include Great Britain? No. Your quarantine advice doesn't include travelers coming back from Great Britain?
I don't know that for a fact. I'd have to look at the map to see. Because the president's directive had to do with travel to the countries. What we use is travelers coming home from those countries.
Well, he enacted a travel ban,
I understand.
partial travel ban for the entire continent except for Great Britain.
Right.
Is your quarantine, asking people to self-quarantine for 14 days after coming back from Europe, is that based on the president's directive?
We are, anytime someone is now coming back from Europe, we are notified through a special CDC program called EpiX that traveler is about to arrive in Vermont, so we can initiate conversation with them and understand what their needs are and what they should do in terms of their day-to-day existence. So we're relying on that totally to know that they've arrived here and what to do. So I'm presuming what we're getting is science-based because it's on the CDC's program. It's not politically biased information.
Which gets back to his question, which is, you know, travelers who come back to Vermont from Washington State or Florida may be a higher risk than travelers coming back from France. But we're not doing anything about people flying back from Seattle.
Correct.
Okay.
As a country.
I'll take one more question.
Yeah, I just wanted to check our neighbor to the north, Quebec, also just announced a state of emergency there. I was just curious if, being such an important trade partner as well as a lot of traffic in between Vermont and Quebec, has there been contact with the Quebec Prime Minister?
I have not had any contact with him at this point. All right.
There was a situation earlier today on St. George Road in Williston, people outside in hazmat suits. I was just looking to see if the Department of Health responded to that at all. Was the Department of Health there?
I have no idea. It's nothing that I've heard anything about. Okay, thank you very much. Appreciate you all coming in. Thank you.
I'm going to turn to that first, and I'm going to turn it over to Representative Donahue first to walk us through some issues around some language that has to do with mental health. Commissioner, welcome. And then after that, I think we should see. I think my sense is we should probably be able to move fairly quickly through some of this, and then we'll transition without a break to some further conversation. We had some briefing last night, or yesterday, briefly, about healthcare affordability issues. And if we need a break in there to do anything else, we'll do that. Then we will have a break and we'll shift gears to a different topic. Yeah.
Hey, great. We talked about, there are 3 specific areas, pieces of language. The one we're starting with, I don't think anybody actually has seen actual language, although we've talked about the concept. When DMH presented on the 10-year vision plan, the commissioner said there was one legislative ask in terms of follow-up, not that there isn't a lot of follow-up that the department's doing, but in terms of legislation. And that was the recognition that DMH and the vision can say all sorts of things, but if the whole health system isn't involved and buying in, then we're not going to achieve integration, because it's integration in with a lot of other stuff. So this is the language that would establish that council, which has a lot of membership, because it's really about getting all those other parts of the system on board. So we can walk through the language. I would actually suggest that we first go to the purposes of what the group does, because that will help make it more clear why there's all of the representation that there is. And I know there was one person who reacted, one of the members of the Techno Council, who said, well, our one reaction is it's too heavily on the medical system people and not enough mental health representatives. And I said, well, actually, that's the whole point of this. The mental health folks came up with a plan, and now this is about carrying it forth by engaging the rest of the mental health system. You're able to scroll, or David? Oh, we're already scrolled up.
I pulled up to that section. Anne.
Great, thank you.
You're welcome.
All right, so if folks look at the where it begins after the list, powers and duties, and this is really the core. This is why this council is being established. So it's addressing integration. At the very beginning, it talked about our statutory requirement for integration and the vision plan. but these are the very specific things that would be the council's responsibility. First, identifying
I'm sorry, and I have no idea where we are.
Oh, I'm sorry,
No,
because
that's
I'm looking
okay.
here. So it's on the one that says on the top,
Powers and duties. Okay, I got it. Thank you. I'm sorry.
Is it what's up here?
I can't see that far.
So powers and duties, the council shall address the integration of mental health in the healthcare system, including, and then there's 1, 2, 3, 4, 5, 6.
6 duties. Okay. So the first one is to identify obstacles. In other words, in all of the parts of the system that each of these people represent, where are there obstacles to achieving the goals that have been set out, both in legislation previously and through the vision plan? Second, helping to ensure implementation of those existing laws that require integration within the members' expertise in the council. So different groups representing different parts of the system. If we scroll up a little, we can see 3. And establishing commitments from all of those non-state entities to adopt the practices and implementation tools for integration. Again, that's referencing back to the beginning where we talked about the vision plan and the legislative mandate. Fourth, the council can propose legislation if our current statute is inadequate to achieve it or creates barriers. And then fifth, the routine language on any other duties it deems necessary. It will then report back in, oops, I'm going to scroll here, in 2023. So this is a 2-year council to work on this, so report back with recommendations, including whether there's any recommended legislative actions and whether they need to be extended. The assumption is it's 2 years. It's not an ongoing forever group, but it's 2 years to identify and put together how we're going to achieve this. So now if we go back to the start, we can look through the membership. I have sent out contact to everyone who's been asked to be a member, basically saying, if you don't think you belong on this council, speak up. Nobody has said they think they don't belong. I've gotten a number of people saying yes, but nobody has said, oh no, take me off. I don't want to be involved in that. So, but we can look through A through F are all commissioners within the state system, beginning mostly with AHS. But you'll see each of those departments in AHS have relevance to integration toward our goal of an integrated system. Corrections has a division in how it delivers healthcare systems and so forth. And the F, then the Commissioner of Financial Regulation, is pretty self-evident why they're important to be a part. We then have both the Green Mountain Care Board and the Secretary of Education. And after that, it begins more the community-wide stakeholders, which includes the Medical Society, the Hospitals Association, Vermont Care Partners, which are the designated agencies, the Vermont Association of Mental Health and Addiction Recovery. That's somebody we haven't actually, I don't know if some of the new members have met, Peter Espen, who is the executive director of that group. The bi-state primary care, important aspect of primary care delivery. Representative from the University of Vermont Medical School, and that's really important. This was some of what the think tank made recommendations about when we're talking about sort of the unconscious bias of the system, if you will, that right in medical school that needs to begin to be addressed, and we need that commitment from medical school. OneCare, the healthcare advocate, the mental health care advocate, represent representation from the insurance industry. And just to clarify, council is getting pretty large. Often there isn't a group that represents all of the private insurers. They each speak for themselves. But it didn't really seem rational in terms of expanding the council to have both Blue Cross Blue Shield and MVP representative. I spoke with them about that issue, and MVP said they were completely okay and understood that only the largest insurer, which for Vermont is Blue Cross Blue Shield, represent that perspective. So you can be assured that's not going to create a problem, that it's just one which, in the language of art or whatever, what that's saying is Blue Cross Blue Shield. And then in terms of direct stakeholders, to keep that voice at the table, 2 people who have received services, one of them being somebody who delivers peer services, so that's the peer workforce representation. And then family members, there are 2 also there, because one is family of people who receive services, but the other is a family member who has a child who receives services. So that's the list. I think there's been some cross discussions around trying to make it inclusive. And that's really the core of the bill. There is language at the end that is the routine, the Department of Mental Health chairs, the Department of Health co-chairs. I mentioned the reports. There are directives around meetings, and that is meeting at least bi-monthly. Ceases to exist July 30th, 2023. We routinely have councils exist beyond when their final report is, because we may need them to come in and tell us what's in their report and so forth. Reimbursement is under our statute, which basically means people who are not getting paid by their job position for their activities are eligible for a stipend. So, if we could now have our witness comment and maybe answer questions.
Yes, of course. Well, thank you. Good morning. For the record, Sarah Squirrel, Commissioner for the Department of Mental Health. I want to thank Vice Chair Donahue for her leadership on this in terms of thinking about the council. From my perspective, as this committee is aware, the Department of Mental Health really leaned into our charge in terms of articulating a 10-year plan for a future of integration of mental health within the broader healthcare system that I think will benefit generations of Vermonters to come. One of our very specific asks of the legislature was to form this council. We have several other action areas that we are able to implement within our existing authority and resources that we, of course, are working on. But when we think about, as I said before, the 10-year plan wasn't the end, it was just the beginning. And we really want to create conditions for change. I really feel that what we have articulated as a state system, as systems partners, really has the opportunity to be transformational. When we think about implementation, as someone who's been steeped in implementation science, we really need a council, a table that is set with high-level leaders across mental health and our healthcare system if we really want to move things forward and actually operationalize some of the incredible opportunities that we have around integration. So the Department of Mental Health fully supports the representation that's been articulated here. I think from a facilitation standpoint, we're always trying to manage inclusivity and representation with a body that is manageable and that we can really move work forward in a reasonable way. I feel very confident that given the scope of the council as it's currently been presented, that we can be very effective. It is proposed to be chaired by the Commissioner of Mental Health, working in collaboration with the Department of Health. I think that's the right way to approach it because really we can really continue our leadership on the 10-year plan and our vision for integration. I think that the council itself can hold the vision of integration under the tent of the council, which is, I think, significant as we look to move this forward. It also creates an accountability structure that we need. It provides structure so that we can create decision making. As the vice chair noted, we have some significant areas that are actually already statutorily in law, but maybe not being fully implemented. So we need the right folks around the table to help us do that. A good example of that is payment parity in terms of equal rates of payment for the same services when provided by mental health professionals as compared to physical health professionals, to ensure that folks can access those services equitably. I also think there is an opportunity, as we look to implement the 10-year plan, that the council creates an accountability infrastructure to oversee that implementation as we move forward. So those are my high-level comments. Again, the department supports what's been presented, and we're looking forward to this as the next step to advance our statewide work around integration.
Great. If we could just scroll back to the very beginning, because one question that had already come back is, are we starting over on trying to identify what does it mean to integrate? And I think the introductory language helps make clear that this is about ensuring that everybody participates in the principles that are already in statute and as envisioned by the plan that's been developed. So this is not to start reworking a plan. This is to involve everyone else in making it happen.
That's a great point. We have put a lot of time and energy over the past year in terms of articulating what our end state is, what those short-term, midterm, and long-term strategies are. The council is a vehicle to advance that work, not to start over.
So any questions?
You have a lot of commissioners here, and then I see or designee. Do you expect all your commissioners to participate in the membership of this board, or do you expect it perhaps will be passed off to somebody at a lower grade?
I think it will depend. I think there are commissioners, some we shared, having talked to some of the other commissioners that really want a seat at the table. For some commissioners that I think oversee large departments, sometimes it's actually beneficial to delegate to someone whose particular purview might be a little closer to the provision of mental health services and integrating that broader in the healthcare system. Department for Children and Families is an example of that. It's so big, it could be more beneficial to have someone who is more directly overseeing that specific area.
I think another good example is the Department of Corrections.
Yes.
They have a medical director. That person probably would be better suited than the corrections commissioner.
If I could say, just as a general observation, this is the type of language that is almost always used when trying to involve, this is not unique to this council, whenever trying to involve a department or an agency, it names the commissioner or secretary or designee so that they have the authority then to find the right person to represent them on any. So that this is not unique language. This is kind of boilerplate language to facilitate the right person being at the table.
That's correct.
Right.
Yeah. Could you scroll back up to the top?
Sure.
I was reading the first paragraph. It says the purpose of it helping to ensure that all sectors of the healthcare system actively participate in the state's principles. Are you saying there are people that don't participate that should right now?
I am saying that we are moving towards articulating a vision for integration, and in order to achieve that, I think there is a lot of commitment to the vision as it currently stands. The next step is to take that make that more actionable. I think our healthcare partners, which was clearly operationalized in the think tank, really came to the table, and now we need to take it that one step further.
How long has this been a concern?
30 years. Or longer.
I'll speak to that. I think what and I credit Representative Donahue and this committee for really, and the speaker, quite honestly, in saying, in moving responsibility for mental health from the Human Services Committee to this committee, the Healthcare Committee, as a structural statement that mental health is a part of healthcare. historically, mental health has often been siloed off to the side, both because of sometimes issues of stigma and sometimes issues of disparate funding, different kinds of funding, like, well, we have healthcare here, and maybe we'll do something with mental health. And I think there's a recognition that mental health is an essential component of health and health care. And so so I think in many ways, this is a reflection of an historic reintegration of the acknowledgement of mental health as an essential element of health care.
And this is a recognition that we're not there yet.
Yeah,
and that there's more work to be done.
So, if you could scroll down to the bottom, then there's a date somewhere there that I saw.
2 years.
January 15, 2023. And you probably will still be here. Would you make sure that there's a follow-up on this?
I sure will.
So that it can be proven that group amounted to something.
If I'm not still a member of the legislature, I will be here as a mental health advocate.
Well, you can maybe speak from the governor's office if you want.
There we go.
Thank you.
Yes, no, thank you.
Yeah, I have a question. It's admirable that it is so inclusive. It's very inclusive. Is it too big, though, and unwieldy?
It's a great question, and as I mentioned in my opening remarks, we're always trying to balance inclusion and representation with actually facilitating a working group. I think that actually our facilitation of the think tank was a good demonstration of our capacity to take a large group, such as 25 or more key stakeholders, to really have good, solid facilitation. I think the Department of Mental Health has a deep bench of talent when it comes to facilitating large groups, and we will be the primary kind of administrative support. So I think my answer is the group big? Yes. Can we manage it and be a productive entity? Absolutely.
I have a couple things. I guess to Brian Smith's point, it's something I think I've been thinking about a lot as far as creating groups and asking for reports. And I guess just a proposal to the committee that I think it might be a good idea if we hold ourselves to the standard that any time we ask for a report or create a group, at least one member of the committee verbally commits, whether they're reelected or here or not, to follow through to the very end. And this is something I've been thinking about, where I would not ask for another report or group unless I personally was committed that I would stick with it through the end and make something come of it. And it's just a thought to float to the committee. And then my other piece, could you go to the duties? Yeah, I really appreciated the intro part about making sure that it's, the idea is not to come up with a new plan. The idea is to implement the plan that extreme work has gone into coming up with. And the only one here I wonder about is number 1. If identifying obstacles to the full integration of mental health, it seems like a lot of what the vision group was doing was identifying those obstacles. So I wonder if there would be a way to word that something more close to identifying obstacles to the full integration of, and then specifically list the statute and specifically list the 10-year vision. And so it's clear that the idea is not to start at square one with a new discussion of what do we need in our mental health care system, but talk with these stakeholders about, we know what we need and what are the obstacles to all of us getting there. I don't know, just to float that out.
Yeah, I mean, that could work. I think because of the overarching purpose at the beginning, I think that's assumed here, but it also, if it was limited to kind of only identifying obstacles to achieving the vision plan, it might close off some really important pieces of not changing what the vision is, but what the obstacles to achieving it might be. There might be ones that the think tank didn't, because it didn't have this broad inclusion, might not have thought about or been aware of. So it's about achieving the plan and the statutory obligations, which were only put in statute, I think, about 4 years ago in terms of those principles. Identifying obstacles probably wants to stay broad enough for obstacles to to achieving those things that might not have been listed in the think tank plan.
What about putting both, like full integration of mental health into a holistic health care system as outlined by, and then list the statute where it says, you know, where it talks about integrate as outlined by the statute and the 10-year vision?
I think that'd be fine. I think that's duplicative of the purpose part, because this is sort of just filling out the details of what was already stated as the purpose of the council in the beginning.
Yeah, the only thing I might add to that is that we did very strategically use appreciative inquiry as a strategy to move this work forward when we look at systems change. Not only do we want to identify obstacles and barriers, we also want to be lifting up the current assets that we have and build on those. That actually creates motivation for the kind of transformational change that we're looking for. So my only other thought reflectively on this was to capture that somehow, that we do have existing assets in the system that we can also build upon, in addition to identifying, you know, the barriers as well.
So can we talk for a minute about the process of moving this forward? There was discussion about having it in our miscellaneous health care bill, which we're talking about moving, which we will move by tomorrow. Because it talks about per diems, initially one thought was that perhaps that would pull it into the pull the whole bill into the appropriations committee, because anytime there's per diems, something has to go to appropriations and then they have to vote the bill out. It doesn't go directly to the floor. I did note that and I'm not sure that this gets around it, but that the per diems are actually coming out of the mental health budget, so they're not additional per diems that have to be authorized by the appropriations committee. And in noting that, it seemed to me that maybe it wouldn't be pulled into appropriations. But I think I would like to take a straw poll on the general construct or language, and then be able to consult with appropriations, because frankly, I don't want the whole miscellaneous healthcare bill to linger in appropriations if, in fact, this becomes a part of it. Then we might find another vehicle, or even have it be freestanding, so that if it was required to go to appropriations, this alone would go there rather than all of our other elements.
So rather than a bill number to vote, or where it fits in,
then we'll talk. I'll discuss that further with the committee in terms of the actual vehicle for moving this forward, because I think there's some strategic issues that we should think about in terms of what it might mean to have it go into appropriations as part of a larger bill that otherwise would not be going there. So, does that seem agreeable to folks? So with that, then
just take a straw poll.
So I think. Are people prepared to just, in general, take a straw poll on the language? Lucy?
Should it be interpreted as a straw poll on generally we like the direction, or a straw poll on the exact language without any change?
Crossovers tomorrow.
At this point, we need to be moving pieces.
So was there interest in expanding it to talk about the asset? I mean, is now the time to have the final language?
Yes.
So should we talk about if there should be a piece about, in the identifying challenges, also identifying the
anything that you wish to talk about, this is the time, because you're making a suggestion?
Yeah.
What is that?
Well, I mean, it sounded like the commissioner just suggested. Do you want to say?
I don't think she was suggesting language. I think she was just talking about.
Well, let's ask her. She was suggesting that.
I think that I don't know that it requires a language change. I think that it can be inherent, kind of linking back to Vision 2030, which is referenced in the beginning. We have a lot of information about appreciative inquiry in our approach in order to engage the council to feel motivated towards change. We will be facilitating looking at obstacles and assets. So I don't think it's necessarily needing to be included in the language.
Is that satisfactory?
Yes.
Okay, other questions?
We're not talking talking about a lot of money with this bill.
There's only a maximum of 4 people who would actually be eligible
Most
to
of
ask
the people
for a
will be
stipend.
already working under a salaried position.
So I don't see why appropriations would have an issue with it.
Well, they probably wouldn't ultimately, but technically, anytime there are per diems, it has to go there, and they don't deal with this until they've completed the budget. Because they have to look at the entirety of the budget. They set aside a pot of money for per diems, and if it exceeds, and if the request for study committees and per diems exceeds that, then they will pare it back. And so it slows something down from moving through our process. Right.
Is your concern the money coming out of mental health appropriations or health appropriations? Is that the concern?
No.
No.
Then I'm missing what this trial vote is going to be about.
Okay, I'm sorry. Let me try to clarify. I was trying to just move us forward and explain that we were initially talking about maybe having this be part of a larger miscellaneous healthcare bill, or alternatively having it stand alone. We could make the decision right now to just have it stand alone as a bill. We could take it to the floor as a bill, and then that would, if it goes to appropriations, so be it. If it doesn't, then our miscellaneous healthcare bill won't have this as part of it.
If it's a standalone bill, there's not a lot of money involved in it, is there?
No.
It doesn't seem to be.
No. Very small amount. So. Maybe that makes sense just to take one thing off your agenda of people you need to talk to. We could just go ahead and say.
So then the process would be asking Jen to craft this as a committee bill. It's not in that form right now, but we would ask her to put it in the form of a committee bill from the House Healthcare Committee, which we can do, and have this be a standalone bill. Does that seem like that? Maybe that's the most straightforward way to do it. At which point, then, I would suggest this, that we ask her to bring that back to us as a committee bill, and we will vote on that sometime later today, rather than take any more time now. And that way, we'll have it in the form of a bill that we will then have a formal vote.
Sure.
Okay.
Is that the best way? There's no, if we do that, this is not going to fail. Is that correct?
Well, I still will communicate with appropriations, but it avoids the possibility of complicating the House Healthcare Committee, the miscellaneous committee.
To respond, would it be fair to say that it doesn't in any way increase the likelihood that this fails relative to including it? And I think that was your question.
Yes.
No.
No, it actually increases the likelihood of something else we're doing, not getting encumbered in appropriations for a period of time. Okay, well, let's leave that there then. But be prepared for us to put that to a committee vote later today, assuming Jen gets a chance to craft it into a committee vote. Okay.
So this next piece is not new language you haven't seen, except that it's pared way back. Because in talking with the Appropriations Committee, this is the part which is a little technical. In fact, in many ways, although it's based on key philosophy about integration, the same topic, it's a technical change in the budget process, which is at its core saying, we should not be siloing our budgets and splitting up where in the budget mental health shows up, beginning the first step being about inpatient mental health care. If you recall when the budgets were introduced to us earlier this year, even a budget adjustment saying, well, we have this increase in rate for the retreat because of their financial situation. Part of that showed up in the DIVA budget, part of it showed up in the DMH budget. So this is really just about having them be in the DIVA budget together. The original language we looked through had this long piece about why this was important. It was language that was important to me, but we got unofficial feedback from the
Becoming important to more people.
But we got unofficial feedback from the Appropriations Committee that they did not have an interest in lengthy language about all the whys and the values and so forth, and they just wanted to get to the kind of the bottom line. So that's really the fundamental change from the language from before. It does still retain the core purpose language, which is there, pointing out that the budget's an essential structural component about integrated care, and that separating budgets is an obstacle to that reform principle of ensuring equal access. This time we have the actual quote, so that's the section that was referred to on the Integration Council just before. This is a principle that we've adopted already, ensuring equal access to appropriate mental health care in a manner equivalent to other aspects of health care. So that's A. B is just the directive. Shall integrate the public funding, in other words Medicaid, for inpatient mental health care with the funding for other health care services within the DIVA budget. Oversight and utilization review and how the care is managed is the more policy end. That's the Department of Mental Health's role, so it's noting that that will maintain according to which department is legally overseeing that. On the request of those departments, the date for it actually to occur will be basically to be achieved in fiscal year 2023, which means proposed for the 2022 budget. In other words, not this year, but the year after. And based on that, there is the new section, Section B, which says, because we're giving you an extra year, next year you do have to come back with that kind of layout showing us exactly where the money is in each budget, so that it makes it clearer for that next step the year after to actually do it. And it outlines the existing categories of where this money gets currently split up in inpatient care. So as we scroll down, you see 1, 2, 3, 4. Those are the different categories of inpatient psychiatric care, and the different categories of which some are in DIVA's budget and some are in DMH, and folks who are in the CRT, Community Rehabilitation and Treatment Programs, as that line right before the 1, 2, 3, 4 points out, they can be in any one of those 4 subcategories, therefore determining whether they're in the DMH or the DIVA budget. So we're saying, fill us in next year on where all those pieces are following, and then the subsequent year they will all be moved into DIVA. This has absolutely no impact. This language and this directive has absolutely no impact on the budget itself or the amount of money. That's subject to the normal budget process. What it does is move it in terms of which budget it appears in, to put it in the budget with the rest of our healthcare budget. So that's the overview of the now much briefer language, and if the Commissioner would like to testify. And my understanding is that the Commissioner of DIVA has spoken with you, and you are representing both departments as testimony on the record about this.
Yes, the Agency of Human Services as a whole has reviewed this, and we are aligned with the recommendations as proposed in the bill language. And just to echo the Vice Chair's points, that this really does provide the structural components of creating conditions that will support the integration of mental health within the broader healthcare system. Many other states have actually transitioned to integrated financing models where managed care plans manage all the physical and mental health programs for Medicaid enrollees. So this is aligned with, I think, national practices and where other states are moving. Again, a goal of this is to enhance shared data, incentives, tools to deliver integrated services. The area that I think we just want to be careful about and thoughtful about is that the potential of this integration of the fiscal part of it is really hinged on our ability to ensure that clinical integration is also happening when we think about care coordination. So it's important that for those with complex health and social needs, that the outcome of this is that their care is better coordinated and we have better outcomes. So I just don't want to lose sight of, that is the ultimate goal of what we're trying to achieve. So broadly, the Agency of Human Services supports this as it's currently written. The timeline feels appropriate from our perspective. And I just want to note a few other points related to the custodial and legal role of the Department of Mental Health. So there are some differences between the Department of Mental Health and DEVA. It's important that we recognize that DMH is not an administrator of health insurance like DEVA. We are responsible for prioritizing and managing the care of specific populations. As a custodial commissioner, I feel an enormous responsibility to the individuals who are under the care and custody of the Commissioner of Mental Health. So we want to make sure that as we move towards integrated financing, and this is, I think, reflected in this bill, that for those who are under the care and custody of the Commissioner, particularly for those who are level 1, my care management team manages the care coordination of those individuals from the time that they are in the emergency department, admitted to inpatient, and then transitioning to lower levels of care. So when we think about that integration of the fiscal components and the clinical and programming components, I just really want to ensure that the Department of Mental Health is still overseeing that care coordination. That feels essential from my perspective. When we look at the current budgets between DMH and DEVA, as the Vice Chair noted, that what currently sits in the DMH budget that is separate from or carved out from the DEVA budget is level 1. So that level 1 is inclusive of the Vermont Psychiatric Care Hospital, our level 1 contracts with Rutland Regional Medical Center, and the Brattleboro Retreat. So you'll note at the very end of this, there is noted language related to that our budget presentation that the Vice Chair was noting shall also include any implementation recommendations to achieve that integrated funding. I do think there are some pieces that we'll have to work out behind the scenes because there's current statutory language of the Department of Mental Health related to level 1 and reasonable actual costs. So if those funds shift over to DEVA, then would those contracts for level 1 need to be facilitated by DEVA versus the Department of Mental Health? And there are some pieces that we will have to coordinate around there. Not insurmountable, but certainly some things that we want to think about because those level 1 contracts are essential to us actually creating some accountability so that those Rutland and the Brattleboro Retreat actually accept those individuals. So that's a little bit of an accountability and a leverage point for the Department of Mental Health.
That I should reflect when the Commissioner pointed those pieces to me, and that was where, in helping to craft this, I agreed that providing that extra year instead of saying this shall happen for next year's budget made sense.
Yes. The other thing that I would note is that VPCH is also currently all within the Department of Mental Health's budget. The Vermont Psychiatric Care Hospital is run by the Department of Mental Health. They're by my people, they're the staff. So if that entire budget moves to DEVA, that will just be another point that we'll have to navigate in terms of the budget for the hospital will actually sit in a different department than the department that's running the hospital itself. So again, that's why I requested the additional time because we need to respectively figure out how that will work and how we operationalize that and maintain the great outcomes and quality that we're currently achieving at Vermont Psychiatric Care Hospital. So those, I think that's the summary of my points for the committee related to this proposed language.
On the surface, I mean, this is, the integration seems simple, it's a short bill, but is this going to, behind the scenes, add more bureaucracy or trying to coordinate or, you're talking about we'll work these things out behind the scenes, but in the end, is there going to be another layer that we're not seeing, sort of like the unintended consequences of bureaucracy?
I think that there are certainly going to be some coordination pieces that we will have to work out behind the scenes. They do not feel insurmountable from my perspective, and I think the bigger gain that we're going to make in terms of the fiscal integration of the funding outweighs some of the inconvenience of having to work out some of these things behind the scene. I think managing the VPCH budget is probably my bigger concern, and what that means from an operational standpoint. We already have an MOU with DEVA in terms of their kind of delegating Medicaid authority related to level 1 CRT that we oversee. We work very closely together and have a lot of collaboration. So I'm confident that we'll be able to move that forward. And then if we have some time to work with our fiscal offices about the details of the VPCH budget, I don't think that we're going to get overly bogged down in bureaucracy. If those are clear. And I think the language actually supports that because there's clarity of roles that's already articulated in the language.
Well, I was going to say, I didn't understand this yesterday, and I think I have a clearer picture now of what we're talking about, and what you just said makes me feel a little bit better that you're comfortable that the benefits of making the switch will outweigh whatever additional work there is.
Lucy? Was there any discussion of like making the switch except for the VPCH and keeping that in DMH for logistical ease?
That is not currently the recommendation, and I think if we truly want to get a picture of inpatient services without VPCH as part of that integration, we miss a big part of it. So there have been no discussions as of right now in terms of carving out VPCH from the intent of this language.
So the ultimate goal is about having the big picture of the services all in one place from a budget perspective.
That's correct.
And that doesn't work between the two. Like it doesn't work to have that big picture when it's split between the two departments.
It makes it more challenging to have that big picture, and it's not aligned with our vision of integration.
I have a couple of questions. Delicate questions, and I don't mean to criticize you or your department or anything like that. But I read somewhere where there was an incident with your department and I guess the corrections department in which an ill patient, whether that patient should go to a hospital emergency room setting versus going to prison corrections department. And I think your department took the stand that that individual should go to a prison setting. And then the corrections department had an issue. They felt that there was a budgetary issue, and that's why that individual was being sent to a corrections department, a prison. Would this bill correct that situation? And do you know what I'm referring to?
We have a lot of situations where the bright line between criminal justice system, criminogenic behavior, and mental health is blurred, and it's confusing. And this is, I think, one of the opportunities we have right now when we think about a true forensic system of care that we're grappling with. So I don't think that this in particular addresses that particular issue. What I can assure you is that the Department of Mental Health as a healthcare provider is managing individuals who might be involved in the criminal justice system to meet their acute mental health needs within an acute care system that is all Medicaid funded. If we are able to treat an individual and their mental illness, it is the requirement that we have to transition them to lower levels of care. That's philosophically and fundamentally what Vermont, a fundamental value of Vermont. Federally, that's what we have to do to meet those mandates. Those decisions are not made for budgetary decisions. Those are clinical decisions that are made to ensure that people are receiving the right care at the right time in the right place. And for some individuals, they might also have criminogenic behaviors and public safety risk that we also have to manage, and so we have to work responsibly with our criminal justice partners. The other piece I would just add is that sometimes, because we are a healthcare provider, we have to abide by protected health information. So what you hear publicly or in the media might not actually reflect kind of the true state of the situation, and that's just something the Department of Mental Health has to manage on a daily basis.
Thank you.
You're welcome.
And I was going to say, well, to finish this piece, there is a bill coming over from the Senate that will be asking the House to look a little bit more into that issue of criminal justice, forensic, mental health, which is separate from this issue of when there is mental health hospitalization, does it go into the DIVA or the DMH budget? So the Department of Corrections aspect is not in this bill. That issue is going to be coming to us.
Thank you, Ann. And then one other question. If we already have an MOU, or if you already have an MOU, why do we need a bill?
Because the MOU allows us, it's really just delegating Medicaid authority. So it doesn't address the integration of the funding within the DIVA budget, which is what we're trying to accomplish.
Other questions? So this is language that we only need a vote, not as a bill, but on sending it to ask appropriations to include it in the budget bill, because this is a budget alignment issue, not a, obviously it has policy behind it, but it's not an independent bill.
Again, just to explain that the budget always includes both numbers and appropriations, but there's also budget language that reflects about how to move things around, or in this case, integrate differently. So, and the Appropriations Committee has asked all committees if we have language for the budget to have that prepared for them by tomorrow. So they are anticipating the possibility of this as language.
Yes, the person in charge of that, actually, I had told them, well, it's on our agenda Thursday. She said, good, I want it Thursday. So,
so are your questions answered? We prepared to, I would do it as a straw poll, really, to move it to the budget language? Yes, Anne-Marie?
I do have. At the end, when they say including any subdivision between the person served by the community rehab and treatment program, they list those. There's no really report, and I know we hate reports, but report back on, yeah, we have these problems worked out, or there's unintended consequences, or we need more time, or is there someone that's going to ride herd on this and bring it back to
So the
committee?
language B that you see here, the department's fiscal year 2022 budget presentation, which will be our way of articulating the integrated budgets, even though we're not there yet operationally, also includes implementation recommendations. So part of our budget report back to, assuming this committee, will also include implementation recommendations related to some of the areas that the Department of Mental Health has some, coordination concerns that we need to work out. So that's what that language is intended to do.
Okay.
Any other questions? Then I would suggest that we take this language, take a straw poll on recommending that this language be moved into, or be given to the Appropriations Committee as budget language. All those in favor, show of hands. Let the record show that all members present. And Brian, are you on the line still? Do you wish to join us in this?
I am on the line. Can you hear me?
Yes. Yes.
I am here.
Okay. Well, we will. I think at this point we have a clear all members present, and we will. That's sufficient to move the language to the Appropriations Committee, and we will do that, and we'll have you. You can weigh in as you wish along the way, because it will be in the final budget as well. Okay, thank you. Now, there.
One last piece which we've discussed before, so I'm hoping this is sort of a, we're already there on it, but this last piece is the technical language to achieve the Brattleboro Retreats budget being under the Green Mountain Care Board in the same way all other hospital budgets are. This had been proposed last year. The retreat had concerns about being fully included, so we sort of created a special language, review light, if you will, and in light of some of the budget issues that came up this year, some folks like me thought maybe we need to have it fully under the Green Mountain Care Board's review process. So what this language does is it strikes the special carve-out language that we created last year, and then the line after that is just the definitional. The existing definitional talks about hospitals meaning a general hospital, and general hospital excludes psychiatric hospitals. So by striking the word general, it means any licensed hospital. But clearly the one budget that doesn't come under the Green Mountain Care Board is the state-run hospital, VPCH. Their budget is controlled by the legislature and wouldn't be controlled by the Green Mountain Care Board, so it requires adding the language that we're not including hospitals that are run by the state. So this is the way that achieves the purpose of saying the Brattleboro Retreats budget does come under the Green Mountain Care Board. And we did have on the record previously testimony from the chair of the Green Mountain Care Board and the director saying they're fine with this. This does not add a burden on them that requires additional staff requests. Sometimes we ask them to do things, resources of any kind. Sometimes we ask them to do things and they say, look, you're asking us to do something more. We would need more resources to be able to do it. And they told us on the record that's not the case with this. They can handle this with their existing resources.
Questions?
Are we going to hear from the Brattleboro Retreat?
We have. They testified earlier on the record in support of this when they were here. Anyone know Steve?
Oh, okay. That's yes. I forgot that.
Oh, no,
yes,
earlier.
when he was here talking about the retreat.
We asked specifically when he was here about the retreat early on in the session, and we raised this issue and said it was likely we would be wanting to do this as a recommendation, and he indicated no problem.
Maybe I'll go back on the record and look at it. It strikes me as interesting because last year when we brought it up, there seemed to be lots of problems from the retreat's perspective.
And things shifted.
No, I know. It's just I'm curious as to what has been done to resolve the problems that the retreat had last year with it.
I'd be happy to chat.
And I think the issues were not one of difficulty. I think the issues were one of transparency. And last year what we agreed to was that the Secretary of Human Services would have access to Brattleboro Retreats records sufficiently to know that they were confident in giving the kinds of support increases and rate increases. And at the time it was Secretary Gobet. So we agreed to back off from asking to have it go through the Green Mountain Care Board as a hospital budget review. And then I think in light of the, frankly, the emergent situation, which we were addressing in the very first days of the session, where the Brattleboro Retreat was here with Mike Smith from the Agency of Human Services. It was in that context, before they had resolved things, that we also raised the question of having the Brattleboro Retreat given the significant amount of their budget, which is in fact state funds now, be part of the hospital budget review, that he indicated that was not an issue at this time.
Other questions? This again, this is not a freestanding bill. This is recommendation that approach is already anticipating that we might be proposing.
Well, let me just say out loud, it doesn't seem like that seems satisfactory. I can tell when there's a consensus in the room, when there isn't. So if that's not satisfactory, I want to hear what we need to do to.
There seems some uncertainty on faces.
Yeah, right. Does the committee wish to hear from the Brattleboro Retreat directly about this? In which case, we will try our best to arrange that.
I remember them saying, and sort of being very.
Okay, well, I just wanted to check because this is not an issue.
Questions I had.
What's that?
I think it was one of the questions I had when they were here.
But, Lori, my response is, quite frankly, it really doesn't matter to me if they are in favor of it, that we have a situation on our hands and they need to be part of the process. So I'm for this thing.
Yeah, I mean, I guess I just feel like there's clearly dynamics that I'm missing, especially, I mean, I guess that's where I feel is I maybe need to understand more of the dynamics and said earlier that we could have a conversation. So I guess in my mind it just kind of feels like maybe that needs to happen before I would feel ready to.
I will say it. I will say it on the record. It's not very distant from what Lori's saying. I think last year they felt able to argue that they were a private hospital and that I mean, their fundamental argument, which I believe to really be an issue of not wanting to be as fully transparent as is required of other hospitals. That's my opinion. Their argument was because they're so significantly funded by Medicaid and the Green Mountain Care Board review, the bottom line of the review is the Green Mountain Care Board has the authority to say you can't increase your rates. It's a by more than X%. The other hospitals are able to do cost shifting inside their budgets that allow for, if they're required to reduce private payment, their amount of Medicaid is less in terms of all of that functional pieces of the budget. And so the retreat was saying last year, well, we don't think we should be part of that because they can't, we have so much of our budget that's state controlled because of Medicaid. And I think this year the retreat recognized that, quite frankly, from a political perspective, recognized that they weren't in a position to say, we're not comfortable with being required to be evaluated as closely as other hospitals' budgets are. And so they were not objecting anymore. And the Green Mountain Care Board clearly will have to look at their budget, understanding the percent that's Medicaid in terms of how it reviews it.
Do we have a sense of how much it will cost the retreat to undergo the budget review process?
No. I mean, we haven't asked that. They did last year, based on the new language, have to start providing a good deal of the information that is required of hospitals for budget review. But
it just seems like an interesting time to be asking them to do something that's going to put more costs on them when we already know that.
Well, I would take the position that it's also a very interesting time, and it's an interesting time when they, in fact, are turning to the state for additional $1.5 million, when we're already giving them millions of dollars, when their entire budget is practically now state-funded, that it's the time when they should be, even at some additional cost, they should be fully transparent, and they should be not treated differently. Just, again, it's interesting in terms of what we were talking about earlier, the integration of mental health and the healthcare system. They are a siloed mental health inpatient facility, or not
they do other stuff, but yeah,
but they're
this
not
is in terms
strictly
of
inpatient. But I think that, I don't think that we should be making them an exception, or based on the fact that their primary, exclusive work is around mental health and substance use disorders. And I think they should be treated the same as other hospitals.
Just to answer that a little bit, at least in my experience at Gifford, the work that goes into presenting the Green Mountain Care Board is sort of presenting the financials you already have. I mean, they do have some format things they want. I would say the bigger issue might be if then the Green Mountain Care Board comes back and says, well, we want a sustainability plan like they're trying to put on other hospitals now, which might involve a little more cost. But they would do it for a reason, and they only do it when the hospitals are financially struggling, and we want to see how it's going to move forward.
That's exactly why we want
That's
them
why we
to
do
go
it.
to the Green Mountain
They
Care
should
Board.
spend whatever time it takes.
Yeah.
I'm sure Secretary Smith would agree with this.
I would think so. Okay. So I'm going to ask that we put it to a straw vote to move it to the language in the budget as well. Those by show of hands, those in favor?
Sorry. Is abstaining a possibility on a straw vote?
No. Oh, on the straw vote, yes. Yes, that's fine. This is a straw vote, yeah. On an actual roll call vote, you can't abstain. So those in favor of moving it to the budget by show of hands? Those opposed? Those abstaining? Okay, that's great. So we'll move to the budget. Thank you. Okay, so I'm now going to, things are shifting as we're sitting and talking. Yes, Sarah. And we'll let you shift.
Yes, thank you
We'll let you shift.
I really appreciate it.
Great. No, thank you for making yourself available. We really appreciate it. While we were working, I was also being communicated with by the Speaker's office, and there is a chairs meeting that's being called for 10:30. And I'm being asked, the chairs are being asked to meet with the Speaker at 10:30. One of the issues that we are being asked to talk about, so I'm going to ask us that I'm going to ask this committee to help me weigh in on a question. And then we will figure out how to get back to affordability, which is on our agenda, which just have to be flexible. Let me make sure I have the. So, I think one of the agenda items from the meeting is to, the language that's been debated is please come prepared to share your top 2 or 3 ideas for emergency support for Vermonters in this evolving crisis. And I think that's an appropriate, and rather than just putting my brain to work, I thought even though we only have 10 or 15 minutes, I would like to engage the committee in helping to think about that. And just as to what recommendations I might take to the chair's meeting with the Speaker's office at 10:30. Just so again, do maybe the length. I miss. Wait, Frank? Sure. And I misread it when I first, because there's also been a request, a different kind of request. But this is a request for please come prepared to share your top 2 or 3 ideas for emergency support for Vermonters in this evolving crisis. Now, I would ask that we, part of, given we're the healthcare committee, that might help kind of frame what we're thinking about. But I would like to open it up for a general discussion, and that will help me just bring some thoughts forward to the Speaker's office. So what I'm going to suggest is that we each get a turn to be heard, and if someone doesn't wish to speak, that's fine. But I'd like to make sure each of us gets at least a chance to kind of share what things come to mind initially. So,
is this the idea of financial assistance?
It could
It
be.
could be.
It could
It's
be.
whatever your
It's-
thoughts.
It could be financial assistance. It's basically what are the things that we need to be thinking about as a legislature or as a, because we hold unique responsibilities in terms of what actions might we need to take to support Vermonters in the COVID-19 evolving situation.
Hello?
Yes, Brian.
I've been thinking a lot about this since I'm self-quarantining right now. Can I say something?
Sure, and I'm just going to suggest, since I'm supposed to be there at 10:30, and I realize this is short notice, but that's why I've been, to be honest, I've been a little antsy in trying to move us along this morning. So apologies for that, but I would like to hear from you, but I want to make sure we have time to hear from everyone else as well.
Yeah, I'm not going to say a lot. What I'm going to say is that I'm going to send to the committee a few documents for us to review and think about. One is, I don't know who it came from. I think it's the ACLU, but it's a long list of things, that suggestions of what government should be doing right now to take care of people. And another thing is going to be a list of demands from the Burlington Tenants Union, which is like an organization of tenants who are concerned about how it's going to affect them. These are mostly people living paycheck to paycheck. I'm not going to read all of it because it'll take up too much space right now, but I'm going to share it with the group, and perhaps we can talk about these things a little bit more in detail later. But it covers everything you can think of, from health care, supplies, financial assistance, how are people going to eat, et cetera.
Okay, is that a document you can forward, Brian?
I'll send it right now.
Okay, great. Is there anything else you want to add at this point?
I don't take up too much space in the conversation. I just wanted to throw that out there as a starter. I think other people will probably say a lot of the details of what I'm referring to. So.
Okay, thank you. Mari?
Hi, Brian. It's Mari. Financial concerns is what I am hearing about most, and people being able to quarantine and not, they not have to worry about mortgages, and whether that means finding a way to encourage lien holders to allow mortgage holidays for a month. The paid sick leave, paid family and medical leave. It would have been great if we had a strong program. That's a kind of a moot point, but if there's anything that can be done on the short term to help people with their incomes while they're quarantining.
Let's just keep going around and hear from people.
Just to follow up on that, as an employer, what I'm hearing from employees is, will you pay us if we are sick, if we're sick? And I'm sure that there's also, will you pay us if you tell us not to work, if we're
quarantined and we can't work from home.
And that larger businesses are making that commitment. Larger national businesses are making that commitment. They have the resources. A smaller business might not. What can the state do to help?
I think if you've got this COVID-19 virus is obviously quite relevant. If someone's going to be homesick, I think there should be some sort of compensation for someone that has COVID-19, not someone that's sick and trying to cash in on it. People get sick every year and they stay home and they lose a little bit of income. But if this virus is involved and the doctor says you have COVID-19, I think there should be some sort of compensation for that if they have to stay home because of this virus.
Yeah, I think pretty much echoing what's been said is my top concern. I just want to add to the conversation. I know I've raised as like a younger member of the legislature a lot kind of the biases that this position puts us in, as far as recognizing that people come to this position from all financial backgrounds, but that we as a legislature likely are biased towards people who could afford to pay for 2 weeks of ourselves needed. And I think it concerns me a lot because I talk to my constituents, and I hope that we stay in touch with the fact that we as a legislature may not be representative of our constituents as far as what it would mean to take. I mean, I just talked to a constituent yesterday who runs a child care center in my town, and she said, like, I should close, I think. Like, the responsible thing to do would be to close, and I cannot make it 2 more weeks if I close, so I'm staying open.
Thank you.
I think the whole idea of large gatherings is something that people talk about. I mean, we've got basketball players and basketball games and all this stuff. But then you have the legislature, which just doesn't seem to be following the large groups. They were keeping outsiders out, and that's a step. But still, when you look at the demographics of the people when you're sitting on the floor, those are the ones that are checking all the boxes, like over 60, pre-existing conditions. And I think we are not leading by example. However, I also realize that money is going to be a big deal going forward on budgets and keeping government running it, and I don't have an answer to that. But I think that's something that needs to go into the conversation, and I'm sure it is, but we don't know anything about it, so that's it. And the other thing is that we are carriers. We are leaving a central point and going to all points of the state and then coming back again. So it's something.
Okay, well, I don't know the nature of the meeting that I'm having, but I can tell you that is seriously being thought about and contemplated, what it means for us to be here and balancing the need for government to function, and that we in fact have a role, and how we need that.
And one last thing, paid family leave, I don't know how we can reconstitute that for another vote.
That wasn't going to be in effect immediately.
Yeah, you can't just roll that out.
You just can't do that.
Well, I mean, they're I don't want to speak for what can be done in an emergency situation.
And I agree with some of the stuff that's been said. I think the one thing that I've been thinking about and getting a bug in my ear from my home representative who's on the board of Capstone is just food.
Yes.
And making sure that, we have a lot of people that, especially kids that get lunch at school, and that's really the best meal they're getting. And whether we need to consider some sort of centralized food production at a school or at a community center or something that can be distributed out to people that are quarantined. I mean, anytime you're moving things around, you're exposing people, but and especially like Meals on Wheels and some of those things we need to think about.
I just wonder, what's the feds doing to help our state? Are they going to provide the state's money to help keep individuals home when they're sick with this virus? It's a difficult time economically. I mean, this could be a very difficult time for our state economically as well as the nation economically. And we're seeing it in the stock market currently, but it has other ripples throughout our state and local economies. And I just worry about the money issue.
Yeah, my top of my mind has been the issue of employment income and quarantine, and I think framing it in terms of health care, I can't imagine people not thinking, I don't even want to be tested, because if I'm told I have to self-quarantine, I can't feed my family. And I think even of my hairdresser who has the hair salon in her home, and if she says, oh, I have to self-quarantine for some reason, she can't have any customers coming in. Maybe she shouldn't be, but then she has zero income.
Maybe no customers will be coming in.
Or no customers will be coming in. And the issue becomes, of course, the money. I don't know if the workers' comp system is a tool that can be used. I don't know what the tools are, but that's, I think, my health care preeminent concern.
Oh, can I mention one other thing? Sure. Besides the economic issue, the medical issue. Do we have the equipment to treat, a major pandemic, particularly when it comes to respirators? How many respirators, does the average hospital have? I'm sure UVM has a great number of them, but I mean, that concerns me.
I'm just going to add, I agree with all of it. I'm particularly concerned about food, not just for children, but seniors and those in need. And also, I think the state needs to be helping municipalities in coming up with plans to physically check on seniors and those in need. A little bit to get to Ann's point of, are there people in their home who are sick who are not coming to be tested because they're scared of what the cost is going to be? And just making sure they're okay.
Did we get the test? Are there enough tests? It's like there are, there aren't, there, you know.
No, I think we don't
know it.
I think we don't know at this point. I want to just mention a couple things. One is that medications, access to essential medications for people who, in fact, if they're being asked to self-quarantine, or if in fact there's social distancing to the degree that different things have happened in different settings as advanced, and the barriers to, like, I was approached by someone who said, my child needs insulin, my family member needs insulin. I can't afford to put out what the copay is for a month's supply of what's being required.
To get advanced.
To get an advanced supply of medication, even though I'm being told, try to get advanced supply so that you're not, you don't have to worry about that. But he said, we literally don't have the funds to do that. And in light of some of what we're talking about, and I don't know what the answer to this is, but quite honestly, I think the mental health pressures are going to be there, or they are already elevated for the entire population. And for people, for everyone, there's a significantly heightened level of anxiety and fear. And, you can name it, just cascade through the issues. And I think we need to at least recognize that, and recognize that the pressures on all of our formal systems, but our informal systems are going to be highly pressured as well. So,
just add on to
please.
that point. I know healthcare workers.
Healthcare
I mean, that's my biggest concern is that this does take off. We have a limited supply, and how are we going to protect them, keep them safe, keep them working to help the people that are.
Please.
Devin Green from Vermont Association of
And I need to go to an emergency
I just
meeting.
want to do a quick public service announcement along those lines of protecting hospital resources is call your primary care provider, get advice from your primary care provider. Do not physically go to the emergency room unless you're short of breath. Don't go to the emergency room if you've had, like
I've been putting that up to my constituents already.
Good. I'm glad you're doing it because you are the leaders in your community. So send that message.
So we're taking our break. Come back at 4:15, see if our chair's back.
Yep.
What time?
And we will hold on to 11 o'clock.
11 o'clock?
Have you heard that?
Yes, Brad.
I'll call back at 11. Thank you. Hello.
Hi.
Oh, all right. So I'm going to just give you some report back from the meeting I was just a part of. We met, the Speaker's office was an emergency meeting of the chairs, and the intent was both to hear what, as we did some go around, what were some of the top ideas to how to respond for Vermonters in this emergency situation. We did that, and I reported back on most of the ideas that we talked about here, and then, as did others, not every committee had taken time to look at it as a committee, but the Speaker then asked each committee to take some specific responsibility over the next several days, and I want to share within the framework of trying to see if there were immediate policy changes or financial changes that should be put on the agenda, literally on the agenda on the floor of the House today or tomorrow, and immediate short-term changes. And we were asked specifically to look at the issues of the impact on home health, on folks, healthcare workers who are going into settings to sustain folks, to look at the issues of mental health and whether there are any financial or policy or financial changes that need to be facilitated to allow what needs to happen over the next immediate period of time. And I also raised the issue of pharmacy and access, and I think issues of access to essential medications or supplies that are sufficient. And I think quite apart from that, but in addition, is hospital situation, hospital preparedness. But I'm going to, and that we need to balance trying to find a way to try to engage the key stakeholders on those issues with our committees. That this is, as the speaker said, this is no time to form a task force to figure this out. This is a time to see if there are immediate actions that people are putting on the table that then we can in turn have drafted. The Speaker's office will take charge of what the vehicle is if there's a decision that something needs to happen. So I think I need to step back and look at what we have left on our agenda, because every committee also is facing crossover. There's some suggestion that maybe crossover will be moved, but in the meantime, crossover has not been moved. And we're trying to find a balance between looking at prioritizing what it is we're trying to move forward and with looking at these issues. Now, I'm just frankly trying to think out loud right now about how best to proceed. I think what we might do is, I think we have a specific proposal in front of us that I think is prepared to, that is a longer term. This is not a short term immediate issue, but is a longer term piece, but I think one which we might be able to go through quickly. And so why don't we do that? In the meantime, I would like, looking around the room, but also thinking that some of the key players, both around home health issues, mental health issues, and pharmacy issues in terms of carriers and obviously pharmacy. So what I'm going to ask is that if you're in the room and you are engaged in that specific, in any of those three specific areas, or in hospital preparedness, that you be thinking about, are there immediate policy changes that you believe should happen and could happen in the in the immediate term, and or financial changes that would be necessary in order to support Vermonters, that the legislature has the ability to take steps in the next 48 hours. I'm asking you to be thinking about that, and for us to be reaching out to other stakeholders who are similarly situated. But I think in the meantime, we'll find a time either later today or certainly tomorrow to come back and see what those proposals are. So I know that some folks who are engaged in these issues are in the room and some are not, but that's, if you, to the degree you who are can communicate with your stakeholder colleagues who would be a key stakeholder on that, if you would ask them. This is a request from the House Healthcare Committee to help us think about those immediate policy changes or financial changes, financial issues that could be addressed by the legislature in the next 48 hours that would be essential in anticipating the needs of Vermonters. Is that, I know that doesn't answer a lot of questions, but I think that's the framework that I'm asking us to think. I would ask us as committee members to be thinking in those terms, but I also want to reach out and engage the stakeholder community as well. But I think we have something in front of us which I think we could take a look at, which is a longer term, because we also have a longer term responsibility, so we're going to try to balance all these issues.
Nothing. Okay.
So I think we have brought some people together around at least one of the proposals longer term, and it is definitely longer term, but nevertheless potentially have to be quite important around prescription drug issues. And Gloria, are you prepared to help us walk through this? And
Christina, would you mind coming up? Yeah. And Jeff's here.
Yep. Okay.
So we talked about this, and then there was a small group that kind of met separately and talked through how we can make this happen. So we have some language that I will walk through, or Christine, if you want to walk through it.
Whatever you prefer.
Okay. Why don't you walk through it since you drafted it, and then we'll answer questions, and then Jeff's here to respond as well.
So Christina McLaughlin, Green Mountain Care Board. I can't take full credit for drafting it, but it was a group effort at the board. So in front of you is some, and it is posted online, some proposed language. This proposed language for the board to develop a prescription drug technical advisory group to do exactly what it says, have some transparency around prescription drugs. So just to read through it, the Green Mountain Care Board shall establish a prescription drug technical advisory group pursuant to 18 VSA section 9374 D2 to provide input and recommendations to the topics described in subsection B to the board through January 15th, 2022. The board shall appoint interested stakeholders with applicable subject matter expertise as appropriate. Part B, the prescription drug technical advisory group may provide recommendations to the board on one or more of the following topics. One, models that enhance the board's ability to analyze, monitor, or report the pricing of prescription drug products, or the relationship between prescription drug pricing and consumer prescription drug costs, the effectiveness of prescription drug initiatives on prescription drug costs, or 3, other mechanisms for increasing prescription drug price transparency at one or more levels of prescription drug supply chain. The Green Mountain Care Board shall provide a report to the General Assembly on or before January 15th, 2022, based on the recommendations from this advisory group, and we suggested that the effective date is effective upon passage.
So I have a question. Why the 2022 date?
So at the board and working with Jeff, Jeff Hochberg, we agreed that either we ask for money so we can contract out some of this work, or we can not ask for money and have a little more time to work on this. And we felt the no money ask was a safer bet.
Okay. Any questions?
I don't see, I mean, we're analyzing, we're monitoring. I don't see where we're actually taking any action to decrease the cost of pharmaceuticals in Vermont.
So that is somewhat of the intent of this. It is to bring in all these experts and others to develop a model or options for the board to review and analyze prescription drug costs and see what the best mode of action is. I think with this Friday deadline and this is pretty broad language, and we wanted it to be broad so that we had some more power to develop.
But again, I just don't see the action in this at all, other than monitoring and...
So I guess if I were to be completely honest, if we were to take action, the path would have maybe a lot of resistance. So I know there is this struggle to want to have action, and maybe Jeff can speak more of this as well, because he is in this work.
I want to see prescription drugs at a lower cost.
Mm-hmm.
I want to see insulin products at a lower cost, and I just don't see that this bill does that.
Can I chime in, my friend Christina, because I know you know this, but you probably don't have it at the top of your mind. Susan Barrett, Executive Director of Green Mountain Care Board. We, and also this committee, has worked closely with NASHP, National Academy of State Health Policy. They're a nonpartisan group that brings together states to work on issues such as, they have a task force on prescription drug price transparency and reduction in prices of cost control for prescription drugs, and I was an initial member of that task force. So they are working right now on some additional programs that are not ready for prime time, and so we can't share the specifics with you, that we believe we would like to work on with them and could fit into this language and does exact, and the intent of the work that they're doing is going exactly where you're going in terms of getting to the root of the matter. So I don't know if there's language we could add, like to work with Mashpee on additional, I don't know what else I can say.
We will work with Mashpee either way. We are and we have been, and the timing's just off.
Yeah.
I believe Trish Riley said that within the next month.
From Nashville.
Yes, next month or two, it will be up and proposed, and as long as everything goes well, again, we just can't. It cannot be shared at this time.
And if I can just add one thing regarding National Membrane. We worked with them on the drug importation for those who weren't here at the time. So there is a working relationship that's established with them, which is good. Are you good? I know you're not good, but are you going to ask me questions?
Well, I guess I would just also say if we had something that we could put on the table to take direct action on at this point in time, would we put it on the table? I don't think we have that. I know the Senate has looked at issues around insulin and capping insulin co-pays or some element of that. That will be coming over from the Senate. That's why we did not take that specific issue up in this committee. But there are and I don't think we're prepared at this point. There's the bill in front of us that would task the Green Mountain Care Board with actually setting caps on prices and controls on prescription drug prices. I don't think we have the ability to move that bill. That would not move anywhere at this point in time. It would simply grind into endless testimony. But I think the intent is to try to give the Green Mountain Care Board some additional ability to dig into prescription drug pricing issues in particular and position them to work with us with more specific targeted proposals that hopefully will emerge in the medium term, if not the near term.
Exactly.
I would just say, if I have your assurances that you're going to do something, that we're going to have some sort of action, hopefully, then I will support this bill.
I think it's a frustration that we don't have some, and the issues are complex about what we can do at the state level and what can be done at the federal level. We're kind of caught in the midst of a lot of this.
Nashville likes to continuously remind us that a lot of these proposals that they have is met with resistance, and that takes time and money sometimes. So we were trying to, I think everyone agrees that we need to do more. It's just we need to find out what's the best path to do more.
David and Lizzie.
Brian.
Oh, I'm sorry, Brian.
I've been listening to this. Advisory groups, suggestion groups. We're going to look into this. We're going to think about it. We're going to talk about it. And we're going to discuss it by January 15th, 2022. That's sitting in a room pedaling a bicycle and pedaling, getting absolutely nowhere. In a year or 2 years from now, you're still sitting in the same living room pedaling a bicycle. And right now, and the Green Mountain Care Board has had plenty of time to do something about this, about prescription drugs, and nothing's been done. And that's all we do in here is talk about it and listen to people talk about it. Why doesn't somebody actually do something?
So our regulatory role is given to us by the legislature. So what we work on is in statute, and with our limited staff, that's what we can do. And there were various bills proposed that would have given us that more authority, but like Chair Lippert just mentioned, there.
And I would say, I mean, I've only been in this committee for a couple of years, but every year we have tried to take steps, and it is frustrating and it is slow.
Steps, particularly
around prescription drugs, I'm sorry, yes. And it's frustrating and it's slow, and in some guards, we have our hands tied between, as Bill said, what we can do versus what the feds have to do. I hear your frustration. I'm there too. I mean, prescription drugs is one of the reasons we have high healthcare costs. So I think this is a good step in the right direction. I wish it was more too, but I think it's what we can do.
I could remind this committee that there are other reports that the state, the board has a report relating to prescription drug costs. There's many transparency reports that are for transparency. So this is really to see what action we can take and just kind of evaluate, just like everyone has mentioned, what the state's power can
And
be.
can I be blunt and just say that if we had a proposal on the table here for the Green Mountain Care Board to take specific action, we would be hearing why would the Green Mountain Care Board, why should they be taking specific action? Why should we allow them to take action? So I mean, and I'm not directing that at either of you, but just generally, this is the dilemma we are in the midst of, and this is trying to give them some additional ability to work with the appropriate people to develop the capacity for us to then to identify and debate, frankly, specific actions. If we were talking about having the Green Mountain Care Board actually put price controls on prescription drugs, which is embedded in one of the bills, we would be needing to take some very extensive testimony. And if we come to that, if we ever come to that, that would be a significant step beyond which we have not given them any type of authority. So it's a frustration for all of us at a time when we know that prescription drugs, and I'll just say that for myself, we passed the first bill on price transparency in the country around prescription drugs. We were the first state to pass a bill around importation, allowing to work with the federal government about the potential of Canadian imported drugs from Canada. And my point of view is we need to keep just taking step after step and not stop. But we are not going to, but there's not a single thing that is available to us to do at the moment that I'm aware of.
Except make noise.
Well, and this is part of that. Yeah. I agree. And I think, frankly, to be quite honest, and I'll just be really blunt about it, for us to make noise on a bipartisan, tripartisan basis, and that's what we have done successfully up to this point. When we have moved the bills on price transparency in the face of objections from the pharma and the pharmaceutical industry, when we did Canadian drug importation, this committee collectively on a tripartisan at the time basis said we need to make noise and we need to make it clear that there's action that needs to be taken. And so I'm hoping that we can continue to do that even in the face of knowing that this is not sufficient.
I would like to see more follow-up rather than wait to 2022 on. I know Town of Derby's still waiting for their Y2K generators. That's 20 years ago. The state promised the Town of Derby generators when we were going to turn into Y2K. Still waiting for them. I hope we don't have to wait that long for something like this to happen. That might be a little bit of an over-exaggeration, but
can we add a line about giving Derby their generators?
I think so. I think we should do that. And where are the Derby generators?
Yes.
I can add here, we're happy to check in with this committee on our progress towards this. I think Christina did an excellent job describing the conundrum we're in, that we have other duties we're performing, and we are very, to your point about the task force and the technical advisory group, we have a very successful technical advisory group, the primary care advisory group, that actually, I believe, brought to light a lot of the workforce issues that you're dealing with now. So I think that this is a promising avenue. And I don't know if you want to put in a check-in, we're happy to do that next year as a progress on our a check-in on our progress. That's easy enough.
And if we are,
that would be absolutely appropriate, because that's what our expectation is. That this is not something we're going to sit back and wait until 2022 for.
If we are being honest too, this has no cost attached, but it will take a lot of staff time, and after the session ends, we are quite busy. So We are happy to do a January check-in if that's what January
There
2021.
be a January check-in, January 2021 check-in with the House Health Committees and the appropriate.
That helps remind us to.
Yes, absolutely. It does.
As much, you know, as Lucy said before, we ask for stuff and then we run out of time.
And we're a very transparent board, so we will most likely have a committee page on this. We will post meeting information. We will make this as transparent as possible.
Okay. Given the context in which we're doing all of this, I'm going to suggest that. Thank you. Unless there are other specific questions for Christina, there are. Okay.
I just was. You also did.
Go ahead.
I just was wondering what in this is outside of the board's current powers versus what new authority does this grant the board?
So this really doesn't. We came to this realizing we can use our existing authority to create a technical advisory group. And since there were all these other bills that were this bigger ask, we took into consideration all the other bills and came up with this that we felt, we can't make everyone happy, but we felt with working with Jeff Hochberg and internally that this is what we can do with our current staff, our current timeline. And so this isn't giving us anything new per se, but this is, to put in language that we will come back and report in 2021 and 2022, really.
I have two questions, and they may not be best directed at you, so you can say so if you want. I'm not clear on what, in number 2, what a prescription drug initiative would mean.
So the effectiveness of prescription drug initiatives, I guess when we propose recommendations as to how to control prescription drug costs or be more transparent or whatever it may be, how effective those initiatives may be.
Okay. So, and if everyone understands that that's what that means, the language just seemed a little vague, prescription drug initiative, but if it's clear to the board, then good. And then I'm also not clear myself on, in number 1, the difference between pricing and costs. So we're using both of those terms to mean not the same thing?
So I guess pricing is pricing, which can mean various things, but cost to, say, the consumers,
the ultimate cost to the consumer. So when we say the relationship in the end of part 1, relationship between prescription drug pricing and consumer prescription drug costs, that's retail or list pricing? Is that what we mean by the first?
List pricing, but then the costs. There's so many.
I can help. So there's quite a few different costs, and Jeff could probably take a minute and walk through it when he comes up. That happen through the supply chain, and then what does the customer and the patient end up paying? There's a lot. When we drafted our last bill, it was very like wholesale acquisition costs versus some other costs. We'll let Jeff comment to that. So hold that question too.
Okay.
Anything else for the Green Mountain Care Board? Sorry.
Yeah, I have one more question. I don't know whether this bill should cover this, whether it's an issue that you would look at. But it has to do with the coronavirus. I don't know what type of pharmaceuticals or meds that will be required to attack this virus. But will the Green Mountain Care Board also be looking at, say, price gouging that I'm sure will probably come up eventually?
I'm sure. That's why we kept this language pretty broad. We can look at everything and anything.
So this would be covered and would be reported, I guess.
Yeah.
I think that's an important point. I think, in this kind of emergent situation, we would particularly need to be aware of protecting Vermonters from being exploited. Thank you, Christina.
Thank you.
Jeff, would you like to comment?
Absolutely. So, Jeff Hochberg, Vermont retail druggist and pharmacy owner in the state. First, I think I need a tissue to cry because I think the comments that I just heard from the committee about wanting to do more to tackle this, it's been my almost career endeavor here for the last 10 years of advocating to this committee and others about the need for transparency, the need to make change. And what I've come to learn, maybe apart from maybe Susan and maybe Mike, who've probably been at this a little bit longer than I have, the point I'd like to make is that, I can come here and I can give you a bill. I could give you NCOIL's recommended language for reforming PBM that's going to have downward effect on patient copays today, but then turn around a year from now and may have lasting impacts on premiums. And I can say that I'm being underpaid on these drugs, I'm being overpaid on these drugs. The hospitals are having excess access issues to these meds, the 340B pricing, the insulin pricing. There's so many factors that go into this that the one thing that I've learned over the years is that what we need more than anything is true, reliable data to move forward effectively. And that's what this bill does. And that's why we fully support this bill. And it is, I think it's a milestone to really put it in statute, to actively drive a cost containment data acquisition program that is going to perpetuate throughout our lifetimes. And that's what's key. Because we could institute something today, we may not see any savings tomorrow. And we want to be able to make sound decisions going forward because we've tried things in the past and they just haven't panned out. Well, why? And we hear from different stakeholders. You hear from me that, this is what's going on in pharmacy. You'll hear from the insurers, this is what's going on in the insurance world. So there's a lot to it. And I'm very thankful that this committee is concerned and wants to act today. But I think this is going to be this appropriate step to move forward effectively and given the time crunch to move forward this year to have something that actually goes across and without drawing in just everyone from the woodworks. So that said, we fully support this bill, and I'd like to thank the Agreement on Care Board for their work on coming up with this. And I'm always available to come here and testify more to the comings and goings of pharmacy matters. I'll just start by saying, too, that one, I don't have any hand sanitizer available for you. So I can't sell anymore. It's not available to me.
I thought you wanted some right now.
I have my own stockpile at home. Thank you, though. To the board's or to the committee's chairman, your comments earlier about what some of the things we need to think about now in the immediate. I have actually thought a lot about this. We've been in active discussion both within our store group, with other stores. I've been in conversation recently with the national committees. There's a lot of discussion going on about what is going on currently. And there are going to be access issues. There already are access issues. I think one thing that I would like to stress to this committee that I would, thinking outside of the box, some things that I would like to see are maybe an emergency access request. Okay? You asked the question about what are the treatments for coronavirus. Viruses, there are a heck of a lot of treatment. Unless you have a drug that's developed specific to target a specific virus, there's little you can do other than really protect against treat symptoms, and you can treat secondary infections. What we're seeing and what we're being told at the pharmacy level now is to try to gain access to inhalers, to steroids, to antibiotics, and all of those are already under allocation from all the wholesalers. So the wholesalers are already limiting how much is available to the local pharmacies and to the hospital entities. So the drug supply chain has been disrupted, and a lot of it has to do with China, because 80% of the raw ingredients used to manufacture all drugs in the United States come from India and China. So there will be a slowdown that will be perpetuated beyond this quarter. It will continue on at least through quarter two before we see a true reform of it. Also, the drugs that are being investigated by the big manufacturers, by Gilead, by AbbVie, you see these in the headlines. These drugs are all very expensive drugs. They're usually limited distribution drugs, and they're usually restricted network drugs. one thing that I think would be helpful is that maybe an emergency measure to require that these drugs be available to every access point possible within our system. So every retail community pharmacy should be able to access these products as appropriate and go through so that we can distribute to the general public as quickly as possible.
So let me ask you specifically about that, because we are looking for immediate recommendations, but that sounds to me like that's probably a federal recommendation rather than a state recommendation. Would that be fair to say, or am I misunderstanding?
No, because a lot of it is dictated by the insurance market.
It's dictated by?
The insurance market, even under the exchange book. So where certain drugs are acquired by patients is dictated to a level within the insurance market, and that would need to be uplifted in addition to any federal stoppages that may exist at the planning point. But there is, without question, a hard insurance market, narrow marketing of certain drug classes.
You're talking about prior authorization and...
Prior authorizations, certain medications, which they like to call specialty medications, have limited restricted networks. They may not be limited distribution drugs. I have full access to some of these drugs, but yet I can't dispense them to patients because I'm not in network to dispense them. So something like that may be of consideration, increasing access. One thing that I hear constantly in the news about is this massive move, which we're seeing today, about liquidation and move to capitalization for individuals and companies. So perhaps maybe a moratorium on deductibles so that constituents are only paying copays or even bottom tier copays in the interim here so that their own financial resources are not depleted amidst any potential fallout that may come so that they can prepare effectively. They can buy other consumables as necessary, water, whatever, just toilet paper, which is hard to get to. And I think the third thing that I would suggest for consideration would be something to protect the healthcare industry. Pharmacies, hospitals, physicians' offices, in order for those to work, all require significant infrastructure of staff. In the event of a massive outbreak, if our staff goes down, we cannot continue to service our population. What I think would be, and this is just an idea that popped into my head, is some assistance with small businesses to furlough positions so that we could self-isolate staff members to keep rotating in without any certainly, so that they can be compensated for this lack of actual work hours. But we could rotate people in so that in the event that there is an outbreak, they're somewhat segregated and can effectively manage with minimal staff so that we can continue to service throughout the outbreak. I think I'm kind of explaining that correctly. I don't know. It's just an idea that popped in my head.
I'm not sure I fully follow.
Let me try this again.
But I'm going to suggest that I'm not going to try to promote, but I'm going to ask you to think about it and try to articulate something further for us at a later time.
So, those are, I think, my comments.
I'm good. Yeah, thank you.
Mark?
About the bill, so you can find this. So I'm concerned that the language about the interested stakeholders, the board shall appoint interested stakeholders with applicable subject matter expertise as appropriate. Do you think that's clear enough and strong enough to make sure that it's not, the stakeholders are not lopsided, it's not one-sided?
No, I think that's sufficient enough. I think one of the things you run into is if it gets, I think the board, I have full confidence in the board to do that. I'm not concerned about that.
Right.
Do you think that January 15th, 2021 would be a better date than January 15th, 2022? Just your opinion.
My opinion would be, of course it does. I mean, the more information that comes, I mean, it may not be the full report. I think an updated report. I do not think that a solid report that's going to give answers, meaningful answers for strong, comprehensive action is going to be ready before 2022. It's just unrealistic.
Boy, that's a year.
I've spent too long trying to convince people about how pharmacy even works. I'm still doing Pharmacy 101. I think Brian Murphy and I think Susan Kowski are still doing Pharmacy 101 discussions here with various committees. It's a very complicated industry. So I think it's unreasonable for a full report to be issued by 2022 with some kind of update periodically or whatever.
Thank you.
Thank you.
So I'm going to ask that we're going to come back to this once we asked for there to be an addition of a check-in with this committee in 2021, and we'll come back to that in terms of having the language in front of the group. So I'm going to need to step back and think about how to touch base with all of you and how best to proceed. We have some new challenges on our plate as well as our ongoing work, and so I'm just going to ask you to be flexible and stay connected with Dennis and with our emails that'll give you an alert. We may choose to be back in here this afternoon, and in the meantime, we're going to be reaching out to the appropriate stakeholders to get further input, in terms of immediate steps that we can take to support Vermonters around issues of home health, mental health, pharmacy, etc. And while at the same time trying to move some of our agenda forward.
Yeah, I was just going to request of members, because we couldn't get to the affordability piece this morning, that to the extent you can get the time to read the language and ask questions offline in anticipation of us being able to discuss it at some point, hopefully. But to the extent that can expedite everybody's understanding, and you're able to do that, that would be great.
I think in the interest of everyone's well-being, let's stop for lunch.
Back to our questions around 464 and 808. We had some time yesterday to talk about data, and today I'd like to talk about training and data with the folks who are here in the room. And so I'm going to ask Ingrid Jonas to come and join us first.
Do you have anything online?
I do not. I have some things to hand out,
okay.
But yeah.
Old school.
Should not put snacks right in front of me during.
Boy, we want you to feel welcome.
Thank you.
How about a giant bag of M&Ms?
I saw that. Yeah. Good morning, everyone.
We're not kidding.
Right. The milk chocolate raisins are preferable, but I guess the M&Ms are.
We're talking a lot of cannabis today. So.
Yeah. Okay. Again, for the record, Major Ingrid Jonas, Vermont State Police. I'm a division commander. Also with me today is Captain Gary Scott, who's the Director of Fair and Impartial Policing, and also Betty Wheeler, who's our data analyst for Department of Public Safety, in addition to other roles. So I've prepared notes because that's sort of easier for me, but definitely want people to ask questions at any time during. It helps me to stay focused if I have notes to refer to. So just for some background, Vermont State Police provides primary law enforcement services to 200 towns approximately in Vermont, 90% of the land mass of Vermont, and 50% of the population. Our dispatchers answer roughly 89% of 911 calls, in addition to all sorts of other calls. We have 334 sworn members in our department and around 64 emergency dispatchers and civilian staff that cover our three sections: support services, field force, and criminal division. So field force is the officers who you see on the roads in marked cars. Criminal division, plainclothes, detectives. My division is support services, training, recruitment, fair and impartial policing, internal investigations, and other infrastructure and operational support to the department. What we refer to as fair and impartial policing, that mission is a fundamental principle to our department and has been for quite some time. And it's really fundamental in that we derive our power from the people that we serve. And without the trust of the people that we serve, we are ineffective as police officers. Our job is to promote safety in the community, and without trust, we can't be effective in our work. So the work that we do to ensure that our practices are ethical and fair goes way beyond traffic stop data collection, and is really a systemic practice and value system that we're always working on, from our hiring and selection process all the way through things like traffic stop data that helps to give us a diagnostic test of how we're doing and what we're doing in the field. I also want to start out by saying that any police action or inaction that is based on stereotyping is completely unjust, ineffective, and frankly unsafe, and goes against the Constitution and department policy. It's a fireable offense to use stereotyping of any sort to derive your law enforcement practices. Traffic stops and tracking those are one small part of the overall safety work that we do in Vermont State Police. So, for frame of reference, in 2018, because I don't have 2019 numbers yet, we made approximately 58,000 traffic stops. At the same time, we responded to just under 60,000 total calls for service. So 58,000 car stops, 60,000 calls for service. By calls for service, I mean responding to burglaries, domestic assaults, DUIs, etc. So about 1,000 domestic violence-related reports, 1,000 burglary reports, 1,100 DUI cases, 7,000 alarm calls. In the PSAP, the dispatching center in Williston, we responded to 141,000 911 calls. In the Westminster PSAP, we responded to 143,000 911 calls. Getting back to data collection with regard to traffic stops. So in 2009, we formed what is still known as the Fair and Impartial Policing Committee, which was basically a collaboration between community members and sworn members in our department to try to answer widespread concern about bias-motivated policing, in particular racially motivated car stops. We wanted to see if there was a scientific way to take a look at determining if there was a cause and effect correlation between a driver's race and the vehicle stopping patterns of police officers in our department. We wanted to know, does a driver's race or ethnicity or even other personal characteristics have a causal impact on decisions made by troopers in the field? That's what these studies are meant to look at. So, as folks know, that effort resulted in the development of data collection forms and the methods that were initiated in around 2009 in Vermont, Vermont State Police in particular. And I should note that that committee is still in effect, has broadened its mission, still is attentive to our traffic stop data, and acts as an advisory group to state police. I think you know, because the commissioner has testified here before, that we commissioned a national expert, Dr. Jack McDevitt from Northeastern University, to help us with our traffic stop data. Through that, we learned that what these data studies are supposed to do is take a look at discretionary car stops. So some of our car stops are considered discretionary and others really aren't. But the idea being that when you have discretion, do you have any patterns or tendencies in terms of how you measure out tickets versus warnings or car searches versus other actions that you take in that capacity. So on the back of the Vermont traffic ticket, yes, please. No, it's fine.
Is the reason that we're focusing on traffic stops because there's some discretion on law enforcement's part versus when you respond to a 911 call?
Yes.
There's no discretion?
That's correct.
Okay.
So, but it's important to kind of look at the nuance of that. So when you talk to troopers in the field, when I was a road trooper, if somebody was going 90 miles an hour and I was sitting in a U-turn clocking radar, using radar, gosh, that was a long time ago, but in any case, if somebody was going 90 miles an hour, I didn't feel like I had the option. Like, I'm too busy right now on my phone. Nothing like that. 90 miles an hour, you feel that that is your job. You need to stop that person. It's unsafe. But in general, we do, even just driving here, 3 cars passed me. Sure, I could have decided to stop one. I had another place to be and purpose, so I didn't. So yes, car stops tend to be looked at as discretionary to some extent. And then, certainly once you have a car stopped, you do have an amount of discretion in terms of whether you issue a ticket, whether you issue a warning, or one of each, so that type of thing. How you handle what it is that you find after you've stopped the car. Okay. So we were intending to study our discretionary actions as a result of stopping cars. Now, we made some pretty big mistakes when we, because we used the ticket itself for discretionary actions and others. This ticket is a universal document. This was the ticket that we were using for for a number of years, and it has a section here, and I can circulate this if that's helpful, because I don't know if folks have had a chance to take a look at a ticket. But you'll see that there's a section on the ticket. So after a trooper would stop the car,
Then when they're filled out.
pardon?
Then when they're filled out.
Yeah, right. So you'll see that there's a section on the right-hand panel where after the car stop is complete, the trooper would check a bunch of boxes. So what is the trooper's perceived race of the operator? What was the reason for the stop? And what were the actions taken? And what was the outcome at the end of that? Now, we use this traffic ticket for discretionary car stops, but we also use it when we issue a ticket for something that is non-discretionary. So we're dispatched to a car crash and we learn that the driver had no valid license or was exceeding the speed limit and caused the crash. So those tickets issued as a result of a non-discretionary response also got thrown into the mix. And that's just a kind of a side note, because what we did was we submitted 6 years of raw data, which was about 291,000 traffic tickets representing car stops. And a number of those were thrown into the mix that were non-discretionary because we used that document for discretionary and non-discretionary ticket-related activity. But folks know that in 2016, Dr. McDevitt and Dr. Stephanie Seguino from UVM both did analyses of our traffic stops with regard to racial demographics and disparate impacts of those. Yes, please.
Sorry.
No, that's fine.
This question was asked yesterday as far as how is the data that you're looking to collect, how does it determine what's on the ticket, what gets asked?
Right. So I was not part of the initial efforts to create that data collection section on the ticket. It's something that, in hindsight, I wish had been done in a more thoughtful way. But those categories are representative of what the statute now asks. So there are categories: gender, age, perceived race, reason for stop, search, and overall outcome of the stop.
So it's generally statute-driven as opposed to...
Currently, it's statute-driven. Correct.
Thank you.
No, it's a good question. It's something that I think could have been done in a more comprehensive, far-looking way in the beginning, but that's just my opinion. So as you know, good quality data is a prerequisite for outcomes that you can really learn something from. In the early efforts, there was no mechanism in Vermont for a standardized way of looking at how to check those boxes. So we heard about everything from troopers leaving the perceived race blank because they really didn't want to make an assumption about somebody's race, to checking boxes based on the outcomes that they had with passengers that they engaged with at the traffic stop, when really these types of data collection efforts are really only to be focused on the operator in the vehicle. So again, concern around standardized ways of looking at the box checking effort. It's very important that we're all measuring the same sorts of things. So I think it's also commonly known that after we had the analysis done of our initial 6 years, including all the error data in there, we learned that we searched cars at around the rate of 1 out of 90 cars. So 1 out of 90 cars that we stopped were searched. Our overall hit rate, which was a new term that a lot of us hadn't known of, but the hit rate is what's referred to as the when contraband is found in a car search. So contraband could be anything from checking the box because you had an underage driver who had cigarettes, which were illegal, to stolen property from a burglary, or heroin. So there was really, we weren't delineating between what type of contraband, but we were checking the box for contraband. Our search disparities with regard to race over the time frame of 2010 through 2015 showed that they grew. Specifically, our numbers show that we searched black motorists and Latino motorists at a higher rate than we searched white and Asian motorists. At the same time, though we had very high hit rates, so 78% of the time when we searched a car, we found contraband. We learned that we found more contraband when we searched white and Asian drivers than when we searched black and Latino drivers. Since that time, it's important to say that we have done an enormous effort with a lot of help from outside and inside assistance and consulting to clean up our data, meaning to make sure that what we are analyzing is actually representative of what we're trying to analyze. Discretionary car stops, actions only taken with the operator as opposed to conflating operator and passenger activity and so on. And this is a commitment we made because, again, it really all boils down to trust and willingness to work with your community on something that's important. Yes?
Is this still the only source? Or, I mean, everybody has in-car?
Well, so everybody, you mean in-car cameras and those sorts of things?
No, like data collection. I mean, if you link the ticket to the statute describes what must be on here.
Mm-hmm.
You have an elective ability to add more data collection.
Correct.
Through your...
Right, so we've expanded the data collection. Okay. So we also collect passenger-related information and actions with passengers, and we also have provided to analysts when they've requested it the breakdown of the type of contraband that we find. It takes a lot of work because it's not written on the document itself, but we can go through and do that when we need to.
Is it ticket-based or is it computer-based on the
You mean contraband?
No, just expanded data collection.
It's ticket-based or e-ticket-based, depending on what method the trooper or the officer is using. And then that's entered into our records management system by admin staff. So, let's see. So we've increased our accuracy in terms of data entry and the intended message for these types of efforts in the field by doing training policy improvement. And by training, I mean training the field and also our admin staff to understand really what is the mission here. We also have an auditing process that Betty can talk more about if you want, but it's something that we didn't have in the past, and that has really resulted in much cleaner and accurate data. The audits occur quarterly. So after the auditing process is done and the year ends, we then go through and clean up all the errors, get rid of all the duplications, any blanks that we can eliminate. And then we meet with our Fair and Impartial Policing Committee in June of every calendar year, and then announce and produce our data to the public after presenting it to our committee.
It's on the Fair and Impartial Policing Committee.
Correct. Oh, sorry, who sits on it? I'm sorry.
Who sits on that?
I'm sorry. So we have a number of command staff and troopers at all ranks, and then a very diverse range of leaders in Vermont, or just citizens who care about these issues. We coach. The committee is co-chaired by myself and Dr. Eitan Nesredin-Longo, who is he's a professor at a college in southern Vermont, but he's also the chair of the Racial Disparities in the Criminal and Juvenile Justice System panel. And he's been part of the committee for quite some time. I can give you a list of all of the members, but
if Alexa was here, he would have answered that question.
Okay.
That's okay.
Okay. So in 2016, State Police created a new position in the Director of Fair and Impartial Policing and Community Affairs, and the focus of that position, it's really we're the first department we know of to have created a specific position, is to really work with all levels of the department to ensure fair and impartial policing at every level. So I mentioned earlier, but it really boils down to what kind of values you put forth as an agency, from how you select applicants and all the way through your policy or procedure, how you message the data collection effort and its importance in the scheme of things. So that position has been around since 2016. One of the issues that we had concern about, and again, we're troopers, we're not data experts, but Jack McDevitt used crash data as the baseline or benchmark from which to compare our data to in those initial studies. And it's something that we think is really important to get right. What is the baseline that your department's data is being compared to? And that answers the question of who is driving in Vermont. So it's really important that there be a way for us to get correct who is driving in Vermont, so that an agency's data can be compared against that accurately and fairly. So a lot of times I hear when I go to meetings or public forums, there's an assumption that who lives in Vermont should be representative of who's driving in Vermont. And officers don't agree with that assumption. You can't just simply take a look at census data and say, well, that should represent who's driving on the roads, because that doesn't account for all sorts of other things. And the other thing that's been, so crash data is what Jack McDevitt used. He took a look at Agency of Transportation crash data and said that people who crash on the roads are representative of who drives. And that's probably true, to some extent. But my point is simply, I don't know what the exact answer is, what the baseline should be, but it needs to be accurate so that we can really learn what our numbers show around stopping vehicles. Because if you don't know who's driving, how do you know what your stop data is indicating? So if I used to patrol up in Franklin County. If I happen to be patrolling within 10 miles of the Highgate border crossing and stopping only cars for exceeding the speed limit. And then my supervisor would take a look at my data and say, wow, do you have a bias against Canadians? You're stopping a disproportionate number of Canadians compared to other drivers or Vermont residents. And then my supervisor would say, oh, well, the alternative factor is that you're patrolling in an area that is over-representation of Canadian residents. So those types of things have got to be considered. Other sorts of questions that need to help us answer: does a driver's race or ethnicity or other personal characteristics have a causal impact on the decisions made by officers? As people who drive more are at higher risk of being stopped by police. People who drive poorly are at a higher risk of being stopped by police. People who drive in locations where police tend to stop cars more frequently are going to be at a higher risk of being stopped by police. And people who drive vehicles with visibly defective equipment tend to be stopped at a higher rate by police as well. So another thing that I want to point out is that for state police, and I know other agencies have this as well, a robust complaint and internal investigation system should be in place, because things like discrimination are unlawful and need to be addressed head on by the agency. So I like to bring up this aspect of our agency because it is an important accountability component and an internal checks and balances. So our complaint and internal investigation process is overseen by the Commissioner of Public Safety, as well as a civilian review committee called the State Police Advisory Commission. Our policies and procedures include a requirement that all members report any wrongdoing or misconduct of other members. It's a Part A violation if you fail to report and know about a misconduct violation or allegation of a member in our department. In 2017, we had, I want to give you a sense of the numbers of complaints we get regarding discrimination. And I'm not saying there aren't a number of complaints every year of all sorts of categories. But in 2017, the commissioner opened an investigation for a discrimination allegation. It was investigated and unfounded. We had 0 complaints of discrimination in 2018. We had 1 complaint of discrimination in 2019 that was investigated and unfounded. Discrimination in our code of conduct is a Part A violation, again, one of the most serious, and it states no member shall discriminate in favor of or against any person or other member on the basis of race, religion, politics, national origin, sex, gender identity, sexual orientation, lifestyle, or similar personal characteristics. I sort of wanted to set that context, but now I want to talk about some of the tools and early intervention systems that we've set up in state police regarding traffic stop data. So we have training at every level around bias, unconscious and conscious forms of bias. The traffic stop data that you've looked at is submitted along with through the ticket or e-ticketing system to admin staff for entry. Our analyst does quarterly audits of our records management system, checking radio logs to see how they match up with the tickets themselves, to make sure that the tickets or warnings that are issued match what is in the radio log. If there are errors, she generates a report, and those reports go directly to the 10 station commanders around the state, whose responsibility it is to get answers and clean those things up. Admin staff have had training to do proper collection and data entry. From the months of January to May, the analyst verifies the data, cleans and eliminates duplicates, errors, and gets the station commanders to fill in any missing entries. As I mentioned earlier, we then release the data publicly in June. We post it on our webpage, and we also provide it to Crime Research Group as part of the statute. We then work with the co-chair of the Fair and Impartial Policing Committee to help us determine from our total organization, folks who are out patrolling, here are our stats. What should the number be that would result in a trooper being called in to meet with, say, a supervisor to discuss what their racial demographics show in their traffic stops? So I believe that last year we gave station commanders the directive based on input from the committee that troopers with car stops above 6%, where the motorist is perceived as a person of color, would come in, would take a look at their data with their supervisor, would do some spot checks of their videos and audios of their car stops to try to determine if there was any discriminatory behavior behind the disparities. So a lot of times we find that racial disparities in people's minds are synonymous with racial discrimination. And that hasn't always been the case when we look into traffic stop data. So there can be a disparity, but is it driven by discrimination? If it's driven by discrimination, then it needs to be swiftly addressed. But when you take a look at people's videos of their car stops or their searches, and you find that those stops and searches are based on reasonable suspicion or probable cause, then you have what is the requirement for a car stop or a car search. So having those conversations with troopers needs to be done in a respectful and appropriate way, because there is a difference between types of disparities and improper practice or discrimination. Does that make sense?
Mm-hmm. Yeah. You threw something out there that I don't know what it meant.
Oh.
Correlating the radio data? What comes over the radio data that would be inconsistent with the report?
So radio logs show, and I might have to have Betty specify it, but what I can tell you is that like a radio log will show that a trooper stopped a car for speeding, let's say, and yet there's no ticket associated with that engagement. So when you dig deeper, you find that the trooper stopped the car for speeding, but then learned that the driver was, that he or she had suspicion the driver was under the influence, and then ultimately arrested that driver, didn't issue a ticket or a warning because it resulted in an arrest. So they didn't pile on other sorts of things. However, Vermont statute requires that for every roadside stop, there's a ticket or a warning where data is collected. And so that still needs to be counted as a roadside stop, or else it goes unnoted. So radio logs can help cross-check those types of events, that stops happened but no paperwork represented the stop.
And it's both the arrest and the get out of jail free. You can go sort of thing.
I'm sorry, I don't know if I understand the question.
Well, I
mean a warning. You mean a warning?
No, not a warning. Just no record whatsoever.
Well, no, so there needs to be a way to document that event. So
radio log would be your only way in that particular kind of situation.
Well, so the radio log shows that there was a car stop, but there isn't a subsequent ticket or warning associated with it. There's just an arrest. There needs to be a way to document those statutorily required boxes.
Jim Howland, GP.
Major, it sounds like you have a pretty full review, look at your data, but you mentioned a little while ago about reviewing instances that might show a bias from the officer. What do you do in those cases?
Well, I can tell you that we don't have a lot of those cases, so it's not something that we're experts at, that we can reach a firm conclusion that the troopers' actions are driven by bias or discrimination. So it's not a common occurrence that we're reaching that conclusion. If that were to be the case, that would be it's a serious policy violation. Bias-based policing is a form of discrimination. It's grounds for termination. We would try to fix that person. If we were able to fix that person and through training and other forms of remediation, then we would do that. If the person was not fixable, then we would follow the due process and terminate them from working for us.
So how often do you have your troopers go through implicit bias training?
Well, we have a number of different stages in which troopers at different ranks and levels go through training. So in the pre-basic, which is the very first phase once they've been hired and they're in a 3-week initial phase of our training, they are, Gary meets with them as well as a member from our Fair and Impartial Policing Committee to talk with them about the overall mission of the department and how fair and impartial policing is fundamental to our practice. That is a 2-hour block of instruction for just like the 20 new recruits that are in our part of the academy. In the basic academy, I see that Director Cindy Taylor-Patch is here and can talk more about what is the way that fair and impartial policing is infused in all of the basic training. In our post-basic for state police, we have an 8-hour block on fair and impartial policing that is led by Captain Scott and also a consultant that we work with, who's someone who helps our department on the whole in this area. So it's an 8-hour block of instruction for troopers who have graduated, but they are not yet out in the field. And then I am trying to figure out how many hours annually is required. I think that I will defer to Cindy for what's required of all officers for the state of Vermont. But VSP, again, we have a consultant whom we pay who works with, comes to command staff meetings and does a 1 or 2 hour block of instruction. And we're able to send Gary out to do barracks level trainings on, say, proper collection of hate-motivated or bias-motivated crime and how to investigate those differently in a more broad way. So we have Gary and others at our disposal to send out on a barracks level. So it would be hard to quantify, 4-hour block here, 2 hour. And again, we don't want to look at it as like checking the box. This trooper did 1 hour of bias-free policing training online. We don't see that as a comprehensive enough way to sort of tackle this issue. Yeah.
So you mentioned earlier from 2010 to 2015, there was a growing disparity of police stops based on race. So
stops and searches.
Searches.
Yeah.
So what's the current trend?
So we don't have the 2019 data all cleaned up yet, but we have 2018, 17, and 16. And I'm going to share that with the committee as well. So the first page is 2018. So if you go down here, the searches, total stops with searches, you see that midway down the first page? So total stops with searches, and it goes by demographics. So 322 white operators were searched, 25 black operators were searched, 5 Asian operators were searched, 15 Hispanic or Latino operators were searched, 0 Native American operators were searched, for a total of 367 total stops with searches in 2018. And then you can follow down through and see the results of those searches. So if you take a look at Asian operator searches, there are 5 of those, 5 out of 5 resulted in evidence or contraband found. 2 out of those 5 resulted in an arrest. If you scroll all the way down to the bottom, out of those 5 total for the year, that indicates that 100% of Asian motorist searches resulted in contraband being found, for a search rate of 0.41 for Asian motorists. And you can do the same for whites, blacks, Asians, Hispanics, Native Americans. So you see our search rate for whites is percentage-wise less than our search rate for blacks and Hispanics as well. Can you see that on the bottom?
I had a couple questions on the actual tickets and things, and we got more into the, got off track, but since it's my turn, if we can go back to
sure.
Real quick. You advised, Major, that the state law requires the, at least I want to clarify that you advised that the traffic stop and racial data is documented.
Correct.
So, having said that, is there a policy that would be as P now? That
yes.
A written warning has to be given versus a verbal warning. And the reason I ask that, if you have a written warning, you have written documentation of the racial data collected, or a verbal, you might not. And I question how a radio log would have that racial data. See what I get that? So is there a policy that you have a written warning, or you have to give something in writing so you can document it, or
yes.
if not, but go ahead.
So there's policy, and I don't have it memorized, but the policy states that we don't give verbal warnings.
Okay. Okay, and that, I think that's a good idea myself. Is most PDs in the state have that same policy? Because that's not law, right? But
yeah, I'm not sure if they do. I think it's hard to say because there's so many different PDs, but our department has a policy that no written warnings will be given.
Okay. So when you're referring to, you're comparing the
verbal warnings, I should say. Sorry. Thank you.
The number of stops and things by radio logs, because there was no paperwork issued on it. Paperwork being your ticket.
Correct.
Or a written warning, different form, obviously, issued because you arrested somebody like on a DUI or something, whatever. But if you stopped me for something and I didn't get arrested or cited in the criminal court for something, I would have at least a written warning.
Correct. That's what policy says.
Okay.
Yes.
Okay, that's good. And then just a little off the thing. Do you guys have e-tickets now? So do all your cruisers have ticket printers or not? Phasing them in.
Yeah. So our fleet staff has been phasing in the printers and the other equipment necessary for for e-ticket, and I can't remember if we've completed every single barracks or not, but we're getting close.
Is it saving time to trooper to sit there on a laptop and do
I
the
think it
entry,
does.
or is it quicker to write it?
It must. I mean, that's one of the, especially for when you're writing multiple documents, like if there's 3 tickets or a ticket and 2 warnings, you don't have to go through and manually.
So auto-populate the basic data, you just put the events in there.
Correct.
Good idea. Thank you.
Rob?
Could we back up to the search rates?
Yep.
I'm curious if, when does age come into part of the equation about whether you're going to search or not, in that we all know that Vermont has an aging demographic, and it would make sense that you're going to stop more whites and people of color because that's how our population is. But the decision to do a search, in other words, like I have a 98-year-old grandmother who still drives, and if she was to get pulled over, I'm assuming that an officer probably wouldn't be so apt to look for contraband or go through that thought process with her as they might with, a 20-something-year-old person. Does that?
Well, so I can tell you that age should never be a driving reason for why you would. It's not a. That's another personal characteristic that isn't a driving reason behind determining reasonable suspicion or probable cause to take an action. There are other things that need to be in place in order to give you what you lawfully need to do a search, which is really a seizure of somebody. It's not taken lightly, and it needs to be very much based in those lawful reasons, reasonable suspicion and probable cause. But in general, I mean, sure, if I were to stop your 98-year-old grandma, then I wouldn't necessarily be, my first thought wouldn't be, I wonder if she has stolen property. Do you know what I'm saying? If there was a TV in the back seat, I wouldn't assume that it was, stolen from somewhere. I would hope that I wouldn't assume that when I stopped anybody, but probably because I'm human, I wouldn't assume that correct. And so that's a good point. It brings up a point, at least to me, that as human beings, we all have these types of, our brains want to work in this way of like putting people into neat little boxes and stereotypes based on basically how we look. And it's pretty, sometimes it can be helpful, right? Because it helps us make sense of the world quickly, and instead of having to just take every single situation with a total blank slate. However, it can also lead us to make grave errors if we're operating only on our assumptions.
So looking at 2018, how would you interpret your findings, and then what would the follow-through be? We're collecting data and then we're using it for training purposes and for certainly to know more about stops, but if you could elaborate on that, I'd appreciate it.
So our station commanders have to own the data. So they have, for each barracks, they have this sheet for their own barracks with a breakdown of their members. And they can take a look, and in theory, they could see if there was someone who looked like an outlier, whose traffic stops and or searches looked outside of the norm for that barracks. And it would be incumbent upon them to look into that further, pull videos from searches or car stops, listen to interactions, sit down with a trooper and talk about what their method is for ticketing versus warnings, or ensure that they are following proper procedure around decision making for car searches. So each barracks commander has this, but for their barracks itself. And then they work with their patrol commanders, supervisors to look at troopers and bring them in if necessary and talk with them. Does that make sense?
Would additional training be required for a member who has data that's being an outlier?
So it could be. So we found, I was actually the person who went around the state when we first had the 6 years of data, the initial effort that I talked about with Dr. McDevitt, where we decided as senior command that any trooper with 4% minority stops or above would come in and meet with me and have a discussion. And I wouldn't want to take up all your time today talking about what that was like, but it was challenging. Those weren't easy conversations. But the outcome could result in training. The outcome could result in, you can find all kinds of things when you look at the way that people engage with the public in traffic stops, and they might need to be reminded that we follow this procedure when we engage with motorists. One example is that it used to be that you stop a car and say, "Do you know why I stopped you?" And we received a lot of feedback through our FIP committee that is sort of a dehumanizing, uncomfortable thing. In fact, it's better if you state why you stopped the person right out of the gate instead of having that awkward tension and people wondering what's happening. It's fear-inducing. So we could learn through looking at videos that, wow, this trooper is not following that procedure well, or that trooper is doing a great job with that procedure, getting right out of the gate. I stopped you, Trooper Ingrid Jonas, I stopped you for speeding. I'd like to have a look at your license, registration, and insurance. So you get that out of the way right away. So something as simple as just, is the trooper following what is now policy for the engagement when you do make a car stop, all the way up to, wow, the trooper needs better guidance on the steps for conducting a search and establishing probable cause for a search. And that would be something that is more extensive, training around proper search and seizure and so on.
Did you find that this extra training and the meetings with the officer resulted in a positive result, that their rates dropped after that?
I think that we're going to see that over time. What we found was that the standardization of checking boxes and making sure that traffic stop, that discretionary car stops are the ones in which you're submitting the data, is that message is clearer, but these things are taking time. So I think that yes, but that we'll need to see a lot more years and a lot more data to show how it pans out. In general, officers don't really like to be called in to meet with a supervisor and talk about this kind of thing, and that these are men and women who take a lot of pride in the work they do, and who understand that without the trust of the public, we can't do our work effectively. And so it goes to your heart to think that something about your numbers indicate something discriminatory. It's not a great meeting to have or to be part of, but it does lead to good discussions, and it's growing pains and culture change, basically.
Jim, Bob, and Ron.
Yeah, Major, I commend you for looking at this, studying it, following up, doing all that you're doing. And maybe this is an unfair question to you, but you're fortunate in that you have a large organization and you have folks like yourself that can devote some time to this. One of my towns has a 2-person police department. How do they do this?
Well, I hear you, and I think that if there's a standardized way of understanding what the mission is for, what we're trying to, if we have a common goal, we want transparency, we want fairness, here's how you accurately check the boxes so that you don't make mistakes. And then, I mean, a two-person department in I assume a small town, you have to also understand through experts, are these statistically significant numbers? Can we really learn something from this? Is this enough? Are we making enough car stops? Is there enough, diversity in this particular area for us to learn something from this? So I think, it's state law that we collect this stuff, but then we need to, understand the importance of the mission, but then we need experts to tell us, does this teeny town, can we learn a lot from this teeny town's data?
Thank you.
Mm-hmm.
So you're doing a lot of look from the troopers into what they do, and it seems like you're starting to do a lot of look into why they do. You just talked about correlation with people who stand out statistically. How deep are you digging into other factors in the workforce, their age, their number of years of experience, their training history, in terms of how often they pop up on the high spikes and dragging in? The more seasoned they are they less just out of academy aggressive in enforcement, or is that something that mitigates?
I think those are all valid questions. I don't know. I don't really have specific answers. I think that in general.
So we're not tracking that kind of thing?
Well, I mean, it's trackable. Certainly, every barracks knows the time on for the member, whether they're new, how long they've been on, whether they patrol and have a more of a traffic safety orientation versus a criminal investigation orientation. I don't know. I think there probably are comments to make about that. I don't know that I could speak anecdotally toward trends. I will say that newer members of our department really embrace and appreciate these types of discussions more so perhaps than those of us who have been on for a really long time. And I just noticed that in general, new troopers are like, oh yeah, I'm comfortable talking about these types of issues around inclusivity and diversity, whereas some of us who have been around forever can be a little more resistant to those ideas. So that's a generalization, but.
You had referenced the crash data before. Is that being used currently as some sort of a baseline? And if it is there any correlation between what you're seeing in the race data and this report?
So I might have Betty chime in about that, because analysts use different benchmarking or baseline data. The crash data even itself has been challenging, because not everyone can agree that people who crash represent people who drive. So, but yes, the crash data is being used. And I might have Betty expand more on yeah.
I just have a comment to share. I think it's well known now that Vermont faces a demographic crisis, and I think one of the strategies for working through this is to be able to attract and retain people of color. So what you're doing is really, really important. And I heard of a story of an African American who was coming to Vermont, landed at the airport, rented a car, and he's halfway to Montpelier. He had to pull over. He had to take a phone call. And then he saw blue lights approaching him, pull right up behind him, and he starts to panic. And the officer approached him and said, "Is there anything I can do to help?" He was the director of the national office of the League of Cities and Towns. And he was here to decide if he's going to have his national conference here. And he did, because of that exchange. So this is really, really important.
Thank you for sharing that. Appreciate that.
Do you have any other thoughts for us, or should we see if Betty can?
Yeah, I think. Would you mind doing that?
No.
Okay. Yeah, I just appreciate the time and happy to be here.
I have one other question for you, actually. You're talking a lot about the training that troopers get when they come into the force, and then sort of the ongoing training and the uncomfortable conversations that they might have to have if their data is showing that there might be some bias in their stops. But you said your division is responsible for recruitment and hiring.
Mm-hmm.
Do you ever try to screen people at the time that they are expressing an interest in becoming a state police trooper to find out whether they come in with biases?
Yes. So, and I tried to touch upon that earlier, that we do view from the very beginning of recruitment and selection, that's a critical place where we instill the values of the department. We don't want to attract folks who are certainly unconscious or consciously acting from biases. So the way that we do that is through the process of, when they're interviewed as part of a panel of commanders interviews applicants one by one and asks and gives scenarios to see how they would respond. Just as, these are young people who are attracted to policing. We throw scenarios at them and listen to their thought process. And we give them specifically examples of how would you handle it if you received a call from a citizen, in a town who said, "I'd like to make a complaint. There's an African American man parked in a car on my street." How would you handle that call? And you can learn a lot from people about how they talk about these types of things that we're looking at as a society, racism and blatant forms of it, unconscious forms of it, etc. So they will then be rated in how they answer scenario type questions. And it's not just those types of scenarios, but, and then there's an extensive background process that occurs. So a detective is assigned to this person if they've made it through several steps in the hiring phase. And the background is intended to get at how they've conducted themselves in their lives thus far. Now, granted, a lot of these folks are like 20-year-olds who live in their parents' basement still, but we are...
But many of them live their lives on social media.
Yes, exactly. And so we go into their social media and take a look at what they value and what types of, how they portray themselves and so on. So, yes. Okay, thank you.
Hello.
Thank you for being with us this morning.
Thank you. My name is Betty Wheeler, and during the day I work for the Agency of Digital Services in the Department of Public Safety as a systems administrator. And my part-time job for the Vermont State Police in the evenings allows me to fulfill my passion of working with data. So what I do for them, and everybody usually laughs at that, yes, because it's like data. What I do for them is I work with their traffic stop data. And you asked a very good question earlier about what happens with the radio log and how do I look at that. So what I do is I go into their CAD RMS system and I run a report that tells me how many traffic stops that particular trooper had. Then I look at how many demographic entries are recorded for that trooper. And the numbers should be pretty close because the Vermont State Police says they shall issue something at every interaction at a discretionary stop. Sometimes, as you said, they stop a car in error. Maybe the light was reflecting wrong on the inspection sticker and it was a different color than what they thought. So there is no problem. They approach the car, say, "I stopped you for an inspection sticker." "Oh, I'm sorry. Your inspection sticker is fine. Have a great day." They still have to submit a piece of paper to the admin staff for that stop. It was a discretionary stop. We need that information. So that's what I'm looking for, is that being done. So what happens is the trooper fills out the same information that's on the back of the ticket as to what they perceive the race to be, why they stopped the vehicle, the outcome of the stop, all of that information, and they submit it to the barracks clerk, admin staff, to enter it. And that goes in the system, and that's what I look at to make sure that that is complete. So that's part of what I do. The other thing that I do is I look to see if they're missing something. Did they stop this vehicle and not tell me what the race was? If that's not there, I send it back to the admin staff, to the station commander saying, this is missing. They go back to the trooper, they go back to the paperwork, they see why it's missing. Is it missing because the trooper failed to record it? Is it missing because admin hit one too many tabs and didn't fill in that place? And if they can correct it, they correct it. If they can't correct it, it's now considered an error in their data. And we look at the percentage of the errors for the overall barracks and the overall state. Part of what happened when we initially rolled out the program to collect demographics information is we didn't train. We didn't train the troopers how to collect it. We didn't train the admin staff how to enter it. We didn't look at it. That was our mistake. We should have been looking at it. We should have been auditing it way back when it started, but we didn't. So we were missing things. We were missing the outcome of the stop. We were missing what happened if there was a search. We were missing what was found when there was a search for that whole gap of data that we gave Jack McDevitt to analyze. We trained some people. Well, we didn't train some people. They thought, oh, I should fill this out on every piece of paper I issue. Well, recording what happened on one stop 4 times because you issued 4 pieces of paper and only once for another stop really makes a mess of your data. So we had to go back and say, did we do that back then? We sure did. So we left it. We're not going to go back 10 years and correct it. So we drew a line in the sand and said, as of 2016, our data is going to be clean. How are we going to do that? So we came up with a process of every quarter, we dump out all the data and we look for missing things. We look for duplicates. We look for things that don't make sense, like they put down no search, but then they put down contraband found. Explain that to me. How does that happen? So these go back to admin. They go back to the station commanders that say, explain this to me, fix it. And then halfway through the year, I look at it to see if there's a big problem going on somewhere. Is there a glaring number that says, uh-oh, this trooper has had 40 stops. Out of those 40 stops, 25 of them were people of color. Is there an issue? We send it out. Station commander will take a look. Well, guess what? There was a special festival in Rutland. They worked with special detail. Nope, those numbers make sense. So that's what I do with the data, just to make sure that nothing is going wrong. The other thing that I do with the data is I look at cases within the system. So if someone is stopped and their license is criminally suspended, they are arrested. Did we capture that data? Did we fill out a piece of paper so that we know that this discretionary stop was for a white person moving violation who ended up in arrest? So I make sure that that data is there. What we found 2 years ago is we were missing a lot of that data. If the person was arrested, we weren't capturing that demographic. So now we have a method in place to make sure that we do capture that, so that we're not missing that big chunk of data. So we were talking about, 1,000 DUI arrests. Did we have that data? So now we go back and look at each one and make sure there's demographic entry for that discretionary stop, if it was discretionary. Now, what if it was a motor vehicle accident? Do we want that information? No, we don't. That's not a discretionary stop. We sent that trooper there to do something. So we've trained our admin staff to look at that. Okay, this is a motor vehicle accident. There's 3 tickets attached to this motor vehicle accident. But wait a second, the trooper filled out demographics. Let's make sure that's not in there. If they find it's in there, they'll send a note saying this needs to be removed because this was a motor vehicle accident, non-discretionary. We don't allow just blanket deletes. You need to tell me why something needs to be removed. So just because the trooper failed to collect the information on discretionary stop and is missing 2 things in that entry and it's an error, sorry, it's an error. We can't delete it. You need to give me a valid reason why something needs to come out of the data. So that's what I do, and I love it. Gives us a good benchmark. You asked also earlier what we use for population to figure out if there's a big issue. Back initially, the crash data did not require that they entered a race of the person. So for 10 years, that data didn't have that. So when Stephanie Seguino did her study and said that's inaccurate information because it's missing so much data, the Agency of Transportation said, well, wait a second, we can modify our program and make this required. So they did that 2 or 3 years ago. Their data now gives us a much better picture of what our driving population is based on accidents. We're missing, I think, 30 to 40% previously of the race. So it didn't give us a good picture. Now they're missing maybe 2%, maybe 3%. So it gives a good picture of the driving population for that area. So now we can say, for example, if we were to go up to the Northeast Kingdom and say, what is the driving population up here? What is the census population up here? You could see a 6% difference between the two. That makes a big difference when you start to look at the number of African Americans that are being stopped, the number of Asians that are being stopped, the number of Native Americans that are being stopped in a particular area. So if we look at the Northeast Kingdom and say we've stopped 3% Asians in the Northeast Kingdom, is this wrong? We may look at the census population and say, well, the census population says we have 0.5%, and these are not accurate numbers because I'm not looking at my information in front of me, okay? This is just a what if. But the driving population is 6% Asian. Okay, so we're within a good range of what we should be stopping in this area. If we were to go to Bennington County says maybe census population says there's 2% blacks that live in Bennington County, but we're stopping 6%. We look at the driving population, it says 8%. So that's a big difference between the two. So we're not looking at one, we look at both. And we want to have a good picture. There's no accurate way. The only accurate way to do it would be to hire someone to go out and stand at the corner and say black driver, white driver, Asian, and come up with driving population that way, but that's not reasonable to do. That's still a perception. Do we stop every car and say we're doing a survey to find out the driving population? That's not accurate either. So we have to use the information we have in front of us, which is the crash data and the census data. So that gives us a good idea. Another thing we like to look at, and we'll take a look at the vehicles people are driving. Older vehicles, newer vehicles. We've looked at color of vehicles because I just wanted to see, did we stop more red cars than blue cars? We'll look at age and sex of the operator. Did we stop more females than males? Because I just wanted to know. Did we stop older people or younger people? Because I just wanted to know. And this is the stuff I'll push out to command staff that says, hey, look at this. Just for the fun of it.
Can we get that color car? I mean, it might, it might influence.
You know what? It really makes no difference.
It might influence what kind of car I buy next time.
It really makes a difference because I forget, oh, they stop more red cars. No, they don't. It really makes a difference. And then I have to stop and think, well, are there more red cars out there anyway? So then you try to find that information. Good luck.
We had a nice conversation with you previously in the larger committee hearing, but there are some other questions that we've been swirling around with respect to training. So
sure.
Have some time with you.
Yeah, so my name is Cindy Taylor-Patch. I'm the Director of Training for the Vermont Police Academy and the Criminal Justice Training Council. And I've been there since around 2001, so I've seen a lot of evolution and culture change. And we did speak about our program before, but I'm here today to answer any questions that you have about more specifics about what we offer. And just as a reminder, we oversee both basic and in-service trainings, and we serve all law enforcement agencies in the state. So I can talk about what we do in basic training, what we do for in-service training. I know the question came up about what's required for fair and impartial policing training. And it's not an hour requirement, but we do have a subcommittee who reports to the council who develops a curriculum for training to be offered every other year per statute. So that is the number of hours that's required to do that is totally dependent on what training objectives the group would recommend in the future that, for our next round. What training objectives do we want to meet, and then how long is that going to take, rather than saying we have 2 hours or 4 hours to fill, but what do we want to accomplish and how long does it take to do that? Could be 2 hours, could be 8 hours. So we purposefully like to not have it statutorily mandated. It has to be X number of hours because it gives us the flexibility to do whatever we need to do at that point in time. But that's every other year, required for every officer, and anybody who's not compliant with that is essentially called to answer for that, and it is required for them to maintain their certification as a police officer. So we do work individually with officers and departments if they are deployed in the military, for example, and can't fulfill their training requirement. Then we develop a plan for how they're going to get there when they return to law enforcement duty. Same if they're on a medical leave or something of that nature. We'll develop a plan for people to become compliant, but if they don't, then it goes forward to the council for consideration regarding their certification.
So how do you know if the training is effective?
It's a great question. I think it's something that we all look at as, what's going on out there in the world. I think the race data collection is a big piece of that. It gives us a nice snapshot in how officers are carrying out their responsibility in the community.
Yeah.
So I recall seeing in our budget memo a request for more appropriation to go from 16 to 20 weeks for basic training. So can you give us a sense of what would be included in those extra weeks of training?
Yes, and I think there's a few things that I think are of specific interest to this group. One is additional training around use of force, and I know that you all met my counterpart, Director of Administration Drew Bloom. He and I work very closely together and making sure that we're both on the same page as far as how use of force training is carried out, and then I teach things related to communication and mental health response because that's my background, and we work closely together. I also work closely with our patrol procedures team, so officers that are teaching patrol techniques like how to respond to an alarm and do a building search to how to conduct a traffic stop. And we do a lot of hands-on scenarios in that patrol procedures program, so it's as close we can get to actual live response in a designed environment. And even those instructors are very focused on making sure that people communicate appropriately. Like recruits are communicating in a way that's respectful and what we would expect them to be doing when they're out in the world on their own. But there's use of force time, there's patrol procedures time, so actual live scenarios where these folks, and as the Major said, some of them very young, really have asked for and benefit from hands-on practice. How do I do this? And have somebody who can be there to guide and mentor them, and this is how you do this. This is how you can have respectful encounters with people, because some of them struggle with communication, and we find that in a generation where they're exceptionally driven by technology, that communication is something that needs some guidance, and it's needs to be done in a live and active environment. So scenarios is a huge part of it. We're also looking to expand fair and impartial policing training. Right now, we only are able to give it 4 hours, and we want to give it 8 hours. We want to expand from the curriculum that we have that really focuses on implicit bias, and we talk about things across the board, as the Major was saying, race, ethnicity, socioeconomic status, age, anything, sexual orientation, transgender issues. And to expand that, to bring people with more lived experience into the classroom. We don't have time for that much right now. And also to make sure that we're more thoroughly able to cover the state's model policy that was developed and things of that nature. So definitely the 4 hours there is pretty important to us. Some other things, right now we have 8 hours of interpersonal communication skills and conflict resolution, and another 8 hours on mental health crisis response. But we're looking for an additional minimum of 8 hours to add more opportunity for de-escalation, substance abuse issues, suicide intervention, and the scenarios that go along with that. So that's a bulk of what the expansion's looking to accomplish.
So, as I look at 464, if I'm hearing you correctly, there's a section on there that requires 4 hours of additional training. Are you supporting that change? And what's the impact on your budget if we add that in there?
I think I would have to understand more specifically what the goal would be. Again, I would be hesitant to label it 4 hours, but just like what's the goal, what's the purpose of the requirement, and just to remind folks that we already do have the mandatory fair and impartial policing training requirement already on the books.
But I think if I read this, it would increase it by another 4 hours.
Basic training is 4 hours. What the mandate is beyond your basic level is what varies.
Okay.
So like all new officers have to get the minimum 4-hour training, but then after that, every 2 years after your initial training, you're coming back again for more training for the rest of your career. And the number of hours associated with that varies. And if we were successful in getting the appropriation to expand basic training, then recruits would be getting minimum of 8 hours. That's specific. I mean, we also have other places where things come together. Like we have a block of training in our domestic and sexual violence training where they talk about human trafficking. There's obviously cultural issues and gender issues within that context. We have a 4-hour block of training on hate crimes that is taught by folks from the AG's office. So it's not just in the courses that are labeled that specific topic, but it's kind of interwoven throughout our programming.
Cindy, just a quick question. The basic academy is currently 16 weeks, but you want to increase the basic academy to 20 weeks. Could any of this additional training, of everything, and this is dealing with this specific, including this, but other things as well, obviously, could any of this additional training that you guys want to put into 4 weeks, could this be done in what used to be called post-basic training? I don't know if you guys still call it that or not.
We still do. We have post-basics training still. Part of the concern around that is that anything we do post-basic would not be required for your certification necessarily, and it wouldn't be testable. Like we spend a whole week, the final week that recruits are there, testing their hands-on live response to different scenarios. And if we were to do that after graduation and the issuing of their certification, it would definitely be a different dynamic, a different environment. We have thought about that, looking at all factors that it would bring into play, but we would definitely prefer to have it within the program so that we can have a more thorough assessment of the whole officer and how they're going to act in the field before certification and graduation occurs.
And part two of that, getting into could it be post-basic, the officers already on the street, the ones that are certified and working, need additional training on specifically this bill itself. And I applaud that 100%. All right, is there going to be a specific course of instruction, such as a 4-hour block? I use the terms that we used to use when I was on the job. So a 4-hour block on Rachel and Vice training things that an officer, a veteran officer in the street, already working, already gone through basic, already got all the certifications. Can he go to that 4-hour block and get all the additional training, and then he just needs to do his in-service every year or two or whatever year? Yeah, so in-service hours are required every year, and for specific to fair and impartial policing, whatever we choose, that every other year requirement, that's in-service. That's what they have to do to maintain their certification. So that's a 4-hour block?
It varies. It varies depending on the year and what training objectives are decided on that it needs need to be met. So they have the opportunity to take any in-service that we offer, but they're required to take that one. And we also changed our rules a couple of years ago that requires updated use of force training every year. So that's also something that officers in the past weren't necessarily refreshing on unless their department made a specific priority for that. And we've now required it. You have to revisit use of force training. Things like that come up. Certainly, we offer mental health training, and most people just take it once. I have had some people that will repeat, but we're also hoping that eventually, if things change at our organization, we have a little bit more flexibility in what we can do funding-wise to offer more opportunities for de-escalation training. Right now, we have a tiny staff. We're pretty maxed out, but definitely would like to offer more around de-escalation training for officers who are currently in the field. I do partner with the FBI either every year, every other year to bring in their crisis negotiations training. It's a 40-hour school that they come here primarily out of their Albany office and offer to state and local agencies. So we try to partner with them to bring that in as another option as well.
And that's a 40-hour program?
Mm-hmm. Yeah.
So we've heard how challenging it can be for small agencies to access post-basic training. And have you ever considered a train-the-trainer model for some of that training so that it can be
always
done regionally?
Yeah, we always do. So, for example, we have had a fair and impartial policing train-the-trainer before and have officers who have offered that at UVM, Colchester, down in our area as well. And when we, probably within the next 2, maybe 3 years, we'll be doing another train-the-trainer for refreshed curriculum and a batch of instructors. But we tend to do that with most things that we do, especially things that are mandatory training. There's just way too many officers for us to try and train everybody with my staff.
Right.
There's just not enough of us, so we do that all the time across topics.
Any other questions for me? Okay. Thank you for being with us.
Thank you.
That would be an amendment in Section 3 of the bill, because Section 1 is about forming a PAC. Section 2 is about the PAC connected organization name. And then Section 3 is really in regard to that issue of limiting who can contribute to candidates and parties. And the operative language right now in the bill is on page 6, which currently provides that notwithstanding any provision of law to the contrary, only an individual, a PAC, or a party may make a contribution to a candidate or to a party. So an amendment, if along with this potential change, would just be to eliminate "or to political party" there. You would keep this language in regard to an ability of an individual to make a contribution to a candidate from their capacity as an unincorporated sole partnership or from their revocable trust. That would remain. And the other change would be at the top of page 7 here to say that just a candidate shall not accept a contribution from any other person other than those permitted to make a contribution to the candidate, which would be individuals, PACs, and parties. And then you just need a title change, a slight title change, because you would not address persons authorized to make contributions to parties. So I could do it as a individual amendment, or I could do a strike off. You just would rather the body see the language in total.
I think the language in total makes it easier. And since we're not printing multiple copies like we used to, a strike all doesn't cost as much. Jim?
I don't know where to start. First of all, if we're going to, so this amendment, as I understand it, in the original bill that came over from the Senate, corporations could not donate to political parties.
Correct.
They could to PACs.
Right, and then they're PACs.
And in this amendment, carves out political parties differently. so corporations could donate to political parties.
As they currently do under current law.
I understand that.
Yes.
So the only thing this does is essentially eliminate corporations from donating to individual candidates. So I, as a candidate, I think I received one modest corporate contribution. Disclosed, visible, the whole world can know about it. Under this law, that corporate contribution could go to a PAC or a party and then come back to me. Is that correct?
Or
Indirectly.
Or the corporation could form a PAC that PAC could contribute to you as a candidate.
Okay, so if we're changing the title, why don't we just change it to the Dark Money Act, because we're hiding it. And I know I'm being a little facetious, but we're hiding it.
That's not a question for me.
No, I know. You just happen to be in the seat.
Thanks. Hold on, I'll be right back.
I'm missing something. We talk about transparency until we don't want to be transparent. So I don't know what this accomplishes. I'm going to form a business on the side. Form your own PAC, because that's how we get around it. I guess it's not for you. You're the good soldier here. They're writing this up. So
are you speaking to the underlying bill as passed the Senate?
I guess
or are
I'm
you
speaking
to my suggestion of removing the parties?
I'm speaking to the underlying bill. Yes. I'm sorry. I didn't mean to mix up.
I was feeling afflicted for a moment there. I'm so glad you clarified.
Sorry.
Any discussion?
Committee confused.
You're confused?
I think so.
Okay. There are transparency provisions in terms of how PACs are named.
Yes.
Yes.
Yes. And so from that standpoint, it's not entirely dark money.
Okay. Mostly dark.
It's twilight. Rob?
Well, I guess I have to agree with my colleague to the left here in that I know he's not on an island as he normally is here. I just don't think that this is going to accomplish what they're looking to do. I think it makes a process that some feel isn't as transparent as they'd like it to be, even less transparent. And somebody who's involved in a few different businesses in different types of corporate structures, so now I would have to go through and set up a PAC if I wanted to, I guess, give money to my local committee even. I guess I just think that this is a solution in search of a problem.
To your local committee, meaning your
State
political party committee, just under the potential amendment, a corporation would still be able to contribute directly to a party with the potential amendment that is being discussed, just to confirm.
Right, prior to the amendment.
Yes.
Yeah, I couldn't do it. Right.
Correct.
Do you have a question? Philip?
Limits in effect?
Yes. So
Change the limits?
no change to the limits. But right now, let's take a corporation, for example, is a single source. And so a single source is prohibited. There's limits on single sources contributing to candidates. Look at the House candidate contribution limits. So a corporation, under current law, is a single source, could give $1,000 to a House candidate. A PAC can also give $1,000 to a House candidate. So what this bill would do is not allow a corporation to give a contribution directly to a candidate. The corporation could form a PAC, but then any person that wanted to contribute to that PAC would be subject to the contribution limits on PACs. And then when that PAC gave a contribution to a House candidate, the PAC would be subject to this $1,000 PAC contribution limit. These have been adjusted for inflation. There's an inflation, so I think it's up to $1,040 or something now at this point, something like that.
So committee questions on what we will see the next time we look at a draft of this. All right, so let's shift gears.
Okay.
We will shift gears to the State Youth Council bill at this point. We have made the changes that we wanted to make to this bill, and so I would ask us to go through this sort of section by section and feel comfortable with where the bill sits right now and with the purpose of voting it out today.
All right. Betsy Ann Rask, Legislative Counsel. I have behind me the draft 1.1 strike all of H 775, which is the act relating to creating the State Youth Council. You reviewed this language at one of your committee meetings, I think, last week, and you had discussed the changes that you wanted to see for this bill. So I have highlighted throughout the language where changes would be made, and so everywhere you see highlighting is a change from the underlying bill. Otherwise, all the language remains the same. So it starts out with the findings here. This finding A1 relates to, I think, a change that you're proposing to make in the makeup of the council. So in the underlying bill, the council would be made up of youth members between the ages of 9 and 26 years of age, and we'll see this in a later provision, but this committee had discussed changing that to members who are between 11 and 21 years of age, and so accordingly, this finding in the original bill is introduced provided the percent of the Vermont's population made up of youths 9 to 26 years of age. So since you are no longer focusing on that 9 to 26 year age range, and you're instead going to wanting to discuss the percent of population in Vermont made up of people who are between 11 and 21, this data point needed to be amended accordingly. I reached out to the Chief Performance Officer to see if we can get, if there is data on Vermonters between the ages of 11 and 21 years of age, and feedback that I got in response was that we don't have that exact data point, but what I was able to be provided with is the age of Vermonters that are under 21 years of age. So note the distinction that it's not counting people including 21-year-olds, but those under 21, so 0 to 20. That's the best data that I could bring back to you. And that percentage of people who are 0 to 20 is specifically 23.74%. So if you want to just have a more general reference to people under 21 years of age, you can say that they represent approximately 24% of the Vermont population. But just note that it's not capturing also the 21-year-olds. So that was that change. Any question there? All right. So then you get into the actual substance of who makes up this council. So the bill is introduced would have provided that it was a 15-member council of members between 9 and 26 years of age, and that there would be, aside from everyone being appointed from one member from each county, that there would be an additional statewide member who serves as chair. This committee discussed not having an extra person because that would mean that one county would get another rep on this council. So it would be one member from each county, bringing it down to 14 members. And you had requested that the membership be between 11 and 21 years of age, and similarly that the council itself elects its chair. So there are those changes. At the end of line 10, I highlighted that period because that used to say that the Interagency Work Group Youth Services Advisory Council appoints one member who serves as chair. So that's just flagging that chair language got moved down here, and that the council itself would elect its chair from among its members.
Jim?
So we talked a little bit about this yesterday, but I just want to be clear. Between 11 and 21, so if you were appointed at 21 or 20, you have a 2-year term, a 3-year term, do you have to get off once you turn 22?
So the language doesn't state explicitly that you can no longer serve after you go beyond 21, but it does say that it's composed of youths between 11 and 21. So I would think at least implicitly that if you are surpassed 21, that you should no longer serve on the council. But if you wanted to make it explicit, you could add language to that effect. I don't know if it's necessary.
Yeah,
but
it's not a big hang-up. I was just pointing out the obvious stuff.
Definitely, I've thought about it as well.
And it might, from the appointing authority, might say, you know what, we better just be safe and but appoint people 19 or 18. And I'm not sure that, gives you the perspective of the 21-year-old.
Mm-hmm.
So, whatever. Just
I just want to support Jim's idea from yesterday. I think we should say between 11 and 21 at the time of their appointment. So you could appoint somebody for 3 years who was 21 years old, but they couldn't be reappointed at age 24. But I think it's tough. If they have to step down the moment they turn 22, you wouldn't appoint young people who were 21 because they couldn't serve a full term. And that just doesn't seem right somehow. But I thought Jim's idea from yesterday was a good way to go at the time of their appointment.
The other question that I have now that we're thinking about it is 18 to 21-year-olds tend to be college age. And if the advisory council was picking from within college age Vermonters or college age students in Vermont, would anything in this ask them to only consider people whose permanent legal residence is Vermont?
It just describes them as Vermont youths between that age range. There's not a definition of what is a Vermont youth. If you turn to election law, it's where your residence is and what you consider to be your home, which might still be Vermont even though you're some other state. But it doesn't define what it means to be a Vermont youth.
Okay. Other questions, Freddie?
Just had a little bit of a nagging one from each county thing, having experience with a statewide organization. There are certain areas that you just can't get anybody, so that either means it's an unfilled seat or you have the option of electing to pull somebody else in. I don't think it's a big deal, but should at least be given some consideration.
Sounds like something, if it does come up, when we revisit that, we can.
Yeah. Quite possible. It's the driving that they need.
Warren?
Well, the thought of college-age youths who may have grown up as Vermont residents, but change their residence when they go off to college so that they can vote in that area. And similarly, students from away who move to Vermont and change their residence so they're here and can vote here. I would put it at Vermont residents. If their right to vote in Indiana is more important to them than maintaining their Vermont heritage in any unblemished way, so be it. But that should be Vermont residents.
Makes sense.
Yeah. I totally agree with John.
Good.
Should be a Vermont resident. He's advising, Pacific River is advising the governor on things to do with the state of Vermont. So you have to take ownership in that. Be a Vermont resident. I like that.
Should we say youth residing in Vermont?
Or Vermont resident youths, whichever.
Resident youth, yeah.
Okay.
Did you also want to add the language that they're between that age range at the time of appointment? Did I hear a decision on that, or?
I think that's fine.
Okay. Okay. Got those two changes? Good to go there?
Yes.
All right. So here on page 4 is about the requirement of the council to give its advice to both the governor and the General Assembly. So here on page 4, line 8, I just highlighted that subdivision A because it was just a new subdivision designation. The language regarding the governor being required to meet with the council does not change, but new subdivision B would be added because you wanted to have language that discussed how the council would give its advice to the General Assembly. So this language would say that the council shall annually report its advice and recommendations to the House and Senate Committees on Government Operations and to any other standing committees it deems appropriate, and that the report may be in verbal form. So they would not feel obligated to draft a written report, although they might want to. That work for you? All right. So on page 5, you get to the part where it discusses how you wanted to make sure it was known that they could participate remotely in committee council meetings, but that also you wanted to have some encouragement for council members to meet in person because you had stressed the importance of in-person interaction. So this new language that I ran by Tucker as our open meeting law attorney would provide first that members of the council may attend council meetings by electronic or other means without being physically present as a designated meeting location as permitted under 1 VSA 312A2. So this is using language verbatim from the open meeting law. That's what that Site 2 is, and that Site 1 VSA 312A2 is a provision of the open meeting law that does allow remote participation in meetings, so long as there is at least a board member or a staff member of the board present at a designated meeting location so that members of the public can go there at that meeting site. So that's why that language is taken verbatim from the OML and say they may attend meetings by electronic or other means without being physically present as permitted under that provision of the open meeting law that requires a designated meeting location and someone to be there for members of the public to participate. And then adding there on page 5, line 5, that a finding to reflect your encouragement for in-person interaction. So the finding by the General Assembly that such virtual meeting attendance is particularly expedient for council members from remote areas of the state to participate in meetings, but also the General Assembly encourages council members to be physically present at meeting locations when possible due to the importance of in-person interaction. That language, particularly expedient. Expedient is a phrase that the Vermont Supreme Court likes to use when they talk about legislative discretional decision making. Expedient meaning what you find is the right thing to do at the time. So you're finding that it's particularly expedient for these council members who are youths, might not have their driver's license yet. They might be coming from remote areas of the state, and this is fine for them to participate remotely, but you're also encouraging them to be physically present when possible due to the importance of in-person interaction. Does that reflect what you wanted to state there?
Yes.
Okay. Thanks. Hi. And then the next change was about their term lengths. So the bill is introduced, stated here in regard to the initial provisions, that the initial appointments would be for 1, 2, and 3-year appointments, and you had suggested that instead that it be their terms be for 2 and 3-year appointment terms, so that they could get a little bit more experience and not just have their time be up after a 1-year term. All right. And then finally, the last change, or one of the last change, is to state when they had to report back to the General Assembly on changes for their ongoing operation. And the bill is introduced, provided this reporting date to be November 1, 2021, and you had discussed instead making that recommendation date be January 15, 2022, when you'll be in session. And then, good to go on that one. And then finally, you had requested a sunset, and to give them, 2 years from their time of appointment, or no, 3 years from their time of initial appointment. So this would provide, Section 4 would provide a sunset of the council to be 3 years after their initial appointment, November 1, 2023. In the meantime, you could revisit the sunset before that occurs to determine whether to continue the council.
All right.
As I was thinking about that yesterday, I thought it's a little strange to have it repealed on November 1 when we've been out of session for the great majority of our vacation. Wouldn't it be better to have it sunset, I don't know, town meeting day, so that we could come into a session realizing that we're facing a potential repeal, and it would give us time to change it then. Otherwise, we'd have to do this, well, certainly no later than mid-May of 2023. We'd have to be looking in advance.
Jim?
Good question for Betsy Ann. Do you folks flag for us each session the sunsets that are coming up? That year that would have to be acted on, like this session that would expire otherwise before we return in January?
We can. We have a ledge council attorney who tracks sunsets, so it is possible for us to pass that info on to a committee. I don't know if it's always standard practice that we do, but we are able to.
I just asked, I'm kind of indifferent on it, but if I would hate to appoint the new terms in November and then we don't act on a sunset that following session. The way it is now, if we're flagged, help us with our memory, we would have acted on the sunset before those appointments that November for the new 3-year terms. That's all. Something to consider. I just hate to take the rug out. Oh, you're appointed, and 2 months later, you're gone. Thank you for your service. I think the sunset, unless there's a disastrous result, I think the sunset's almost automatic. To be renewed, I would expect.
Now's the time if we want to make a change to that.
Well,
You can agree with me again.
Warren?
we have them reporting to the House and Senate committees on government operations and to any other relevant committees that they think should get the information. That they would probably do in the early part of any given session. So if a little later in that session they were facing the potential for a sunset, that would be a good time for them to say, by the way, we're doing good work and we'd hate to have you sunset us 2 months from now. So I still think it would be better if the sunset happened while we were in session. Certainly not in the first week of it.
I agree with you. I think that we need to, we and other committees need to be here to review this for the possible sunset action. You can't do that in November. It's unfair to call the committees in to do this in November. So pick a reasonable date, March 1st or whatever. Gives a couple months for the legislature. It's been in session almost 2 months by March 1st. Gives them time to look at this. No, I agree with that. Kind of, whatever.
I would just push it back to February 1st.
You can push back.
March is a tough time to.
Right, you're working crossovers and everything like that too. Like at least give a month or so for the legislature. And it could be a new legislature even.
Enough time for it to go through both the House and the Senate.
Yeah, because you're really committing. You're committing the Senate to things too. And you've got to make it reasonable.
So you would like, Madam Chair, a walkthrough of what the House Appropriations Amendment is going to be today. Great.
Yes, please. Thank you.
Okay, so for the record, this is Representative Diane Lanfer, and I'm here today to represent the House Appropriations Amendment that we passed. There might be confusion whether it could be confusing. House Appropriations passed this amendment because we look at just very specific things within the bill, and we passed this amendment out of our committee 11-0-0. So we all liked our work, and but we've got, when the whole bill came, there's a varying degrees of concern from many different places, but the final bill was a 6-5-0. So, but I'm just going to speak to our amendment.
Do you know where I can find your amendment?
On today's calendar and today's calendar, if it's up there.
Is it the last document on this list?
Yeah.
No, it's a summary of all the amendments. I think.
Yes, we've asked Michelle to update the summary by topics and include in it the money committee's amendments as well as
856
information about the supplemental GovOps amendment, which is under Gannon's name, and the supplemental Ways and Means amendment, which is under Sam Young. So we will hear in that summary.
Here we
We've
are.
got.
Sorry.
You got it?
Yeah, right there.
Oh, there I am. Okay. So I have just a larger hard copy of it, but
Okay, that's fine.
I can go along with here. But if you so there are 12 instances of amendment, and that seems like a lot, and that is, but they're doing basically a few things. So in the first instance, which is in section 2, we amended the board from 5 to 3 members, and that was strictly on a financial reasoning, and you'll see later that we actually reduced the board, but the dollars seem to have grown because when we got a new estimate on what it was really going to cost, it was actually higher. So the second instance is in section 3, which continues to adjust the 3 members to a 1 member to 2-year term and a 1 member to a 1-year term. And then the third instance, which is section 5, the Cannabis Control Board, we do 3 things is accomplished in that section or that instance. The first is we removed, you won't see in that, we removed the language that made the connection between the application and the licensing fee to those established in Massachusetts. So we were looking at the dollars thinking, okay, if it's going to cost this much to run the board and they have to do fees and they can't raise fees longer, put them in a box and put everybody in a box, and whether or not they were going to be able to eventually get to the point of being able to fend for themselves on the fees that were raised. So we just released them from this Massachusetts connection, but that doesn't say that they won't pay close attention to that all the time. So we took that part out. The second thing that we did is we had the fees fund the duties of the board, and then the third is we recommended the fees repay the general fund for the deficit that's allowed to accumulate in section 6C over time, over 10 years if they need to. That is, some of us have sort of a little bit of a trauma issue around when Vermont Life magazine was allowed to, no, I don't know if it was allowed, but because it could draw on receipts, as a lot of funds can, and they're going to need to. At the beginning, they're going to have to be able to draw on the receipts, be able to get going. And what we're looking at is to not let that get so far, I don't know if you remember, but it's like $3 million in the hole. We could never get ourselves out of that. So there was some serious backstopping and having the fees try to pay for the deficit. In the fourth instance of amendment, we continue to move from the 5 to the 3 board is what that is. And in the fifth instance, you will see that we moved from the $810,000 with updated knowledge from joint fiscal as to what the costs were going to be is $860,000. So,
Jeff has a question.
Okay.
So
yes, sir.
on that line, if we had kept it 5,
it would have been a lot more,
any idea?
$1 million plus, I think was the.
Okay, so the 810 was wrong.
The 810 was probably their best guess at the time, and then JFO
So
probably being as
we're
kind as
saving
they
money.
can.
It just doesn't look like it.
It doesn't. That's
Okay.
why it seems a little illogic, doesn't it?
Right.
Yeah. But
Thank
it
you.
was another reason why, oh my goodness, we should probably
Sure.
keep it at 3 for now. And then in the sixth instance of amendment, in 6C, the original bill has the A and only the A. So we kept the A is the same language, but we added B and C. So 6CB, that's kind of a funny sound, moves any positive balance that may be at the end of that fund, at the end of the year, or at the end, positive balance in the Cannabis Regulation Fund to the general fund, okay? So that it isn't left there as like this little orphan excess dollar hanging on the bottom. So we scrape for every penny you can imagine. So that comes back to the general fund if it's there. And then in section 6CC, that we also make sure that if there is a positive balance on the end of that fund, 30% of that fund will then go to the prevention as we indicate in 18A. Okay? The seventh instance of amendment is a little more active. Much like you had this discussion that I came in on, which I'm glad of, talking about sunsetting, not sunsetting, letting something be. This is fairly new. There's language that the auditor in the bill will come back in 2023 after the Cannabis Board is up and running. Will come back with their examination and recommendations on, well, this is how I would interpret it. Time goes on, he's going to take a look at it, and then he'll come to the General Assembly with, this is what's working great, you don't need to do anything, or, okay, we need to make an adjustment here because this is so new, it's going to probably have a lot of variables at first until it settles out. So we sunset the board in 2024, a year after the auditors, which gives us that year, the General Assembly, to come back here and react. Either say, it's fine, we just move the sunset out, or we're going to need to work on some issues with it. And then the eighth instance of amendment is the place where the 6% sales tax. The Ways and Means Committee, unlike the Senate had 100% excise tax that would have gone to the general fund, and our Ways and Means, which I don't disagree with, it's a taxable product. It's like buying this postie, it should be, a part of the tax revenue. However, this 100% of the sales tax goes to the education fund. Okay, that's good, and nobody disagrees with that. But this is where, from hearing about the issues, and actually in the governor's recommend to actually try to develop a universal after school, and I'm sure you've heard, where we come to an agreement here in our committee to guide the 6% dollars to the efforts of the grant programs to start and expand after school and summer learnings with a focus on increasing access to underserved areas of the state. We did not create a fund, and I don't think we needed to, so I get a little uncomfortable just personally having it just fall there, and we're going to have a line item that we track that says this is what the 6% sales tax of the cannabis sales is brought in, and that, you know, AOE, please use them, and then you'll see in 17D, in the manner to which the legislation intends you to do. And even in 17D, we don't just leave them alone to make that decision. We actually ask for, in mid-November and each year after, to report back or submit to the General Assembly a plan to fund grants in the way that was laid out in 17C. So that's the grant process. There currently is a grant process at AOE for the 21st century. I keep saying century 21, so I apologize because I have to think about it. It's 21st century. It's not the real term. Those are federal grants that come in and flow through AOE out to communities that apply. It's a competitive grant piece. So it would be in my thinking that the funds that would flow, that we would provide a number that says this is the 6% sales tax that would boost that grant program. And if you had heard, you probably have heard that in order to get to that goal of universal after school, in 2015, it could have been 14, but 2015, there was a report that it would take approximately $2.5 million to get there. So not to put words in the governor's mouth, but I was so excited because I've been a part of many of these conversations to see that he was so focused on it in the state of the state and in his budget address, and actually referenced cannabis. Keep my fingers crossed. All right, so that's what that does. There's an amendment in the calendar, the Beck and Browning amendment, that is proposing to strike this out and just let those dollars fall to the ed fund with no guidelines. Our committee voted on that amendment to find it unfavorable 11-0. So we'll have that discussion on the floor. The ninth instance of amendment does for the prevention fund. This is a similar setup as what we did for education, but takes the 30%. It takes the 30% of the revenue and has the Substance Misuse Prevention Oversight and Advisory Council recommend the prevention programming that 30% should go to. And then the 10th, 11th, and 12th are just the, it's never just, but it's the alignment of the effective dates to our amendment. So in a nutshell, and I'll probably say this on the floor, but there are so many needs in our state. There are so many holes for resources that are needed just everywhere you look. So for us to vote 11-0 to use this money in this way is a significant say that where we find the priorities because of the nexus with cannabis and in our prevention programs and our desire to wrap this money around our kids and to keep them safe in so many ways. And we have already avenues. We don't need to reinvent the wheel. We don't have to do this from scratch. There are programs and entities and avenues, just needs the resources. So that's why we chose those directions, Madam Chair and everybody. I'll be quiet if you want me to. So that, yeah.
Thank you.
You're welcome.
Committee, do you have questions? Rob and then
Good morning, Diane.
Good morning.
I'm still trying to understand the connection between the initial cost going up $50,000 and we're dropping back to cannabis board members. Where is the additional costs coming from?
An update from JFO. Stephanie
Right.
to tell us that when they looked at it again, this is what they feel is the true cost. Now, I can ask her for a little more explanation as to where and why that came up.
Yeah.
But that was, she just wanted to update us that this is
So
no
they didn't
longer,
give you any specifics, they just,
when they,
as far as what their estimates were, they didn't really drill down as to, I mean, I don't know, why would it be 50,000 more with 2 less people? That to me is quite a significant shift.
The 810 is wrong.
Well, apparently
I think
wrong.
Representative Young has an answer to that.
oh, good.
Oh, Michelle has an answer.
So, I don't blame you for not remembering this because it was last year that you dealt with it, but when y'all were working on this piece and you decided to increase the number of, because it came over from the Senate with 3 members and the 810, is you guys increased it back to 5, which is what the community jurisdiction in the Senate had originally before Senator Probst reduced it to 3. But you didn't, even though you increased it from 3 to 5, you didn't tweak the 810. You left that. If you had made it go to 5, it would have been more than 810. But you left that 810 number, knowing that appropriations was going to do their part. So the 810 was reflective of 3, and so it's really only an increase of 50,000 for a 3-member board, and part of that Stephanie said was it's another year out. And then they also just kind of looked at it and tweaked a little bit. But the 810 was always for 3 members.
Okay,
See,
thank you, that helps.
there's another little piece, because I have a tendency to get way down in the, no pun in the weeds on this, but the,
It's okay.
I'm sorry.
It will be
We've
said
got,
a few
you know,
times today.
We've heard it
Yeah,
so
I
many
get it.
times that we don't even chuckle anymore.
that this is only 10 months. This number is only because it's only a 10 months, so it's not the true annual cost. So the year after that, it will be a full 12. Just so that when we take a look at it, we know, don't freak out when we see that this is like $1 million in the next year.
So you're saying that the 860
Is
is a
10
10-month
months.
number,
Mm-hmm.
and the next number will be even higher.
Could be. It would be anticipated to be.
Jim?
So
Oh, sorry, Mike.
the sunset on the board. So if we don't extend the sunset, the board goes poof, they're gone, right?
Right.
So if some of us wanted to, at that point in time, have that conversation, whether it's up and running, we've done all the regulations, et cetera, and want to put it, for example, under DLC, we could have that conversation then. Okay, thank you.
Quick
You can
question
have
on
a
your
lot
way
of
out.
conversations then.
Jim? Or Mike, quick question on your way out.
Yeah, just thank you. This is good work and a really tough bill. I'm wondering, you're going to get
I was-
questions about the money going to after
Oh, yeah.
school. I wonder if we do better to reflect the reality that this is extended day summer learning.
Yes.
It's not after school, so kids can have swimmings to go on. This is an extension of the school day. It's structured learning that happens in the after-school hours and in the summer to prevent summer learning loss. So those
Yeah.
questions will come up, and I'll certainly
Yes.
speak to it, but hopefully
Yeah,
we can
because
help
after
inform
school
people who don't know.
means YMCA, Boys and Girls
It
Club,
does.
your teen center. So I have that in my notes.
C too, the state program.
Is a part of that, exactly. So it should be,
It's quite a
we've heard it's
landscape.
called, after school you hear it called third space, and
Yep.
trying to get the language correct to the actual activity.
Questions, committee, Bob?
And just to really be ironclad sure, the 30% that's going to prevention and education is effectively a business expense. There's no way that gets not contributed from
It'll be.
day one.
I would have liked, just me personally, would have liked to see it a little harder placement, only to keep, I would like it to have gone into a fund, but I do understand the dynamics around that, because right now it would be a line item in our forecast that says this is the cannabis forecast, and a number that would be agreed upon, like the dollars, I call it balancing the checkbook. In January and June, there'll be a forecast number of what the dollars are going to come in from cannabis. And then we know that 30% of that goes to prevention for this Substance Misuse and Advisory Council to say, here's what we want to use those dollars for in the prevention programming.
But there's no avenue by which somebody gets to say, oh, we're going to start to pay back the general fund a little bit more
We
first.
have that authority as legislators. I may not be here in 4 years, so somebody can always do that, notwithstanding, and so it's going to take vigilance, which is where, like this weekend, I can honestly say that we're trying, in our committee, we've got the budget, and we had a couple other bills. There was the global solutions, and there's Act 250, and so we kind of broke this bill up into some sections that we worked on pieces of it, and plus the whole. So I can say Friday it was all weekend and Monday. Monday was of wrestling to get to a place that we could go 11-0. Nobody in our room likes everything, even within our own amendment, but we got to a place where we could all support it.
Representative Young, for the record, Ways and Means Committee. And I also point out that there's a fiscal note that got emailed to everybody.
By Janet
Latest updated fiscal note should be in your email, and there will be some paper copies as well. First, the Ways and Means Amendment is
here. It's on the screen.
The basic gist of it is the Senate had a 16% excise tax and a 1% local option tax. The basic gist of the Ways and Means Amendment is that it would be a 14% cannabis excise tax and apply the sales tax, and that would also allow for a 1% local option sales tax. The other thing that we did was to remove the $6 million cap on the Substance Abuse Prevention Fund. And if you look at the fiscal note, it doesn't look like it really gets close to the $6 million cap, but in case there was if more money came in, more tax revenue came in, and it hit the $6 million mark, it would just continue to fill up the prevention fund. I think that's pretty much the Ways and Means Amendment.
Rob, question.
So I have the 1% local options tax. That only applies to the communities that currently have it.
That's correct.
Let's say that a community goes through and has an affirmative vote and gets one in the future. Would they be able to apply the 1% local options tax?
Yes.
They would.
Yeah, and currently about 40% of the sales in the state actually have the 1% local option tax on it. But I don't know, since my time on Ways and Means, we've probably approved 5 more towns that have the local option tax. Sometimes it's by charter. It kind of depends on whether it's like around Act 60, whether you had to do it by charter or not. But if it's a charter, we generally approve the charter change. And actually it goes through this committee too.
But aside from that, there really wouldn't be any revenue sharing from a tax perspective.
That is correct, and which kind of rolls into the next amendment, which is a recommendation from the Cannabis Control Board for next year, when they recommend the fees for the state, also to recommend fees for local municipalities. And if it was just a local option tax, only towns with retail establishments would get any revenue, and this would allow for if you had the other types of entities in your town, that you would actually be able to get some money for the municipality for the different types of licensees and not just the retail licensees. So it kind of spreads it out a little bit more.
So, based on what I've heard today, then if I am somebody that's applying for a license, I'm going to have at least 2 license fees that I'm going to have to contend with. I'm going to have the state one, and then potentially I could have the local one as well.
Yep.
Okay.
Yeah. So where does the municipality get the money? The state or the local or both? When I say get the money, I'm talking a portion of the license fee. Unless I'm wrong here. the portion, I'm looking for a portion of the state license fee or whatever they're doing. And if the municipality forms a cannabis control board and they set local license fees.
Yeah.
So does this bill allow the town to collect the fees from both licenses? Or does the town have to go through a charter change to do
No.
the local one?
For the fees, there doesn't need to be any sort of charter change. But it's just like we had that was in the bill before for the Cannabis Control Board to come back with recommendations for the fees for the state licenses. They'll also come back with a recommendation for local fees.
And we will have to
approve whatever
or
that
change
is
them.
next year.
Raise them, lower them, whatnot. Question?
I was just going to clarify for JP is that I think what you were talking about is when the local, so if you have your select board create a local cannabis control commission, they'll still do their local permit fees and can do that, and then this new local fee that's assessed at the state level is separate, and then that'll go back to the towns.
Right, and my question or issue was, could the local select board, when they establish a cannabis control board, commission, whatever you want to call it, I don't care, and they decide to establish a local license fee, can that be done here without having to come back to the state? In other words, I know you're going to come back with the state fees, and the legislature will look at it again, but at least I think that's what's going to happen.
Right, but there's two, so.
Two separate things, two
separate local fees. There's the one that because not all towns will establish a commission and issue their local permits, but if they do, they can collect those fees on their own, just like it came out of here. They don't need anybody's permission separate or apart from that.
Just want to make sure.
Yep.
And I'm sorry, but I'm still a little confused about that then. So the Cannabis Control Board will set fees at the state level, correct? Or recommend fees at the state
recommend
level?
fees to us, we have to approve fees.
But the fees at the local level, the municipal level, will they also be making recommendations, or the local governing bodies that would have oversight over the cannabis, can they set their own fees, or does that need some other approval?
That hasn't changed from the way that you guys had it in your local, local government piece around issuing, if you decide to issue local licenses.
Mm-hmm.
You guys hadn't, it was just, there wasn't anything that really addressed the issue of how to set those fees or what they're supposed to be.
Well, but initially we were only talking about retail establishments as well. Now that's been broadened to any license, correct? So I'm still trying to find out, so who's going to have the final say as to what a fee can be at the local level? Is it going to be the local governing body, or is it going to be the state level cannabis control, cannabis board?
Well, ultimately, setting the fees has to happen in the Ways and Means Committee with a recommendation from a policy committee, with a recommendation from the board. Right. Jim?
I mean, isn't this similar to what we do with liquor licenses? We set a liquor license, $400, $100 of that, which you do here, goes to the municipality.
Portion goes to the municipality.
Isn't that what we're talking about? Or are we talking about a totally separate license?
That is essentially what we're talking about, but I wouldn't say that anything has been set in stone. We're just asking for a recommendation. And I'm sure there's going to be a lot of public input from the municipalities in that process. I'm sure.
All right. So confusion level went from here to here now. Back to the initial question. Does the town, municipality, whatever you want to call it, have the authority? But the town does have the authority to establish a local cannabis control board, commission, whatever name you want to give it. And then, does the town have the authority to set the dollar amount for the fees without any necessary approval from the state of Vermont, period? Anybody in the state of Vermont, legislature, cannabis control board, anybody, governor, I don't care. Can the town set it without any authority being required from the state of Vermont?
I think the answer is yes, but I'm going to look to the lawyers.
So Section 863, which is the regulation by local government that y'all work so much on, that is not amended at all by the Ways and Means Amendment or by the separate Young Amendment. The only thing, so whatever you had with regard to your inherent authority to issue the local licenses, there's nothing in that language about how you set fees or anything like that. There's nothing restricted. It's not addressed. So I think the presumption was that it would be following the way that you do with liquor licenses now. So there's no requirement that you get anybody's approval for fees or anything like that. There's nothing in there that says specifically an affirmative, you can set fees for those permits. I presume it's, I would consider it to be implied because that's what you do, is you issue a permit and you collect a fee for it.
Right.
That's completely separate. That's not touched by any of these other amendments. The only thing that the Ways and Means and the subsequent Ways and Means amendments are dealing with are this new additional fee that would be, the board would recommend to you, legislature would choose what it is and say, board, you're now, when people get licenses, they're gonna collect a state fee and a local fee. And they're gonna figure out what those are, and then that's gonna go out to towns regardless of whatever type of cannabis establishment they have there.
Okay.
Does that make sense?
Yeah.
So some towns may choose, so under this proposal, the idea is that all towns will get probably some money from the state collected local fee, and then only the towns that choose to issue a local license permit through their local select board, / cannabis control commission, will be doing that individual permit fee.
Right.
Based on fees that are recommended and approved by?
No.
It's completely local.
Yeah, it
Okay.
doesn't, yeah, the recommendations, and I'll double check, but the recommendations are just having to do with the new local fee. But I'll double check to make sure that you couldn't read it otherwise. Huh?
It's very clear cut as long as it's down.
Other questions, committee? Sam, is there anything else?
I think that's it.
Great. So committee, John, is there anything that you want to add to this?
No.
Okay.
I think Sam did a great job.
So we have a Ways and Means Committee amendment that will come up very first after the initial floor report. And then we'll do the Appropriations Committee amendment on the floor, and then we'll come back to the other amendments, in one of which being Sam's second amendment, which is this local fee issue. So I'd like to do a show of hands on the Ways and Means Committee amendment. So that looks like, all right. If you are a yes on the Ways and Means Committee amendment, it's 1, 2, 3, 4, 5, 6, 7. And if you are a no on the Ways and Means Committee amendment, 3, 7, 3, 1. And Sam Young's second amendment with the local municipal fee. Show of hands if you are in favor of a municipal.
Do we want to bring it up?
Well,
Can we search it?
Hold on, we're
Wait,
looking
search.
for the actual.
Oh, there's, it's.
Yeah, look at
Yeah, that's a state fee.
But Young.
Oh, yeah, that's good. Let's look me up.
So there's young for Ways and Means, and then there's young for, there we go. Right.
And really the
Local fees to be charged and collected. Are we ready to vote on second Young amendment? JP?
I'm reading this, and which is why I brought the question up. The question I had was, the towns, municipalities have total control over setting the local fees. In this amendment states that the Cannabis Control Board, which is a state board, remember I said anything from the state of Vermont, all the way from the governor down to a committee. And the answer was presumed that the town could set the fee as they saw fit. So I accepted that. This amendment states that the Cannabis Control Board is going to recommend for the local fees. The board must recommend design to create a cost. We all know why and everything like that. And then it creates the authority for the board to charge and collect the local fees. Why was the state going to collect a local fee, a local license fee, if the town's going to have total control over it? So you don't get that.
It's the new fee that's added by the Young Amendment. I think I understand how you're reading that, and I think if it helps, you know, I can do an amendment that anybody can offer out on the floor today that will just clarify, and I would amend 863 on the regulation by local governments is, you know, affirmatively state that the commissioners may, you know, determine a fee that they may then, you know, charge for the local control license that is under 863, which is separate and apart from the state assessed local fee. So I'm happy to do some clarifying language if that would help folks.
So let me see if I understand this. There will be a state fee. There are just two fees involved in this, one at a local level and one at the state level. But the new board will recommend the rate for both. And if I'm a municipality and I have a grower, I'm going to collect that local fee for the grower's license for the municipality regardless. It's going to be coming to the town, and then the state fee goes to the state. So they're just two, not three.
No.
Okay. And I know
maybe text Abby. And I'm doing my best here, but I didn't write this amendment actually. So what you guys have worked on with the, just like liquor, you can establish the local control license, and you can set a fee for that. The intention of all this, that is untouched, that exists. And then the new part is that the board is going to recommend, you know, fees, all the multiple fees. As part of that, a new, in addition, local fee that would be collected on, you know, at the state level for all applicants. That would then, and then figure out, right, make recommendations about how that's distributed to all the municipalities. And they would be recommending to the General Assembly, who, remember, it's always the General Assembly that sets the fees, not the board, about what that would be. But, so the idea is that there is a potential of two, what you would consider to be local fees. Okay. One, which is, you know, assessed at the board level to every licensee, and then the other one being an option for towns that they don't have to do it. Maybe they don't want to do a local, cannabis control commission. Or maybe they do, and they're saying, well, we're only going to issue local control licenses to retailers and integrated licensees, but if it's cultivators, we're not going to do that or whatever. So they still get to have that authority that you created in here with regard to the local government. And that's separate and apart.
And they can set that fee.
Right, but I understand why folks are getting a little confused about that, because there are ostensibly, potentially two local fees, one at the state level that's collected, and then one potentially at the local level if they issue the local control license. And so I think that, we can add just some little clarifying language in 863, and on the other one, and we can do it as a separate amendment, just to make it clear to people that if this, by adopting the Young Amendment and having the new state-assessed local fee, does not negate any powers that the town is able to have under 863.
And I'll bring this feedback back to my committee as well. So discuss it.
Just so I can get my brain wrapped around this. So basically what we're talking is that if you have a local legislative body that's got oversight over cannabis, they will set all the fees. But if you're in a community that doesn't have one, that this gives the state the right and the authorization to...
No, this would be the new proposal with the local fee collected by the state is going to be something for everybody. Everybody wins under that in terms of the towns. Whether you, and they'll figure out, they'll make a proposal with regard to distribution, things like that. So if you look at the language in the amendment, it talks about that it's, to deal with any impacts of the regulatory scheme.
So let's read the language in the Young Amendment. So the recommendation, this is, shall be accompanied by information justifying the recommended rate as required by 32 VSA section 605D. The board shall recommend local fees that are designed to help defray the costs incurred by municipalities in which cannabis facilities are located.
Right.
So it's not every municipality, it's where they're located.
But it's
State board.
That's the state board.
right, but it's for every type of licensee.
Yes.
So if at the local level you decide that you're only going to issue local control licenses to retailers or whatever, then that's your prerogative to do that and collect a separate fee.
Without a local cannabis control board?
No, you would have to do it.
You'd have to
You'd
create
have to have
a
the
local cannabis
control
board
board
to issue permits.
to issue the local license.
Just like local liquor.
But the problem with the liquor analogy is it sounded like the $400 is set here.
So it isn't 100.
Where with the local board, it sounds like that's being set in Milton with their local cannabis control board. Not irregardless of what the state sets as its master fee for everybody. Once City Council in Milton decides they're going to allow a sales establishment there, they set the fee for that permit. Is that correct?
Jim?
Can we ask Abby, she works on the tax and fee stuff, I don't mean to put you on the spot, but...
Can I give you the seat? I have 5 minutes more. I'm supposed to be in committee, but
They haven't taken up. I was just, they're about to. Just so you know. Okay, thank you for inviting me in. So Abby Shepherd, Office of Legislative Counsel. I did work on this draft, so I think I can answer part of that question. This is just for the report that the board would make about what the local fees should be set at, but then it would still be up to the state to set those local fees, and they would follow the fee bill process. So this language is sort of an opening so that local fees can be proposed. It does not establish any. It does not set the rates or the amounts. And again, it's still required to follow it's 32 VSA 605, which requires fees to be for the cost of providing the service or the cost of administration.
So just to be clear, if my friend in Milton wants to establish a higher fee, he can't.
It would depend on what the
Unless the
board
legislature-
proposes and the legislature
Right, okay.
then allows. Then if
Right.
that board thought that the fee should be higher, they would have to come to the legislature and propose a higher fee, and the legislature would have to enact it.
Thank you.
That's clear.
So you just said, so now we're back to the opposite from what I told earlier. Now the local commission, whatever, is gonna have legislative approval to set that fee. So, scenario. State of Vermont sets a license fee for whatever they're gonna set, whatever thing you're gonna do, cultivating, retail, whatever, make something up. $5,000. And then the state's gonna set a fee that the local people will get us to get $2,000. Now you're up to $7,000. Okay? So now the local municipality commission wants to set a fee, and they want to say $5,000. In order for them to set that fee of $5,000 for the local, the third or the second actually local tax, that $5,000 has to be approved by the legislature. And for simplicity, that's a yes or no answer.
Yes.
Okay.
And that would apply to every local fee. It wouldn't be just for, if that particular municipality said we think that it should be a higher amount, it would change it for all localities. Assuming that that's the structure that we follow. This is also a recommendation.
Okay, so why
Yes,
should
the
the
answer
city
is
of
yes.
Burlington have the right, or actually, why shouldn't the city of Burlington have the right to set a $10,000 local fee where a town municipality, or whatever name, pick mine, sets a local fee of $5,000? Why does it have to be 5 or 10 for every municipality? You see what I'm getting at? I'm talking about the third tax, which is the second local tax. You see what I'm getting at?
I don't think this language gets to that amount of specificity. I think that would be part of the proposal of what the board would recommend to the legislature.
Yeah.
So I'm afraid I can't answer.
This sounds to me like the board was going to recommend, and may recommend, and whatever happens, and you might get one.
And the
Sorry.
final say would be
Yeah.
by the legislature.
Okay.
Jim?
I would move that we find Representative Young's amendment favorable.
More discussion? Show of hands if you approve of Representative Young's amendment. And if you disapprove.
Thank you.
Thank you, Sam.
All right, so we have one other amendment that we need to look at, committee, and that is John Gannon's amendment. So we're gonna let him do a dry run of his floor report on this.
You hold that open, I'll come right back.
Okay.
So there are 11 instances of amendment here. Most of these are very technical corrections. So in the first instance of amendment, what we were doing is changing the number of names that the governor has to submit to the Cannabis Control Board Nominating Committee from 10 to 5, which just seems like a more reasonable number of names to submit for each vacancy. So when the Cannabis Control Board is first set up, he'll have to submit at least 15 names. Any vacancies after that, it would be 5 names. The second one really just eliminates a redundancy. So, it said groundwater, quality requirements or regulations, so it's now just groundwater quality requirements. And so that's just removing a redundancy that was in the bill. The third instance of amendment is changing the definition of small cultivator by increasing the square footage that a small cultivator can grow cannabis in from 500 square feet to 1,000. The reason we did this is we heard from small growers, and they are more comfortable and think it's more economically viable to have 1,000 square feet than 500 square feet. The fourth instance of amendment is very similar to the second one. It just eliminates redundancy. Then E replaces, the fourth instance, just changes language with respect to pesticides and ensures that federal regulation of pesticide applies to cannabis cultivators. The fifth amendment is a language change that we intended to have in our amendment to the bill but failed to make it in. This was a recommendation from the Committee on Healthcare, is that all advertisements shall contain health warnings developed by the Department of Health and adopted by rule by the board. That is the language that we agreed to.
John, is the fourth instance, number E, 40 CRF, the most stringent regulation? There's no state that would...
Well, we'll get to another, I'll get to another thing that deals with pesticides, but this is just ensuring that federal pesticide regulation applies to cannabis cultivation. So then we move on to the Sixth Amendment, which gets sort of to your answer there, is this makes sure that any rules adopted by the Cannabis Control Board around pesticides need to be at least as stringent as those developed by the Agency of Agriculture, Food and Markets. So they can't make something less stringent. They can only make it more stringent. The Seventh Instance Amendment is another thing from healthcare, just again making it clear that the labeling requirements for cannabis sold by to retailers and integrated licensees includes health warnings developed by the Department of Health. The eighth instance of amendment changes the number of milligrams of THC in basically edible products from 100 milligrams to 50 milligrams. Now the serving size hasn't changed here, so the serving size is still 5 milligrams, but the purpose of this change is to reduce the risk of somebody consuming too much cannabis in an edible product. And I will say this is the most stringent standard of any state in the country. Most states set the total milligrams of THC at 100 and the serving size at 10. So we are under both. The Ninth Instance Amendment is, again, this is coming from healthcare and deals with labeling and appropriate warnings developed by the Department of Health. Again, the Department of Health has to develop the warnings, and then the board has to implement those. The 10th Instance Amendment says that, well, there can be exceptions or accommodations for small cultivators. There cannot be exceptions or accommodations with respect to land use and environmental things, which is what Section 869 of our bill covers. The 11th Instance Amendment we just learned about yesterday is that the National Highway Traffic Safety Administration is getting out of the business of approving roadside devices or setting impairment levels. And so with this change, it really makes it, what will happen is the Department of Public Safety will make a recommendation to the General Assembly as to what, is there a measurable level of impairment for cannabis? And two, is there a testing device, a roadside testing device, that can accurately determine that level of impairment? And so they will be making a recommendation on those two things to the General Assembly, and then the General Assembly can determine whether to approve the use of that device for roadside testing. And that's it.
Jim?
Do we need to take action on this? I would move that we find Representative Gannon's amendment favorable before we lose any more people.
Questions for John? Most of these are issues that we're kind of bringing this into alignment. The The NHTSA amendment is the one that popped up yesterday, but I think we still have a solid expectation that DPS will come to us if and when there's a device that is accurate and can do a timely test. All those in favor of the Gannon amendment? All right, let's leave it open for those three.
What was that?
That was unanimous so far, but we're missing 3 people, so 8.
Quit while you're ahead. He's
So,
feeling very
Marcia.
feisty today, so.
I hate to beat this licensing thing to death, but what happens if municipalities decide that they will set their own local fees so high as to prohibit any kind of growing, manufacturing, processing? Up to them.
Jim?
I think it would be if we allowed it next year. You know, the board comes back with a recommendation,
Right.
and if we decide collectively that we want to give that authority, so right now I think it's a moot point because we don't know what they're going to propose and we don't know how we're going to feel about it. If we want to allow Burlington to, you know, set a $100,000 license fee, when I doubt we would do that, but
Right.
I mean that would be up to us to give them that authority. I think, as I understand it, my friend from Ways and Means left, but
Or range.
I mean we could do that. It would be unusual, just like it is with liquor license. It's the same in every single community, and that share is the same in every single community today.
Y'all know my intentions behind all this. That was to represent the people that I'm here for, and that's the residents of the town of Milton.
Yeah.
So should the town of Milton decide they want to allow cultivation of cannabis for retail purposes and or allow a retail store to sell the cultivated cannabis, they have the right to do that by town vote initially and by saying town commission, but I do understand that the state wants to have control over how much the municipality can charge somebody to do this, and that bothers me greatly. But bothers me greatly that the state is going to be able to mandate to the municipality, you can charge this amount, but you can't charge what you decide you want to charge.
But that's always been the bill even before this Ways and Means changed.
I know,
there was a
I
2%
know.
local option tax that was set by the legislature.
I know, I understand that, but at least with the 2% local options tax, the municipality on retail sales anyway, I know it was the retail sales, was going to get the 2%. So that was something that the municipality was going to get. Right now, the municipality is going to get what the state decides they're going to get. They're going to give them whether it's $500 or $50,000 from a 2% options tax, and there's a big difference. Big difference.
Option tax was based on sales. This is
Sales.
based on permit.
Licenses, yes. So, for example, in Milton,
I understand
so
that.
let's use the example of Milton, which has a dispensary. So if the dispensary, you know, can get an integrated license, so there would be a potential fee set by the state for that license.
And the town will get a portion of it.
Yeah, no, the town will, there's a local part that they will get all
Right.
And there might be other growers or other manufacturers who seek to be licensed in your municipality, which could offer more license fee revenue than in the scenario where it was a percentage of sales. From the perspective of my small community, where I don't know whether anybody will
choose to open a retail shop. I actually think that this is a more even spread of revenue sharing across the landscape, because you can imagine that there, is going to be a wider distribution of growers and labs and wholesalers and manufacturers across the landscape than there will be for the distribution of retailers. So, from the perspective of my community, I could see having more of an even revenue spread across the state.
Not a question, but the other side of that thing is the thing that I've always been concerned about, is the inducement to have the sales. And that's the horse that's out of the barn.
Okay. Well, this is the next stop of the bill on the floor for the House to adopt it. After that, we will have to sit down in conference with the Senate, who has a different scenario of taxation than we do, and so that will be an interesting conversation.
Yeah. I anticipate that, this bill is supported on the floor this afternoon. We will have a conference committee, and I think one of the things that will be hotly debated in that conference committee is local taxation. Given that, I've heard that from the Senate. I think that is one of their concerns. So, with this bill, as it comes out of the House. So, there's still another step in this process, assuming this gets passed on the floor this afternoon, where we will have a say, because we'll be part of that conference committee process.
We who vote for the no.
Yeah. We who vote for it.
JP?
Another problem I have, and I understand, I know why the fees haven't been set. Anyway, the problem is that I see is we have no idea what these fees are going to be, and we won't until the Cannabis Control Board sets these fees. So these fees could be thousands of dollars, or these fees could be hundreds of dollars. We don't know. Yes.
We're setting the fees. They're making a recommendation.
True. Okay, and that's fine. I'll stand corrected on half of that. But we set the fees, but based on their recommendation. But to date, I do not know what these fees could be.
That's fair.
So this could be a $50,000 integrated license fee, or it could be a $500 integrated license fee, and that's a big difference.
Yeah.
Well, let's look at what.
Again, I'm trying to represent because my constituents in my town, because we have the largest medical, right now it's medical marijuana dispensary in the state, and who knows, that could expand.
Well, a dispensary's licensing fee today is $25,000.
That's the recommended fee.
No, that's what
That's what it is.
That's what it is.
State fee.
That's what Shane pays.
Yep.
Yeah, but that's medical. I'm talking retail.
What do you get now?
Probably ballpark.
And there's no taxes, so there's no ability to collect a option tax on dispensary sales. On this.
So what you're saying is, I think you're saying, John, is again, we don't like to use the word assume, but we need to assume here because we don't have set things. So we're going to assume that let's say an integrated fee, which is the biggest and the best and the largest fee, which is going to get the most money, is going to be at least how much?
I think, you could model it after the integrated not the dispensary fee that is currently charged.
Which is 25, I think, is that it?
Right.
And that 25, all that 25 will go to where?
It will go into the Cannabis Regulation Fund to support the cost of the Cannabis Control Board.
So what part is going to, what the amount do you think is going to go to the town?
Well, there's a separate fee that will be set for the town.
Again, we don't know.
We don't know, but we don't know any of these fees.
I know
But ultimately, here, we decide.
It's going to be something.
And you'll have input into that process.
We continue.
All right, the only other amendment that I know of was an amendment to the appropriations section of was an amendment to the appropriations amendment, which essentially takes out, you want to describe that to us?
6% sales tax going to the grant program.
Okay.
For private schools.
So it does not It does not designate where the 6% sales tax revenue goes, it just dumps it into the ed fund.
Correct.
Okay.
We voted on that, we would like.
Yes, I'd love to know what you.
We voted to find that amendment not favorable on 11-0.
Okay.
And I just have in my hand too, just an update for those that